Good morning, everyone, and thank you all for joining us and everyone who helped put this hearing together. I want to welcome you to Exploring Solutions to the Disproportionate Impact of COVID-19 on Minority Communities. This hearing is going to be a long hearing. And some may say, why even have a hearing about racial disparities? We already know what happened, and that's true. We all heard the rumors, and many of us legislators have experienced this disparate impact in our community. In both New York City, New York State, Black and Latino populations make up a far greater percentage of our dead than they represent in our overall population. In New York State, for instance, only 9% of the population are Black, but we represent 19% of the COVID-19 deaths. We also seen inexcusable incidents of anti-Asian racism that result from a climate of fear and ignorance around the virus and its origins. These facts and narratives are in the air right now. And hearings like this one about distilling action items from those numbers and experiences. This feels like too large a topic to cover in one day, even in what may be a long hearing. So I hope you brought your breakfast and lunch and dinner. We could and should spend a week, 2 weeks, a month on the disparate impact of COVID-19 in our communities of color in health outcomes, economic impact, policing, and more. And there are topics we haven't even begun to broach yet. For instance, in New York City, in New York City, we have the greatest number of Native American tribes of any US city. Yet we haven't had a citywide conversation about the impact of COVID-19 on indigenous peoples. And we will have to wait years to fully understand the disparate impact of COVID-19 on our school communities in Black and brown and working class neighborhoods throughout New York State. There is so much more to be unpacked. And while we are going to do as much of that work today as we can, we have to balance the need for information with the need for action. And this hearing, I hope, will put both houses of our state legislature, the Assembly and the Senate, on the same page about what has happened so far, where things went wrong, and what we can do to support our minority communities in their healing. I look forward to hearing from all of our distinguished guests today about the issues and concerns you have with the disproportionate impact of COVID-19 has had on minority communities. I also want to encourage our constituents who are out there viewing this several platforms, who are able to tune in right now, touch base with our officers about what you hear. All of this input will go into policymaking process and inform how we move forward. I thank you for being part of the solution, and in unity we go forward. And let me turn to my colleague, the co-host, Ed Bronstein, the chair of the Committee of Cities in the New York State Assembly. Ed?
Thank you very much, Senator, and sorry for the delay. We had a little technical trouble. Good morning. Before we begin, I'd like to introduce the Assembly chairs and rankers participating in this hearing. The ranker, I'm the chair of the Cities Committee. The ranker on the Cities Committee is Mike Riley. And then for the Health Committee, we have Dick Gottfried is the chair, and the ranker today will be Jake Ashby. For Labor, Marcos Crespo is the chair, Carl Brabenak is the ranker. For Local Governments, Fred Thiel is the chair, Colin Schmidt is the ranker. And then for the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus, we have Tremaine Wright. For the Task Force on Asian Pacific Americans, we have Ron Kim. For the Task Force on Puerto Rican Hispanic Americans, we have Maritza Davila. And for the Task Force on Women's Issues, we have Arabella Simotas. I want to thank all my legislative colleagues and the many witnesses who are participating virtually today. I also want to thank the Assembly and Senate staff who worked overtime this weekend preparing us for this hearing. We have all heard the statistics about the disparate impact the COVID-19 pandemic is having on minority communities both nationally and here in New York State. Data from the New York City Department of Health and Mental Hygiene indicates that the mortality rate for Black and Latino residents in New York City is 2 times higher than it is for white residents. According to a recent NBC News report, there has been a 92% increase in demand at food banks nationwide. This skyrocketing increase disproportionately impacts Black and Latino Americans, who are twice as likely to experience food insecurity than white Americans. The Stop AAPI Hate Reporting Center received over 1,100 reports of verbal harassment, shunning, and physical assault against Asian Americans during a 2-week period at the end of March. This is after the FBI issued a warning to local law enforcement officers that the agency expected to see a surge in hate crime incidents against Asian Americans due to the spread of the coronavirus. I could keep talking about statistics, but that's not why we're here today. Behind these stark numbers are individuals, family, friends, and neighbors. We are here today to hear from you about solutions to address the disproportionate adverse impacts of COVID-19 on minority communities, including access to food, housing, and healthcare services. We are interested in hearing solutions to help New Yorkers both in the short term as we grapple with the current pandemic, but also in the long term as we start to chart a path to recovery. With that goal in mind, I'm going to keep my comments brief and get to the most important part of the hearing, is listening to what our esteemed panel of witnesses have to say. Since this is our first Zoom hearing, I wanted to take a few minutes to go through some housekeeping. For the witnesses, please don't read your testimony. We will be reading all of the submitted testimony, so please summarize your main points. Due to the large interest in this topic, each speaker will have 5 minutes to speak. There is a countdown clock to help us stay on track that can be seen in the Zoom gallery view. When the light is green, please begin to speak. When the light turns yellow, you have 1 minute left and it is time to wrap up your testimony. After 5 minutes, the light will turn red and it will be our turn to ask questions. Please keep your video on and use gallery view. You will remain muted until it is your turn to testify, and you will be muted once again after all the questions have been asked and answered. Please mute cell phones during the hearing. As a reminder for those who may be watching but are not scheduled to testify, please be aware that you can still submit written testimony to the email address on the hearing notice reply form within 10 days. Reminder to members, please, because of the considerable amount of interest in this hearing, each chair and ranker will have 5 minutes and each member will have 3 minutes to ask questions of each panel. Chairs and members will have 1 opportunity to ask questions of each panel. Please use the raise hand function if you wish to ask a question. You will remain muted until you are called on to ask questions. With that, Senator Jackson, if you wouldn't mind introducing our first panel.
Thank you. And before I do that, Assembly Member, let me thank you for your leadership as the chair of the committee's, cities committee. Thank you. And hopefully we will come together like this and move forward on behalf of the people that we represent, all of the people of New York State. But let me introduce first my colleagues in the New York State Senate. We have Gustavo Rivera, the chair of the Health Committee, Jessica Ramos, the head of the Labor Committee, James Gorin, the chair of the Local Government Committee, Julia Salazar, the Women's Issues Chair. We've also been joined by Todd Kaminsky, Andrew Gennardis, Roxanne Passard, Kevin Thomas, Tim Kennedy, David Carlucci, Shelley Mayer, Jen Metzger, Brad Holman, Brian Kavanaugh, Monica Martinez, Brian Benjamin, James Skoufis, Jamal Bailey, James Sanders, Zelnor Marie, Kevin Parker, John Liu, and Anna Kaplan. And the minority, we've been joined by Andrew Lanza, who is the Labor and Cities ranker, Pat Gallivan, the Health Committee ranker, Betty Little, the women's issue ranker, Patty Ritchie, the local government's ranker, George Borello, Michael Ratzenhofer, Sue Serino, and Chris Jacobs. These are all members of the New York State Senate that are involved in the committee right now. And with that, let me then now introduce the first panel. And they are Frankie Miranda, the president of the Hispanic Federation, Lorraine Brathworth Hart, the health chair of the NAACP New York State Conference, Wayne Ho, president of and CEO of Chinese American Planning Council, Joanne Wu, executive director of Asian American Federation, Lance A. Gums, vice chairman of Seneca Indian Nation, Teresa Sanders, president and CEO of Urban League of Long Island. With that, that is the first panel. So President Frankie Miranda, you have the floor.
Good morning. Thank you so much. My name is Frankie Miranda. I'm the president of the Hispanic Federation, and I would like to thank all the chair people here for bringing us together today. The COVID-19 virus is laying bare the devastating racial and ethnic inequalities that hover over our state. A legacy of structural discrimination is putting our people most at risk of catching and dying from this virus. And I will not go over the numbers, they have been already mentioned here, but we know how this is devastating our communities of color, especially Latino communities. For us to finally come out ahead of this pandemic, we must incorporate community into all efforts to combat the spreads of COVID-19 and the destruction it had caused. Two areas I will want to focus today are the critical role of community-based organizations and ensuring culturally and linguistically competent contact tracing. Both topics have incredible potential to help communities of color during this crisis. If we are to effectively address the unprecedented crisis in communities of color, and especially Latino communities, we must make sure that community-based organizations, and especially for us, mean Latino-led, Latino-serving, bilingual, bicultural service agencies that are at the front and center when it comes to resource allocations and interventions directed at our state's most affected populations. It is imperative that resource allocation is proportionate to the harm caused on communities. CBOs serving neighborhoods have been devastated by the health crisis and will naturally require greater amount of resources than others to adequately serve their community in recovery efforts. Our nonprofits are deeply embedded in neighborhoods, providing frontline health and human services to millions of Latino New Yorkers. They also serve as economic engines and employing tens of thousands of people. Since day one, nonprofits felt the brunt of these harmful economic effects of the COVID-19 pandemic while providing services to the most affected. Our underfunded, overstretched organizations are working night and day to provide for communities of color across New York. Due to the overwhelming needs within communities, they have begun providing services that they were never built to provide. Day labor centers have become food distributors. Immigration service providers are assisting people with an employment application, and the list goes on. Our agencies have quickly adapted to provide direct services with minimal contact and minimal resources, funding, and personal protective gear. And when society can once again convene, our organizations will be on the front lines helping people restore their lives. I want to also talk about nonprofits are also economic engines. Nonprofits alone account for 16% of the private workforce compared to 10% nationally, and this is in New York City. With the time left, I want to talk about contact tracing. If done correctly, contact tracing also has the potential to uplift communities of color. We must do contact tracing working with nonprofit organizations in communities. When speaking with COVID-19 positive individuals, contact tracers are collecting the name and information of everyone, every single individual that have come into contact with the person infected, potentially including undocumented relatives or friends illegally subletting apartments. To have effective, accurate, and candid conversations with community members, contact tracers must have cultural and linguistic competency appropriate for the local community. For these reasons, it is imperative that contact tracers come directly from communities they're working in. And for that, we need to make sure that local CDOs are working hand in hand with any institution or agency leading this effort. With that, I want to thank you for this opportunity, and the Federation is here to help with anything that you guys need. Thank you so much.
Lorraine Hart, you're next, so welcome, and you have the floor, my sister.
Good morning. I represent the New York State Conference of the NAACP, and I'm here on behalf of Hazel N. Dukes, our president. What I will speak about today briefly is on the issue of the nursing homes and what is happening in there. We all know the stats. Once again, no need for me to go into details, but I will say that from March 1st to May 1st, there have been 4,800 COVID-related deaths in New York in the nursing homes. Many of these deaths could have been prevented. It seems as if there wasn't the health department or serious thought into how these nursing homes could handle COVID patients, because the mandate was to return to nursing homes COVID patients that were recovering. Nursing homes are notorious for being understaffed. The nursing home staff was not properly trained to handle COVID patients. So where was the thought process? They didn't have PPEs, and they did not have proper training on how to handle COVID patients. Neither did they have the proper isolation units with negative pressure to make certain that the disease, the droplets, the air droplets did not disperse to other patients. Henceforth, we had an increase in the number of patients becoming sick on top of what they had, their illnesses that they already have, becoming ill, and then having COVID infection. This was a double whammy for these patients. Then on top of that, you had the staff becoming ill on top, along with that. This was not proper planning. Fortunately, now it has become obvious that nursing homes require a certain kind of care. And the governor has put into effect that no more will nursing homes be required to take on these patients from the hospitals. We don't understand how that decision ever came to be. But moving forward, what we would like to see is that provisions for testing in nursing homes go up, provisions for removing patients that are COVID patients out of there and placed back into hospitals that can handle this. The nursing home in Cobble Hill made the request that patients be moved out of there and put at the Jacob Javits Center that was created for COVID patients. But they, at the time, when they made that request, were told, no, the Jacob Javits Convention Center is only for ameliorating the issues in hospitals. They had nowhere to go. Now, double that with families not knowing and being able to contact their own family members to see what was the status. This was a seriously poor planning. And nursing homes, the patients are some of the most vulnerable to this disease. We all know it. That was one of the first thing that was said. This disease will affect the most vulnerable in the population, which are the elderly. So as a social justice entity, the NAACP, we look to see who is the most disproportionately targeted or not even targeted in this situation or affected by whatever is going on in our society. Everyone is handling all of the other issues, but this is just one of the many issues that we're looking at. And nursing homes need, moving forward, to be treated in a way that patients, when you put your family members in there, you're not going to have to worry that they're not going to be properly taken care of. And then added to that, having a disease like COVID or any other disease coming down the pipeline. If we don't do this right now, fix the problem where at the root cause where it is, meaning treat the patients that have the condition and then prevent any further spread of the disease into the nursing home, down the line, we're going to have this problem again. So from our standpoint, we want to be involved moving forward in how these programs and these measures are put in place. We want to be part of the solution because we don't want to see this happen again. And that is what we really want to be involved in. Thank you for this time. And I hope that moving forward, the NAACP continues to be part of the solution.
Well, thank you. Thank you on behalf of the statewide NAACP Chair, Hazel Dukes. We appreciate you coming forward to this hearing. And now we're going to turn to Wayne Ho, President and CEO of Chinese American Planning Council. Wayne?
Thank you, Senator, and thank you to all the senators and assembly members who are here this morning for this very important hearing. I'm Wayne Ho, the President and CEO of the Chinese American Planning Council. CPC, we're the largest Asian American social services provider in the nation, and we employ about 5,000 New Yorkers and serve about 60,000 New Yorkers every year. I'm here today to speak about the impacts in the Asian American community, specifically our health economic impacts, as well as the anti-Asian discrimination, which was mentioned at the beginning. And then I have some recommendations around Medicaid, revenue raising, and supporting our human services workers who are deemed essential workers during this time. It's important to note that the Asian Americans are the fastest growing racial group in New York State, and we make up about 10% of the population. And we're the fastest growing group of those getting naturalized as well as voters at this time. Unfortunately, we're also have the highest rate of linguistic isolation and limited English proficiency. And that's where our community currently has over about 15% are uninsured. And given language issues, there continues to be Asian Americans not seeking out care during this very critical time of the pandemic. It's also important to note that without Medicaid being expanded and then having the New York State Health Act, we know that there are many immigrants and other community members who are not seeking out much needed care. In terms of economic impacts, our community, because we had a president calling this the Kung flu as well as the Chinese virus, we unfortunately, going back to January, many Chinatowns as well as Asian American neighborhoods throughout the city as well as the state was already feeling economic impacts. About 40% to 80% of local businesses were struggling back in January, and that's 2 months before the shelter-in-place order was executed by our governor. And that's where we already knew that people were losing work. We know that during this time of high unemployment at CPC alone, a survey of our community members show about 50% have lost their jobs. And these are only the numbers of those that we're able to collect. And we know that unemployment numbers might be higher because of many of our community members work in cash-based businesses. It's also important for us to note that we have the highest rate of overcrowded housing. So not only do we have multiple families still working on the front lines as grocers, deliverers, or other essential workers, that at the same time in their housing, they might be have more exposed and more at risk. You've all seen in the news around anti-Asian violence. My staff alone right now, who are continuing to be on the front lines providing services in terms of home care, residential programs, meal delivery, I've had staff spat on, yelled at, pushed. We've had Zoom bombing, swastikas shared, and ethnic slurs during Zoom virtual town halls that we've been on. And we have many allies and partners who are experiencing the same verbal and physical incidents during this time. That's why we think it's very important that we move forward with making sure that any solutions that the state has looks out for essential workers, the Asian American community, and we stand with our Black and Brown brothers as well as our Native American brothers and sisters during this time. In terms of recommendations, how can we handle all these issues? First, we need to look at revenue raising. We know this is a tough time. We know the federal stimulus dollars are helpful, but this is a time for us to be bold, and we need to make sure that we invest in the services that are needed for all our underserved communities. So we strongly recommend to the state that we need to look at revenue raising during this time, and there are loopholes that we can close. Secondly, we know we need to defend Medicaid against any cuts. We know that the governor has been pushing Congress in order to pass federal stimulus that gives him the right to do more Medicaid cuts or shift these costs to localities. If we shift these costs to localities, not only is it impacting health services, it will also impact human services. Most local tax dollars go toward human services to support kids, youth, immigrants, and seniors. And these are the communities we should be investing in at this time. We also know we need to support our workers. New York State must come up with a relief plan that supports all immigrant families, including our undocumented. It's great that private philanthropy is getting involved, but that does not meet the full need of New Yorkers. And that's where we are asking for an opportunity for the state to look into packages that support all types of workers and all types of families, especially those left out of federal stimulus packages. Last but not least, we know that human services workers are on the front line, as Frankie said, and that's why we need to make sure that all workers are supported. So we have workers who are putting their health and their family's health on the line. I myself at CPC, we've had 2 staff members passed away supporting individuals during this time. Unlike the city, the governor has not said that contracts would be kept whole during the fiscal year. They've not reimbursed us for COVID expenses. It's great he's talking about hazard pay, but he has not committed to hazard pay for human services workers. And these are all things the city has done and committed to, but the state has not done so far. We need to keep in mind that human services workers
I'm
and
sorry, your time is run out.
all right, thank you very much. And I look forward to questions on more of these issues. Thank you.
Thank you, Wayne. Please make sure that your written testimony has all of the suggestions and everything that you've spoken about. And next, we're going to turn to Joanne Wu, Executive Director, Asian American Federation. Joanne, I hope I didn't mess up your last name. So help us, please. Help me.
Sure. Good morning. My name is Joanne Yu, and I'm the Executive Director of the Asian American Federation. Thank you so much for this opportunity. It's really great to see so many of my government allies, even if on Zoom. I think this is a critical opportunity for us to voice what we are seeing in the front lines. Obviously, this virus has really laid bare the American class and caste system that we're living through. And I want to share a story with you about one of our member agencies. We were on a call with the city to talk about food access, and one of my member agency staff was crying on the phone, and she said, in order to feed my starving seniors, because we don't get any government funding, we found a restaurant who would deliver food. And for them to do that, I had to fill out a form that permitted them to be able to get funding from the city. But she said, I'm a trained social worker. I don't know how to fill out this form. And so all of a sudden, I'm filling out these forms to be able to ensure that they're getting paid so they can deliver food. I mean, everything in this, I think as much as we compartmentalize what our work is, social services, healthcare, seniors, it's not compartmentalized. This virus has linked all of our work so that way everything, it's a domino effect. If you hit one industry, it goes down the line and everybody is impacted. I'm grateful that Wayne mentioned the private philanthropic dollars. We got a small grant and we're sharing that with six nonprofit organizations that got no money. And so we're able to figure out how can they, I think the funds that we're giving them, they're going to be able to maybe feed their seniors for maybe a month. So we know that we're in dire situations. We are dealing, the question that I've asked our member agencies was around public charge. With the Trump rule, people are disenrolling, Asians are disenrolling at a very high rate. And when I asked my member agencies, the one answer they gave me was, everybody comes to us and says, is this gonna impact any potential, my future immigration plans? If so, I don't wanna enroll in food stamps, I don't wanna enroll in Medicaid. These are very real situations that are happening. We need to determine what is truly the essential worker in our state. I mean, as much as we think about who is, 7 o'clock every day, everybody claps all the time for all the essential workers. I know that I'm not an essential worker because I get to stay home and have deliveries. The real essential workers are getting on the train, risking their lives, and having to work without masks. I think this is the real reality of our city. In our state. I want to also talk about the hate crimes. I really appreciate you mentioning that. Anytime we've had these crisis points, government has always been, law enforcement has been really slow. They need to be much more proactive. It is not our responsibility to create reporting systems, to teach our communities what's happening, to make sure that we patrol and safeguard our communities. This is the job of law enforcement. We have seen them be really, really unresponsive. I can't tell you how many calls I'm on with NYPD telling me what their numbers are, and they're telling me, it's only 14 hate crimes. Each of my nonprofit organization members has 14 hate crimes reported to them. There are hundreds and hundreds of hate crimes, and yet the NYPD has been incredibly passive. We need to be able to educate our communities on what their rights are, and to be able to protect themselves. The other opportunity is, how do we work with other communities of color to really build solidarity so that way we can stand up for each other? This is the work that we've been doing. I sent out, my testimony is all of brief 9 pages. And I sent it in the middle of the night. So it's a lot of light reading for all of you. But I thank you for this opportunity. And I just want to say, I think after being at home for months, I'm sure we're going to all rush out to do what feels good because that's going to be normal. But I think this is also an opportunity for our state to figure out what the new normal is going to be. It cannot be how we prioritize, who we prioritize. And we need to figure out a way to step out of our house our homes into a bold new economy that really embraces all the people who've held us up during this crisis. Thank you.
Well, thank you. And we look forward to reading the 9 pages of testimony with recommendations and solutions to resolve our problems. I mean, not your problem, but our problem. We've been joined by one of our colleagues in the state Senate, Senator John Brooks. I wanted to mention that he's in the House. Now we're going to turn to Lance Gumbs, Vice Chair of Shinnecock Indian Nation. Lance.
Good morning, Honorable Committee, Task Force Chairs, and esteemed members. My name is Lance A. Gumbs. I'm the Chairman of the Shinnecock Indian Nation, and I'm also the Northeast Regional Alternate Vice President for the National Congress of American Indian. I'm honored to be here to appear before you today to help you understand some of the unique circumstances that are facing our Indian communities and our Native people here in New York. I'm also aware, though, that looking at the task force and the committee list, that there is no task force, no Native American task force here in New York charged with addressing the concerns and well-being of the many tribal nations here in New York. We have 9 tribal communities here in New York. And I'm also happy, Senator, that you acknowledge that New York City has the largest Native American population in the country. So New York has a very, very large Native American population, and that seems to go unnoticed a lot. I come before you as an elected tribal leader today, and also an elected board member of the largest Native American organization in the United States. The impact on our communities is dire. You may have heard about, the Navajo Nation out in the Four Corners. They actually take up 4 states, and the infection rate there is second only to New York State. Smaller tribes in New Mexico, they possibly face total extinction if this virus continues to go through these communities. Luckily, here at Shinnecock, we have avoided that through some stringent measures that we have implemented as the tribal leadership and the council. But we cannot survive the curve. We must exclude that curve entirely. My nation is located on the east end of Long Island. We are surrounded by the town of Southampton out in Suffolk County. Our territory consists primarily of 3 peninsula. We're surrounded on 3 sides by water. We have implemented several measures in our community, including a food distribution tent, and I have been distributing food and PPEs to keep our people safe. But our territories are vulnerable in that we are surrounded, and especially in the Hamptons, with all of the people that came out from New York City. So we have some issues that are unique to our communities, but we also have some issues that are unique to all of the minority communities here in New York State. One of those issues is the fundamental healthcare disparity. Like other communities, our Indian communities have pre-existing health conditions. We have great levels of diabetes, cardiovascular disease, and obesity, which puts our people at great risk. So one of the solutions is to address this inadequate health care and to expand access to primary care and preventive health and wellness programs. Nutrition and food medicine is another area. The health vulnerability now reflects generations in our communities that have had lasting impacts through the colonization of food and the loss of our traditional foods. Without these important nutrients, we are unsuited for any type of diseases that come into our community. In response to that, tribes throughout the country have sought to develop food sovereignty rather than live in food deserts. Our tribal communities need support to restore to the extent possible traditional food sources and means of protecting our fisheries and guaranteeing access to our water rights and some of the other issues that I won't go into that are affecting our Native communities here in New York, as well as across the country. The intertribal organizations are working on this, and increased funding and support would help to create a healthier community, both internally and externally, for these food gardens and other ways of producing food that would help all communities, not just our Native American communities, in this health challenge we now face. Food insecurity is another big issue, and housing is one of the other main issues that we're all facing. The digital divide in terms of having proper internet in our communities for our children right now who are out of school is another one of the main issues that we are all facing. So I have written testimony that I have sent in, and I greatly appreciate you having our Native American communities represented here and now as that has not been the case here in New York. And it has been quite disturbing to all of us that New York has not reached out anyone from the governor's office, the state senate, or the assembly to our Indian communities to see how we are faring, with the large number of Native Americans that we do have in our communities. So with that, I thank you for allowing me to have this moment, and I look forward to any questions that you may have.
Thank you. Thank you, Wayne. I appreciate you coming and communicating on behalf of all of the constituents of the tribes in Shinnecock Nation. Next, we're going to hear from Teresa Sanders, President and CEO of Urban League of Long Island. Teresa?
Thank you. Thank you very much, Senator Jackson, and thank you, Assemblyman Bernstein, for having me today. This is a privilege and an opportunity to present testimony based on engagement with the constituents here in Nassau and Suffolk counties on Long Island. COVID-19 has had a disproportionate impact on Black and Brown communities, which is why we're having this discussion. There are the social and the economic impacts that we already know pre-existed in communities of color on Long Island, and now is being amplified during this pandemic. Out of the 5 top communities on Long Island with the highest rates of COVID infection, those communities have 70% or more of Black and Brown people living in it. And we are surrounded by pockets of wealth on Long Island. The disproportionate impact of how people were able to access healthcare was extremely scary in the beginning of this pandemic. And it didn't matter if you had insurance coverage. We have constituents that called and were turned away from hospitals, told to go home and isolate. You probably have the flu, and not even being able to breathe at the emergency room. But these Black and Brown people were turned away and told to go home. We need to do better. And we need to do better because, again, relative to this topic at hand, I just want to remind you that Long Island remains one of the top most segregated places in America. And that segregation seeps into the structures of all of our systems, including our healthcare systems. So when people are turned away or giving misleading information, it's a matter of life or death, and that's what we're seeing now. So today I present just a couple of recommendations how we're going to mitigate this growing crisis in our communities. One is that we have to have a very fair assessment on what's happening now. It scares me to think that we're considering reopening and we don't have enough PPE for the people that are in phase 1, our healthcare workers, et cetera. And how are we going to open more businesses? And what's going to be the supply plan? That needs to really be assessed, and there needs to be real resources being put behind the PPEs. That's number one. And then the phase 2 businesses, as they start to open, are we going to hold them to the same protocols as the phase 1 businesses? Maybe there should be a grading system like we do for food. If a business is keeping its customers safe or adhering to safety protocols, the public should know that. The public should not be exposed to a business that is not taking precautions or exposing unnecessarily their workers or the public to continued exposure. We need to provide more testing. And testing now, as we see, now that it's being expanded to communities, when again, Long Island was very unique when the first test centers were like out at Jones Beach. Well, that assumed you had a card to get there. So we need to be as serious as we were back in 1948 when we had the Marshall Plan and we infused $12 million into helping Western Europe recover. I would love to see a collaboration with federal resources, state resources, so that we can take some action behind what you're hearing today in these hearings. Without the resources, we had a great conversation. With resources, we can truly make sure not only our local communities recover, but we can recover with even more equity than in which we started. Just spread the resources out, have consistency and accurate information that we're giving out to all communities, and make sure that we are inclusive of providing adequate health care. I want to thank you again wholeheartedly for allowing me to provide some testimony, and I will send in my written statements. Thank you.
Well, thank you, and all of the members of the Urban League of Long Island. I'm glad that you're in the House giving testimony on behalf of the constituents of Long Island. We have a couple of questions, but before that, we've been joined by State Senator Luis Sepulveda of the Bronx. He's been in since the beginning. Welcome, Luis. And with that, I want to turn to the Health Chair, Gustavo Rivera, for questions or a statement about this particular section. Gustavo Rivera.
Good morning. Thank you so much, Robert. Thank you, everyone, for joining us. And since I only have 5 minutes, I will get right to it. Thanks to all the folks who are here in the first panel. Wayne, I wanted to start with you since you are a service provider in particular. Could you talk a little bit about the impact that Medicaid cuts are having on the work that you do on a day-to-day basis? Probably Frank, you could add on this later, but if you could tell us a little bit about that, and also finish your point, the point that you were making about the resources for agencies that refers particularly to frontline workers and human service workers.
Sure. I think thank you for the question, Senator. There's a couple of hits on Medicaid. I think the first one is we know that it's critical at this time to make sure individuals have access to healthcare. And too many times when we are doing our wellness checks every morning, seniors, kids, young people who are saying their parents don't want to go in, and whether it's to get tested, go to a hospital and they are sick, go to a provider, is all because they are not insured, or they're undocumented, or they're worried about public charge. So that's why it's critical at this time we make sure that New York State is bold, and that's why we are recommending and continue to support and advocate for the New York Health Act. That would take care of a lot of issues that our community is facing. Secondly, any package that's passed at the federal level, which allows the governor to do Medicaid cuts, will be detrimental not only to the state's Medicaid funding services, which for us, for example, that's nursing homes as well as home care. We are 100% funded as a home care agency. Our home care program is 100% Medicaid funded. And if Medicaid goes down, and we already had that 1% budget cut, that's less services for homebound seniors and the disabled. Last but not least, this will shift any cost to localities. And again, in New York City, city tax levy dollars pays for summer youth employment, summer programming, pre-K services, senior services, libraries, other first responders. So those are what's going to be hit if there's any Medicaid cuts. And we know our communities are the ones that need those services to go back to work, to recover, to invest in their neighborhoods and local businesses. And then to your last question, we need support for our workers from expanding, and a lot of this is captured in the bills that Senator Ramos is sponsoring. We need to make sure there's PPEs for our workers. We are out there scrambling for PPEs, donors who are helping us with PPEs at this time. To me, it's ridiculous that we have to find donations to get PPEs for our workers who are on the front lines, as opposed to having the state come through and give us PPEs when we've been mandated and contractually obligated to continue doing this work. We need more childcare options. We need hazard pay. And once again, we have our staff who are putting their health and their families' health on the front lines during this time.
Gotcha. Frankie, since if you could add, particularly because of all the organizations that are part of the coalition.
I just, Wayne is on point. All that I want to add is that it's really important to be able to provide information in Spanish for our community. There's a lot of people very confused about what is the opportunities out there. What exactly is the current status? Joanne mentioned as well that it is critically important that people understand that they can go and get services, whether or not this is going to affect them, that they feel confident. We know that the numbers we will know later on the real numbers of how many people have died, because we know that people have been dying in their apartments and they have been very afraid to go out, to go to the hospitals, and they are not reporting. So language access is critically important when it comes to any information about healthcare.
Okay. Last but not least, in the last minute, anybody on the panel, if regarding the governor's insistence that we should not raise revenue, he doesn't even want to talk about it. Would that be helpful to be able to get some resources to some of the work that you do in each of your communities? Anybody can jump in, please.
Sure. I'd like, there are lots of ideas, and we're going to have a gazillion ideas, right? And they're all worthy and they all have merit. But I think what we need to do is prioritize what we're going to stand for. I think, there's the pie is small, but we need to prioritize getting help to the most vulnerable. I think we've always been a culture that celebrated, white collar Wall Street. Where's the help for Main Street? The folks who are holding up our communities, the small business leaders. I've been talking to thousands of small business leaders since this started in January, and they are scrambling. And so I think as much as we talk about
so my time is up. My time is up, and I'm going to cut off, and we have a little, but more revenue, more revenue, more revenue. Just want to put it on the record. Thank you so much. Thank you, Mr. Chairman.
Thank you, Senator Rivera. And now we turn to Senator Tim Kennedy up in the Buffalo area. Senator.
Yeah, thank you very much, Chairman. First of all, thank you all of the testifiers today. You've been extraordinary, and I know we have many more to go. I'm going to get right to some questions I have regarding the Native American issues on the table. Chairman Lance Gumbs, first of all, thank you for testifying on behalf of the Shinnecock Nation and all natives in this great state. I just want to clarify the record, a couple of things. The Majority Leader, Andrea Stewart-Cousins, created the subcommittee on Native American Affairs. I chair that committee. Last year was the first year we had the majority that I was in the Senate. On June 6th, we held a roundtable in Albany to discuss issues related to Native American affairs. And the Shinnecocks were reached out to. We reached out to Ms. Paula Bess Collins, Roberta O'Hunter, the council there, as well as Braden Smith. I have their emails. We got that information off of the website. I'd like to get your information so we can follow up. Following that roundtable discussion, we had visits to the various tribes across this state. We definitely want to get down to see the Shinnecock Nation as well, but this committee's been very actively involved, and we're looking forward to engaging with you. Aside from that, though, Chairman, I want to talk to you about what's at hand here, and I want to talk to you about the data that's being collected. I want to find out from your estimation whether or not this data is actually accurate. If the data that is being collected on the nations is actually underrepresented because of a lack of testing. I want to hear from you about the testing kits, what the state can do as far as being helpful to you, and you really what challenges that you're facing aside from clearly what's at hand with this pandemic, but ways that we can engage furthermore from not only this discussion, but following the recovery efforts that we are going to undertake.
First of all, thank you for that information. None of the individuals that you named are on our council, and our council was completely unaware that this committee had been established. So I do appreciate that information, and we will look forward to participating in the next round of discussions.
Great.
To your point, our community, we've had, and just looking at the numbers that came out about Shinnecock, we've had 7 confirmed cases. We've had 3 deaths. 2 of those deaths were in nursing homes, and those numbers are not reported anywhere. It's still saying, when we look at the numbers, that we've only had 3 cases. So right out of the bat, those numbers are wrong. To your point about the testing, we did manage to secure one of the Abbott ID Now test analyzers. We are using that currently in our community along with the antibody test to hopefully, identify those individuals who may have the virus, and then to check to see who may have already had it. Again, our health facility is through Stony Brook University, in conjunction with the Southampton Hospital. We do have our own health center here in the territory, and it has been very active in moving forward with this. But when we first got the tests in, we only got in 24 of the tests. And I don't know what 24 tests was going to do, for our community. Since then, we have reached out to not only New York State, but to IHS, Indian Health Services, as well on the federal level to secure more testing. But again, we're running into the problem now of our health worker who's there refusing to administer some of the tests because of regulations and red tape, I guess with the hospital. We're not even really sure. So these things are affecting us a great deal in a disproportionate way. And it is something that this red tape right now is not necessary. It's frustrating, and it's causing a lot of unnecessary stress in our community. So those are those issues, and I think you had one more I missed, if there was something else.
Well, just basically the societal issues that you're dealing with on a typical basis that are effectuating this outbreak on the various tribal nations.
I think just, the amount of people that have come out here from New York City to the Hamptons, it created a real issue in the grocery stores. There was no food. And that's one of the reasons we established our food tent distribution, trying to not only that, but, in the 2010 census, 60% of our people were below the poverty level in our community. And so we were trying to feed our people and those who have lost their jobs, as well as prevent our people from going downtown and possibly bringing this virus back into our community. So we essentially isolated ourselves, shut off our roadways, which a lot of tribes have been doing across the country in order to protect our people. We have a lot of people that are 80, 90, and 100 years old, and they're a vulnerable population, and they're also our national treasures. So those areas of our concern.
Thank you.
Chairman, I will get your updated information, Chairman, and reach out to you tomorrow. Thank you.
Thank you both.
Thank you.
So our last speaker is Senator Jim Gorin from Long Island. Senator Gorin.
Thank you, Mr. Chairman, and to all my colleagues and our distinguished panelists. Chairman Gumbs had mentioned the issue of education and concerns about internet access and equipment. And I guess I just want to follow up a little bit on that, maybe if any of the other panelists have some suggestions as well, because, I think we had a divide before COVID and before we, went to remote learning, because, many families in a bunch of communities, particularly minority communities, did not have internet access that was strong enough or at all, as well as the lack of equipment. And I know also now that everybody's home, families that have more kids in the household are also lacking equipment. So I'm just wondering if we could get some thoughts on that, on what we need going forward, because we do need to get back into the school buildings safely. Because that's the best way that we can provide, education. But I think we're still going to need to have better internet capability, better equipment for homework, and especially as we're continue to go through this remotely, including higher education too. I think we're going to see more of that. Just any general thoughts any of you have? I guess maybe starting with Mr. Gumbs, Chairman Gumbs.
Yes, I thank you for that. And that is one of our main concerns here in our community, and actually in some of the surrounding communities here with our children who are currently out of school, and their ability to access the networks that the school is providing. I think there needs to be a better solution. And I guess that comes with funding. I know that, on the federal level, there is broadband funding for Indian communities, and we're looking into that now as we speak to hopefully enhance the internet services around our community. And that includes creating more hotspots, more hot zones for those of our people right now who don't have actual internet connections hooked up to their homes. And that is not only an issue here in our community, but it is an issue in some of the communities in our surrounding area here too, as I've talked to some of the other leaders, the political leaders in our community. So I think that, if there is a way that funding could be put in to increase the Wi-Fi access, I think that it would be extremely helpful and essential. Our kids right now, one of our fear factors is that they're going to be behind when they finally, get back into the school system, because some of them haven't been able to access the school learning sessions properly. So hopefully that will be taken into consideration as we move forward and be able to look at these zones, or these, especially in the minority communities or the Indian communities, which lack really, adequate internet service.
Thank you. Anyone else on the panel?
Yes, Senator
Yes.
Goring, this is Teresa
Oh,
Sanders.
Teresa, thank you for participating. It's good to see you.
And good to see you too. And I'm glad you raised this, and not only raised it for, K through 12 education, but our college students who, that's our feeder group for workforce, have been totally thrown off. And one of the suggestions is that we look into some public-private partnerships. I know that there are some socially responsible corporations that are doing some great things, but we need to look at expanding some of those models. So not just a bunch of tablets that are given out to one school district, but is there a way for you to create a statewide policy to kind of share resources so that it's equitable? All schools should be able to get access to the tablets. And then there's a learning curve for the parents, even some Zoom sessions, maybe on a Saturday, to show a parent how to access the homework. So some of it can be done. We have the platforms. We need an orchestra leader with all of you in the Senate and the Assembly, and get some of these corporations to be a little more socially responsible during this pandemic.
Thank you so much.
Okay, that's your time, Senator.
Yeah, I was getting ready to call you. I'm sorry, Ed. My colleague Ed Bronstein from the Assembly.
Thanks, Senator. We're going to go to William Dick Godfrey, Chairman of the Health Committee, next. Okay, Dick, are you there?
Yep.
Okay.
Couple of things. One, Chairman Gumbs, just quick question. Can you tell me roughly what is the total population of all the nations in New York?
No, I don't have an accurate number to that. And we're hoping, because one of the reasons why is because we were grossly undercounted in the 2010 census. So we're hopefully going to have a better number here now as we move forward with this new census count. There is a push not only from the National Congress of American Indian, but even out here in Suffolk County, where they've created the task force to increase the census takers for the Indian communities. So hopefully we'll be able to have a better handle on that and a better number on that as we move forward. But to answer your question right now, I don't have a number like that. That's
Okay.
adequate. That's adequate.
Okay, and I just wanted to thank Wayne Ho and the others who mentioned this. Two things in particular. One is the New York Health Act and other healthcare funding like Medicaid. And secondly, is the need for more tax revenue from big wealth. I think that's a key point to keep mentioning. Thanks.
That's it, Dick? Okay. Next, we're going to go to Labor Chair Marcos Crespo.
Can you hear me?
Yes.
So before I get to a question, I just got to let this out for a second. First of all, this is the one we told you so moment I wish we would have never lived through, which is to say that the disparities and the impacts of COVID, whether it's deaths or just the sheer numbers of people of color who have been infected, is a direct result of narratives that we have been fighting for a very long time. Words like health disparity, language access, immigration status, food insecurity, worker abuse. These are things that we've been talking about, and every one of your agencies have been putting programs for a long time. But because we didn't have a COVID death result to push us, they always ended up at the back burner of expenditures. And I think over the last decade plus, I think we've moved away from investments in CBOs and have really shortchanged their efforts in the community. And I have to get that out because there's so many things that I want to talk about and ask about, but it's really frustrating. Language access. I was offended early on when I heard people suggest that the issue here is that minority communities aren't understanding the messaging. Well, then how much have we spent as a state in advertising through minority platforms, whether it's radio, television? How much have we given our CBOs who have networks to spread the word, the right information in a coordinated way so that real-time things are getting out, where testing sites are, et cetera. So that's frustrating. The second thing is food insecurity. Look, I'm going to focus my time on this. Food insecurity. Right now, in the immediacy, many of your organizations work with local partners, food pantries that are not the big networks. I want to know how many of them are getting equal resources to do work, or have you experienced being left out? And second, worker abuse from a labor perspective. I appreciate, Frankie, you mentioned the workforce you represent and people of color, all of you hire from within your communities to do cultural competent outreach. And I think you're absolutely right. The contract tracing is imperative. If you want the right information back from people who are already frustrated about federal efforts against immigrants and all these other narratives that are scaring them, well, how do we create trust in getting the right information? So I want to know whether all of you agree as partners in the ground that your staffs and your teams and your networks can partner for that contact tracing outreach. And lastly, just in terms of workers, are you seeing an increase or hearing about an increase in abuse? We know that immigrant workers are essential workers. They're not qualifying for federal programs like UI and other things. Therefore, they don't have a choice but to go work. And so they are subjected to conditions, and some employers who want to figure out how to get by are probably okay with putting them at risk so long as their business keeps operating. So are you seeing an increase, and are there any requests for, from a labor perspective, work that we need to do to address some of those needs?
Very quickly, Chairman Crespo, and thank you so much for all amazing points. I just want to add that in terms of food insecurity and the resources that have gone to communities of color or Latino serving organization, very little have gone to it. I know that people say that there's no money. Money decisions have been made at the city level, and they have supported organizations that are very well, they mean the world, they mean very well, but they are not in our communities and they don't have access to the knowledge. And even some of those organizations that have to transform their model into doing stuff that they were not able to do before. There has been some issues with contracting with the city and reimbursement and what is being labeled essential services. So these organizations are struggling. Our members are struggling. We did a survey 3 weeks ago, and they said that 70% of them, they were keeping all their employees, but only 50% said we only have 6 weeks of funds to be able to keep them. So we are looking at a sector that is going to be devastated, and later on there's going to be more people that will not be able to be served. And we have been talking to Joanne, to ARVA, New York Urban League, Asian American, ARP. We're all talking together. So there is coordination, and we have agreement on all of this. And that's why it's so important that we're talking to you right now.
Mm-hmm. Yes. And you know, the labor side is so important. I am so glad you raised this, Assemblyman, because we have had people that are in our constituency base and many in service industries that have just been told outright lies by their employer. We have people that work in the hotel industry that applied for unemployment, but when the request came back, they said they're not laid off, they just have 0 hours. I mean, these are the types of things that people are being told. So thank you for focusing in on labor.
Look, before my time expires, I know there's a lot of comments, but just lastly, immigrant families that are, and I just got to put this on the record, I know all the panels will touch on it, but immigrant families who don't qualify for these services are already falling significantly behind. I know all your organizations work with them directly. And I think we need to continue to highlight how, as we look towards the things that we're going to have to deal with funding-wise, we're going to have to be really creative in putting resources to help those families. I know some philanthropic dollars, but that's not going to be anywhere near enough to cover the need, and it shouldn't be winners and losers. The one organization that maybe got a big donation, there has to be a systemic effort to make sure that resources are put for those families who will not qualify for traditional programs, especially with this federal administration.
Okay, thank you, Marcos. We're gonna go to the ranking member of the Cities Committee, Mike Riley, next.
Thank you, Chairman Bronstein. Thank you, Chairman Jackson. Thank you for the panel members for giving their testimony. It was very enlightening, and I appreciate all the things that they're sharing. I have a couple of questions. One in particular to Ms. Yu, focusing on hate crimes and reporting, and how specifically police departments, especially New York City Police Department, are responding. Do you think there's an ability where we had a shortfall where we need some training for community organizations? Being a former lieutenant in the New York City Police Department, I understand that sometimes the layperson thinks about a crime and associates it immediately as that crime, but there's certain criteria that has to be met. Do you think it would be worthwhile for police departments to partner with community organizations so that the messaging could be there and understand what actually constitutes as a hate crime? And I think that would help the police department understand as well. Your thoughts on that, please?
Absolutely, and that is exactly what we've been calling for since January, that there be an infrastructure set up. People don't know the difference between a hate crime or a bias incident, so certainly that's something that we've been asking for months. There wasn't any proactive effort, so the Asian American Federation ran a workshop ourselves that had 70 people, 70 nonprofit organizations coming on. The reality is that our community, because of language access, that we get told all the time, just call 311. People are not going to call 311 because of the language access issue. So who hears all the stories? It's the nonprofit organizations, who are the storefronts, who are the frontline folks. So we need to build those relationships. We need to build those relationships not at crisis points, but when there's actually things are quiet, things are seemingly back to life, back to our regular lives. Law enforcement has been incredibly passive, and that is not what we need. We need to be able to build. They need to be able to. One member agency said, I have, a long list of people who've come and told me what's happened to them. Can we please, who do we call in the precinct? Because we can't call 311. And, honestly, we were on a call with 311. We were on a call with NYPD, and the response was call 311. And in fact, one of our member agencies said, actually, somebody just came in and reported a hate crime, like a bias incident, or, they wanted to report something to NYPD, and they had to, we've been trying to call 311 for the last half hour. So I think this is very real. I'm worried about, the community residents who are going out. Like, we're hearing stories of seniors who can't go out and get food because they're scared. As Wayne mentioned, there are people who are frontline workers who are getting attacked. So I think we've seen this before. You know, the Arab, Muslim, South Asian community saw this during 9/11, right? And so our community has, members of our community have experienced this, but yet, you know, some of us have been screaming since January, but there's nothing has been done. So
Has there been any dialogue with the mayor's office or the governor's office regarding that?
Every day.
Okay.
And I think the governor's office, the New York State Commission on Human Rights, did a workshop about bystander training, which is really helpful. So we hope to extend that, and we are actually putting together programming that works with communities of color, because we know that in these crises, you know, who is vilified and who is targeted. You know, we want to be able to build bridges and, you know, learn from each other, because we have this shared experience of being communities of color in an over-policed city.
Okay, fair enough. Thank you. So I think my time may be running out soon, so I just have one quick follow-up question in regards to community outreach. I know there's been some mixed messaging coming from the governor's office and the mayor's office in New York City. Is there this goes out to anyone on the panel, if you can offer any insight into how you think the city and the state could collaborate more on outreach to the community, especially when it goes to messaging.
I think everybody has mentioned language access. I think that's critical. I also think investments being made to nonprofit organizations. They are the the nonprofit organizations, everybody runs to their neighborhood nonprofit organizations because that's who they're telling stories to. But also, the nonprofit organizations have a capacity to ask the relevant questions, you know, as they're doing services. So I think, you know, that is an untapped resource. I know all of us have mentioned it, but, you know, during the crisis and after the crisis, we're going to be the ones to help rebuild this economy.
Mm-hmm. Okay, thank you, Mr. Riley. We're going to go to Local Governments Chair Fred Thiel next.
Thank you, Chairman Braunstein. My questions are for Lance Gumbs from the Shinnecock Nation. And at the outset, Lance, let me say thank you for participating and agreeing to testify. I know it was extremely short notice. And, you know, we know how busy you are at the Nation. And this has been our second Zoom conference now in a week. I wanted to follow up on the education issue. You and I had some conversations about education and some of the disparities before COVID, and those have been brought up today. Any suggestions when we're working with the local school districts about programs or initiatives as we go forward? You know, we'll see whether schools open in September or not. You know, we still have to get through the rest of this school year through remote learning. How do we address that issue that was mentioned about trying to catch up? And those that have not had access to the internet, haven't been able to participate fully in remote learning. What kinds of things should we be looking to do?
Thank you for that question. And yes, it's our second Zoom conference together here. There's a couple of issues. Obviously, you know, with the lack of internet, it's hurting some of our students. We have some hotspots in the community, and you'll see a number of cars parked in the field by these hotspots with people trying to work on their computers and phones and things. But to your question, I think that the biggest issue, because I don't know if you're aware or not, or the rest of the Senate and Assembly, but we still do not have a contract with New York State for our students. It's been almost a whole year now, and we still have not completed the contract with New York State Education and our school district for our children. And part of those issues were how far behind our students were, even when they were in school. And I think one of the biggest things that we've asked for going forward is a liaison, to have a tribal liaison that can come, you know, and work within the school, but can also come back into the communities. And we keep being told by the state education department, by the school district, that that's not possible right now because of funding. And so if our students are going to play catch up now as we move forward, it's going to be imperative that we have some kind of tribal liaison liaisons that can go and deal with the school and come back into the community and have that communication, that bridge right now. Otherwise, it's going to be disastrous for us as we continue to move forward.
I have just a second question, and it's more of a economic impact question. The area that you and I mutually represent, the local economy certainly is service-based, construction, tourism, second home industry, all of that. I was wondering if you could share what you've seen with the nation as far as unemployment and during this, and what impact that's having with regard to food security and rent, home security also.
Well, one of the blessings is we don't have to worry about rent in our community here. But to your question, we have an extensive amount of people who right now are out of work. And that's really hurting the families up here. We have intergenerational families. We have people where you have the grandmother, the mother, and the daughter, living in one household, which has been an issue in terms of trying to protect the elders as well from the virus when you have the intergenerational housing that we have. But we've been running the food distribution tent for the last 10 weeks. And as was alluded to earlier by the assemblyman, the food insecurities that we're facing, we were doing great with some of the food distribution networks that have been servicing the community. But as more and more entities started to rely on those like Island Harvest and some of the food banks, those numbers have dwindled down. So we're getting a minimal amount of food right now. So the impact has been really great on us in terms of being able now to supply food to those individuals who are actually out of work. And as you know, we're surrounded by, great wealth and opulence out here in the Hamptons. We're not one of the gaming tribes. We do not have a casino. And so it has affected us greatly with the few economic ventures that we do have in the community. So we're looking forward to hopefully getting some of this stuff back on track. But it has been quite stressful to us as the leadership trying to maneuver through all of the situations that we're facing right now.
Thank you for your testimony, and thanks for answering my questions, and we'll see you real soon. Thanks.
Thank you.
Thank you, Assemblymember Gorman. Ed Bronson, let me thank you for allowing us to walk our way through this new Zoom process. And I appreciate it very much. I would like to turn to my colleague in the State Senate, the chair of the Labor Committee, Jessica Ramos. Jessica, I apologize, I didn't see your name up there earlier.
That's okay, Robert. Thank you so much. Hi, everyone. Well, greetings from Jackson Heights, the epicenter of the COVID crisis. And as many of you know, we've been going through some really rough times because there were so many cases of COVID here, because we have so much overcrowding in our housing. The rates of deaths were very high. And we saw many disparities from the get-go, from what our public health system was and wasn't able to do, especially at Elmhurst Hospital, which is just 2 blocks away. And of course, the more imminent crisis that is economic, of work and being able to feed our families. And for that, I wanna of course thank everyone at the Hispanic Federation, but especially Frankie Miranda for your leadership, because you've been helping me greatly. A lot of the people I represent are undocumented and don't have access to any state or federal aid of any kind, as so many of the panelists have described. And that's exactly what I want to get to, because it seems that as New Yorkers or as Americans, we like when we get into that income bracket where I can afford to have a cleaning lady or I can afford to hire a nanny. So we hire all of these folks, but we're not being respectful of their work in how we're not compensating them or providing them with appropriate PPE. So I was wondering if Frankie and the rest of the panelists can talk a little bit about what their workers need, because I know so many social workers and so many of your organizers are on the front lines.
Yeah. Thank you so much, Senator Ramos, and for your leadership as well. I want to touch very quickly on the point that you are making about the being able to be creative and work with nonprofit organizations to get funding very quickly to the communities that actually need it, and come up with ideas like Joanne mentioned before about like how to put restaurants back online and being able to transport products from upstate into the hard hit areas. We can do that. We can do these creative partnerships when the city cannot actually provide the opportunity for these fast action solutions. So for us, the most that we have been seeing is that people are really desperate to get access to PPE, right? They are being expected to work. Our people in our communities are expected to work. We are, I say that we are dying because we have no choice, right? We got to go to work. We have to go out there. We have to deliver food. We have to do all of this. And at the same time, we are just don't have any safety net, right? So that is one of the biggest issues, like access to PPE, access to cash assistance, being able to bridge some of these needs. And that is one of the things that we're working with many of our member agencies, especially in the area of the epicenter in Queens.
Senator Ramos, thank you for that question. You know, I want to add to Frankie's testimony. You know, as I check in with all our executive directors, you know, a lot of them are telling me that their clients who are undocumented are choosing to go to work. And when, you know, the staff say, you know, there's a crisis going on, you know, it's COVID-19, you know, you can't do that. They said, you know, who's going to put food on the table for my kids? This is the reality for them because they're exactly what Frankie said. There isn't a safety net for them. So they have to risk their health all the time. And I know that the city has, you know, hotel rooms for people who are infected that they can go shelter for a little bit, but we're not sure, you know, I think they're just rolling that out. We have a lot of workers who need to access those rooms because, you know, we're hearing stories that there are 5 adults living together, and if one gets sick, then, you know, they need to go, you know, their roommates are kicking them out to say, you can't bring that here. So I think that's one of the challenges that we see is, you know, everybody acknowledges how the communities of color have been impacted, but those resources don't come to us first. I feel like in many ways, we are incidental to getting all the resources, and that has to change. Mm-hmm. And the one thing I want to remind you, Senator, of where I see the inequities that keep me up at night, food delivery workers. For 2.5 years, we
Me too.
And what happens?
Me too, Joanne, but can I halt you right now only because I have 7 seconds to say that, because I also wanted to ask about small businesses and the trouble that they've been having in getting PPP as well, because it's so many of our immigrant small business owners who don't have that relationship with banks. We saw it in the New York Times edition today. So I'll leave it there.
Okay, thank you very much, Senator. We're going to go back to the Assembly now. We're going to go to Ron Kim, Chair of the Task Force on Asian Pacific Americans.
You hear me?
Yeah.
So on May 5th, Governor Cuomo said, a human life is priceless. And of course, we all agree with them. But based on the outcome of what's happening in our state, especially in New York City, it's clear that only the lives of productive members of our state are priceless. In other words, there is a disconnect between what the governor is saying at his daily press briefings and the outcomes we are seeing in our communities. So if you're deemed an unproductive member in our market-driven society, our state policies so far has more or less told people that you're on your own during this crisis. So if you're stuck in a nursing home, behind a prison or jail, homeless, unbanked, undocumented, uninsured, and poor, the outcome is telling us you are on your own. As a result, a disproportionate number of Black, Latinx, and Indigenous community members have been infected and died from COVID-19, and Asian Americans continue to be undercounted, but scapegoated every single day. The results are clear. We're leaving the most vulnerable on their own. But mark my words, doing it after this pandemic, we are as strong as the most vulnerable in our community. We need to test everyone, protect their civil liberties, put benefits and usable money into everyone's pockets, regardless of their background or immigration status. So for me, one of the main goals for this hearing is to actually help our governor reach his vision for New York State, where every human being is truly priceless. And the first step is to get accurate data and facts. And for us in my community, we don't have any of that. So my first question is to Wayne, what do we need to do better to get accurate information and data for Asian American immigrants? And secondly, for the panel, what do we need to do now to center our policies around workers and the most vulnerable?
Thank you for the question, Assembly Member. I think the key one is that we need Asian American disaggregated data. I want to thank the Assembly, specifically Yulene, as well as Julia Salazar on the Senate side, and then others who fought for that bill. It overwhelmingly passed both houses last session, and the governor vetoed it in December. If he didn't veto it, we would actually have accurate data. While some of the data right now shows that Asian Americans are dying less than other racial groups, we know that there's about 10% of deaths in New York State are being classified as other. Historically, the other category is where most Asian communities are placed. So we need disaggregated data, and also for the recovery, we need to make sure that we have the proper language lines, the proper targeted services, and that's where data disaggregation on the diverse Asian ethnic communities would be helpful.
Ron, you have more questions or?
Yeah, so for the rest of the panel, what can we do immediately now to push, the one person who can immediately issue mandates and orders to center everything around protecting and designing our policies around workers and protecting the most vulnerable members?
I'd like to address that. Can I be heard?
Yes.
Oh, okay, sorry. Yes, I'd like to address that issue. The governor has had sort of like a one-track mind. This is what we're doing. This is what is going to happen. And yet the results have not always, we're giving him credit for staying on top of the issues. But the fact is that he does not have a system by which everyone in the minority community is being heard. You have to hear people where they are. And so when you begin to institute policies, you can't institute them without having an input from all of the community that is being affected. And this has been addressed already in the beginning, but it seems to be such a disconnect as to what we need versus what he is implementing overall. And then it's like, oh, this did not work. But geez, the issue of this disease is like a thief in the night. We know it, yet you're not implementing services that will stop the most vulnerable in our society from being infected. And this is what I looked at this is why I brought up the issue of the nursing homes. They were highly affected by the policies that were in place. And so overall, not only did the nursing homes were affected, but the community is affected the same exact way because the services and policies that are implemented don't match the needs. And moving forward, we have to get this right now. It has already been said. We have to get this right now.
Okay.
So that we don't have this again.
Thank you.
Okay, thank you very much. Next, we're going to go to Maritza Davila, Task Force, Chair on the Task Force of Puerto Rican and Hispanic Americans.
Thank you, Chairman. I appreciate this this type of feedback. I think that I'm getting more information than I have been in the past 3 months. And I want to thank all the people who are testifying today because there's a lot of information. But my question is going to go to Frankie Miranda. And Crespo spoke about the food insecurity. We are aware that there's a lot of food insecurity throughout the entire city. By any chance, do you have any numbers in terms of where these hot spots are at in the city? Number one. And then my second question is about the testing and tracing. And one of the reasons why I want to ask about testing and tracing, my community was probably the first community that had the first casualty of COVID-19. And as of yet, we still do not have a testing site. We're going on 3 months with this pandemic and no testing site. Actually, yesterday I found a list of places that people can go and get testing. They are all urgent care facilities, but you have to have some type of payment or Medicaid or some type of coverage. And that is extremely disturbing. If we want to put our city back on track, we need to know how many people are infected, and we need to trace them. So again, my first question is about food insecurity, because I can almost guarantee with the amount of food that we're giving a day, and it's not enough, we keep seeing more places asking for food. Do you have any actual numbers as to where the Hispanic minority community is in need, especially with the immigrant population, as it pertains to the immigrant population? So this question is for Frankie Miranda.
Thank you.
Are you there, or anyone
Yeah.
else that wants to?
Thank you so much for the question. What I can tell you right now is probably how the city has responded to the needs of our neighborhoods. And I can tell you right now that there has been millions of dollars that has been allocated in the city for food security, and they have gone to the traditional big food distribution, food bank organizations, and some other organizations that have access to City Hall. They have not gone, these monies is more of like, we're gonna give it to these big buckets, we're gonna check the box, and then let them figure out how to get to the communities that actually need it. We know that the food pantries are not getting enough food. We know it because you, like the elected officials like you, have been working every single day to try to serve your constituents, and Senator Ramos and many others, and there has been very little communication with you and with other, even in the council members. They don't have communication as to like, where is this going? Because everybody's so overwhelmed in their district. And we see it every single day with our member agencies. Regarding contact tracing, again, it is really, really important that if we are going to protect our workers, regardless of who they are, documented or undocumented, we really need to know where are the real hotspots and how this disease, how this virus is spreading. And if you don't have people with the buy-in, hiring from nonprofit organizations, those people that are in those tenant associations, people that are on the ground, people are not going to open their doors. People are not going to answer their phones. This has to happen right now. And the mayor has a plan, and the governor has a plan. I don't think that they're talking to each other, and there's controversy of who should manage the plan within the city, if it is health and hospitals, or it should be the Department of Health. So there is a lot of questions right now, but other states like Massachusetts already are doing this successfully. So we need to put this army of people that are going to be hired right now to be the culturally competent people from community, and the nonprofit organizations are the community-based organizations that can provide the guidance for this.
And I thank you for that, because it's extremely important that people understand we're all on this conference call or conference via Zoom because we're all in disparity. Even with the Native Americans, I knew nothing about that, and that's great that we were able to include that today. That was extremely important. But if they're not doing it, we have to find a way to do it ourselves. And I just want to make sure that you continue to be a partner with us and try to figure out where those hot spots are at so that we can continue to fight and get them to where it's needed. So I want to thank you for coming on today. I want to thank all of the panelists and everyone that has submitted their testimony. I think this is a great way to start some dialogue. So God bless you and thank you all for everything that you're doing.
Thank you very much. We're going to move to Assembly Member Yulene New.
Hi, everyone. I just wanted to say thanks to Ed for managing all of us. It's not easy, and thanks to Senator Jackson as well. I wanted to also say that I really appreciate Wayne talking about data disaggregation. It's very important right now as we're seeing that a lot of our communities are not being counted. And I also wanted to mention, and further, I guess, the question about the food options. The food options provided by the city and the state have been woefully inadequate, I think. They're not culturally appropriate, and there's health risks associated with some of them, because you have seen that, when we have seen pictures of these things, it's applesauce over cookie crumble, it's like Cheerios, it's milk, it's things that would cause certain folks diabetes. A lot of our minority communities are lactose intolerant. There's a lot of folks who have health issues that are associated with certain foods and diets. And so I wanted to kind of ask to see if there was any funding given to our community organizations for food.
So thank you for the question, Assembly Member. So CPC, we are on our own doing about 3,000 meals a week to our seniors and others. The sad thing is this funding is all private funding. There's out-of-work restaurants in the different Chinatowns or different restaurants struggling, and we've got donors and private funding to fill the gap. And once again, I have staff going out, risking their health and volunteers' health to deliver. The city unilaterally cut out community-based organizations, as Frankie alluded to, from meals programs. And then they retasked $170 million for new food vendors who've never done food for our communities, and then added more money there to have TLC drivers who are struggling in order to deliver the food. They've basically left out human services. Once again, we're 15% in terms of the Asian population. We're 15% of New York City, 10% of New York State. We get less than 1.5% of human services funding from the city. We get less than 0.5% from the state. And that's where we are the ones on the front lines making sure we can do culturally appropriate and linguistically appropriate services that are needed not just for relief, but also for recovery.
And I don't want to speak for Frankie, but when we found out all this money is being distributed, literally we were too late. We said, what money? What communities of color?
Oh.
I mean, so we got nothing. And so, we're advocates. We know how to advocate for our community. We are not, we're not defeated. We're pushing back and we're working together. I will say, we hear stories exactly what you said of seeing Asian seniors getting bags of carrots as their meals because they don't have culturally appropriate vendors. Every single nonprofit in our 70-member network, they're doing food programs and they're doing food pantries. And it's, as Wayne said, it's all by donation. My fear is what happens as people become unemployed and they don't have money to give to their favorite nonprofit organizations. The other, the thing I want to recognize is that there is tremendous innovation from our communities because it's out of necessity. If we're not going to get recognized, people are going to be really creative.
Yeah.
I want to mention Homecrest. They're working with restaurants to cook food and deliver it to the seniors every single day. It keeps the restaurants open, it gets people working, and it helps to provide food. It's delivered with language competent, language access, culturally competent services. And so these are the innovations that we need. And so, yes, we didn't get money. Yes, we are frustrated, but, this game is not over yet. And we are going to be, we are right there in the front lines.
Yeah. and I wanted to also mention, and this is just for all of you guys, but even before COVID in the budget, how much did our community groups actually get in the regular budget? And now during COVID, has there been any changes? And since we're all on the front lines, as we have already emphasized, have there been any changes? And what are we, what, if we raise revenue, what should we be pushing, right?
So,
So,
to
oh,
my-
go ahead, Frankie, sorry.
So just really quickly, so in terms of the Asian community, to my understanding, the first time the words Asian were ever in the state budget was 2 years ago when CPC got a line item in the budget for, I believe, $80,000. And thank you for all of you for supporting that. But that's ridiculous that it took that long to get the words Asian into the budget. I'll defer over to Joanne and to Frankie to get into details on other overall support. But I would argue there's actually less money going to communities of color now because of the budget cuts that have happened, contracts that are held up, and here are the impending cuts to localities.
I'm sorry, your time is up.
So we gave Assembly Member New 5 minutes because she's co-chair of the Task Force on Asian Pacific Americans. For the remainder, members will get 3 minutes. Next up is Assembly Member Joanne Simon.
Okay. Hello, thank you. I have 2 questions. One is I want to thank Ms. Braithwaite, I'm not seeing your whole name here on the screen, I'm sorry, about mentioning the nursing homes. This is a big issue. The Copple Hill Nursing Home is in my district. And very much this has been a problem of policy, of leadership, not consulting with the industry to understand what the challenges are, and a persistently underfunded system. And I, for one, am very glad to have your testimony and would like to continue to work with you, because I really think we need to move from a prosecutorial kind of approach in terms of our tone to one that is helpful and will help us, in fact, take some new effort, new focus on this issue, and adequately staff and address and support our nursing home industry and other congregate settings as well. So I did want to ask a question about language access to any witness, because I'm concerned about the deaf and hard of hearing population. There has been very little done with that population in terms of sign language access, as well as the issue of masks and people who are hard of hearing. And I know even some of my colleagues who have difficulty hearing are struggling with that. And then the other thing for somebody who spoke specifically about employment is the whistleblowers. I'm very concerned that New York's whistleblower protection is not adequate. And I'm wondering whether you are also getting complaints about retaliation or against people who are raising issues in the workplace. And so whoever can answer that, I appreciate.
So this is Teresa Sanders, and I think I had raised an example of a labor complaint that we had gotten from someone that worked in one of our hotels out here in Long Island, and they had applied for unemployment, and the response was that they were rejecting the unemployment claim because the person technically was not unemployed, but they were on a 0-hour schedule. So this is the kind of abuse that people are eligible for unemployment, and you know, to try to have some enforcement around an employer like that, the individual is afraid to report it formally because they do believe that when the industry opens back up that they will be targeted. So, you know, I don't know how we resolve this, but that is one example, and this is several in the restaurant industries and people's unemployment claims being rejected by employers.
Assembly member, I appreciate the question. I think the challenge is that, you know, you have to feel secure to be able to be a whistleblower. And I think, you know, the frontline workers right now, there's so many who don't have status or for various reasons feel insecure about, whistleblowing on their employers. So I think that is a huge challenge. I think a lot of immigrants don't realize that they have rights. So I think they're not certainly going to be talking to anybody about what is happening to them. The language access, I appreciate that question because, you know, everything we're doing for the Asian community, you know, we're, you know, the hate crimes reporting website that we put up, that's in 8 languages. Everything we're doing that is very public facing is 8 languages. And I think that is a reality that we need to be able to get as much information to the community as possible. And it's, you know, this is the underfunded work. You know, one of the questions that I want to put to all the—
Sorry, the question time has ended.
Okay, thank you. We're going to move on to Assemblymember Felix Ortiz.
Thank you very much, and thank you for holding this important hearing and roundtable. I'm unfortunately COVID has managed to wake up everyone. So I don't know how many of you remember the governor, one of his press conference. He stated that over the sons is 34% of the Hispanics, 24% African American, and was an increase of 10%. But I don't know why that happened. Well, at that moment, I texted Chief of Staff and I said, well, just look to the past. Inequality on funding to our organizations, inequality of our health disparity, and really don't tackle in the issue of poor community, a disenfranchised community. I have a quick question, and it's go for the whole, for some of the non-profit organizations, maybe for CPC and the Hispanic Federation, and it's this one. Do the governor or the mayor has been including this organization as part of any conversation when it's come to testing site, like Assemblywoman Davila, and also regarding food security or food distribution for minority community as well as NYCHA?
Thank you so much for that question. Let me start by saying that no, we have not been part of many of these conversations. Actually, Joanne was the one who called me and said, like, Frankie, do you know that these decisions are being made and they are not including us? Why are we not on this table? Why do we need to push? So we have been requesting meetings. We have been very respectfully asking to be part of these conversations. And as for the governor and the city, they have been starting to create these task forces that are starting very, 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 very early work, and is almost like we are starting just to listen to how this is going to work out. So no plans or really recommendations have been taken in.
Okay, I only have 40 seconds. I'm very quick. You know, I have 220 people who die in my community in Sunset Park and Red Hook. Finally, as of today, we're going to be getting a test, like 3 testing sites. You know, it is inhumane. It is a disgrace that we have to wait until this point to make sure that we have sites. So my advice to anyone who doesn't have a site, just continue to hammer the governor, continue to hammer the mayor, because, you know, our community cannot continue to be left behind. And unfortunately, we have to continue to fight on behalf of our community, on behalf of our nonprofit organization, and we have to make sure not only CPC, but the Federation is part of any of the future task force get developed. Thank you very much.
Okay, thank you, Assemblymember. Now we're going to go to Assemblymember Aravella Simotis. She's chair of the Task Force on Women's Issues. So just a reminder, she'll get 5 minutes.
Thank you, Assemblymember Braunstein. And I want to thank everyone for being a part of this panel and for providing us with incredibly important information. Most hardships, most crises, most economic downturns overwhelmingly affect women and girls, and particularly women and girls from minority communities. Whether it's because of income inequality, lack of access to resources, or violence against women and girls, we regularly see that women are greatly affected when bad stuff happens. I have 2 questions, and I open the floor to anybody who can provide us with an answer. Do you have any specific insights into the causes for the increased rates for women and girls, for the disproportionate effect to women and girls in minority communities? And what can the state do to respond to the rising rates of domestic violence and support survivors who are sheltering in place with their abusers?
Wow, that's a really big question. Yes, I know that one of the nonprofits, the nonprofits that stayed open during this entire crisis that remain open, it's the domestic violence shelters, because often the victims are saying, I'm home with my abuser and I need to talk to somebody. Can you please stay open? I don't want to get on a call because he's home with me. I want to come to the office. And so, some of the conversations that I've had with our member agencies who run VV shelters has been, how do you put up glass partitions? How do you put up, do you have enough equipment to be able to have your staff have masks when you talk to clients? Do you have hand sanitizers? I mean, stuff that we never thought we'd have to think about. So I thank you for that question. I think, women and children, we're always underserved. So, the domestic violence funding has to be increased. They need to be recognized. The women in our community who have been going to work, they're the nannies, the cleaners, they're the ones who having to go to work. Some of the stories that I share about undocumented heads of household going to work, they're undocumented women, they're moms who need to feed their kids. And so, these are the heartbreaking stories that we share. Other than, and the other thing I want to, other issue I want to put up here that we haven't talked about is the issue of mental health. And I know that the questions have been coming up about, what resources do we put in? I think mental health is going to be the #1 issue that we have to tackle. And I say that as somebody who has been fighting City Hall to make sure that funds are distributed equally to talk about this issue. And right now, I think it's not just communities of color who are going to be impacted by mental health. I think it's everybody. And, my friend Jennifer March had a op-ed about how our kids are feeling all of this anxiety as they see their parents unemployed, as they're home, seniors with the social isolation, people who are, out of jobs. I think that is the one investment that I ask all of your help in ensuring that is a priority. I know that Assemblymember New asked the question about, what resources have we gotten before? Even before this pandemic, I had a chance to meet with the state mental health folks to talk about the needs of our community. And the response I got was, well, we don't fund things like that. And, we give our money to the city, and that's fine. I get that. But they're like, you give money to the city, but what's the oversight to make sure that it's, going to diverse communities? And so the response I got was, you need to ask rich Asians to help you fund this program, right? The mental health. I'm pretty sure Asian Americans are paying taxes, and those tax dollars should be divided equally. And my community has the highest rate of suicide for elderly. And so why is this not being addressed? Every time I share statistics about mental health, everybody gasps. Now the reality is everybody's gonna have those statistics. And this is the one issue I hope to God that we make a priority and put real money down, because otherwise we are gonna see the ripple effects for generations to come.
Thank you.
Okay, with that, I would like to turn to Senator Kevin Thomas to speak for 3 minutes. Senator Thomas.
Hi, can everyone hear me?
Yes.
All right, awesome. Thank you to all the panelists that came in today. My question is, I'm the only South Asian in both houses, and I haven't heard from any of the panelists about South Asians and how COVID has impacted the South Asian population. So I was wondering if anyone knows what the impact is on the South Asian population, and whether there's been any outreach from organizations such as yours to the community, because there is a a need there, just like with all groups. I'm just wondering if you know any specifics about the South Asian community and what the need is there.
Certainly, Senator. Thank you for that question. We are a Pan-Asian organization, and so we have quite a few South Asian serving organizations. I think the challenge with the South Asian community, the poorest New Yorkers are South Bangladeshi community. And so we know that, there's also one of the highest rates of being deported out of New York. So they're a vulnerable community. I think there was a article in the city that South Asians are not being counted. I think as Wayne had mentioned, the death rate in the Asian American community is much higher than is being reported, because I think a lot of people who are vulnerable workers don't get tested. I think this goes back to the testing question, that we have stories of people going to the hospital 2-3 times and not being able to get tests. People are uninsured; they can't go to the doctor, and so people are dying at home. And
Is
so
that
I
a
think,
language access issue as well?
I think it is all of those issues. I think it's socioeconomic issues of access, language access. I think it is, under, the Asian American community, all of us are chronically underfunded to do this work. And so during a pandemic, we are having to build a runway as we're taking off. And so, I know, groups are getting together. Like I said, everybody is doing food programs right now. Everybody's doing outreach. Every good model of crisis intervention and support is being implemented by all 70 members of our nonprofit organization members. And so, yes, there's been some, the South Asian community has a really great food collective that they're getting food out to. The story I mentioned about in earlier my testimony about a social worker upset that she had to, because she felt so helpless that she couldn't help a restaurant fill out the application to be able to provide food. That's a South Asian organization. I think the diversity in our community, and we are at least 10% of the population in 26 of the 51 city council districts. So we are pretty spread out, but that doesn't, there's tremendous needs. So, as much as we're all trying,
Question period.
That's really tough.
Okay.
Thank you so much.
Thank you very much.
I'd love to work with you on this issue.
Will do. Thank you.
Thank you. We are going to move to Assemblymember Tom Abenanti.
Call back in 2 minutes, okay? Hello. Hi. How are you? Good morning. I just want to make a comment. I want to thank you for holding this hearing. As the chair of the Banking Committee, I've been participating in hearings on the impact of the federal response, which was basically through banks. And you're filling in some of the blanks, the things that we didn't get to talk about. You're telling us about how a major part of our community has not benefited by the programs that have been put into effect by the federal government. And I think that's very important. You're documenting that for us. And I just want to thank you for that. I'm going to be here for the rest of the day, listening and learning and seeing if we could figure out how we can help Congress shape the next measure. They passed one on Friday, and I don't know where that's going to end up. The House of Representatives passed one on Friday. I don't know where that's going to end up, but we have to make sure that what they end up doing, which will probably be their last effort, unfortunately, at least for this year, what they do actually helps everyone, not just, as somebody said, the people at the top. So thank you for holding the hearing, and I'll be here for the rest of the day.
Okay, thank you.
Assemblymember, can I just respond to your question? I really appreciate the question about what we can do with Congress now, but we also have a census going on right now. And, we've all talked about the digital divide. My census team is parked at home right now, and I think they're just, itching to get out, to get boots on the ground. But, the whole census being done digitally was really going to handicap communities of color, low-income folks, because, many of our communities don't have internet access, let alone computers. And so, the question, the citizenship question was a huge hindrance. But as we think about what that census is going to be, the impact of the census and how we're all stuck at home is, that's how we're going to be counted for the next 10 years. We are slated to lose seats. The funding is going to be an impact because that's how we fund infrastructure. And so, any help that all of you can give the communities of color or just the state in general to, get the census funding out to groups, I think that would be tremendously helpful because we do need to push this. We are looking at where the communities have not responded, and it's devastating, and we are terrified right now.
Let me ask you a question if I can. I think you're raising a very important point. We in the Assembly have talked about attaching the census notice to everything that we do, but even that doesn't get to all of the people. Are there community networks that we're not now using who we could use to get the message out? For example, the food banks and some of the other community organizations.
Question time is over.
Thank you.
Thank you, Tom. And we are going to go to Assembly Member Kathy Nolan to close this panel.
Thank you. Thank you. I just want to thank the panel and really support what Assemblywoman Maritza Davila said. In our community, our joint community of the Ridgewood-Bushwick area, we really have not had any city response on the testing issue. And I really find it so frustrating that there's not a coordinated effort to kind of say, okay, we need to respond to this area, especially given that Wyckoff Heights has been so overwhelmed with cases. The same thing in our Sunnyside community, where we have a lot of people who speak other languages, and all the communities I represent have many languages are part of our community. But again, a testing site has supposedly opened. I actually got in the car, strapped on my mask, and drove up there. It is not open. So we're getting very mixed information, unfortunately, from the city. And then the last thing I just want the panel to address is NYCHA, where I have a very large African American community. There's been kind of a sporadic effort to respond. So it's just very concerning on all levels on how we can reach people. And I want to thank the senator who brought up our South Asian community, because again, our district has so many people, and it's very important to try to meet people where they are, not just with language, but also perhaps using schools. Even though the schools are not in session, there is distance learning. And I want to point out, as someone who chaired our education committee for a long time, I would love to see those committees get involved in this type of hearing. But I think between the grab and go meal hubs and some of the other Zoom distance learning or whatever they're using, that might be a way to reach out to our very diverse population, in not just in languages, but in a kind of a culturally appropriate way to get more participation in the census, as well as a better plan from both the city and state to evenly just distribute things like testing and masks. Because I can tell you honestly, it's been very frustrating. Just recently we worked to make sure that young women could have access to feminine hygiene products. And we worked so hard on it, and then the list came out, and I know Maritza will feel the same. There was nothing in the 11385 area code, even though we have a junior high school. So we have to now go back to the city and revisit that. And just a frustration. Thank you to the chairs for having the hearing, to Bob and to Ed and to the panels, and I appreciate it. And I just wanted to associate myself with those remarks and kind of key the panel into also looking at the educational system. Thank you.
Thank you, Kathy. We have one more Assembly member who wants to ask a question, Assembly Member Harvey Epstein.
And thank you, Chair, and sorry to prolong this panel, but I really wanted to ask a question. I've heard a lot around the lack of resources for the nonprofit community. And I just want to know about the proposed cuts we've heard from the governor, what impact that would have when we saw 20% across the board cuts, that we've been hearing about, and how do you feel like we should be dealing with this crisis on the revenue side for you all to ensure that communities of color continue to get at least what we have, but more services that we need, especially during this COVID-19 pandemic time?
Thank you for that question, Assembly Member. Just for CPC alone, we are looking at $2 million worth of cuts just for the summer from July 1 to August 31st. That $2 million will translate into about 300 staff being laid off or furloughed. That will also translate to about 5,000 community members not getting any services. To all the digital divide questions that came up during the summer, that's the time when CBOs are going to help make up for all the inequities that exist. If there are the 20% cuts that happen at the state, We've already heard from the mayor's office that we will have more cuts to our senior programming. That's Meals on Wheels, that's senior centers that have to be cooling centers during the summer. We already know that if that happens, there'll be more cuts to pre-K programs and other summer camp programs. And that's when people need the childcare in order for them to go back to work as the economy reopens. So once again, we need more revenue options. I know that many have put them on the table, from Fiscal Policy Institute to others on who are attending here as legislators have put things on the table. And we are in support of raising revenue in order to make sure we don't have cuts and we support our lowest income communities during the recovery.
Thank you. That was really helpful. Any other panelists quickly? I know we don't have a lot of time.
I would say we were always under-resourced. We were, I felt like, we were chronically starved by the state and the city. So, anything that we can do to be able to maintain our nonprofits, certainly none of the nonprofit organizations want to lay off staff and add to the unemployment line. And there is going to be, the rebuilding is going to have to include us because we know how to reach our community. And as Assemblymember Nolan talked about, the best places to know how to, the best resources, it's us. We have the networks. We know how to get to every corner of the city. The Federation's work is the census work we're doing upstate as well. So we are hitting all of the upstate communities with the largest Asian population. So, we are the untapped resource and we need the funding to keep going, because if you think about how do we get out of this crisis, we're going to need, government is going to need us. And so I just want to add that.
Great. And I know, thank you for that. Revenue is the answer. Thank you all for talking about it.
Thank you.
Okay, Senator Jackson, you want to introduce the next panel? You're on mute.
Your introduction, Assembly Member.
Okay. Thank you to panel number 1. We're now going to move to panel 2. First is George Liu, MD, President, CEO, and CMO of the Coalition of Asian American IPA Incorporated. Luz E. Correa, Vice President, Government and Community Affairs, Union Community Health Center. Anthony Fortenberry, Chief Nursing Officer, Callan Lord Community Health Center. Trevor Cross, Community Liaison, Hudson River Healthcare. Jacqueline Kilmer, CEO, Harlem United. And Nadia Chait, Associate Director of Policy and Advocacy, the Coalition for Behavioral Health. I apologize if I mispronounce anybody's names. Mr. George Liu will start. Remember, testimony is limited to 5 minutes. We encourage you not to reread your testimony that's been submitted. And we also encourage you to try and focus on solutions that we can explore to solve some of the problems that are being discussed. Thank you very much.
Thank you, Chairman. My name is George Liu. I'm a physician and have been practicing internal medicine and endocrinology in New York City for the last 28 years. I'm also the president and CEO of the CAIPA, which is the Coalition of the Asian American Independent Physician Association. CAIPA is representing over 1,100 physicians, practitioners to care for over 500,000 patients in the metropolitan New York area. 90% of whom are the Asian ethnicity. I thank you for the opportunity to speak with this forum about our experience caring the patients during the greatest healthcare challenge of our lifetime. The Asian community of New York City has been devastated by the COVID-19, much as the rest of the communities have been. And so far, too many people have had their families and lives shattered under the economic and medical consequences of the virus. However, we have seen some signs of our initiatives of the community have had some success. According to the New York State tracking numbers, although the Asian represent 14% of the population in New York City, they have suffered only 7% of fatality attributed to COVID-19. We don't believe this is related to any genetic protection that Asians may have against COVID-19. In fact, Asians were almost exclusively the ethnicity that died during the early SARS epidemics, which is caused by the virus, very similar to the one that caused COVID-19. We don't believe that there's anything about our demographic might lead to the disproportionately low mortality either. The Asian population is not specifically healthier or younger than the New York City population at large. In fact, Asians are at high risk for diabetes, hypertension, and stroke, which has been identified as the major risk factor for death in COVID-19. Asians in New York City have similar level of education and actually have a lower per capita income and a higher average household than the average New York City family. And this certainly causes us more isolation problems for the disease. Instead, we believe the relatively low mortality in our communities has been due to the few initiatives that has been in place since early in January. First, our doctors and other health providers have spent an enormous amount of time and often uncompensated resources in educating our patients and their families about the virus, including how it is spread and how to protect themselves. This has led to a very early uptake and acceptance of the need to wear masks and isolation infected patients. Second, we have been extremely aggressive in testing our patients. Initially, we did the mainly in the doctor's office for all the complicated with all the complicated safe measures, but we have now moved to the mobile testing model, we call it MRTC, the Mobile Rapid Testing Center. We have modified the ambulance, which specifically, changed the special design that we totally eliminate the cross-contamination and we can drive into the community to test the patients. This will allow the patients to avoid the cross-contamination, the crowded and potentially risky public transportations and non-waiting at the crowded ER testing tents or not adequate to protect doctor's office and waiting area. At the present time, we are established 4 testing centers in the mobile service in Brooklyn, Manhattan, Flushing, and Elmhurst for the community service. Some of our outcomes can probably attribute to the close relationship we have built with the patients in our community over the years, but our aggressive testing model, and especially our mobile testing program, may be the initiative that could best be explored into other communities in need. Currently, our mobile testing programs are funded entirely by the Kaipa Foundation, which is a very small foundation supported solely by the contribution of individual physicians. Increased funding for our program or other programs like it may greatly increase testing capacity and decrease the risk of the testing process to patients in heavily urban communities like NYC. We are also very happy to provide the testing. We're very happy to provide the testing to support other communities in needs, include the uninsured and unregistered. As the need to return to work is closing, need to increase the testing is essentially to identify the infected and their contacts in order to prevent an explosive second wave of the infection. In addition to the supporting of the community testing, the Kaipa Foundation has also donated about $500,000 worth of PPE to about 50 hospitals and health facilities at high crisis.
Mr. Liu, thank you. We're going to move on to Luz Correa, Vice President, Government and Community Affairs, Union Community Health Center.
Thank you. On behalf of Union Community Health Center and our 38,000 patients in the Bronx, I would like to thank the Senate and the Assembly for inviting me to speak today. Union is a federally qualified health center made up of 6 sites and 1 mobile medical unit in the Bronx, New York. Our locations are in District 15, one of the poorest congressional districts, as well as District 14, which is reported to have some of the highest rates of COVID-19. Over 3/4 of Union's patients are Latino, live below the federal poverty guidelines, and many of our patients are in fact the working poor. A high percentage are immigrants, and increasingly our patients are or underinsured, due in great part to a lot of the federal policies that have been implemented lately, and specifically the public charge. Our community, obviously, as it's been said here before, has higher rates of chronic illness, hypertension, cardiovascular disease, obesity, diabetes, asthma, depression, all of these chronic illnesses that complicate a COVID-19 diagnosis. Union provides primary care for all, regardless of ability to pay, just like the other 70+ community health centers throughout New York State. We do this through an integrated model of care that incorporates behavioral health and primary care services. Although we're not at the end of this pandemic, to date, we know, and just as it's been discussed here, that this has devastated communities of color. In fact, on April 21st, the Washington Post called the Bronx the coronavirus capital of New York City. Our community has been through a lot. They've experienced a lot of loss of jobs, loss of loved ones, sickness, lack of information, and it really has impacted people in a very negative way. But it's also impacted the safety net, the community health center, and community health centers throughout New York State that provide the needed care that our patients need. At the beginning of the pandemic, Union had to turn its model of care basically upside down. We had to switch to a telephonic model of care, which meant that it was an all hands on deck call for all of our staff to reach out to our most chronically ill patients to make sure that they knew that we were open, that they could speak to their providers, we could have medications delivered right to their door, and most importantly, to let them know that they should not stop managing their chronic diseases. And we had to make also a lot of difficult decisions as a health center. We closed 2 sites. We had to lay off and furlough staff. You know, it's important to note how important the outreach was at the height of the pandemic. It wasn't a service that we were guaranteed. Telephonic visits wasn't a service that we were guaranteed to get paid for. However, reimbursement for telephonic visits has been approved by the DOH, but only throughout the duration of this pandemic, or what they say is the duration of this pandemic. We know that a second wave of this pandemic is coming. And that is when our patients with chronic illnesses start to come back to us. These folks that have not been managing their care, their diabetes, haven't been taking their hypertension medication, haven't been eating properly, and maybe have no hope of eating properly for some time to come. We are going to have to provide that lifeline for them and continue to be able to treat them through telephonic services. In addition to telephonic visits, we also had to launch very quickly, very hastily, telehealth services, so virtual patient visits. This is great, and it was something that we were already on the road to do. But as so many have said here, a lot of our patients are not connected. They don't have devices, they don't have internet, they don't have Wi-Fi. And even if they do have internet, Wi-Fi, or maybe even if they're fortunate enough to have a smartphone, they don't know how to connect virtually. They don't know, especially a lot of the seniors that we take care of. So going forward, this is going to be an issue because we know that in the fall and winter, researchers are telling us that we just might have another wave of COVID come through our communities. So how are we going to address that? So I'm going to give some recommendations.
Your time is up.
Sorry about that. I forgot to unmute myself. Thank you, Ms. Correa. We're going to move on to Anthony Fortenberry, Chief Nursing Officer, Callan Lord Community Health Center.
Hi, everyone. My name is Anthony Fortenberry. I'm the Chief Nursing Officer at Callan Lord Community Health Center in New York City. On behalf of Callan Lord staff, our board of directors, and patients, I thank everyone for the opportunity to testify today. Callan Lord Community Health Center has served the LGBTQ community and people living with HIV in New York City and beyond for over 50 years. Last year, we cared for more than 17,000 patients from our Chelsea and South Bronx locations. A quarter of our patients are living with HIV, and a third of our patients identify as transgender or gender non-binary. More than half of our patients are people of color, 1/3 are uninsured, and 35% use public insurance. Our patients are people who have been systemically excluded from healthcare, housing, and economic stability. For Callan Lord, health equity equals racial equity, and we believe true liberation will only come culturally competent and comprehensive healthcare services. This pandemic has re-exposed the structural racism, oppression, and patriarchy that creates poorer health outcomes for people who are more exposed to and less protected from COVID-19 due to living conditions, wage disparities, underlying health conditions, and lack of access to quality health care. Located in underserved communities and open to all regardless of ability to pay, community health centers like Callan Lord serve as a model for improving access to care, reducing healthcare disparities, and achieving health equity. I believe that fortifying public investment in community health centers is the best strategy to address the disproportionate impact of COVID-19 for people of color and the LGBTQ community. Federally qualified health centers are the safety net for our country's broken healthcare system, and our scarce resources are stretched thin. As an example, Callan Lord is currently operating at a $1.5 million loss per month. Our statewide primary care association reports that 74% of community health centers in New York have had to close at least one site, and 77% have had to furlough, lay off, or reduce staff hours. With this in mind, we offer these recommendations. We ask for ongoing parity in the reimbursement of telephonic care. The rate for audio-only telephonic visits remains well below what we are typically reimbursed for care. And importantly, these telephonic visits are providing primary and preventative healthcare access to medical, behavioral health, psychiatry, and even dental services by state-licensed clinicians. We urge you to protect Medicaid by rejecting any state-level Medicaid cuts. Medicaid is a lifeline for Black, Brown, and TGNB communities, as well as people living with HIV. In addition, we ask you reverse the pending decision to transition the pharmacy benefit from Medicaid managed care to fee-for-service. This decision eliminates millions of dollars from community health centers participating in the 340B drug discount program and undermines the sustainability of our organizations. Next, please help us with the call for increased federal funding by urging our congressional delegation to add at least $7.6 billion to the next stimulus bill to meet the immediate needs of the COVID-19 response. We are pleased that the HEROES Act recently passed in the House includes this funding, but are alarmed by the final section of the bill, which undoes protections in the Families First Coronavirus Response Act and allows disastrous cuts to the Medicaid program in New York State. We ask that the state include wide subcontracting to local organizations for contact tracing and establish a meaningful community advisory council empowered to advise this critical public health initiative. The state must work with local communities and collect data about populations underrepresented by current methods, including LGBTQ populations, people with a history of engagement in the criminal justice system, homeless populations, people who use drugs, and others. Where possible, this data should be disaggregated. For example, the Department of Corrections COVID-19 totals should be disaggregated in published data. We must also advance policies and increase funding for interventions that improve equity and social determinants of health, such as housing. In response to this pandemic, Callan Lord is providing comprehensive healthcare services in hotels for homeless youth and adults suffering from the effects of COVID-19. We are ensuring that homeless individuals receive the quality of care they deserve, but would otherwise not receive. Funding and policies that address homelessness go a long way in reversing underlying social inequities. Lastly, this pandemic underscores the tragic inadequacy of our fragmented, profit-driven healthcare system. Thousands of New Yorkers are losing their jobs and insurance at exactly the time when guaranteed universal coverage is most needed, not just as a moral imperative, but as a matter of public health. Now is the time to pass the New York Health Act and build a truly universal healthcare system so that we can manage this pandemic with a fully insured society. In summary, investing in community healthcare is the best strategy to addressing the disproportionate impact of COVID-19 on people of color. We call upon each of you to keep fighting to support the sustainability of community health centers, help us advocate for federal dollars, and partner with us on critical initiatives like contact tracing and data collection. We ask you to advance policies and increase funding to address social determinants of health, and finally, to advance legislation that would create universal health care in New York State. Thank you all again for the opportunity to testify today.
Thank you very much, Mr. Fortenberry. We're going to go on to Trevor Cross, Community Liaison. Hudson River Healthcare. And I just encourage witnesses, if you use the gallery view, there's a countdown clock available. Thank you. Mr. Cross?
Hi. Hello, my name is Trevor Cross. I'm a longtime citizen of Suffolk County and fortunate to be an employee of Hudson River Healthcare, HRH Care. This pandemic has had, of course, a devastating effect on everybody. And I want to just lay out that, you know, we all are our brother's keeper. And, you know, when one is affected, all is affected. We all go to work and we go to the stores and our children go to school together. So it is important that we take care of everybody, including the minority community. But I want to just talk about a little bit about some of the things that I've worked in Suffolk County that I found very impressive. I think as we go forward, we have to get rid of this silo mentality. And there has to be a greater integration that will take the whole collective citizenry to have greater collaboration between community-based organizations. I want to quickly talk about the pop-up testing that was done here between where HRH Care worked very closely with the Office of Minority Health in Suffolk County. And we had sites all over Suffolk County, and we did a lot of testing, close to 5,000 testing already. And I think organizations working together can really get a lot done. We also need to insist on, you know, the cultural competency of all caregivers. That is so critical. We have to continue to do that. We have to provide more education, I think, in the schools. Schools are closed, I know, but find ways, you know, their online learning that's going on. Also, the churches, meet through the churches where the minority communities are usually together. Attend the churches or the synagogues. Also, use the media. I think we could use the media a lot more in terms of public service announcements to provide information, important information to the minority communities. And we need to increase access. Organizations like, you've heard a lot about the Federal Qualified Health Center, HRH Care is one of them, that really goes beyond the call of duty to assure and reassure the community, minority communities, that they can receive access to care at our different centers. And it's as if we go out there and try to get them to come in to get care. And that's a cost, and that can be very, very expensive. Most of our, a lot of our minorities members do not have insurance, but they're welcome at all our federally qualified health centers. So any help that federally qualified health centers can receive and enhance, that will definitely make a whole lot of difference. And as you heard earlier, that a lot of our health centers had to move to telehealth very, very quickly. And it would seem that there needs to be a greater increased reimbursement for health centers who have moved to telehealth. I mean, it's a big investment in time, and it's assisting patients who are scared to come out of their houses to receive care via telehealth. This is a major challenge, but I think that if we can all work together, find common ways to deal with the issue, because there might be another pandemic, and there might be, we're not sure when, but it's best that we prepare ourselves and have things in place so that when that comes, we'll be effective and we'll be able to deal with it effectively. Thank you.
Sorry, once again, I'm having trouble with my mute button. I'm just gonna leave it on. Thank you, Mr. Cross. Our CEO, Harlem United.
Thank you very much for the opportunity to testify today. My name is Jacqueline Killam. I'm the CEO at Harlem United. For the last 30 years, Harlem United has worked to address the issues and concerns of underserved communities in New York City. Our mission is to provide housing, healthcare, and supportive services to those most in need, fighting for our community's right to access these services equitably without barriers of racism, stigma, or discrimination. Harlem United's geographic service area and client population come primarily from the neighborhoods in Central and East Harlem and in the South Bronx. These areas include communities that are historically underserved and, of course, now disproportionately impacted by COVID-19. Our commitment to healthcare equity has taught us important lessons about how to reach our clients and support them in accessing the services that they need. Our experience gives us insight both into the impact of the pandemic on the communities we serve and on the ways that the impact may be mitigated. First, we need to prioritize testing in the hardest hit communities. As some of my colleagues have mentioned, community health centers are uniquely positioned to be the first level of care, either in brick and mortar facilities or through the use of mobile testing units that are deployed throughout the community. In addition, there are other community-based organizations located in and serving communities of color that should be considered as viable alternatives to the traditional healthcare settings for purposes of providing testing and immediate connection to care as necessary. We know from our significant experience in HIV and STI testing that we are most successful in reaching people when we go out into the community and meet people where they are. We know that people can be reached in non-traditional sites in a way that cannot be duplicated in more traditional settings. But scaling up testing requires significant financial support. With increased testing also comes an increased need for resources for follow-up to ensure that individuals testing positive remain connected to care and adhere to isolation protocols. Funding will be necessary for increased personnel costs, for testing training, for testing kits, for adequate supplies of PPE, and cleaning and disinfecting supplies. In addition, renovations may be necessary to brick and mortar facilities and to mobile units in order to keep staff and clients and patients safe. As some of my colleagues have already mentioned, we have all gone to a telehealth platform in a way that we never had before. But regulations surrounding remote service delivery of primary care, behavioral health, and care coordination need to ensure that the providers are adequately reimbursed for these services. In addition, regulations should be changed to allow for the provision of certain services, such as testing, in outside of clinic settings, and to allow the providers to be adequately reimbursed for the services provided in those non-traditional settings. We need significant investment in IT infrastructure and support. We know that in many cases, there is a lack of access to internet or to the actual physical computers or iPhones that are necessary in order for both providers and for individuals to participate in this new level of telehealth. Our community is experiencing increased levels of grief, isolation, and anxiety. Technology would enable people to stay connected to services, family, and society during social distancing periods of isolation. But significant funding is necessary in order to make technology available to all, and that is both providers and individuals as well. We also need to greatly expand the number of COVID-19 medical respite accommodations for convalescing or exposed community members requiring quarantine or post-hospitalization respite. This is especially important for anyone living in high-density living situations, such as people who live in multi-generational family settings, which is common in many neighborhoods and communities of color. We know that the disproportionate impact of COVID-19 on communities of color exists because of serious structural barriers to accessing quality, affordable healthcare, and also because of the historical treatment of people of color in the healthcare system, which has led to distrust in the medical profession in general. In order to improve and maintain the health of marginalized communities, we must now make quality, affordable housing, healthy food options, and livable wage jobs available to every New Yorker. This will take significant and ongoing investments from every level of government. Additional significant Medicaid enrollment is inevitable given the economic impact of COVID-19. As all of my colleagues have said, now is not the time for Medicaid cuts. And I will just echo Senator Rivera in saying more revenue, more revenue, more revenue. Nonprofit CBOs are already working with extremely challenging financial limitations, serious gaps in both state and city budget that threaten FQHCs, HIV services, mental health services, and supportive housing. Funding for existing programs should not be diminished, but rather should be increased in ways that consider the future needs of our community.
I'm sorry, the time has expired.
Thank you.
Thank you, Ms. Kilmer. And now we're going to go to the last witness on this panel, Nadia Chait, Associate Director of Policy and Advocacy, the Coalition for Behavioral Health.
Hi, thank you so much for providing us the opportunity to testify today and for including behavioral health as a key part of healthcare and the disparities that we will need to address to recover from COVID and to help our communities. The Coalition represents over 100 community-based behavioral health care providers who serve over 650,000 New Yorkers annually. And our members are providing mental health and substance use services in the communities that have been most heavily impacted by COVID. And I want to be clear that this is not just a physical health crisis, this is a behavioral health crisis. We are going to see the need for mental health and substance use services increase in a way that we probably have not seen, perhaps ever. We're already seeing a level of demand that for many of our providers is unprecedented. We recently surveyed our providers, and over 70% of them are seeing an increase in demand for services from new and existing clients. And 21% of them reported that they don't currently have the resources to meet that demand. Surveys of New Yorkers that are done by the city's Department of Health and Mental Hygiene show that right now about half of all New Yorkers have symptoms of anxiety and over a third have symptoms of depression. If you talk to anyone who operates a mental health hotline at the state level, city level, or national level, calls are increasing at an unprecedented level. The need is really clear. What's not clear is whether we'll have the resources to meet that need and to meet that need in the hardest hit communities. Our providers serve primarily a Black and Latinx communities, and they work very hard to ensure that they have the appropriate staff to provide services, that they have staff who can provide services in multiple languages with native fluency, that they have staff who are from the communities. And that's why our providers are based in the communities. That's why, one of my providers recently, when they were building a new location, they brought in a community group. They worked very closely with the members of the community. So when the building went up, the community calls it, this is our building, this is our community. And that's why we know that we're the right people to serve this community and to help deal with the disparities. We know before COVID hit that these were communities that were already harder hit by mental health and substance use disorders, reflecting, all of the ongoing disparities that we talk about all the time. But it's going to be worse after this because these communities have been so hard hit by COVID, because of the grief, because of the trauma, because of the rising rates of unemployment. And of course, because we also know that these communities are overrepresented as frontline workers, and the trauma and the mental health challenges for the frontline workforce are going to be very significant. And that's true both for physical health workers and also for our mental health providers and our behavioral health providers whose staff have continued to go to work in person in many places. Certainly some of our services have transitioned to telehealth for those that are possible to transition to telehealth. But for staff who work at a supportive housing residence or at a residential treatment program, those programs cannot close and they have not closed. And those staff have continued to go in every day and to help this population at a very challenging time. And so I think some of the issues, have already been highlighted by others. Of course, we need continued support for telehealth services, and particularly for telephonic. Obviously, many people simply don't have access to video technology, to a data plan, or even if they do have access, it's not technology that they're comfortable using for something as intimate as a behavioral health session. So we need to ensure that telephonic is included in all billing as well as telehealth, and that it's reimbursed at the same rate as an in-person visit. But we need more than that. Behavioral health has always been underfunded, and we need to really step up and fund the sector at this time. Medicaid cuts would be devastating. It's not an exaggeration to say that our providers are already barely surviving. And with cuts at this time, when what we need to do is increase capacity, if we had Medicaid cuts, we would see decreased capacity, potentially substantial decreased capacity. It's also critical. I want to acknowledge that OMH and OASIS both moved incredibly quickly to put in place the emergency regulations that have allowed the transition to telehealth. And that's been wonderful. One of the regulations that was put in place has allowed for providers to be located outside of New York State and to continue to serve clients in New York State. That's critical overall, but it's been especially important for serving clients who speak languages other than English, because it widens the pool of clinicians that our members can hire, and it makes it easier for them to bring in staff who speak other languages. So that will be critical to keep. Thank you.
Okay, thank you to our panelists. Senator Jackson, do you want to introduce? All right, since Senator Jackson is not available, I will start on the Assembly side. We'll start with Assembly Member Ron Kim, who's chair of the Asian Pacific American Task Force.
Thank you, Assemblymember Bronstein. So back in February, we created a task force in Queens of Asian American medical professionals to start focusing on COVID-19, on how we should prepare. And it was actually CAIPA, the Coalition of Asian American Independent Physicians Association, and Dr. George Liu, he started warning many of us back in January that this is a serious pandemic, and we need to be taking this very seriously. We need to start preparing right away. So we began spreading information about wearing masks and started to source PPE. We try to speak with leadership and all in the governor's office as well back in February about how we should be activating our emergency funds as soon as possible to start securing PPE for the state of New York, because we saw early on what was going on the ground. People were just hustling and trying to buy as much PPE in districts like mine. So we kind of foresaw what was happening when there was a scarcity of resources all around. So fast forward a couple of months, we wait for the testing that's sponsored by the state to scale, and it's not reaching our most vulnerable communities. So groups like CAIPA took it upon themselves to create their walk-through mobile testing sites. Now, these are the type of sites that we see in developed countries abroad, where it's like a phone booth testing site. And I've been to 3 of these openings, and it takes about 5 minutes for a person to walk through and get tested. And it's mobile. We can go where the needs are. So my first question, I want to bring back Dr. George Liu to see whether the state and the city should help scale this program up, because right now it's been self-financed and paid for by generous individuals. Secondly, the question for everyone else, testing and tracing. Why aren't we designing a system that's people-powered and people-centric and patient-driven? Why do we continue to design programs that are highly extractive and not focused on how do we center everything around protecting people's privacy and making sure that the tools we're giving them empowers them to re-engage in the economy? Dr. Liu?
Yeah, thank you, Ron. I think it's so important what you're saying, that the CAIPA physicians, because we have some knowledge information from China, and we understand the serious and how dangerous that could be in terms of the virus. So actually, at that time, we're trying to get help. We're trying to get the equipment, the PPE, and we found that this is a grossly shortage. So we originally will have other channels to go to China to purchase the things, and later on it's become a problem. There's some of the political, some difficulties of quality or something in this situation. But Kaipa Foundation has been provided a lot of services. As I said before, we provide $500,000 of the goods to support the hospitals and the emergency room, the nursing homes in order to support our colleagues who's in the first line. And this is very important. And since we have the Kaipa the mobile service, this is, I think, is very important to prevent people getting infected during some people get sick, they wanted to see the doctors, and they go to the emergency room. They're very, very unfortunately, it's a long line. People sit there for 7-8 hours, and with a crowded area, if you're not sick, you may get sick by waiting in the area, getting infected. And the same problems in the doctor's office. You don't want to infect the doctors, and you don't want to infect the front desk people. So those are the other problems. That's why we developed the mobile services, which we can drive the car to the patient's home. Actually, in addition to the several spots that we continues trying to provide the services.
Thank you, Dr. Liu. There's 10 seconds left. Can we create a tracing program centered around protecting people's privacy? Yes or no?
Yes, it's important to provide the service of the privacy, but I think it's the patient volunteer to actually want to come in to ask for the services, and no, I think that would be okay.
Thank you. The question time is up.
Thank you. Now we turn to Senator Salazar, the chair of the Women's Issues Committee. She has 5 minutes. Senator Salazar?
Thank you. I've been muted. First of all, thank you all for your testimony. I wanted to ask Amy Doran if you are seeing among the community-based behavioral health providers in the coalition sort of a similar triaging of patient care that we are seeing in healthcare facilities that don't typically focus as much that don't typically focus as much on behavioral health. And are you seeing or anticipating an impact on people struggling with specific behavioral health issues right now, perhaps not getting the treatment that they need due to not being prioritized during the coronavirus pandemic?
Thanks for that question. I think fortunately our sector so far has not had to do the kind of triaging that we're seeing on the physical health side. I am concerned, given the increase in demand that we expect to see, of how that will be handled without additional resources for a sector that has always been underfunded. But no, I would say right now, I think providers were really able to transition most of their services quite quickly to telehealth. And then one of the things that's incredibly wonderful about behavioral health is the use of peers to deliver services and to work with clients. And so many of our members had their peers really doing intensive outreach to make sure that individuals were not lost in care, that if they didn't have a phone, that they were provided with a phone, if they didn't know how to use Zoom or whatever the service was, that they were taught how to do that. And so I think that's really helped to keep people in care. I am concerned about how we'll make sure that people who need care but have not previously used services will get connected to services. There are obviously hotlines and referral mechanisms, but if you're someone who is maybe doesn't have a primary care provider or is otherwise disconnected from care, you may not know how to access these services. And so I think that could be a real problem.
Senator, are you done? Okay. Now we're going to move to the Assembly side. We'll have Assembly Member Marcos Crespo, Chair of the Labor Committee.
Thanks, Ed. Just again, thanks to all the panelists. And Luz, maybe if I could focus a little bit on you on this one.
Sure.
again, I'm going to start off by saying this is the unfortunate we told you so. I could go back when I was an intern. I remember then Assemblyman Peter Rivera, as chair of the task force, was behind the creation of the Office of Minority Health within the State Department of Health, an agency at the time, so many years ago, to focus on the growing disparities in our communities. And that got defunded over the years to the point that it's now one person in an office that's never heard from and cannot execute this work. And now we're seeing the results of what happens when we ignore those specific needs in our neighborhood. So then, again, I had to start off with. But Luz, the federally qualified health centers in my community, the Bronx has the highest percentage of workers in our county work in healthcare. Many of them, not only in the big hospitals, but in organizations like yours, federally qualified centers, who, in my opinion, provide the most culturally competent healthcare service. And you're also large employers. You provide employment to people within those same communities, and you service those that otherwise have less access to coverage and other issues. And so the impact you guys have had financially, both from an employer standpoint, you mentioned quickly that you furlough staff. I don't know if you can elaborate on that a little bit more.
Sure.
But I also want to know, I understand that the reimbursement issue with telehealth was addressed late in this pandemic, but it's now a little bit better and it's only limited to this pandemic. What is your biggest financial concern? Something the state needs to control in terms of the viability of our federally qualified health centers. I know many of the smaller organizations in particular were under threat of not reopening because of this, even though healthcare is now going to be our greatest need. And addressing those underlying health conditions has to be a priority. There's nothing to reinvent here. We know what those underlying conditions are, and we know they need to be impacted: diabetes, high cholesterol, all these issues. And it's there are many prongs that address those needs. But from your standpoint, federally qualified health centers, what is your biggest concerns, both from an employer standpoint and as a provider, in terms of where are the resources that you need most to make sure that you stay viable in the new economy?
Well, thank you for that question. Yes, there's so many layers. There's so many layers to this. And for federally qualified health centers, I mean, we had to fight to get the telephonic visits approved and be able to get reimbursed for that. We had to fight for telehealth services. Yes, telehealth services, it's looking like that is going to be okay, and we're okay for now. But we're going to need money. We're going to need capital money to retrofit our sites, to make them safe for both of our patients as well as our staff. We're going to need money to just bring on telehealth services. Some of our community health centers were not on track to bring on virtual services yet. And this is an investment they have to make if they're going to stay viable and if they are going to remain open. We're going to need money just to bring on staff, personnel. We have furloughed staff. We have laid off some staff. We closed 2 sites. Dental is our biggest, we're one of the largest dental providers in the Bronx. There's a dental shortage in the Bronx. So we're never at a loss for patients trying to access dental services. That's why Union had 85%, an 85% impact on our visits, because we had to close basically dental at the beginning of the pandemic. When we bring it back on, we're going to have to take a lot into consideration. How do we protect our dentists? How do we protect the patients that are accessing those services? So from a capital, operating, and personnel expense, we are going to need a lot of help. And as it was said before, we also need to be reassured that Medicaid and reimbursement for services like telephonic telehealth are not negatively impacted, because right now the revenue stream is so important.
So just to be clear, for anybody who may not realize this, telehealth is when there's a virtual, a video conference. Telephonic is just when that's not available, that you can at least speak to the patient, correct?
Exactly.
And that's key, because, and again, the digital divide in our communities, that phone call can make the difference. And I guess my last question, as time is running out, I just want to be clear, because the anxiety is real. I know I've dealt with it. By the way, I tested positive. My family all did, my kids. We've gone through it. We're okay, thank God. But the anxiety remains, because there's still so many unknowns. Are anxiety calls to your clinics in a telehealth call covered?
Yes. Yes, and through telephonic as well. And I can tell you that our social workers, our behavioral health specialists, our psychiatrists are pretty busy these days and doing a phenomenal job because there's a lot of anxiety in our community right now.
Thank you.
Thank you. Now we turn to Senator Gustavo Rivera, the chair of the Health Committee.
Thank you, Mr. Chairman. And Luz, I'm one of those folks that is not getting the dental clinic visit because I use Union for my dental visits. All right, so I know I have 5 minutes. One of the things that these hearings are good for is actually we're not only talking about the things that are going on now, but we're thinking about the things that we're going to have to do afterwards, right? The idea that we're going to go back to normal cannot, I would argue, cannot possibly be the way that we do this. We have to go back to something else. And the something else, particularly as it relates to healthcare, as we're talking about here, I wanted to linger in that for just a few seconds, for just a little bit. Particularly, Mr. Fortenberry, I think you did an amazing job of actually kind of laying out what are some of the recommendations that you have for us, because as it relates to federally qualified health centers or other community health centers that are being amazed that the impact they're feeling is immense. I wanted for you to talk a little bit about that. This is what I want to just I want to lay this out and then let the panel kind of take over. You mentioned the New York Health Act. I cannot say this enough to everyone that's listening, to all my colleagues. The ability for everyone to have universal access to care would actually help us quite a bit in a situation that's a public health emergency. The idea that we need to make sure that we do not cut Medicaid, I say again, that we do not cut Medicaid during a time of crisis, that we raise more revenue so that the hit is less. We can't tax our way out of this. Our dear governor says that all the time, very well, but how about not 2 hits, but 1? How do we make the hits less? And on mental health issues, because I know that Ms. Scheit was talking about this, and I apologize if I messed up your name, but talking about mental health services and all of the issues that are kind of plugged in here. So Mr. Fortenberry and then Ms. Correa, if you can, only have a few minutes, but talk about what are some of the things, if you could underline, particularly Mr. Fortenberry, the things that you talked about as far as the recommendations for us and the things that we cannot do during this crisis so that at the end, we're in a worse off place. Could you make sure that you underline those for us, please? Thank you.
Hi, thank you so much for that question. I really appreciate the opportunity. So, I think it cannot be stressed enough what you just said around cuts to Medicaid and how disproportionately it impacts, specifically the communities that we care for, that are so dependent on Medicaid dollars, not only for the life-saving treatment that they access through FQHCs, but also as FQHCs, our ability to maintain our viability to continue to serve and expand that coverage. So I think that is the biggest takeaway. I also really think it's important to lean on the infrastructure that FQHCs have created in the strong response to the HIV epidemic. We know contact tracing, right? We know how to maintain privacy. Please utilize us as an infrastructure to address this pandemic. I think it's important to mention homelessness. Callen-Lorde is currently taking care of both youth and adults in hotels throughout New York City and providing comprehensive healthcare services. Addressing housing is going to be, I think, an incredibly increased need for the future. We talk about planning for how to manage this pandemic moving forward. Supportive housing, affordable housing is going to be increasingly important to ensure that we can ensure the safety of our communities.
Luz, if you could talk a little about FQHCs, please, and what we can't, tell us what we cannot do. What are the things?
You cannot ignore the fact that this is going to create a tsunami of mental health illness. We cannot not talk about that. And for generations to come, someone said this earlier, this is impacting us now. The children who are experiencing this will be impacted by this. And we have to address it. We have to talk about it. We know that there's stigma in our community already about talking about mental health, about admitting that we need help. Every basic need has been taken away from our community. There are people that are struggling with housing, now wondering how they're going to pay their rent. There are already people living in shelters, obviously. Their healthcare needs are, you know, I don't know if they can rely on the healthcare system right now, if they feel that they can rely on it.
Luz, I'm gonna interrupt you only because I have a couple more seconds. Make billionaires pay. More revenue, more revenue, more revenue. We need more damn revenue. Thank you, Mr. Chairman.
Mental health services.
There you go.
Co-Chair Bronstein.
Thank you,
It's on
Senator.
you.
Thank you, Senator. Now, we're going to move on to Tremaine Wright, Assemblymember Tremaine Wright, Chair of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus.
Thank you, everyone. Oh,
Hi, Madam Chair.
Tremaine, you got to unmute. Unmute. There you go.
there we go. Sorry, it told me I couldn't unmute myself. If you can hear me now, thank you. Just want to thank you all for coming together for this. Luz Correa, I guess I wanted to ask you more specifically. At the end of your statement, you said that you had a number of recommendations that you did not go into. Could you
Thank
please
you.
give that to us?
Sure.
Just
We need
recommendation.
PPE. We need PPE to protect our staff, to protect our patients. Personal
Okay,
protective.
I'm sorry. Let me be really clear. Not just what the need is, what is your solution? So we need a provision of PPE, but how is it that you're asking for it? What is it, the supply chain that you want out of it? What is the payment plan? What is it that you want?
So we need it, and we need the state and the city to come together to find a way to get it to healthcare providers in the community. We need public health messaging that is culturally and linguistically appropriate. Again, we need the city and the state to come together on that. Our community has been reporting back to us that they're getting a lot of mixed messaging and that they don't know who or what message to listen to. And sometimes we feel that way as well. We need mobile devices for our patients. We need connectivity for our patients and for our community. Those were going to be my top 1, 2, 3, 4, 5 recommendations. And then obviously the capital that's needed for community health centers to sustain themselves.
Okay, perfect. Thank you. And then Mr. Fortenberry, I wanted to follow up with you on a couple of things. So you're doing housing for homeless youth. I just wanted to be clear. Are you doing all of that in hotels?
Yes, that is correct. We've partnered with The Door and Ali Forney Center to provide those services in hotels.
Now, is this, and so I know you all as health centers, is this a new, is it a new project for you to do the homeless housing? Okay.
Yes.
And how is that currently being funded?
So it is being funded separately in the different hotels that we are working in, either through DHS, or the Office of Emergency Management. And I do want to clarify, we are just providing the medical services.
Oh, you're just doing the services for the people who are being housed. Okay. So you're not doing the actual home.
Correct.
You're not doing the services. Then I also wanted to ask you about, you were supposed to be opening a clinic in Brooklyn. That was on your radar for this year. And I wanted to know, how has this impacted it, and what are the concerns surrounding that development?
So we have been able to utilize our Brooklyn location to begin to see some patients in an attempt to try to not have people travel any further than necessary for the clinical services that they need. And so we are doing a bit of a soft launch, if you will, and we're really hope how this has affected our Brooklyn opening is that we were so excited to be able to expand services to Brooklyn, right? There are so many underserved populations in Brooklyn that we're hoping to reach with this location. And so COVID-19 has certainly put a bit of a damper on that opening, but we are still hoping to expand services there as safely as possible.
Okay. And I know that there were 2 conversation points, and I didn't write down who said it, regarding increase in respite accommodations and increasing the number of mental health providers. So I wanted to know one, if someone could speak more on the respite accommodations, and then also if someone can identify what is needed or what's missing to meet the need with mental health beyond staffing, beyond just hiring more people. What tools do we need?
I'm happy to take the mental health question. Beyond staffing, I think one of the key issues that we face is stigma. And so really efforts to tackle stigma and to make people see that this is part of healthcare, and that just like you go to the doctor when your ankle is hurt, you should reach out to a behavioral health provider when you're experiencing substance use or mental health issues. And I know the Assembly and the Senate have both done a lot of work on that in the past, and acknowledging Mental Health Awareness Month and efforts there. But I think that is probably as well one of the biggest barriers to people accessing care.
Okay.
I'm sorry, the question time is up.
Okay, thank you. Sorry about that.
Well, thank you. Next, we turn to Senator Brad Holman of Manhattan for 5 minutes. Is it 5 minutes? I think it's 3 minutes. I'm sorry. Brad?
There, I'm unmuted. Thanks so much. Thank you, Senator Jackson,
Welcome.
Senator Vera, Senator Salazar, all my colleagues. When we look at the issue of COVID-19 and the disparities on communities of color, just yesterday you had the federal HHS Secretary, Alex Azar, basically blaming our communities of color for their underlying health issues, for the comorbidities that he points out that are resulting in a disproportionate impact. But we know that it's really about poor decision making, whether it's in the weeks and months leading up to the crisis or years and decades before. And that's largely on government's watch. Just to point out, on March 9th, a letter was sent to Mayor de Blasio and his health commissioners by 18 academics and community leaders demanding that the mayor seriously begin to consider closing schools and curtailing business hours. The signers included at least 4 distinguished professors at major schools of public health, as well as the presidents of several organizations devoted to African American and Latino health and justice. Those who signed the letter saw a particular threat to minority and poor communities who are sicker and often rely on the local public hospitals as their only source of care. That's from this week's ProPublica report. With that in mind, I wanted to raise the issue with Mr. Fortenberry of what we can do now as a state and in terms of an issue that you raise, LGBTQ data collection and its the intersection of that community with communities of color. We know that LGBTQ communities of color have the highest rates of HIV/AIDS, and I'm interested to know what you're seeing at the moment in terms of LGBTQ people, communities of color, and COVID-19. In the last several months, we've understood that the LGBTQ communities are often left behind. You had Franklin Graham and his rabid anti-LGBTQ health ministry on Central Park, and you've seen the impact of the blood ban for gay and bisexual men that has diminished our blood supply during this crisis. What can you tell us at this point in terms of HIV, AIDS, and COVID-19 in communities of color?
Well, thank you so much for that, I think, really important question, because it highlights, I think, the lack of data that we have for these specific subpopulations and the impact, the disproportionate impact of COVID-19 on these communities. I think it won't even really be known until we're able to collect the data and review it to see where we can best implement strategies from the state and funding to try to address those disparities, right? It's kind of hard to know where to start without the data to begin with. I'll share from my personal experience here at 18th Street for our patients that we're caring for. Sorry.
Yeah, well, Ed, let him allow him just to finish this response, if you don't mind. Go ahead, finish, sir.
I was just going to say, our patients that are immunocompromised, we've tried so hard to keep them out of the hospital systems, right? We don't want them to be unnecessarily exposed. And so that's why it's so important that FQHCs remain viable to keep these populations that are immunocompromised out of danger and out of the overcrowded hospital systems. Thank you.
Thank you. My co-chair.
Thanks, Senator. Now we're going to go to the ranking member of the city's committee, Assemblymember Mike Riley.
Mike Riley of Staten Island.
Thank you, Senator Jackson. Thank you, Chairman Bronstein. Appreciate it. Thank you to the committee, to the panel for all their insight and their testimony. I actually, what strikes me is the mental health aspect. I know firsthand about the mental health issues that families could be facing. My mom suffered several nervous breakdowns while I was growing up, and I understand the strain on the community and the family bond. I can only imagine what's going to happen after this pandemic subsides, at least temporarily. So I think the main point that I'm looking to gain some more insight in is what we can do to give more resources, not necessarily funding wise, because I know that's always going to be a reason and a need. I'm looking for what we can do at the ground level in each community, because I think along with that mental health aspect, we're going to see a dire need for detox beds, I should say, because the isolation, I think, is going to bring about more substance abuse, whether that's drugs or alcohol. We see that we're losing some detox beds throughout the city, and the state, and there's always been a need. Is there anything that we should keep an eye on? And this is open to all the panel members. If you can give us some recommendations and suggestions in that area. Thank you.
Sure. So, I mean, you're absolutely right that substance use is going up, and we've heard from a lot of our providers of, people who are experiencing relapse or really struggling with kind of the structures that had helped them going away to a large degree. You're not going to work every day. No one knows if you open a bottle of wine at noon or whatever. But I think in terms of resources, I mean, I think you highlighted a couple of key issues. I think a lot of it is also thinking about, the conversations we have and how we direct people to the resources that we have right now. So, and the resources that we can build. So I know the state has already applied for some FEMA funding and is intending to apply for more for FEMA's crisis counseling. That I think can be a really powerful program, certainly was in the state and the city after Hurricane Sandy and after 9/11. And then also for our kids, thinking about the resources that we have in schools and how we can make sure that those resources stay in place when students aren't in school and aren't attending, some of the after school and enrichment programs. So, a lot of schools have social workers. How are we making sure that kids are still accessing that? And that, last year, New York State, thanks to all of you, has started to do mental health education in the schools, which is wonderful. How can we make sure that those sorts of things continue when students aren't in the traditional settings? So those would be two things I would keep an eye on.
So I know that we've always needed more SAPIS in our schools. Is there a specific targeted area where we would want to make sure that we advocate for more of those, professionals?
Sure. So I don't know the breakdown super well, but I would say certainly where we're probably going to see the greatest increase in need is going to be in those communities that are the hardest hit. So looking at, where have there been the most infections and the most deaths? Obviously kids processing loss is really complicated and really hard, or processing that, maybe your mom is a nurse who didn't come home for 3 months because she was afraid of getting you sick. That is going to need help to help those kids be resilient and to go on through their lives.
And I think switching gears a little bit, the CDPAP for seniors and disabled, having their families take care of them. I think we're going to see that there is a great need for that and want, especially given the impact this has had on nursing homes. I want to know if there's any insight you can offer in how we can advocate more for that. I mean, I know that we have to push for the budgetary hearings for these things, but we see that this is more important now than ever, and we can't have those programs cut.
Okay, thanks, Assembly Member. Now we're going to go to Assembly Member Aravella Simotis, Chair of the Task Force on Women's Issues.
Thank you, Ed. So I have a couple of questions, but access to reproductive health care services in communities of color are already scarce. Many New Yorkers have to travel long distances to access services. So I have two questions, and I'm going to direct them either to Luz, Anthony, Trevor, whoever can answer them. First, how can the state protect access to reproductive health care during this pandemic? And second, my question revolves around the increasing rates of maternity mortality rates throughout the state. What can we do to ensure that COVID-19 doesn't exacerbate the maternal mortality crisis for African American mothers? Have any specific policies been implemented to minimize the risks for mothers and newborns, and have they been sufficient?
I can jump in first, just to very briefly say, as I said before, I really do believe that supporting the sustainability of federally qualified health centers is one of the best strategies to address both reproductive and sexual health for communities of color, for the LGBT community, for reducing maternal mortality. I think FQHCs are meant to be the safety net to help support these functions, and supporting them will help address that.
And I agree with Anthony. 100%. I mean, I do know that during this time, and it's been widely reported, that there are less opportunities for women to access reproductive health services. Services like PEP and PrEP in our community right now are at a standstill because people just do not feel comfortable going into a health center right now, or they don't know that they can call their health center and speak to a provider. So we know that right now, a lot of these services are being impacted, and the community is being directly impacted by this pandemic.
Thank you.
Okay. Until my colleague comes back, let's go to the next Assembly Member that's assigned that waved a hand. Here's Ed. Ed, back to you.
Yeah, sorry. So next, I believe we're going to go to Assembly Member Yuli New, co-chair of the Task Force on Asian Pacific Americans. 5 minutes, correct. Okay, thank you.
Thank you so much, Ed. And I just wanted to ask, I guess, has there been any considerations that you guys feel have been made by the state to make sure that there are culturally appropriate health services? Anybody can answer. It's okay to be honest.
Well, I will speak. I know that there has been a lack of materials and outreach in Spanish language for our community. That's not only at the state level, but also at the city level. And we're very concerned about that. We need to get information out in all languages. I mean, and not just Spanish, Chinese, Arabic, French Creole, I mean, you name it. We need to have information translated. It was a shame that Joanne spoke earlier about not knowing where the COVID-19 isolation hotels are. I mean, she runs an organization, a large community-based organization. So if she wasn't aware of how to refer someone to a COVID-19 hotel, could you imagine the layperson, people who live in our community? They don't have this information, and we need to put it out there. We need to put it out in all languages, and we need to arm our community-based organizations with this information as well.
So, I mean, I just want to go back to the question, which is, do you feel like our state has really provided culture, like, you know, a revenue, I guess, or budget for culturally appropriate, you know, healthcare to our communities? Because I know for, you know, one of the biggest things that we cut in our budget was our community health centers. And that was one of the biggest avenues in which people could reach out to their communities with culturally appropriate care. We also see that there's a lack of culturally appropriate food in the city and state's, I guess, preparations for folks. And I also wanted to point out that, I guess, what you guys have said already is that, you know, right now the health disparities have been very, very apparent within our different community groups, and the racial wealth gap is really visible now and amplified and magnified. And so, you know, we've seen the service disparities that our social service agencies have talked about, and now we see from all of you some of the health disparities that we are seeing across the city and the state. And so I guess I wanted to ask, you know, besides language access, besides, you know, food insecurity and the things that are not really appropriate, is there some other things that our you know, our state should be funding, and how much of it should our state be funding? And hi, George. Hi, Uncle George.
The point is, actually, I listened for a long time. Actually, I don't see or don't hear too much about how we have to pay people go back to work. I think the most important thing now is how we can help everybody can go back to work safely. And that's the reason we are pushing very hardly, trying to get the people to get tested, to find out we call it identification, and then we get isolation on those people who are sick, so they don't go back and infect other people on the process. So this can prevent the second wave of the disease comes up again. So that's the reason we're trying to push as much as we can, trying to do the testing. I think this is the most important thing at this point. And, you know, I hope everybody agree with that. And of course, there's the money in the Kaipa Foundation. We have not very much of good support on that at all. And I hope that we can get some support from the government.
Thank you for talking about that. And thank you for bringing that up, because I think that you're right, that there hasn't been a lot of government support for culturally appropriate services, because there are people who trust Kaipa, right, within our communities more than other places. And I think that that's really important to make sure that we get revenue and get money to the places that our communities trust. I think, you know, we have seen now that, you know, these are actually, you know, people say that we're letting people fall through the cracks, right? But actually, I think that it's not really cracks. It's a system that is not broken, but working exactly the way that it was designed, right? It's basically a system that is designed to leave out certain communities. And like Wayne had just said in the previous panel, that the first time that Asian Americans were ever even included in the budget was a few years ago.
Okay, thank you, Yulene. And now we're going to go to Assembly Member Harvey Epstein to close this panel.
Thank you. I want to thank all the panelists as well. And I know we talked earlier, clearly we need to focus on healthcare and healthcare services, the New York Health Act, not cutting our community health clinics, you know, obviously with not enough social workers in schools and potential PTSD for our students, not actually having opportunity for confidential space or mental health issues. I'm wondering what people see with the cuts we're coming down the pike. What are the long-term health impacts we're going to see for communities of color and low-income communities in New York? And what are the longer-term costs they're going to incur based on our failure to deal with some of these health consequences now? That's for any of the panelists who want to answer.
I think that some of the long-term consequences are going to be, you're going to see FQHCs fail. You're going to see community health centers fail. And so there already aren't sufficient facilities within communities of color outside of hospital for them to receive care. And so a loss of even one FQHC or other community health center will be detrimental to health outcomes for the entire community.
And on the behavioral health side, I think without, if we see funding cuts, instead of being able to intervene early and help people recover from COVID, help people feel comfortable on the subways, being out in public without having, overwhelming anxiety, help children deal with this incredibly traumatic period in their lives, we can intervene now and it will be much less expensive than it will be later on, and the outcomes will be better. Or we can let that trauma really sink into people and manifest in a variety of ways, both physical and mental health impacts, right? Like trauma is a mental health issue, but it impacts your physical health substantially as well. And we can do that in a way that will be much more expensive and also that will harm people's lives. It will cost the state more, and also people will be sicker and they will die younger. And that's a choice.
That's a really important point, that it's going to cost us one way or the other. And the only question is whether we want to spend more money later and with the human costs associated with it, or manage it now. And it's going to cost us, we're going to have to figure out a way to pay for it, but the costs are going to be much more problematic. I'm wondering on the children and the long-term impact that they might have on children. Can you extrapolate if we don't deal with these issues now? What are we seeing on unresolved issues?
Yeah, so we know, like looking at young kids who experience trauma, they're likely to become much more aggressive later in their life, to withdraw from social support settings. So kids who have PTSD or have experienced trauma are much less likely to graduate from high school. They're less likely to, enter the workforce. They tend to become kind of the term like disconnected youth who aren't engaged in our social institutions. But we also know kids are resilient, and if we act now and we intervene, none of that has to happen.
Thank you so much.
And this is Luz. I just wanted to say that, the state really needs to make a commitment to reinvest in programs like PCMH. That's the medical home program. Union Community Health Center is a level 3 PCMH program. That means that we're providing the most vulnerable patients with case management in addition to their healthcare. So doing that outreach, doing that intervention with the most vulnerable populations, including children, to make sure that they're connecting to care and accessing the services that they need. That is a state-funded program, and we need the state to continue to reinvest in programs like that.
Well, thank you everyone for the panel, the panelists for coming forward. We're going to move to panel number 3, and we have several panelists. Minerva Perez, the Executive Director of OLA of Eastern Long Island. John Cho, Executive Director of Greater Flushing Chamber of Commerce. Honorable Rose H. Sconiers, Chair, the Community Foundation for Greater Buffalo, and Kenya Abreu, President of the New York Women Chamber of Commerce. And let me turn it over to Minerva Perez, Executive Director. But Minerva, I was looking at your testimony and to see what OLA stood for. And what is that, if you don't mind telling me? Minerva?
Minerva Perez has disconnected for the moment.
For the moment. Okay, so then we move to John Cho. John, you're there, the Executive Director of Greater Flushing Chamber of Commerce.
Yes, I am.
Hey, John, long time.
Yes, good afternoon. The Greater Flushing Chamber of Commerce is a nonprofit membership association of small business owners, entrepreneurs, and civic leaders representing the most diverse and dynamic community in the United States. While Flushing is a majority Asian American neighborhood, we are home to people from around the world. According to the census, 66% of the population can trace their heritage to Asia, 16% to Latin America, and 14% from Europe. We are also the center of small business activity in New York, with more than 5,000 firms employing 10 or fewer workers, according to the state comptroller. And we're the fourth largest commercial district in New York City, generating more than 1.5 billion in retail sales annually. In the last Great Recession, our Main Street was growing economically, creating jobs, and generating tax revenue, while Wall Street was imploding from commoditized debt obligations and other high-risk financial bets. Neighborhoods like Flushing, Queens are the key to New York's economic recovery. This weekend, I conducted a quick survey of our community. Very few businesses were open. Before the pandemic, we used to have long lines of people waiting on Main Street outside Tiger Sugar, a bubble tea purveyor popular with millennial Instagrammers. Now the only line you see are the 5,000 local residents of all ethnicities and ages, many without jobs or health care, desperately waiting for emergency food assistance distributed by the volunteers at La Jornada Food Pantry. A line that starts at the Bland Houses Community Center and wraps around 6 blocks on Main Street, 40th Road, Prince Street, and 41st Avenue. Because the city refuses to close down streets in downtown Flushing to private vehicles, these residents literally risk their lives every week, unable to social distance on narrow sidewalks just to feed their families. We estimate that 30 to 50% of the restaurants and eateries in Flushing will not reopen after the pause is lifted. Our business community, which has suffered so much during this pandemic, was already victimized by racist profiling in the media, including the New York Times and the New York Post, which published photos of Flushing when reporting about COVID-19 outbreaks in Manhattan and other areas of New York. The pandemic has exposed fundamental inequalities in the distribution of resources. Many of our businesses, like those in neighborhoods outside Manhattan, have still not received any economic relief from the city or the federal government, even after submitting applications more than a month ago. When received, these relief programs, including the Payroll Protection Program, are not helping many of our businesses because loan forgiveness is based on continued hiring or rehiring of workers at a time when no business is possible. Even when businesses want to stay open, like many of our neighborhood markets, they cannot because they cannot get enough employees to come to work. If New York is serious about helping business of communities like Flushing, we need to think outside the box and envision a post-COVID world that supports resilient and sustainable neighborhood-based economic development. This could mean closing off streets to private vehicles so restaurants and bakeries can provide safe dining venues, establishing busways that prioritize public transit for those who need to get to work, or providing protected bicycle lanes to those who need safe access to shopping and recreational areas. States like Connecticut have already lifted parking minimums for restaurants to utilize their parking lots and on-street parking spaces for outdoor dining. Proposals could also mean dramatically expanding support for local currencies that promote neighborhood circulation of money, the widespread use of open-air markets for New York farmers to sell fresh fruits and vegetables directly to consumers, or distributing state vouchers to every family in New York for use in local businesses to jumpstart the economy. And finally, this vision could mean a moratorium on large-scale development projects that continue to displace low-income residents and small business owners, like the current Special Flushing Waterfront District being pushed by the city. It could mean the creation of a state regulatory framework to protect small business owners from rapidly escalating commercial rents, or support the expansion of community land trusts that prioritize the development of affordable housing and neighborhood-focused commercial spaces. I'll end my comments now and hope to have a further discussion about these ideas. Thank you.
Thank you, John. Appreciate it. Now we're going to go to Minerva Perez, who's back on from the OLA of Eastern Long Island. And Minerva had asked, what does OLA stand for?
Organización Latinoamericana. But thank you. Thank you. I want to thank you for this opportunity to share the needs of our Suffolk County East End community as it struggles through this COVID-19 crisis. My name is Minerva Perez, and I am the Executive Director of OLA of Eastern Long Island. OLA was founded in 2002 to support Latino members of our community within our 5 East End towns of Suffolk County, while we work together with everyone to create a safer, healthier, and more equitable East End. Our pillars of focus center on advocacy and education. As we succeed, so does our full region. During the month of April, we were able to support the needs of 9 East End school districts to supply over $700,000 worth of Chromebooks and needed Wi-Fi for distance learning in our districts. This was not a Latino-only effort. It was a way to fully express our belief that anytime any student is deprived access of education, as OLA has been the only Latino-focused nonprofit founded and based on the East End of Long Island, we are well poised to discuss the disproportionate effect that the crisis has had on Latinos, as recent undocumented immigrants, as citizens, and as members of mixed status families. Our isolated region, while it is a scenic and coveted destination point for the wealthy, is home to a glaring disparity of service industry workers, many of whom are Latino, called upon and relied upon to ensure the economic growth and viability of this beautiful and tawny region. This crisis has taken a sledgehammer to the already faulty systems that have not caught up with our region's 30-year demographic shift to show that our Latino population is at 20 to 25%. Our 24 East End school districts have on a low average 50% Latino student body. This crisis is showing the many ways Latino members of our shared community are being disproportionately ravaged. And I offer these insights with hopes to assist in creating solutions. At the onset of this crisis, healthcare messaging and information did not adequately take into consideration the Spanish-speaking members of the community. They were held in limbo with no clear guidance, leading to greater levels of spread. Once testing was finally established, lack of transportation to and from testing, fears related to cost, related to collection of personal data, fears related to public charge, all slowed down testing and treatment of COVID-positive community members, leading, without a doubt, to greater spread within the community. Worker safety in essential jobs is a concern. Without economic ability to stay home, essential job status compelled many to work who had no healthcare support, leading to greater risk for themselves and their loved ones. Public K-12 education has made the best of this new distance learning shift, but with the lack of communication and access to Latino parents, it means that many students are either not reachable or harder to maintain contact with. Beyond this tragic loss of education, there is also the mental health component that we've been hearing more of, thankfully, that our students are dealing with. Students are struggling with heightened fears related to loss of housing, lack of food, anxiety and isolation. And without the benefit of schools having eyes on students, we are looking at a collateral damage of great magnitude. We don't need to wait for self-harm, addiction, damage, suicide related to deaths or injuries to escalate, to know that this is a concern that has to be addressed now. Latino students and other teens are needing access to mental health support now. Possibly telemental health contracts should be considered. Immigrant and mixed status families need better access to police protection and victim services. Domestic violence reporting is up 30% in New York State. As a former domestic violence shelter director, I know the critical importance of communication with law enforcement at the moment they arrive at a home. We need enhanced communications such as simple cell phones in every patrol car with access to language line to ensure that law enforcement has the ability to fully communicate, build trust, and learn the specifics of crimes and threats to best support victims and their families. Food is one of our largest crisis points, specifically reaching homebound community members. Illness, compromised immune systems, quarantine, small children out of school, no transportation, sudden loss of income are contributing to how homebound needs to be redefined. Thank you to Suffolk County and our towns for some efforts that we've just begun on getting food delivered. Eviction threats and illegal displacements are tearing apart our once thriving workforce and their families. More supportive landlords to ease burden on renters would help, along with other approaches. Unemployment assistance to navigate resources for all workers unable to go back to their jobs is needed. Public transportation in Suffolk County is gravely lacking. We need ways to safely and consistently transport members of our community to jobs, healthcare, and education so that further economic and health-related devastation doesn't escalate needlessly. Ola thanks you for holding this hearing. We are honored to assist in all ways possible. This is a hard time for all, and let's give New York State the best opportunity to thrive and survive this together. Thank you.
Thank you. And next, we're going to hear from Honorable Rose H. Sconiers, the chair, the New York Foundation of Greater Buffalo, and I hope I pronounced your name correctly.
Thank you. Thank you. Good afternoon, honorable bodies. I am Judge Rose Sconiers, chair of the Greater Buffalo Racial Equity Roundtable. This current COVID-19 pandemic has laid bare long-standing inequities in Greater Buffalo's communities of color, which have resulted from centuries of institutional oppression. The Greater Buffalo Racial Equity Roundtable, convened in 2015 by the Community Foundation for Greater Buffalo, represents an unprecedented cross-sector partnership of over 250 organizations representing government, business, faith, and nonprofit leaders, which have joined forces to achieve an expanded and inclusive economy. The following esteemed members of the New York State Assembly and Senate are members of the Roundtable. The Honorable Crystal Peoples-Stokes, Majority Leader, and we thank Honorable Crystal Peoples-Stokes for inviting us to this important hearing. We also have Honorable Tim Kennedy and the Honorable Chris Jacobs. Our Roundtable's work is rooted in data and focused on systems change. The Roundtable respectfully puts forth an agenda focused on removing systemic barriers and providing coordinated supports to advance equitable life outcomes for people of color. We've attached a diagram that reveals the established components of the social determinants of health. And that diagram demonstrates that 40% of the social determinants of health are related to economic status. 30% of the determinants are related to health behaviors such as tobacco use, diet and exercise, alcohol and drug use, and sexual activity. 20% are attributed to access to and quality of care, and 10% to physical environment, such as air and water quality, and housing and transit. The Greater Buffalo Racial Equity Roundtable is advancing 10 initiatives which are captured primarily within the 40% of the social determinants of health related to social and economic factors. And these factors include education, increasing post-secondary completion for Buffalo youth through the Say Yes Buffalo Partnership with a focus on MBK, My Brother's Keeper, programming for young men of color, employment and income, engaging employers in inclusive workplace practices, including strategies to support economic mobility through career ladders, and creating multiple on-ramps to economic opportunity for in-school and out-of-school youth. Family and social supports, collaboratively working with social service agencies and family court to engage the community in creating solutions to remove barriers to achievement and economic stability, as well as address the disproportionate numbers of Black and Brown people in the foster care and welfare system through racial healing. Community safety, reduce contact with and improve outcomes resulting from youth involvement with the juvenile justice system and improve outcomes for re-entering citizens. Additional strategies of the Roundtable focus on creating the conditions for system change, with narrative change and racial healing as threads which run through all Roundtable initiatives. Narrative change achieves an accurate, authentic, and just narrative about communities of color. Racial equity impact analysis training teaches decision makers how to insert a racial equity lens into their decision-making processes for policies, practices, and procedures. The training offers executives, one, a shared understanding of the history of community of colors and how policy has shaped them, two, a shared language on racial equity, and three, a shared tool for decision-making that results in equitable outcomes. And racial healing expands and deepens connections across racial groups. In closing, the Greater Buffalo Racial Equity Roundtable is a collective impact initiative. We understand the importance of community partnerships for removing barriers and addressing the social determinants of health. The Roundtable is committed to partnering to coordinate and complement efforts addressing the other social determinants of health for the betterment of our community. Economic mobility is clearly a powerful lever to advancing social determinants of health, and the Roundtable will continue to facilitate this extensive cross-sector partnership to lead on this front. I'd like to thank you for this opportunity to present on this most important subject, and I welcome your comments and your questions. Thank you. Have a good day.
Thank you. Our last panelist is Kenya Abreu, the president of the New York Women's Chamber of Commerce. And from there, we will go to Q&A with Senator Ramos, the Labor Chair, going first.
Good morning. Well, sorry, good afternoon. On behalf of our women entrepreneurs, I want to thank you for the opportunity to testify today, and thank you, Senator Robert Jackson, for the invite. I also want to thank you for your support, the support that we have been receiving to be able to continue to provide services remotely from home to hundreds of women entrepreneurs and to those that are self-employed in need during this pandemic. The majority of them women of color, owners of beauty salons, those that rent chairs in beauty salons, own small retail shops, restaurants, and childcare providers. In the last 2 months, we have provided services to 1,930 women. Services were provided in applying for financial assistance and unemployment, mainly. COVID-19 has impacted women's health, their businesses, their jobs, and their ability to go back to work because of the lack of childcare provider services. We talk to these women every day, and I will tell you, it breaks my heart. I get emotional when I talk about them because these women are petrified. They're scared. They're scared that they're going to lose their job. They're scared that they're going to lose their business. They're scared that they're not going to be able to provide for their family. And in a city, in a state like New York, it is incredible. It is almost unbelievable that this is happening. And I come to you to ask for help for them, for help for the organizations that continue to work to economically empower our women. The COVID-19 crisis will have significant implications on the economic empowerment of our women and the organizations that work to empower them. The gender and social norm manifestation of COVID-19 present an urgent need for governments, businesses, community leaders, and decision makers to act quickly to prevent the disastrous social economic impact that the lack of funding would create in our community of colors. To help mitigate the negative impact of COVID-19, these are my recommendations and hope for solutions. Make funds immediately available and direct our efforts, including, but not limited to, ensure program address the different impacts of the crisis on all genders, including on their health, businesses and micro enterprises, employment, income, access to social safety nets and financial services, gender-based violence, and other factors affecting women's economic empowerment. Create a rent subsidy for both residential and commercial tenants to address unpaid back rent as a result of COVID-19. This will prevent evictions and an increase in homelessness and allow for women entrepreneurs to stay in business and continue to financially provide for themselves and their families. Supporting women as entrepreneurs, self-employed, and workers should stop gapping financial measures to firms experiencing losses due to COVID-19. Measures should include expanding and making the SBA PPP loan more accessible to micro enterprises, solopreneurs, contractors, and self-employed. Extend the deadline for the 8-week requirement on the payroll protection program of the SBA, and also extend the deadline, the June deadline, for the applications. June is the deadline for small businesses to apply for the PPP program for those that have not applied yet, and that needs to be extended. We also need to create other alternative sources of lending and grants. A lot of our women were left out of the PPP program. And a lot of our immigrant undocumented women were left out of the PPP. They could not apply for it. And we need to create all the sources of funding for them. These women pay taxes to the city and state of New York. It is right, and it is the right thing to help them. One of the things that we encountered when helping our women entrepreneurs apply for financing was the lack of available applications in different languages. We faced that with the SBA, we faced that with the city loan application and grants, and we faced that with the majority of financing applications, and this needs to be addressed because that's also another impediment for women and women of color, immigrants, women especially, to apply for available financing. It is important to create contracting opportunities, training and skill development and job placement programs for women to access jobs in industry responsive to COVID-19. Healthcare products, manufacturing, information and communication technology, and food accommodations. One of the things that we found also when dealing with our women entrepreneurs is that many of them still don't have health care. They're still lacking access to health care.
Can you wrap up? Can you please?
Yes, it is important that we create health care that is accessible to everyone. This is very important that we also make PPE available to our women entrepreneurs, especially those that have direct contact with clients like our beauty salons, our barbershops, our restaurants, our childcare providers. They are hoping to be able to open soon, and they still don't have the equipment, and we need to provide that to them, either free or at a very low cost. It is important that we did, and that we also provide the training for women entrepreneurs and other entrepreneurs in different industry on how to stop the spreading of the virus, to make sure that no one gets affected, not them, not their employees, and not the clients.
Thank you. We
Thank
turn
you.
to Senator Jessica Ramos. She's one of the co-chairs of this hearing. She chairs the Labor Committee. She has 5 minutes. Jessica Ramos.
Yeah, thanks, Robert. I'm so thankful for this panel because I think it really gets at the crux of what our economic crisis is as communities of color. One of the statistics that stayed with me the most from my time at New York City Hall is that 46% of small businesses in the city of New York are owned by immigrants, by people who were not born in this country. And so if we're really thinking about the hurt, the pain that we're inflicting on these small businesses, what we're doing is actually completely changing the character of many of our neighborhoods. And so I was very interested in hearing more about, because, and I referred to this earlier today, earlier in this hearing, about the piece in the New York Times today that's talking precisely about how PPP has not been accessible because of the lack of bank relationships, because, for example, Bank of America is only working with people who are existing customers. That's also a problem. But I also want to hear what you guys think about in terms of restructuring leases. I like what John said, and good to see you, John, about the open streets, and lots of other things that I'll likely talk to you guys about. But since I'm now trying to figure out how this clock thing works, yes, if you can talk about the PPP stuff, restructuring leases, and then talk to me more about the community land trusts and see if there's a relationship with opportunity zones, probably. But anyway, yeah, I guess this is for John, for Kenya, and for who anyone else wants to share.
Yes, thank you so much. Senator Ramos. Our experience with our clients with the PPP has been exactly that, the lack of relationship with the banks, and the banks really catering to their existing clients. We have to turn to Ponce Bank, for instance, who have been a lot more friendly and opening to especially to the Latino community. And so we have seen a difference, but that's one of the challenges that we found, that banks were really turning giving preference to their clients and not, and also clients that have more money in the bank. That's, you know, that's the reality of what we saw. They did come in this time. I do have to say that we saw more loans being approved. But it's still a small percentage. It's not as many. For instance, we had out of the ones that apply, we have over 1,000 that apply. We got less than 100 that were approved. And then we had the issue of not having the applications in other languages, which also is an impediment.
Right. Now, what about restructuring leases? Like, for example, I have a popular restaurant here in my neighborhood who has a triple net lease, which they shouldn't because they have no corporate backing. But nevertheless, you know, this isn't the case for everybody, of course, because there's different commercial leases. What do you guys think about, and perhaps John can chime in too, about how it is that we can work with these leases so that they can be a little more favorable?
Senator, thank you. I don't have an exact solution for your question, but I do feel it's important to create a regulatory network infrastructure to start stabilizing the commercial rents for business owners. And I used to work at the Rent Guidelines Board, and one of the protections that rent stabilized tenants have living in households is that you know, you can actually negotiate your lease with the landlord, and right now those protections are not in place for small businesses. They, especially immigrant-owned businesses, have language access issues as well as access issues to competent legal services. And so I believe that right now state intervention is required to make sure that the leases are not only fair, but also they're sustainable for the business community. I don't think anyone here wants to have vacant storefronts in Flushing, Queens. These are the people who in the last recession were creating jobs and economic activity and generating taxes and paying everyone's salary in this committee.
Well, thank you very much. And on time.
Thank you, Assemblymember Bronstein, my co-chair.
Thank you, Senator. And we're back to the Assembly side. Just to remind Assembly members, if you're just joining us, we're going in order of chairs of participating committees and task force, and also rankers who get 5 minutes. And then later on, we go to other members who get 3 minutes. So right now, we're going to go to Tremaine Wright, Chair of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus. Tremaine, you have to unmute.
Sorry about that. Good afternoon, everyone. I guess my question is going to be directed to Honorable Judge Skinner. I'm sorry, Scanier. Am I saying it correctly? From Buffalo, the Greater Equity Commission. You mentioned an executive training for decision making for executive decision makers as part of the Racial Equity Impact Initiative. And I wanted to know if you could build that out a little bit for us and sort of give us some of the nuts and bolts of what's involved with that, and how other folks might be able to engage with it, because while we are talking about economics and identifying that as part of the cause, the root cause, I think that we can definitely determine that that is not the only, nor is it the determining factor in a lot of cases.
Yes, thank you for that question, Assemblyman Tremaine Wright. The racial equity analysis training is something that we insist on that all of our providers and all of our community contacts participate in. It's a training where they come and they get to see things through a racial equity lens. What we do with our businesses, which is especially important, it helps them to change policies. And we have also coaches that will follow up with the trainees to make sure that they understand and that they're going back to their particular workplaces and instituting this training. We've even had churches to go through this training. But the basic idea is that it helps them to insert a racial equity lens into their decision-making processes. And as I indicated, offer them three things, which is the shared understanding of communities of color, which a lot of their businesses do not have. It also gives them a shared language on racial equity. And also it's a tool for decision-making that results in equitable outcomes. And we're trying to get other organizations to adopt this racial equity analysis training because it really has been very successful for us.
Okay. Have we seen any healthcare providers avail themselves of this opportunity?
I think so. We have some healthcare providers that's on the roundtable, and one of our healthcare providers who really is over a community health center, and I think she's had her staff to be trained. We've also had the county executive staff to be trained. We've had City of Buffalo employees to be trained. We've had the police department, the fire department. We've put a lot of agencies through this particular training, and I said it's very successful.
And how is it funded right now?
Well, right now, there is a charge. If a community organization wants to participate, they would have to pay. There is a fee for it. But we started with the Kellogg Foundation that helped us to sort of underwrite some of the costs. But right now, there is a fee. And but anyone can certainly call, and I should probably provide you with the number in the email where you can get in touch with the Director of Racial Equities and also our Executive Director, Clotilde Dedecker, which can put you in touch with who you would call to get that training offered in any of your agencies.
All right, thank you.
Okay.
And I guess my next question is for Mr. Cho. I would like to know if you can expand the idea of what you're envisioning with the neighborhood-based regional planning committees.
Okay, I don't remember talking about regional planning committees, but I did.
A neighborhood-based regional planning, so maybe that's, you didn't say committee, but I wrote down neighborhood-based regional planning.
Okay, well, I talked about a couple of ideas, including a moratorium on large-scale development projects in New York City. I had referenced the Special Flush Waterfront District. It's a proposal that is being pushed by New York City government, and it would create a huge influx of luxury condo and big box stores. And this is a type of development that has been historically displacing and pushing out small business owners in Flushing. And this type of a development needs to stop. It needs to be reevaluated, not just this particular project, but the sale of public lands should not be provided to private for-profit developers. Instead, we should be helping to establish community land trusts that would be composed of nonprofit community stakeholders who would prioritize the needs of a community, whether it's affordable housing or affordable commercial spaces for neighborhood-based businesses. That's something that I think is critical right now, not more a large-scale development that produces luxury condos and million-dollar homes and big box stores that displace small business owners.
Okay, thank you. I just wanted, I thought you were something else. This is a zoning, that was a zoning conversation. Okay.
Thank you, Assembly Member.
Thank you very much.
Now we're going to turn to Gustavo Rivera, the Chair of the Health Committee. He has 5 minutes. Senator Rivera.
Thank you, Chairman Jackson. So obviously, as the Chair of Health, I am deeply concerned about everything that has to do with providing, making sure that people have access to healthcare and all the issues that we need to fix regarding healthcare. But one of the things that keeps coming up after housing in my district is small business. And all of the issues that you mentioned definitely hit a nerve, particularly with everything that we've been hearing in my district office for the last 2 months. So I wanted to give you an opportunity to expand, particularly in what you believe. There's no question, unless I'm going to give you 5 seconds. Do you believe that the federal government has not failed in the way that they've dealt with small businesses across the nation, certainly New York? 5 seconds to see if you say. Okay.
You ask me?
We all agree that they failed. So if they failed, I want to, because maybe I'm wrong. Maybe the orange pile of feces in the White House is doing something right, but I doubt it. But let's, in all seriousness, I want to give you the rest of the time to speak specifically about the things that the state needs to do. Now, one of the things that I'd want you to talk about, because there's obviously, and I recognize this is something that the federal government has to help with because it is so big that states on their own can't necessarily deal with it. But as it relates specifically to people who are business owners but do not own the property that they rent, so talk a little bit about that. And also, what specifically could the state do? What are the recommendations that you have for the state to be able to best address the concerns of small business owners across the state of New York, particularly those owned by people of color? Anybody can jump in.
Just very quickly, I just want to reiterate this proposal to lift parking minimums for restaurants to utilize their parking lots and on-street parking for outdoor dining.
Okay.
This is especially of concern in Flushing, which is a restaurant destination. None of our restaurants can really open and make it a healthy environment for people to come back and revive our economy without more space. And we are suggesting that the state lift any parking requirements, minimum requirements for restaurants so that they can use their parking spaces.
That might be, I'm sorry to interrupt, only because I want to make sure that we get to other people. That might be a city thing, not a state thing. I'm not sure. But is it a state thing or a city thing?
I believe it's a state requirement, but again, I'm not an expert on this. I'd be happy to talk with you further.
Gotcha. Kenya, do you want to chime in here?
Yes. One of the things that the businesses have been saying is the payroll tax. Not to increase the payroll tax because that's an additional burden which some of them have been getting in the last 2 months, which is crazy. Also the property tax that is passed on to them. The property tax that is passed on today, that it's not fair. I mean, it says the property tax, they're just renting. If you don't own a property as it is, you shouldn't be paying property taxes. But now, because of the situation, I think that's something that needs to be addressed and removed.
Gotcha. How about Ms. Perez? How about you out there in Long Island? Give me a perspective from out there, please.
Sure. From the business community, I'd say that there are Latino-owned businesses. There's certainly Latino-fueled businesses that wouldn't exist without Latinos. The sort of the engine for all of this to work out here in this region are the immigrant workforce that we have. I would say that one major thing the state can do, it's not related to small business, but more related to health outcomes and tracing, making sure that in the areas out here that are very, very isolated, we have no real public transportation at all. We didn't have it before, and now these situations have made it even more dire. So in terms of how we are going to be engaging with people that already have a high level of fear and understand who has had this COVID virus and who stands to get it again because of the kind of situations that we're dealing with is critical.
Gotcha. Ms. Scaniers, out in Western New York, what are the things that the state can do?
Well, the state certainly can provide more funding so that we can do more of the things like the tracing and so on. But I think that one of the things that they can do with us, because we work with 250 partners to move this out into the community. So certainly they can support us. And I think Senator Tim Kennedy, who has been coming to our roundtable meetings, can certainly share with you that the state has been very, 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 very supportive. I think also they can institute this training, this racial analysis training within the State Department. We've been trying to get that done by some kind of legislation so that businesses and not-for-profits can make that a part of their employment practices. When someone comes in, then they would have that training.
Gotcha. And we can all agree that the hits that we're taking in communities of color and across the state would be less if we had more revenue. Can we all agree on that? Tax the billionaires. Millionaires and billionaires, tax them. Let's get more revenue. Thank you, Mr. Chairman. Go ahead.
Turn it over to my co-chair, Assemblymember Bronstein.
Thank you, Senator. And now we're going to go to Assemblymember Ron Kim, Chair of the Task Force on Asian Pacific Americans.
Thank you, Chairman Bronstein. So as a son of immigrant parents that ran a small grocery store when we came to this country. And after being in New York City for 10 years, seeing them file for bankruptcy and shut down that store, I spent the majority of my adult life trying to understand, what's been happening to our small business communities, and what do we need to do better to protect them. And we all know that the policies over the last 40 years have favored the chain stores, the big conglomerates. We stopped enforcing antitrust laws for many decades now, focused on just consumer-driven, bigger is better models all around us. So my first question is, and this is something that was very disturbing when John Cho had mentioned that in places like Flushing, he, after surveying the impact, he foresees that up to 40% of these independently owned mom and pop stores may not recover post-COVID. And I think there's a good chance those businesses may be replaced by chain stores or be dominated by online stores like Amazon. So first question is, what is the impact of an economy that is completely run by the biggest corporations and chain stores in the world? And secondly, and I think this might be the first time we've ever discussed, someone brought up the concept of local currencies in a state public hearing. I know that there are 4,000 of these that have been designed around the world, from Massachusetts to upstate New York and Hudson Valley to London, and it's all designed to protect the local economy. So can you speak a little bit more about that as well?
I can start with the last question, Assemblyman Kim. You have actually provided a lot of leadership on the inclusive value ledger, which could really be of great use at this time because it would release up to $55 billion in tax credits and welfare benefits. This is money that could be used by local residents and businesses to purchase groceries, personal protective equipment, other immediate necessities, and New York State should immediately implement IVL. And I commend you on your leadership on that issue. I think for the closing of small businesses in Flushing, it's going to be a huge tragedy, not only for the individual families that run these businesses, but for what we understand as America, that America has a mosaic of different cultures and languages and foods that make up a beautiful mosaic. And the small businesses in Flushing make Flushing. They are what create the unique character of our community. So we're gonna have a huge cultural loss. But as I had referenced in my testimony, neighborhoods like Flushing are the ones that in recessions, when Wall Street is falling down, are the ones that are creating the jobs, creating the activity that generates taxes, that keeps everything afloat. And so I think we have a vested economic interest in making sure that neighborhoods like Flushing still continue to survive as they are now, not as places that host national and international chain stores.
And I do want to just also emphasize that this is not a compassion plea for local business owners. This is an economic argument that keeps us resilient moving forward. Because the more we spend money in local mom and pops, the more we retain that money and the value locally, instead of if we spend $1 on a chain store or go on Amazon, that dollar goes out of our ecosystem. And so that's why I think it's so important that we do whatever we can to support and support and make sure that our small businesses come out of this. Thank you, Ed.
All right.
Senator Jackson.
Thank you, Assembly Member Bronstein. Now we're going to turn to did I say Gustavo? Jim Gorin. our co-chair from Long Island Local Governments.
Thank you, Mr. Chairman, and everybody. Great panel, great discussion. I just want to follow up on a couple of things. One, this was Ms. Perez, you spoke of the lack of transportation. Yeah, I mean, really, all of Long Island is a transportation desert unless you're like right near one of the train stations. And even if you are, you can't get to work on Long Island. I know on the East End, it's even, you know, a bigger issue because I don't know what would be the solution. You know, even bus systems, you know, being dramatically expanded. Are we talking about, you know, some sort of ride sharing? I mean, what can we do specifically to help the workers that, you know, that you described, you know, who work in the industry, a lot of them in the restaurant industry, to actually get to their employment without it costing them a fortune?
Sure, that's a great question. Thank you for that. I've got a couple of solutions and suggestions. There has been a Suffolk County Transportation Committee that was set up when some bus lines were being cut. Right now, because of COVID, even more of a crisis. But before, bus lines were ending at 7 p.m. Out here, that's when the dinner rush hasn't even started yet. So you have to wonder, does anyone care who gets home after they've worked at a restaurant or finished cleaning up? And it's not just restaurant industry. We've got domestic industry, we've got landscaping, we've got construction, we've got childcare. There's a lot of industry that it takes to make this place run out here. So some solutions that we've done some research on include rideshare, but rideshare for the future in terms of municipalities. So an organization or a company such as VIA is a municipal answer to rideshare. So that's a bus that's on demand, on call, goes to your house, takes you where you need to go. It doesn't require that you have a bank account to be set up to connect with it. There can be ways of utilizing something like that, at least in a pilot project. OLA would be willing to do a public-private partnership, maybe work with the state on implementing something like that to show that it is possible. We need to move out of this dinosaur era of the huge gas guzzling bus that has 5 people sitting on it when it's not the prime time. We need to move into on demand, and we need to do that in a municipal level.
That sounds great. And I forget the person who talked about restaurants and relaxing zoning restrictions. I defer to my esteemed colleague, Senator Jackson, and others on how it would relate to the city of New York. But I think in the suburbs, you know, the state does have some role in terms of overseeing zoning. Localities can then, you know, adopt their own zoning codes within the parameters of the state statute. But maybe we should be looking at just some general emergency power to allow them to relax some of their codes, because, you know, it often takes hearings and you know, a lot of time just to make these changes, maybe on a permanent, on a temporary basis, and also even some discussion of allowing nearby public space to be used by some of these restaurants, so that they can have some socially distant tables that are a lot safer than, you know, what they have now. Because many of them opening at 50% capacity, it may not even be worth it.
Yep.
Thank you.
Okay, thank you, Senator. And now we're going to go to Assembly Member Marcos Crespo, Chair of the Labor Committee.
Thanks, Ron, and to this whole panel, thank you. I know I wasn't a part of Monday's, last week's conference or hearing that was related to small business impact, but this is such a key part of this whole broader conversation. And a lot of good ideas have already been floated, so I'm just gonna try to get to some questions. Kenya, I know you and Luz mentioned this, Minerva, that a lot of these businesses and small businesses networks that where Latinos are predominantly participants in, whether it's childcare, whether it's the salon owners, the beauty salon industry, bodega industry. I know, for example, the NSA couldn't be a part of this conversation, but if it wasn't for our local supermarkets who kept the food supply chain open, kept their doors open, and created their own sort of distancing protocols, so that, and they actually hired more staff to try and create more delivery service to compete. But those are the local hires that I think Ron and others have been talking about, right? That's an important mechanism. And those are, many of them are Latino business owners, but they have a strong network. But a lot of other Latino businesses, for example, don't really have those networks. They rely on chambers like yours. They rely on volunteer organizations that really support them, but it's a lack of communication. So I guess my question is, are there small items? I know we've talked a lot about big ideas, but sometimes there's little things. We know the childcare industry, for example, those providers are under immense new regulations and the implementation of changes. How are you proposing, or do you have specific ideas on things that need to change there? Or as just employers and small businesses meeting demands that we have placed for employer-employee relationships that for big businesses, it's easy to implement. For the smaller businesses, it could mean a fine that can put them out of business. I love the idea of dealing with the cost of the rent issues and making sure that they can stay economically viable. But I think some of that has to be negotiated with the landlord industry so that we can come up with some workable solutions. And so aside from ideas that require resources, and maybe this is not the time to elaborate on all the answers, but I would love some follow-up from you specific to some of the industries where you see Latinos and other minority communities greatly participate. Is what are some of those small ideas that need to be addressed quickly? Language access, right? Our forms and applications available. We have mandates, executive orders requiring language access, but we all know that those don't get implemented accordingly. It's actually difficult to get somebody who speaks your language to quickly respond, to walk you through a form. So from little things like that to, I would ask you this, are the small business owners you're working with able to talk to someone at the state level right now, the relevant agencies, to help start to develop what those implementation of new protocols could be in their specific businesses as reopening begins to become the narrative? Like, are they ready for that? Is anybody even reaching out to them or incorporating them in those conversations? Those are some of my concerns. So what are some of those small ideas? And I know I only got 2 minutes, less than 2 minutes to respond, but as a follow-up, if you could just send me additional information from a labor perspective, what are some of the things we should ease up on? What are the things that we should consider postponing the implementation of, or easing, regulations so that small employers can actually bring their employees back and get their businesses back and running?
Well, I just have to jump in. Linkages from small business to the state would be fantastic. That does not exist right now. There are too many layers and levels of things that people do not feel comfortable just reaching out or having their own contact to do it. We've got some great representatives out here. Fred Thiel, our assemblyman, is wonderful. We need to make those linkages very, very strong, and we need a sort of a flow chart to explain to people and business owners what they can be doing next. Also, childcare, I think, for some of the essential employees that we have. We need to make sure that that is accessible, and that can maybe be, certain groups that we sort of pull together on that. We don't have that right now at all, and those folks can't get back to work without that support.
Yeah, and also I'm going to add to that is the information by industry specifically, because one plan doesn't really fit all. Because we have different industries, and even in the stages, you see that there are different industries that are going to open, at different stages. So we need, we would love to be able to have a website where businesses can go and by industry look at what is the requirement. How can they, implement social distance? How can they be in the protocol that they need to implement, and have them in different languages? Because right now, I'll tell you, Crespo, we are developing the New York Women's Chamber is working to develop something for the beauty industry, for the beauty salons, and be able to train them, because we don't have anything.
I appreciate that. Thank you. And that industry, Charito Cisneros, should be involved.
Thank you. Next, we're going to turn to Senator Tim Kennedy from the Buffalo area. He has 3 minutes.
Thank you again, Chairman, and to all of our panelists. Thank you so much for this extraordinary and very robust conversation. I'm looking forward to hearing from the rest of the panelists as well. I want to zero in on one of the panelists here that I know very well, who's just done a magnificent job, and that's Judge Rose Sconiers, who's led the office of the Racial Equity Roundtable Task Force here in Western New York. And Judge Sconiers, first of all, thank you for being here today and testifying. What I'd like to do is just kind of zero in a little bit on many of the partnerships that I think could replicate statewide that your roundtable panel has really led on, and that is with the schools in the community and some of the successes you've had there, the business community, and even the government community. As you mentioned, we are a part of the task force. So I want to hear a little bit about some of your successes, if you could elaborate on those. Also, the need to focus on minority-owned businesses in the aftermath of this pandemic. Obviously, we have to use this crisis as an opportunity to focus on some of the successes that you've learned in the roundtable and implement those statewide. And also, finally, and I'll leave it at this and listen to your answer, Judge. The bill that I carry in the Senate 8209 that creates the Office of Racial Equity and Social Justice, that is carried in the Assembly by Majority Leader Crystal Peoples-Stokes, that would do many different things with the creation of this office, including racial equity training statewide. Can you just talk about those things and the importance of all of those, please? And again, thank you for being here.
And thank you, Senator Kennedy, for that opportunity. Can I just pivot to the small business question first, because we are doing some terrific things with reference to small businesses. We have a business leaders task force, which is one of the initiatives that I mentioned. I mentioned 10, that's one of them. And under that, we have a Buffalo Purchasing Initiative. And what we're doing with that, we're working with small businesses of color, and we're trying to have them partner with larger businesses, employers, not necessarily of color, to help them with their purchase. And what they would do is purchase things in a bulk. They can get a better rate if they purchase with some of the larger employees. We've been doing that now for about a couple of years. It's been very, very successful. We have a program manager that oversees that works with all the businesses, works with employers, and it's been very, very successful. And that's under our Business Leaders Task Force. But the racial equity training, and Senator Kennedy, I don't know if you mentioned it, but someone mentioned maybe making that a mandate when someone goes to the city hall, goes to the county government for employment, that as part of that employment, they would have to participate in some racial equity training, because we've seen a great response from that. In fact, we have trained over 1,800 leaders in our community, because we offer this to agencies that want it, and we offer it to agencies that's working with us. Of those 250 partners, they have all participated in racial equity training. So that's one of our initiatives. And then, we have the Boys and Young Men of Color Coalition, where we're working with young men, training them to be leaders. That's been something that's also been very successful. We have our new initiative is the Reentry Coalition. We are building a one-stop center for people coming out of incarceration, that they will go to this particular center. They'll be connected with employment, with housing, anything that they need. We're trying to get them back into the system so that they don't recidivate and have to go back into prison. That's really exciting. We've got several people working with us on that.
I'm sorry, the question time is up.
Okay, thank you.
Thank you, Judge.
Thank you, Senator Kennedy.
Thank you, Judge.
Okay, now we're gonna go to the Assembly Cities Committee Ranking Member, Mike Riley.
Thanks again, Ed. Appreciate it. And thank you again to this panel for giving us some insight. One question that I have is basically focusing about the theme that we've all been talking about here. Do we know, have you had any conversations with the governor's administration or New York City, the mayor's administration, or your local municipalities about how the administration's plan on supporting small businesses, especially those businesses owned by women and minorities? And one thing that I really think we haven't touched on yet is those types of businesses with the MTA, because I know that there was a strong model there where we were trying to keep that aligned. Has there been any conversations in that direction? And so, with anyone on the panel, please.
I would say one thing that would help us out in the East End is that there really isn't a chamber of commerce, a Hispanic chamber of commerce out here in the East End of Long Island, with the kind of wealth that flows through here, the kind of workforce that we have, and the businesses that are owned by Latinos, obviously, that we do need to have something like that in place. So I'm hoping on this panel and with anyone listening that we could start taking a look at that, because that is sorely lacking.
Well, I can talk to you about that. once we're off the panel. I have been just recently elected as the chair of the Coalition of Hispanic Chambers, New York State Hispanic Chambers, just to build the different chambers in different different geographical areas here in New York State. So I'll be more than happy to talk to you about that. And in reference to the MWBE, I sit on the task force for, not the task force, the advisory committee for the mayor. And yes, we are working on just trying to get more especially MWBs that have products and services that they can sell right now to the city and to the state, and also reaching out to those that are not MWB certified to get them certified so they can start the process of selling to the city and state. But what we want to see, to be honest with you, more of is also the financing piece. That is key, because if you don't have the financial means, if you don't have the capital, even if you have a product to be able to sell, you can only go but so far. So you will not be able to purchase the amount that you might need to purchase, or that the city or the state needs, because you don't have the capital. So we also need to work around that, just having more funding for our MWBs.
Okay, great. Thank you. So I'm going to shift focus a little bit here into the Department of Labor at the state level. I know that we've all been hearing about unemployment issues. Specifically, I was looking to see how many issues you've heard from in the minority workforce, women and people of color. But also, have you heard anything about initiatives that the Department of Labor may want to refocus and retrain people to re-enter the workforce? I think that's a direction that we're going to have to go towards when we start losing jobs.
I have not, but one of the things that I proposed when I was doing my testimony was training people in those fields that we're beginning to see a demand on, like in the healthcare industry, for instance. That's one of the things that I think would help a lot. And we were talking about women at that time, but I think it's not only women, but to the entire population.
Anybody else on the panel have anything to add?
I think we have BOCES out here, Eastern Suffolk BOCES, vocational programming. I think taking a look at what they'll be able to offer as well, knowing that a lot of our students right now at the high school level are really suffering. A lot of Latino students without full capacity of English, full proficiency in English. There could be some other ways that we look to give folks some opportunity out there and sort of re-engage at a new level so that we can thrive out here and not just be hobbled by all of this, all the crisis that's happened.
And I think that we can put that, if we have time, we can put that issue on the table for our business leaders task force, because we have all the major employers in Buffalo that's on this task force, and they can maybe use that as another initiative that they can kind of work with. So that's an excellent suggestion. We should put that on the agenda for them to consider how we can retrain and get people back into the workforce. Thank you for that, Assemblyman.
Thank you so much. I appreciate all your input.
Okay, now we're going to go to Assemblymember Yuli New, co-chair of the Task Force on Asian Pacific Americans.
Hi, everyone. Thank you so much for participating today. And again, thank you to our chairs for being so patient with all of us. I wanted to just basically piggyback on a couple of things that other people already asked. I don't know if everybody's aware of how hard we fought for CDFIs, for community development financial institutions. And I see a thumbs up. I love it. I just wanted to say that, you know, unfortunately, we know that the timing wasn't great, obviously, but you know, $25 million was put into the budget for CDFIs, but finally, I've been asking for it for years now, and it would have been great, I think, to have had it a couple of years in advance in order to help to ramp up and to build that network and to really kind of make CDFIs robust to be able to handle this crisis. But of course, hindsight is 2020. I just wanted to kind of touch base and see if those, if CDFIs are the right avenue for certain things, and to see like what else we can do on the banking side that folks have touched on. The other thing is also we've been seeing with the PPP process and with a lot of the things that are going on with unemployment insurance, that, with a lot of the things changing midstream, there's been a lot of fraud within our smaller communities and with our minority communities and within our small businesses as well. And so like a lot of people have defrauded people. What have you guys been seeing, and what are things that we can do to help to stop that? And then also I wanted to ask about, what are some of the things that, we've seen within our different communities of color that have been more difficult for our small businesses?
Assemblywoman, to
Hi,
answer your
Dawn.
first question, hi. The only CDFI that the chamber works with in Flushing is Asian Americans for Equality, and they have been doing a very good job of developing a community fund to lend out money to small businesses in our community. And they're one of the only groups that has been really effective in utilizing language and other cultural competencies to reach a wider group of people, and have been responding very quickly to providing business relief loans. Unfortunately, they're, I think, at capacity, and I don't think they can provide additional funding to small businesses. So I would definitely advocate for additional expansion of CDFI funding at the state level.
Can I respond to that one? Is that okay?
Absolutely.
Okay, I sort of want to underline kind of a long thing, I guess, but I don't even know what that was. CDFI, I just had to look it up. OLA's been around since 2002, again, as the, founded and based out here on the east end of Long Island. There's a lot that happens at Albany. There's a lot that happens in other areas of the state that does not make its way down to Long Island, across on the eastern end, or even Long Island at all. So these are some things that I think that I want to make sure that we highlight. So please, all of the partners out there, there's a lot of work that we do in the 5 East End towns. That's 5 towns. That's kind of huge, but because of the siloed systems of law enforcement, of educational systems and districts, there's a lot that gets missed out here. And I just want to put that out there, that Long Island needs that support. We've got great representation, but we need to make sure that this information, this flow of great ideas comes out to Long Island. Thank you.
Amazing. I would love it too.
Yes. Assemblywoman, we have been working with BAC in Brooklyn, which is the Business Outreach Center. They got approved to be a PPP lender, and just last week they did 3 of our loans, which we're very happy about.
Oh, that's amazing.
Yes, that is amazing. And they got approved not too long ago by the SBA. So we're very happy about that. And I think we need more of that. We need to bring the CDFI organizations and fund them and make sure that they are included in every area, including Staten Island, because it works, and it works a lot for immigrants. I have to say that they, most of the time, they are culturally prepare, and they also have the language that our immigrants community speak, which is very important.
Absolutely. And I also want to put out a plug for Abacus Bank in my district as well, and the Lower East Side People's Credit Union.
Yes, I use them too.
Yes. And then did anybody have any comments on the consumer protection piece before my time runs out?
I don't have a comment about that, but I do have a quick comment about the banks. One of the things is that banks have been getting a lot of money because they get a processing fee from the SBA. And when they were talking about revenues, if people are elected talking about revenues, I think that we need to get the banks more involved in giving back to the community, in creating more options for financing, and also putting money in organizations that provide technical assistance and training to our small businesses. I mean, we bailed them out years ago. And they are doing very well still. So I think they need to put money into helping our small businesses, because those small businesses are their clients.
Okay, thank you. Now we're going to move to Assembly Member Aravella Simotis, the chair of the Task Force on Women's Issues.
Thank you, Assemblymember Bronstein, and thank you all for your very, very valuable testimony. I want to piggyback off of something that Assemblyman Crespo raised with respect to childcare. Many home-based childcare providers are suffering major financial losses and will probably not be able to survive this crisis. With less providers available as businesses reopen, women will disproportionately shoulder the burden and may be forced to drop out of the workforce to care for their children. What specific steps should the state take to protect access to quality childcare for low-income families? And I would direct this question to Ms. Abreu or Ms. Perez, either one of you. I think I know the answer, but I would love to hear the testimony.
Well, and thank you for that question, because that is something that we deal with, that we're talking to our women about, that we get this question every day. And I think one of the answers is we have to put more money into daycares. We need to put more money into childcare services, because otherwise we are going to go back to where we were years ago when it came to women's economic empowerment and women's ability to go out into the workforce. So we need to make sure that we fund childcare centers, and we open more of those, and that we make it affordable, and that if not, just make it just free for women entrepreneurs, and not just for women entrepreneurs, but women in the workforce.
I don't mean to cut you off, but I see my colleague, Senator Ramos, who is very excited. And look, I think I agree with her approach that we need to make sure that we have childcare at the age of 3 throughout the state, because it's just not tenable to think, again, a lot of these childcare providers or small businesses, they're not going to be able to survive this crisis. So they might not be able to come back online as people start to work again. So we have a broader systemic solution than just providing the money. If the childcare providers, the smaller childcare providers aren't there, then what are we going to do when women have to re-enter the workforce?
Yeah, I want to also add in that to really look at this also during this recovery period, which isn't to say that we don't get to a shining spot in the future, that we have to have our vision in that direction. But during this recovery period, we have to recognize that some of the childcare also that's been taken on by grandmas and aunts at the home in intergenerational households, to take a look at what cannot be done right now because of health issues. So sometimes it might be that we're going to keep the older folks in the household a bit safer. So what's going to happen there? Or what are other ways to kind of look at this in the same way that we might approach giving vouchers to other to take care of children, to take care of the elderly? Can we look at that for childcare? Can we sort of reimagine what childcare looks like as well in this environment until we get to that shining spot in the future?
Thank you.
Okay, Assembly Member, you done?
Yes.
Okay, now we're going to move on to Assembly Member Fred Thiel, Chair of the Local Governments Committee.
Thank you, Chairman Braunstein, and I want to address my comments and questions to Minerva Perez from OLA. First of all, thank you for providing really great testimony. It was a rather short time frame, and I appreciate you putting the effort into it. And I also want to thank you for the taking the leadership that was shown with this initiative with the Chromebooks in our 9 school districts and Wi-Fi. That really leads into my my question. And having those Chromebooks available, it's a great thing, and Wi-Fi, it at least get you in the ball game when it comes to remote learning or distance learning. But from my conversations with school superintendents, remote learning and distance learning has been a mixed bag at best during this period. It's very difficult. And I would think with the issues with English language proficiency, that makes it even harder. My question really is going forward, we'll, schools closed for this year. We'll see what happens in September. But what kind of programs, what kind of initiatives are we going to need, and what would you like to see happen to make sure that students that, who have had to go through this everybody can get back to the same level?
Okay, thank you, Assemblyman Thiel. I want to just say that, pre-COVID, a lot of the work that Ola's been doing, we're doing professional development training in schools. So within our East End districts, being invited into school districts to talk with the faculty and the staff about better ways to integrate Latino parents into the framework of the schools. This is stuff that has to go on, has to be stronger, because there's some dynamics around that, cultural dynamics, linguistic dynamics, that not all schools are prepared for. And it's not easy to say, okay, just hire more people. We need to build up the level of Spanish-speaking professional folks within our school districts, but there are also resources that we have in each of our districts, because we've got so many of them, that we need to make sure that we're connecting out with those resources. And oftentimes school districts can feel a little bit closed off. So I think we need to keep going in that direction, so that right now some of the reasons why some of the distance learning isn't working is because it's been hard to reach some of the families that have been hard hit so badly that you can't even get them on the phone, or you can't get to their home because that's not appropriate for the school person to go drive over there. At least it wasn't, a couple of months ago. But in ways of accessing and having an ongoing dialogue, you can't just tell a parent, hey, go to the portal. And not that all school districts do that, but we have to reimagine how we're connecting and drawing faith from our parents, and trust, because there are a lot of issues around that then come to bear in a moment like this. So going forward, right now, we're going to lose these kids now throughout the summer. What's going to happen over the summer? We should be looking at ways that they're either summer programming. I'm not talking about summer school, because I think the teens that I know will kill me if I walk down the street. But I am talking about other kinds of access, because we have a lot of access to parents right now. Ola does, through the other work that we're doing, the educational programs that we offer, some of the food crisis work that we're doing with families that have never ever needed support before. And right now we're meeting the needs of about 77 families on a weekly basis. That's over 250, almost 300 people. We're working right now with Suffolk County and also the local towns to help implement a crisis food line so that food deliveries can happen for those homebound individuals. So Ola is trying to make sure that that these kind of connecting points are going to happen. It also gives us that connection to families that that lots of other people wouldn't have, or wouldn't have the trust, so that we can talk about things like what's lacking with education, where are the students at right now, what's happening with mental health care with our teens, where are those crisis points. This is what allows us in. So your support doing that, your support of us, the transportation piece is huge. People got to get back to work, but we can't lose contact with some of these things that are sort of life and death conversations.
In the minute I have left, I'll try to get this question out quick so you can respond. But I think we've been in touch with your office about this too. Evictions, and especially in an area that we live in, where there's winter rentals, summer rentals, seasonal rentals. We've had a number of cases where you've got landlords that have, and it seems disproportionate to the Hispanic community, where there's pressure. Landlords are trying to get people out of the house. We've worked with law enforcement. We've worked with the AG's office. Any more suggestions on how to better address that issue?
Let's just make sure we can get all that information out in Spanish. So something coming from your office in Spanish. I know you've got Talia, who's awesome. I know that personally. What are ways that we can get this information out? Videos are good. People need to see a face. If you're in a crisis point and you're desperate and you feel like there's no one out there that's going to listen to you that you can trust, you need to have some videos from people that you really can trust out there. Your office and Talia would be an awesome resource to help with that.
Right. Thank you very much.
Okay.
Hey, thank you, Fred. Now we're going to go to Assembly Member Maritza Davila. She is the chair of the Task Force on Puerto Rican and Hispanic Americans.
Thank you, Chair Bronstein. These questions are going to be directed towards Ms. Perez and Ms. Abreu. I was listening to everything you had to say, and you are absolutely right. There has been a disparity from the beginning with Latino communities and other minority communities. You spoke on training businesses to come back and service customers. That's extremely important. The immigration disparity that you have in Long Island, and I know it's a very big one. We are at a point, and I'll give you an example. I visited, by the way, Ms. Sconiers, I was in Buffalo last year. I had the opportunity to go and visit with a lot of the universities there, and I spent a good 24 hours trying to absorb a lot of the issues that were going on in Buffalo. But I want to compare Buffalo to Long Island and other regions within our state that have been in disparity for a long time. And no one is talking about that. We know that downstate we have issues. We know that. But we have never had an exact number. What is it going to take? How much money, how much state money is going to take for us to be able to even start? Because the issues are big and they keep growing with this pandemic and it's getting worse. And I just wanna talk about moving forward. And I also would like to ask you all to please do not be shy, and I know you're not, Ms. Perez, to share information so that I can bring back to the task force, and that would be in a form of a letter, letting us know exactly what you need, what is the immediate need right now. So I'm just gonna leave it there, but I'm just curious as to, we're talking about millions and millions and millions of dollars, perhaps billions of dollars throughout the entire state. Can you give us a roundabout number in terms
of percentages or
percentages?
Yeah.
And you know, let's say education. We're going to start in education. A roundabout number in education. How much money was allocated in the past, and how much money do you think you're going to need moving forward?
That's a tough one because we have 24 East End districts. We are so siloed out here. 24 East End districts, and the low average is 40% Latino student body. And it doesn't mean they're all new immigrants, but it does mean that you're talking about families surrounding those Latino students. So in terms of money, you know, we're about 20 to 25% Latinos out here on Long Island. This census that has been hit so hard, we are not getting the numbers back that we'd like to see coming back. A crazy idea might be, how are we going to deal with that? How are we going to we're going to know that the numbers coming back from the census are not correct or not adequate. So are we just going to go with that? Is there another way? Is there another way we could look at this? Other numbers that we could take in smaller pieces to understand who really is living out here on Long Island in terms of the census numbers, or New York State in general? Those are some things. Without those numbers, that funding is not going to be there.
And I also wanted to mention just very quickly, after Hurricane Maria, a lot of families migrated from Puerto Rico into New York, Buffalo, other regions of the state. And we are aware that a lot of these young children are still lacking in the English language. So they're left behind regardless, right? So imagine now with this pandemic, I'm not sure how they're going to be able to catch up, but I would love to continue to have some more conversation with you and others to be able to try to resolve some of these issues. But thank you.
Thank you.
Okay, thank you, Assembly Member. That concludes the chair's part. So if you're following, we're just going to go down the list of hands raised in the participants area, and we're going to start with Assembly Member Catalina Cruz.
Hi, apologies. So I have just two quick questions. One is a comment, and I think it's going to be a trend given what we're seeing, the folks that are on the panel. A lot of the questions that we have should have been answered by members of city and state government. And it is outrageous that there are no representatives from any of those entities, whether it's Department of Labor, whether it is SBS at the city level, that could clearly answer our questions that we have. And so I want to thank the advocates and nonprofits who did show up and are doing their best to answer questions from their angle. And that brings me to Kenya. Kenya, it's always great to see you. Thank you for being here. I sensed the emotion when you were speaking on behalf of your members. I thank you for your decades working on their behalf. And I know that you mentioned that only about 100 of the folks who applied for the help from from the federal level, from the SBA grant, received it, I would love to know if there were any specific efforts either by SBS at the city level or by SBA at the federal level to reach out to your members to let them know of the existence of these programs before they were all of a sudden given to people who frankly didn't need it because they probably had more resources than your members. And then the second question, I saw a post that you recently did related to the fears, it was on social media, related to the fears of your members, specifically the salon owners, of reopening and what that means. So I'd love to hear a little bit more in depth because I know you touched it on what are the needs that your members have in order to feel safe. Lots of folks are talking about the need to reopen because of what happens to businesses, but your specific post was that in spite of the needs of your businesses, your members don't want to lose their lives in order to do that. So if you can elaborate on those two things, I'd love to hear a little more. And thank you again for being here.
Thank you, Assemblywoman Cruz. So in reference to the PPP loan and also the other loan from the SBA, there was very little in terms of reaching out to the small businesses really on their part. They pretty much relied on organizations like the New York Women's Chamber to bring that information to the small businesses. And one of the things that I said before was the lack of information in different languages, which I keep asking for. And the same thing happened with SBS. When the SBS had their loan and also their grant, I kept asking for information in Spanish, and I asked them to translate the forms. And that never happened, which left a lot of our minority, our immigrants out of the equation. That never happened. And it's one thing that I keep going back and saying to them, you need to make things available in different languages. You have to make sure that the information gets to all of our small businesses, because the reality is that a lot of the small businesses are owned by immigrants, and that's important.
I'm
and
sorry,
that never happened.
Time is up.
I mean, there was very briefly, there was another question about salons that she had asked. Catalina, do you want to give an answer? Or?
Yes. So the salons, we were very concerned. They're very concerned, and we are very concerned as an organization that works with them. So far, we don't have guidelines. We don't have protocols for them, and that's something that we want the state to address, and we want the city to address. We're willing to work with them, but we need also to be working with both the city and the state. We can't make up things to be able to provide it to them.
Okay, thank you. We're going to move on to Assemblymember Tom Abenanti.
Thank you, Mr. Chairman. I'd like to speak with Kenya. How do you pronounce your name?
Kenya. Yes.
Kenya. Okay. I am the chairman of the Assembly Committee on Banks. We have been holding hearings, but have not yet invited the smaller businesses to appear. And so I'm very interested in what you had to say, particularly with respect to women-owned businesses. You indicated that they are having great difficulty in accessing the monies that the feds are funneling through the banks. First of all, who do you represent? How many of them actually applied? How many of them got the monies? And what can we do to make sure that there's a better, that these are more accessible for them so that women-owned businesses can share in the relief from the federal government?
Okay, so we represent, the majority of our members are small businesses, and they're even smaller, what we call micro enterprises, where you have the beauty salons, where you have the smaller restaurants, where you have even the childcare providers are in that group. And so in terms of the ones that apply, we have restaurant owners and we have small construction companies. The ones that apply, we had an average around 1,000 that apply. And what we have, the ones that did receive the money, it's a little less than 100. I think we're now like a 94 from the last numbers that we looked. So those are the numbers right now. We're hoping that those numbers are going to increase.
You said extend the deadlines and
yes,
new financial sources and PPEs. What deadlines do you need to have extended?
Okay, the deadline to apply,
The repayment deadline or the filing deadline?
well, the filing deadline ends June 30th. June is the deadline for the businesses to apply. So we want that deadline to be extended. That's important because June is right around the corner and the businesses are still trying to figure out when they're going to open. So that needs to be extended. The other deadline is the 8 weeks of the salaries, the employee salaries. Once you get the approval, once you get the money, you have 8 weeks pretty much to use that money to keep your employees on the payroll. But guess what happens? 8 weeks are going by very quickly. Very quickly. Some of these businesses, the employees are collecting unemployment because they didn't get the approval until much later. So that means that they have to get their employees back. They have to be able to open. And once they open, where is the money to pay their employees? So that's something that needs to be addressed.
Right. Okay, good. Thank you. Would you mind giving us whatever information you have to back up what you just said so we can put it in the record?
Of
I'd
course.
like to include it with in the Banks hearing as well.
Mm-hmm.
Thank you.
Definitely.
Okay, thanks, Tom. Now we're going to go to Assembly Member Michael Blake.
Good afternoon, everybody. Hope that you are doing well. Thank you for all that you're doing. First and foremost, I just want to say how much I appreciate everyone and all your leadership regularly. A lot of friends are participating in this conversation. And as was mentioned, of course, it'll be important for us to focus on having some more of the city agencies and state agencies. That said, I would love to hear from Sister Abreu. Specifically, I know there was some notice and information that was given out recently from the council that would not be helpful to your local business owners. And equally, I think to everyone, I've been talking a lot about nonprofit contract flexibility and the impact that's going to have on small businesses throughout. It'd be very helpful to get a sense from any one of the panelists what kind of impact that would have on you. Second and third, and finally, is there anything that we can be doing from regulation standpoint here in the state that if we made changes would be helpful to you immediately? We obviously know a lot could be coming from the feds, but it'd be very helpful to know if there's regulations and things we can be working on immediately. So Kenya, first of all, secondly, contract flexibility, third and finally, what regulations can we change? Thank you, everybody.
Well, in terms of the regulations, I mentioned this before. One of the things is the property taxes that are passed on to the business owners in terms of rent. I also said that it would be great to have a subsidy really for the business owners to pay the back rent, because it's very hard to go back to open your business. Your business has been closed for several months. Go back, open your business, and then here comes your landlord asking for the entire rent, and you don't have it, and you can lose your business. So that has to be addressed. And then the other thing is the payroll tax. Some of the businesses have been complaining that they have been getting increased on payroll taxes, which is not fair considering the times. And then the other thing, Michael, is the whole situation with insurance, the claims not being paid, not being addressed by the insurances. If you cannot help the businesses now, then you shouldn't be doing business in New York State. Go do business someplace else, because right now we need them. These businesses pay insurance, and they pay insurance so that the insurance can help them when they need it. And this is the time to do so. So we need to address that.
I want to add something to that. I'm just looking at some news. California, for the first of its kind, is offering unemployment benefits, unemployment support for undocumented immigrants, stating that they are essential to their state. I think it's part of a public-private partnership, about $50 million coming from private donations. I don't know. I know that that's not enough for all of the state of New York, but what regulations can be shifted or eased or changed enough to allow that there's some sort of fund or combined fund to address the needs of our undocumented folks who are keeping our industries afloat?
Okay, thank you. We've run out of time. We're going to move on to Assembly Member David Buchwald.
Oops, one sec. I think I have to go off.
David, you there? Should we
Yeah,
go
sorry.
to someone else? You got to turn your video on.
Oh, sorry. Thank you.
Okay.
There we go. Sorry, apologies, everybody. And thank you to the chairs and everybody else for organizing this very important forum. And my thanks to all the panelists for their time. Small businesses, as we know, are crucial to our entire economy and employ vast majority of Americans, but it's especially important to minority communities, not just because we have a lot of minority-owned businesses, but also because of a lot of the employees and suffering disproportionately falls to the employees of small businesses. And so I wanted to ask our panelists, who I note come both from within New York City and outside New York City, their reaction to right now. One disparity is that within New York City has a program for small businesses and nonprofits to provide no interest loans, I believe up to $75,000. And that program was announced relatively early on in response to the pandemic. So for those of you inside the city, if anyone wants to respond on how that program is working in its launch. And then for those who, like me, are outside the city, whether any sense of whether a no interest loan program for small businesses and small nonprofits would be helpful model along what New York City has proposed. And so whoever wants to take that, hopefully one person from inside the city and at least one outside, that'd be great.
I think that would be helpful. I mean, the terms would be important, but I think that would be very helpful for a no interest loan for sure.
I would agree that would be very helpful for outside of the city. But I also want to mention something about the landlord and the rent payments. It seems to me that if they could come up with some kind of legislation where you would tack that rent arrears to the end of that lease or whatever, rather than expecting a person to pay if they're out of work for 3 months and they have rent at $1,000 a month, that's $3,000. They're not going to be able to pay that when they start back to work. If they can come up with some kind of regulation that will be prorated and it'll be tacked into the end of the lease or mortgage or whatever, rather than asking people to pay on the spot when they get back to work. But I think the no interest loans would certainly be very helpful to small businesses. Yes.
Does anyone inside the city have reaction as this New York City program is being rolled out? Whether it's yet having an impact on the confidence of small businesses, or whether it's more of a plan on paper that's not yet effectuating things on the ground?
Well, the loan, the money was giving out. One of the challenges or the issues that we had was that there were certain areas where the money didn't really get to, in the sense that very few loans were approved. The Bronx is one of them. And what we would like for some of the elected officials to ask from the city is a total breakdown of those numbers. Not just Manhattan got 64%, because that is not accurate information in the sense that which areas in Manhattan got the 64%, because I know for a fact that Washington Heights and Inwood and Marble Hill didn't get anything. So we need a breakdown, a total breakdown by geographical area of these numbers.
Thank you, Chairman Bronstein. Appreciate the time.
Now we're going to go to Assemblymember Rodney's Bichat to close this panel.
Yes. Hello, everyone. Thank you, the chairs, for putting this panel together, and all the panels and putting this hearing together. I see a lot of people I know. Kenya, good to see you, and thank you for you and the panelists for being at the forefront for our small businesses. First, I wanted, as I was listening, and I just heard from Ms. Perez that what California is doing, just want you to know that Open Society had given the New York City mayor $20 million for undocumented workers, okay? I've been on the phone with them. It's something that was kind of announced. Not many people know about it. It's $20 million. Patrick Gaspar, who's running it, who's of Haitian descent. Oh, today, by the way, you can see my flag. It's Haitian Flag Day. Had rolled it out, and so we're working to make sure that the nonprofits or the organizations in our community make sure that they give it to those workers. Okay, and that's been an issue. I have an issue with some of the larger nonprofits that's been eating up all of the smaller nonprofits who are on the ground. So I would like for you to know that. In terms of the rent arrears and the mortgage, that's something on the assembly that we've been working on in terms of putting a bill. I know there were some talks about canceling leases and so forth. But when we're doing something like that, we have to do the whole chain. We can't just do one aspect. If we're gonna do rent cancels or rent arrears, we have to do that with mortgages. We have to do that with property tax. We have to do that with the people who works in the building who needs to get paid. We have to do a whole thing. So, when we're thinking about that, commercial spaces, and we're talking about that in the assembly. I understand that most of the PPPs went to the bigger companies, even in the second wave. We're hoping Congress can turn around and come back with another fund specifically for smaller businesses. We understand about the 8 weeks, and we understand that a lot of the smaller businesses are not going to get their loans forgiven. It's going to be loans. New York City had some funds, and apparently that ran out, just like in Congress. They were paying 45% of payroll. And unfortunately, everybody's in need. My question to you is, I didn't hear Catalina's Cruz answer in terms of the salon. I need to know, because in my area, we have lots of salons, lots of barbershops. I mean, it's penetrated, and we have lots of churches as well. It's penetrated with, we're the borough of churches, we're the borough of salons and barbershops. What are the concerns you're hearing from the salons and the barbershop? Because we were looking for them to be one of the first entities to be rolled out.
Okay, Assembly Member, your time is up, but we'll give a minute for Ms. Abreu to answer this question briefly. Go ahead.
Yes, hi, Renisi. Thanks for the question. What is happening with what their concern is that they haven't heard yet of a specific plan, specific protocols for them, for their industry. And because this is an industry, as you know, that has very direct contact with clients. So that's one of the concerns. It's like, how do we do this? How are we going to open? What training do we need to take? Do we need to take training on safety? Do we need to take training on creating, an environment in our business that's going to allow for that? And then where's the funding coming from? The funding for that to make their environment safe, and also the funding for the PPE. Who's going to provide for them? Because you got to remember that they've been closed for all these months with no income.
Okay, thank you very much. Thank you to our panelists. We really appreciate your time today. And we just want to thank all the panelists who are waiting for your patience. We're moving on to panel number 4 now. I'm going to read the names of the panelists who are going to appear. We have George Nicholas, Senior Pastor, Mayor of the African American Health Equity Task Force of the Buffalo Center for Health Equity. We have Timothy F. Murphy, MD, Student Distinguished Professor, Director, Community Health Equity Research Institute at the University of Buffalo, the State University of New York. We have Sarah Phyllis Jones, MD, MPH, PhD, of the Radcliffe Institute for Advanced Study, Harvard University. We have Naomi Zuda, Assistant Professor, CUNY Graduate School of Public Health and Health Policy. And we have John Flateau, PhD, Executive Director, Dubois Bunch Center for Public Policy, Medgar Evers College, CUNY. Once again, I apologize if I mispronounce anybody's name. We're going to start with Mr. George Nicholas. 5 minutes, sir.
Thank you so much for this opportunity to share with you and to all the participants who I've heard before. I'm just honored and just want you to be encouraged all the great work that you've been doing. I am the chair of the Buffalo Center for Health Equity, which is a community-based organization that was birthed out of the African American Health Disparities Task Force. And our organization has 5 pillars. We focus on research, advocacy, community engagement, program development, and public policy. Our clear and explicit goal is to eliminate race-based health disparities in Buffalo. We focus on the social determinants of health, and our main goal has really been to try to get the city of Buffalo and the region to make addressing the social determinants of health a priority. As it speaks to solutions, one of the things that's worked very well for us is our African American Health Equity Task Force. And I would think that it would be a good idea for the state to look at regional task force to look at the issues around health disparities. One of the things about health disparities is our focus is not just on that what happens within the medical system, but the social determinants of health, looking at education, looking at economic development, looking at housing, looking at the environment. And so we're calling for this development of high-level influencers to come around the table in partnership with local grassroots communities to begin to start coming up with some realistic root cause solutions to these problems. Moving, it's important to deal with short-term issues as it relates to charity, but we have to begin to start investing in root causes because the root causes are what's driving the disparities. So one of the things that we focus on with our work, and again, as a possible solution, is making these connections. So for example, we know that poor health outcomes are related to poor economic situations. Well, we know poor economic situations are related to poor education. So we're looking at, if we want to change the health outcomes for Black folks in Buffalo, we know that we have to change the academic achievement of Black children in the Buffalo Public Schools. Well, we can't change the academic achievement for the Black children in the Buffalo Public Schools if we don't address the economic condition of their parents. And if we don't do those things, then they'll never be able to put themselves in a better housing environment. We know that there's major environmental issues, air and water quality issues. There is what they call a cancer cluster on the east side of Buffalo by American Axle plant. And the state came in and they showed us the data. And then they're trying to say that the reason why these people have such high rates of cancer is because of smoking. But at the same time telling us that the water and air quality is contaminated in that region, but not contaminated too much. So we have to stop playing these games with poor people and people of color and begin to start doing some real serious problem solving. We have been able to partner with the University of Buffalo, and my colleague, Dr. Tim Murphy, will share with you as well, to begin to start having these conversations about how we address these root causes. And what's so great about our partnership with the University of Buffalo, it's not just with the medical school, but it's the School of Management, the law school, because we know that the interaction with the criminal justice system is something that drives negative economic situations for our people, which will contribute to negative health outcomes. So our main focus today is to get us to think about these problems or think about these solutions to these problems in a more holistic fashion. One of the things that is kind of, when we talk about the state, it's great to have the health department involved and it's great to have other entities, but we need Empire State Development. And we need to be able to put the kind of investment in the solutions that are needed. So for example, oftentimes I'm told that when I'm trying to boil the ocean, I'm trying to do too much. But if the solution to the problem requires these drastic kinds of systems changes, we have to do those things. We can't be afraid to do the big things. In Buffalo, Elon Musk, one of the richest men in the world, was given $750 million of state dollars to build this solar panel plant. And it was supposed to have this big impact on the Buffalo economy. It has not. And there was no plan to connect this investment to helping people within these communities change their economic condition. So I would challenge the state to begin to start measuring success, and by making a criteria of giving money to businesses on how they will impact the social determinants of health. Make that a category. Make that say, okay, if you want this money, tell me how this project is going to have a positive impact upon the poorest people or the people who have been suffering from these major health disparities. I thank you for this opportunity, and I'll look forward to questions from you.
Thank you, Mr. Nicholas. We're going to move on to Timothy Murphy.
Thank you very much for the opportunity to present to this panel. These have been great discussions today, and it's a great privilege to be part of them. I'm an infectious diseases physician scientist on the faculty at the Jacobs School of Medicine and Biomedical Sciences at the University of Buffalo, and also director of the recently launched UB Community Health Equity Research Institute. And last but not least, I'm a proud resident of the Buffalo area, the second largest city in New York State. I came to Buffalo in 1981 to join the UB faculty directly out of my training. The Community Health Equity Research arose from the work of the African American Health Equity Task Force that Pastor Nicholas just spoke about. The mission of our institute is to perform research to advance understanding of the root causes of health disparities and develop and test innovative solutions to eliminate these inequities in our region. It is no surprise that minority communities in Buffalo and really throughout the country are suffering worse outcomes from COVID-19 than the general population. The underlying disorders that result in more adverse COVID-19 outcomes and have a higher death rate are the exact same disorders that are more common in the 7 zip codes in Buffalo with high rates of poverty and minority populations. African Americans in Buffalo have a 50% higher rate of hospitalization for heart disease, 250% higher rate for diabetes, and a 500% higher rate of hospitalization for asthma compared to the white population in Buffalo. And remarkably, life expectancy of African Americans, who make up 39% of Buffalo residents, is 12 years shorter compared to that of white residents in Buffalo. These underlying disorders are a direct result of the social determinants of health. They include poverty, failing schools, high unemployment, property values, poor access to healthy food, lead contamination in homes, and poor access to health care. These are the main reasons for the worst outcomes of COVID-19 in African Americans in our community and similar communities throughout the country. So when you look at those social determinants, most of them are unrelated to healthcare. It's estimated that about only 10 to 20% of health disparities is accounted for by healthcare. So ironically and almost paradoxically, the most important solutions to the worst outcomes of COVID-19 won't be solved by healthcare per se. We need innovative solutions to the systemic problems in our society. The worst outcomes of COVID-19, in a way, are a symptom of the social determinants of health. So as Pastor Nicholas outlined, we have established a framework and a partnership in Buffalo between our institute and the community-based Buffalo Center for Health Equity. The institute is engaging faculty experts from all 12 UB schools that span the social determinants of health. And this partnership is well positioned to tackle the problem using community-based participatory research approach based on a true bi-directional partnership between the community and the university. Society will judge universities and communities and elected leaders of the 21st century by their ability to solve urgent socioeconomic problems, our ability to solve urgent socioeconomic problems. It'll take creative approaches from people with diverse expertise, a broad range of capabilities, and big ideas. And we need different approaches. We can't keep doing the same thing we're doing. It's not working. We need generational changes. So if there's a silver lining in the tragedy of the impact of this pandemic on communities of color, my hope is that it will be the fact that this issue is now part of a statewide and a national conversation, the kinds of conversations that are happening today during this hearing, and that these conversations will lead to a true commitment and investment to develop lasting and fundamental solutions. So thank you again to this Joint Assembly for your interest and for your courage to tackle this enormously important problem.
Thank you very much. And now we're going to turn to Dr. Kamara Phyllis Jones.
Hi, I'm Dr. Kamara Jones. I am a family physician and an epidemiologist whose work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of the nation. I have thoroughly enjoyed the previous panel and the first two speakers on this panel. But I would say that I differ even from the people who've spoken before in that I don't just talk about the social determinants of health, the context, but I talk about those systems of power that determine the range of contexts that we see in our cities or in our states and the differential distribution of people into those contexts. So I am explicit about naming racism. So I want to just say that we are very lucky that at least the conversation, the little bit of window to acknowledge that maybe there's something structural going on that accounts for all of the Black and brown and indigenous bodies piling up so fast from this virus, which was supposed to be the equal opportunity infector. At least people have said, oh my God, there's something really bad going on, something really structural going on, because the bodies were piling up so fast that we couldn't ignore them and we couldn't normalize them. And so we are having these conversations about racism as the core at these COVID disparities, that it's not difference in biology. All humans were susceptible to this virus. It's not differences in knowledge. And our questions, I'd like to maybe go a bit more, but I've been inspired to take this notion that we must name racism as far as I can take it during these 5 minutes. When I was the president of the American Public Health Association 4 years ago, I actually launched our association on a national campaign against racism with 3 tasks: to name racism, to say the whole word, not just race or disparities or implicit bias or disproportionalities. All of these are important things to say, social determinants of health, but to say the word racism, because we have to put the system part in it. Then to the second of the 3 tasks is to identify within the elements of decision-making the answers to the question, how is racism operating here? Looking at the who, what, when, and where of decision-making, which is in our structures, who's at the table and who's not, what's on the agenda and what's not. Looking at the written how of decision-making, which are our policies. Looking at the unwritten how of decision-making, which are our norms and practices. And then looking at the why of decision-making, at the values. So the first task, to name racism, which is very important in the context of widespread denial. The second is to ask, how is racism operating here, to identify levers for action. And then the third is to organize and strategize to act. So just as right now we have the opportunity of COVID-19 exposing, pulling the sheets off, laying bare the structural inequities in our society, that happened with Hurricane Katrina, when people were like, why is it all the Black folks on the roofs? That happened when we learned of the poisoning of the Flint water supply. But what happens after each of these disasters is that we as a nation fall back into what I describe as the somnolence of racism denial. And so it is my intent that we do not fall that we as a nation embrace a national campaign against racism. So I just want to very quickly identify 7 barriers to us. Actually, the first 3 of these barriers are things that enable most of this country to staunchly deny the existence of racism. The first is that we're so narrowly focused on the individual in this country that it makes systems and structures invisible or seemingly irrelevant. The second is that we as a nation are ahistorical. We act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. The third is that we endorse the myth of meritocracy, that if you work hard, you'll make it. And I give you most people who have made it have worked hard, but there are many, many other people working just as hard or harder who will never make it because of this uneven playing field, which has been structured and is being maintained by racism. The fourth is that we endorse the myth of a zero-sum game. The fifth is our limited future orientation, not investing in the children, not investing in the planet. The sixth is the myth of American exceptionalism, and the seventh is white supremacist ideology, the notion that there is a hierarchy of human value with white people at the top, and that makes people have a fear at the browning of America and the like. The last thing I need to do is give you my definition of racism, which is that it is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. Thank you for inviting my testimony.
Thank you very much. We're going to move to Naomi Zuda. I apologize. How do you pronounce that?
Zodi.
Zudi. Okay. Thank you. You can continue.
Great. Thank you so much. And that was I would say, a rousing testimony from Dr. Cameron. Okay, so I kind of want to orient us towards like how we're understanding these racial disparities. When we say we need to solve these disparities, I think that those communities are where the burden is. And so in order for us to overcome this public health crisis, we have to solve the problems that are happening in those communities. They are us. Okay, New York State has 1 out of 4 COVID deaths nationwide, and 1 in 3 deaths worldwide are happening in the United States. So we have a really critical responsibility as leaders, especially elected representatives, to act on the scale that is necessary to solve this problem. And it turns out that these communities that we are talking about today are the ones that are going to, those are the key to solving this problem in a competent, effective way. And so different ways that we can do that. Number 1, frontline workers. In my testimony, I've submitted like 2 maps next to each other. One is where frontline workers live, and the other one is a population normalized map of COVID contraction across New York City. And they are very concentrated in both cases, in the Bronx, in South and Central Brooklyn, and not really in Manhattan and Lower Manhattan especially. So people who have to go to work, frontline workers, they can quit and they can collect unemployment. But what's gonna happen, down the line, first of all, they're afraid because there is a looming recessionary environment, so they don't wanna quit. And second of all, even let's say they get sick for some period of time, a lot of them are getting sick. They get sick, they can't go to work for a couple of weeks. Now they're out of their paychecks. So either they simply have to go to work and they risk themselves and their family members getting sick. Otherwise, they won't be able to pay their rents or anything else. So I think that one thing we can do is to provide unemployment compensation to all frontline workers, regardless of whether or not they decide to go to work. That way, we're not forcing them to go to work and infect everybody if they got sick. Okay, another thing is just rent in general. I understand that it's complicated, but I think that, let's say we cancel rent for 2 months and also whatever processes are necessary. There's a federal bill to this effect as well. But in this state, and definitely in this city, we have an extreme rent burden. Half of New York City residents are considered rent burdened, but like 40-something% of state residents are rent burdened as well. It's an expensive state to live in. If we canceled rent for 1 or 2 months only, then people would have less of a strain and need to go out and engage in labor activities. They could stay home, and it doesn't take that long to quarantine our way out of this situation. We just need to be in a situation where people can stay home for some number of weeks so that we can solve this problem and we can move on from it. Voting, I think that they are sending everybody an absentee ballot in the mail, whether or not they have requested this. I think that's really important. Of course, we're still going to have in-person ballot locations for people who have unstable housing situations or who are unstable addresses or disabilities, if you're blind, for example. So we need to make sure that those people who are going there to vote in order to keep our legislators in office have really good protection. We need like masks, gloves, just messaging also to voters so that they know that they don't need to go in, that they know what to expect. Because I haven't heard a lot about it. Okay. In South Korea, you know, they have sent every single member, every single person living in that country, a care package with toothbrushes, toothpaste, toilet paper, paper towels, noodles, soy sauce, all of these things, 30 eggs per person, enough so that they could stay home, not go anywhere for 2 weeks. Imagine if you don't have to pay rent and you have enough food for your family for 2 weeks, you have no reason to leave your apartment. We could actually stop the spread of this disease, start to treat the people who have it. And again, we can move on. Another thing is arrests in prisons. I think that the state, to the extent that they can, but whoever it is, and I don't think it's a good idea for anybody to shirk responsibility on this issue, immediately intervene to stop any kind of distancing related arrests. We cannot imprison our way out of a contagious disease. And of course, most of those arrests are happening to poor and segregated minority communities. And anyway, it just doesn't make sense. So stress itself and the stress of all of these economic issues and the stress of imprisonment or a family member who's being imprisoned is part of what causes flare-ups or immunosuppressed states in which people will get sick. Finally, just in general, the policies themselves need to be people-centric. I would urge you to avoid the situation where you give over more and more budget power to the governor, who calls in people like Eric Schmidt to reinvent the new Department of Education instead of the very highly credentialed teachers who are more whose lives have been committed to advancing the well-being of students rather than amassing billions off of search engine optimization. Thank you.
Okay, thank you very much. And now we're going to go to our last panelist, Dr. John Flatteau.
Thank you. Thank you, visionary legislative leaders, for bringing us all together. Thank you for this opportunity. Comment on a very critical challenge before us. My presentation, 3,000 words, but I have 5 minutes, was previously submitted. My title is In a Post-Pandemic World, Ending Black Inequality and Promoting Public Policy Equity in Pursuit of the American Dream. We've had, I've been on this video conference since the beginning, so we've had brilliant presenters on problem definition. I'm gonna spend 80% of my time on the solution side, because I think you've already, my brilliant predecessors have already laid out problem and critique. I would echo one key comment made by Dr. Kamara Jones, though, and I believe that structural racism is the underlying explanation for why we are where we are right now. And what we need to do is imagine, envision ourselves on the other side of this crisis. Solutions should reflect where we want to be or never be again when we come out of this crisis. So there are a number of topics, solutions that have been touched on that I would just like to elaborate. Digital education, distance learning. We're in a new world and we're not going back. There is an opportunity in crisis. In this crisis, there are several opportunities and we're being pushed forward, and we need to make sure that the tools, the devices, the internet access, the broadband access is universally available to Black communities, communities of color, and all New Yorkers, including rural New Yorkers, where that is short. And I'm talking pre-K, K-12, and university level. We've all been pushed into the future there. Telemedicine, telehealth. Some of our previous health center directors, community-based health providers have mentioned that. I think that is another opportunity to give us near universal access, assuming that we the people have the devices to communicate with our health professionals, it's much less expensive. It'll be much more cost effective moving into the future to have our seniors in particular, the ability to consult with health professionals to make for a better life. This is also an opportunity to train our next generation of doctors, nurses, healthcare providers, community health workers, and we should take advantage of this opportunity before us. Contact tracers from our communities moving about in our communities is also an absolute must. Food security, solution, in farming, aquaculture, hydroponics. We should not be worrying about how pigs and cattle who are being slaughtered in the middle of America can't get to our tables here on the East Coast. We should be looking at new supply chains that make us less reliant on other sources, whether it's PPE that we have to get flown in from China on the private jet of the Patriots owner, or all kinds of other equipment and materials we may need. Improved data analytics for all of these health crises that we're going through. There are too many holes in the data, whether it's coming from the state, coming from the city, is going up through many layers, and some of the best information providers are investigative journalists. That should not be. Our regulatory agencies, state health departments, county health departments, city and coroner's offices, we need to weave together a comprehensive system that lets us know who's been infected, who died, where they died, why they died, because that's going to tell us where to micro-target the solutions and not misallocate resources. And I'll stop there. I have a number of other recommendations. Again, they're in my written testimony, but the clock has run out.
Okay, thank you very much. So I'm going to start with a question for Dr. Jones. Did you testify before the city council a couple of weeks ago? Was that
I
you?
did.
Yes. Okay.
I did.
So I watched the beginning of that hearing. That was a long one as well. And I believe you were asked this question, and I'm going to repeat it again because I thought you gave a good answer if it was you who was on the panel answered it. Right now, the federal government, officials in the federal government are trying to frame this problem as the Black and Latino community lacking personal responsibility. And that's the reason for the comorbidities. And I think I remember you gave a good explanation rejecting that argument. And I think it's a troubling argument that they're trying to make that we need to reject. So if I could just ask you to explain to us why that argument doesn't carry water.
Right, and it starts with recognizing that not only is our structural causes the basis of what we're seeing with COVID-19 all along, but that by living in disinvested communities with racial segregation, which results in educational segregation, occupational segregation, segregation of green spaces, segregation of food access, segregation of clean air and clean water because of being near more polluting industries. The fact that we have more diabetes, more heart disease, more hypertension, more renal failure in our communities is not because we don't know what to eat. It's because of generations of living in disinvested and actively neglected, I would say, communities. I also want to say that when people think that the fact that there are two problems to COVID-19. One is that people of color are being more infected because we are more exposed and less protected. And then once infected, we're more likely to die because we carry this more burden of chronic disease, and we have less access to health care. And so there are strategies that already one of our other panelists started talking about to talk about if you're more exposed, how do we make it more feasible for people to stay home? And if you're more exposed, how do you do that when you're incarcerated? If you're more exposed, how do you take care of that if you're unhoused? And so strategies that deal with that. The fact that we're less protected has to deal with that. Even in our essential roles, we're not as valued, not given the PPE, not given hazard pay and the like. The other thing is, so that's why we're more infected. And then once infected, because of carrying the burden of these chronic diseases, which is not that we just eat so much fried chicken, is that the healthy choice is not even a choice. It's not that the healthy choice is the easy choice or the hard choice. The healthy choice is not even available in many of our communities. And finally, the healthcare piece comes in at the very end.
Okay, thank you very much, Senator Jackson.
Assembly member, you have assembly member on queue first.
Say it again, Senator?
You have an assembly member on queue first.
Okay, then we'll go to Assembly Member Marcos Crespo, Chair of the Labor Committee.
Thank you, Ed, and thank you, Senator, and to this panel. Look, I've been starting off every one of my comments by talking about the "we told you so" aspect, and I think Ms. Jones, you so eloquently put that answer, and I tend to really work at holding my emotions when it comes to this. There is nothing that we are talking about today that is new to so many of us. The only difference that I see of late is the fact that COVID and the deaths that have occurred in our communities have forced people to respond to things that we have been clamoring for a long time. When I talked about the governor's support in my district for a $1.8 billion investment in the Bruckner Sheridan, it wasn't just because traffic flow would be better. It was because that ramp and what Robert Moses did in our communities has led to generations of asthma and bronchitis and respiratory problems, which are now one of the reasons why so many of us have died from COVID. And so again, I think George talked about this in the beginning. The fact that as a state moving forward, if we are going to make capital investments, think about how those investments don't just improve infrastructure, but quality of life and the ramifications of that. When we talk about housing, we talk about new development. What about the weatherization of older housing stock where so many of our constituents live, which the conditions of that lead to those same health disparities, children whose windows don't open and close, and therefore they get, drafts that cause, health issues. I mean, there's so many levels to this, but none of this is new. And I think one of the things that is talked about, and I think John mentioned it as well, data. We've talked about collection of data. It is unconscionable that in the beginning of this pandemic, we couldn't get racially broken down data until God knows when we started asking for it. And it's not a novel idea. We have bills that have floated around the legislature requiring data collection by race. We don't like to do that as a state because we know we're going to box ourselves into realities that we don't want to address. That is what has to stop being acceptable. This is where the urgency now is clear as day. And so I have to just kind of vent. Look, I won't be around. Many of you know I'm not running for re-election. I unfortunately won't be around to continue to talk about this. But it's just, look, when I was an intern, these things were being talked about. Here we are 20 years later, and there's still the issues that are leading to these conditions. So I just implore us, as we think about all of these issues, it's really going to come down to, if we learned anything from this pandemic, it's that we can't continue to ignore things that have been in our face and talked about for so long and just took a backseat because, yes, there is injustice even in how we set priorities at the legislative level. And I think data is important. Now, the one thing, before this panel leaves, I know we really haven't touched on census. And I don't know if any of you have updates on where we are. John, maybe you could tell me, where are we in our communities that have been impacted? Have we been able to use the emotional connection to this COVID and our impact to really encourage our communities to participate? And if not, what can the state do to really encourage that now before it's too late? Because we know this federal administration doesn't care, won't care about us for a number of reasons. And we know at the state level, we tend to, and at the local level, we take a backseat. How can the census help us ensure resources for the next decade?
Assemblyman, we have not leveraged the crisis as a consciousness-raising mobilization at this point. Very communities that have been hit hardest by COVID have the lowest census response rates right now. So we have a crisis on top of a crisis, because those same census counts are going to be used to allocate $9 trillion over the next decade, including healthcare. So we're behind in that area as well. Census, outreach, and mobilization. And we know those numbers not only are used for resource allocation, but representation. We can lose a couple of congressional seats right now. We could lose assembly seats, Senate seats, city council seats, because right now we're at the cusp of a massive undercount for Census 2020 in communities of color if we do not mobilize very aggressively from now through the end of the summer.
Look, I'll just, before my time is up, I'll just leave you with this thought also, and I hope this comes up in other panels as well. You mentioned remote learning and the lessons we can learn, and I know many of my colleagues, we're all focused on education. I just want to give an anecdote. My two daughters happen to be in a charter school, Success Academy, and they have had a very different experience than what some of the children in my community are going through in the public school system, with the inability to secure the tablets and or have a more thorough experience. And look, without getting into the whole big debate, I would simply say that now is not a time, again, for these divisions. And I think the responsibility should be on our public school systems and all these other networks to really share best practices. Because I'll tell you, my kids have been glued from day one of this pandemic to their tablets. They were quickly distributed, and a full day implementation of programming was given to them that I'm not hearing has happened in so many of our other schools. And I think this, I really put this on the city of New York in particular, and the chancellor and his team. There's no reason why a network can deliver on that, and a system as big with the resources that New York City has sort of struggled with this. And I hope we can figure that out as well. But there are lessons to be learned, but none of this is new to us. It's a big I told you so. Let's just get it right moving forward.
Thank you. Thank you, Assembly Member. Now we're going to turn to Senator Julia Salazar, the chair of the Women's Issues Committee, and she has 5 minutes.
Thank you, Chair. And first of all, thank you to the panelists, especially for explicitly naming racism as a driving force in the inequities that we are seeing that are really being elucidated by this pandemic. I want to first ask Dr. Jones, in response to what you were saying about racism in our decision-making processes, what actions can we take immediately or near immediately in order to change this? Are there existing models that we can look to that have effectively, demonstrably addressed systemic racism in this way?
Well, I think the most important thing is to ask who's at the table and who's not. So whenever there's something going on, whenever there's a decision-making table being set, we should all look around and say, who is not here, who has an interest in this proceeding, and then not just represent their interests, but find them a way to the table. When I think about it in terms of what we're trying to roll out in terms of public health strategies right now, and we're going to have contact tracers and all, we need to be hiring people in our community to be contact tracers, people who may or may not have been a community health worker, may or may not have done anything, but people who can do contact tracing. It has to be an investment in our communities and employment, and actually educating up and developing a cadre of people in our communities. I would say, so I think that's the most important right now. I don't want to use all your time, but I think the who's at the table and who's not, and what's on the agenda, what's not, those are the two most important questions if you want to be actively anti-racist. Just one more thing. There are 3 principles for achieving health equity: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources not equally but according to need. And even though we use the census to apportion resources, could it be that we recognize, even if, especially if we recognize an undercount, that if there are communities that are hurting, if there are cities that are hurting or regions that are hurting, that we could allocate resources according to need, not according to the number of people who are enumerated in the census. That would be a very health equity minded way to do things.
Excellent. Thank you. I have one more question, a little bit of time for Naomi or anyone on the panel who would like to answer it. To clarify that the absentee ballot application will be mailed, but the ballots themselves, of course, will not automatically be mailed to eligible voters. Would you recommend that absentee ballots, if possible, would be automatically mailed to all eligible voters as well, in order to make it easier for people to vote and counter, what we expect to otherwise be depressed voter turnout in the upcoming primary election?
I want to say, yeah, you just send them. I mean, so first of all, do we expect people to have envelopes and stamps, or is that going to be like pre-addressed return envelope and prepaid? It's hard to find an envelope and a stamp, and people have a lot of other things to deal with. I think that if you look at the state of Colorado, where they had 97.5% of eligible voters voted by mail in their primary elections this year. So not just voted, but voted by mail. So it can definitely be done. And I would imagine like they probably, you want to put as few barriers in place as possible, as few kind of draining as few resources of people's time as possible too. So whatever just gets them to just check it off and mail it in, just like to get it done, I think is the best thing to do.
Agree.
Okay, thank you, Senator. Now we're going to go to Tremaine Wright, Chair of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus.
Good afternoon, everyone. Thank you very much for your presentation. I think I'm going to echo a lot of what my colleague, Mr. Crespo, said, because I am happy to hear that this panel identified that structural racism is at the core of many of these problems, and that our solutions have to lead us in a direction where we don't want to be ever again. I was hopeful that we would come out of this hearing with ideas for what public health in New York State should look like, because I am of the ilk that we do not have a real public health program here in New York State. And that's part of the reason why we have so many disparities in health outcomes. So I guess I'm going to focus somewhat on what Dr. Flateau presented, in that your 4 points that you provided us, digital education, telehealth, food insecurity, those were touched upon by other people. But what you mentioned that most people did not discuss was the training of the next generation of healthcare providers. And I think that that's the space where if we could hear a little bit more from you, and also if we can tie it into what we know about the structural racism that exists and how we have horrible maternal outcomes for Black women. And we also have a lot of people of color that were sent home from hospitals who died at home during this COVID crisis. So I guess I would ask you to address that. And then on the tail end, so I don't miss my time, Naomi Swady, I believe, if you can address, there's also a big concern amongst what I'm finding, at least on the ground, amongst, I would say, 50 and older Black voters. We're putting a lot of energy into this vote by mail. However, there is a inherent distrust. And so how do we also support the spaces so that we can make sure those who want to go to the polls and exercise their rights in person might be able to do it? So those are the 2 things I'm going to present. Thanks.
Thank you, Assemblywoman Wright. I'm one of your constituents. From the semi-sovereign nation state of Central Brooklyn. Training the next generation. Just think of where we were and still are in this crisis. We've been importing health professionals from all across the country, from upstate and out of state, to help us deal with a crisis, when in fact we have approximately 5 million people in New York City of African descent, Latino descent, and another million Asian Americans in this community. If we were in a post-pandemic world, we should already have enough Black doctors Latino doctors, nurses, and healthcare workers in the city of New York to have addressed the problem we're in the middle of right now. So this is an opportunity. This ties into structural racism and one of those social determinants of health that our experts mentioned. A poor educational attainment. That's an institutional racism built into a public education system that just, I believe, admitted to one of our top specialized high schools something like 7 African-American kids out of 900 in the freshman class at Stuyvesant High School. That's part of the problem. So an improved quality public education system that gives a quality education to all of our kids, including making sure that they're masters of STEM, science, technology, math, so that they can move on up that ladder. And in 5 or 10 years, we're looking at our next generation of doctors, nurses, respiratory therapists, all kinds of healthcare workers who are residents of New York, serving the people of New York. And we don't have to put out a panic call, throughout the nation to get enough nurses on the front line to help keep us from dying in our own communities. That's sort of the backstory of that. Now,
Thank you.
The political scenario of voting. We have, I think you were indicating that there may be seniors that want to come to the polls. We have an election on June 23rd. Not just that it'd be safe to come out. We saw what happened in Milwaukee, where people had to choose, senior citizens, Black senior citizens had to choose between staying home and not being attacked by the virus and showing up being forced to come out and vote at the polls because of those, Dr. Jones, those decision makers at the top, the Wisconsin Supreme Court, the legislature of Wisconsin deciding that they would not have the option but to show up at the polls.
Thank you. Thank you. Obviously, I'm sorry, we just have to move on. We have so many panels left. But let me turn to Gustavo Rivera, who is the chair of the Health Committee from the Bronx.
Thank you, Mr. Chair. Dr. Zoud, I want to make sure that I pronounce your name correctly. Zoud? Zoude? Correct me.
She's on mute. You're on mute.
You're muted. You're muted.
Zodi.
Zodi, apologies. Dr. Zodi, I'm going to give you the rest of the time and anybody else wants to jump in, particularly because you finished your testimony talking about people-centric solutions. And I know that that Assemblymember Kim talked about this a little bit earlier, but I want to make sure that you get the time to talk about this as we discuss the things that we need to do afterwards, the way that we cannot possibly go back to a normal, that we need to use this process as a transformative point. Tell me about, in as much time as you have, tell me about people-centric solutions here and people-centric approaches to how we actually solve this. Now.
Yeah, I mean, it's like we're trying to figure out like what scale is going to be effective, what is necessary, how do we meet the problem? I think the way that we can design that or decide that is by understanding like what does an individual need in their family, in their household, in order to stem the spread of the virus. Okay, they need a place to stay, they need food, they need to be in one place. What are the barriers to that? Like thinking about just the person, the human being, and what they need, and having policies that adequately address that, rather than trying to come up with a dollar figure about what we can get, or we can fight with them, and maybe we can get some more and put it in. No, like
the dollar figure thing, and I'm sorry to interrupt, but in the dollar figure thing, so do you have anything related to revenue, perhaps taxing billionaires and millionaires? Is that anything that you want to?
Absolutely, of course. I mean, I think that, so we've decided to cut hundreds of $millions out of Medicaid, out of the public hospital systems. It doesn't make any sense to do that right now, in part because healthcare all over the state is one of the only industries that's going to survive. So by cutting all of that money out of the budget, we are hamstringing ourselves and preventing, like, there's going to be multiplicative effects of that economically and for our health. And in the area of health care, I mean, so it has never been a good idea to tie our health insurance to employment because, the labor market discriminates. We know that for sure. Darnell is not getting called back on the same resume as Dawn is. Women spend so much of the life course with less ties to the labor force, just for pure biological reasons. And also the fact that what we've been bringing up before about unequal education and how that leads to employment disparities, which means you can never get health insurance if you're born in the wrong neighborhood because you never went to a good enough school to get.
Doctor, on this issue of health insurance, because we only have about 2 minutes left, particularly considering that we're talking about access to health care or access to health insurance, whether that provides you access to health care, do you think that there's anything legislatively that we can do to actually resolve this issue?
Yeah, it needs to be, number one, tax finance. That's the only way it's going to be equitable. Number two, it needs to be single payer because that's the only way we're going to be able to afford it, because otherwise it's too administratively complex. The New York Health Act, which Senator Rivera has proposed.
I've heard about it. I've heard about this.
Is sponsoring, and that I think we're like one Democratic senator short of. Look, it's been simulated to death. It's obviously saves money. It's becoming increasingly untenable to have employment and healthcare being tied to one another. It was never a good idea, but right now it's absolutely unraveling. So the kind of progressive taxation that's called for in the New York Health Act and the just erasure of all of that unnecessary administrative complexity, which is what sets our healthcare system apart from everybody else. It's the reason we don't have universal access to healthcare and the kind of treatment that people need to get over this crisis. It's because of that administrative complexity. We need single payer, and it needs to be progressively tax financed. The New York Health Act, honestly, I've never come across a better solution.
I got you. And you're speaking.
Or another solution.
And you're speaking as someone, do you study this for a living? Is this what?
Yeah, so I'm a professor of health economics, and most of my work has been about consumer well-being, evaluating the well-being of consumers of insurance markets, especially in health insurance, and looking at the Affordable Care Act. And then more than just their well-being in terms of financial risk protection and access to medical care consumption, but also then what are the second order and third order economic effects of access to public health care. We find reduced rates of home eviction with Medicaid expansion, reduced rates of poverty in the United States.
So your level of expertise is exactly on this. So you're saying both let's tax people more that can afford it, billionaires and millionaires, make billionaires pay, and we need the New York Health Act to actually provide universal care for folks. Doctor, thank you so much for your time. Chairman?
Thank you, Senator. Now we're going to go back to the Assembly side. We're going to go to the Assembly Health Chair, Assemblymember Dick Godfrey.
Gustavo, it's a good thing this isn't a trial. You'd have been thrown out for leading the witness. You're shameless. But so am I. So I also have a question for Professor Zodi. It's hard enough for us as a society, let alone for individuals, to overcome the burdens of racism. But would you say that in our modern economy, that while the economy helps to keep a lot of people of color in poverty or more at the bottom of our income ladder, the structure of the way we pay for healthcare, the way we pay for higher education, our tax system in general discriminates against people towards the bottom of the economic ladder. And that solving the problems of racism is also going to require solving the structural problems in our economy.
Dr. Zodi, you're muted.
Okay, absolutely. I think that racism has always been a tool for economic control, to separate people so that they don't come together and point to whoever it is that actually has all of the resources. And that has never stopped. So in order to stop the racism of the healthcare system that causes absurdly disparate rates of maternal mortality, for example. I mean, maternal mortality is something that we can solve. It has been solved around the world. It is not an issue about not having enough technology or something like that. It's about just disparate levels of access to really basic kinds of medical care. And in order to address that, we have to address the reason that racism exists in the first place is for the purpose of squeezing those who have less power, political power, economic power, to say otherwise. And I think that, like, even so, and in terms of just having an extractive for-profit healthcare system, when you think about, for example, electronic health records, doctors, they have to fill out so many different forms every time they see you. And those forms are designed in such a way as to maximize billing. That's what they're for, because that's what our healthcare system is. It's a process of creation of capital. We could have been using our electronic healthcare systems, number one, de-identified data by race. We could have been analyzing this immediately. We could use that for contact tracing. We could be existing in the service of public health. And if we had something that could, disentangle profit from our healthcare system, we could actually just focus on using it for health. I mean, we would have been in a lot more powerful position now to be able to use our healthcare systems and not having to go through these community-based organizations, because those are the ones that do actually exist to represent and to benefit the people. But if we had our healthcare systems, our financing systems, racism, it's a symptom of just the extraction.
I just want to say, though, that it's not that there's racial capitalism, racialized capitalism. So it's not that one is a symptom of the other. And it, as you said, it doesn't just so happen that people of color are overrepresented in poverty, white folks overrepresented in wealth. There's this interplay, but it's there are other racist societies that are not capitalist as well. So I think that there's the interplay, and racism is not. It's another system.
Yeah, and so it means, like, taking profit out of the healthcare system is not going to completely eliminate all of our healthcare disparities by race. We have to, at the same time, build in, like, all of those anti-racist structures within them. I think that maybe once we remove profit, it gives us more room to decide to build that in, but it's definitely a concerted individual effort to build an anti-racist healthcare system.
And then, if I just want to say one more thing, that health is not created within the health sector, which is what the first speaker said, so that even if we get an anti-racist healthcare system, that's still not going to eliminate health disparities because of the residential segregation, educational, occupational, environmental segregation that is baked into our system. So we have to be very intentional to make strong investments in communities of need if we're going to do anything.
Yes, let's do it.
Anything else, Dick?
No, that's it.
Okay, thank you. So next we have Senator Tim Kennedy from Buffalo. He's the chair of transportation in the state of New York State. Tim Kennedy, 3 minutes, I'm sorry.
Yeah, thank you very much, Chairman. And again, thank you to these wonderful panelists. I've been looking forward to this panel discussion all day long. You have not disappointed us. I want to bring it back to Buffalo here, shockingly, I know, to Dr. Tim Murphy and Pastor George Nicholas, only because they have just been doing extraordinary work on the ground ahead of this and leading up into the pandemic that broke out. With the African-American Racial Equity Task Force, now the Equity Task Force, along with the creation of the State University at New York first, and potentially the country's first Institute on Health Equity. And I just want to get into how we can use this as an opportunity from this crisis to really create solutions. Your work has just been amazing, and you've been focused on solutions in the community. And I know, Pastor Nicholas, you touched on in your testimony the statewide regional structure of this. I've mentioned the bill that I carry, 8209, creating the Office of Racial Equity and Social Justice, along with Majority Leader Crystal Peoples-Stokes in the Assembly. So there are real specific solutions we can focus on. I'd like to hear about some of the solutions you've already come up with in your work in the community.
You're muted, Pastor George.
Oh, wait. Okay, there. Thank you, Senator Kennedy. One of the things that we're working on right now, and it was interesting, the panel was talking about citizen-driven or patient-driven or community-driven responses. And we have been funded through the Preferred Provider System, the PPS, through the Millennium Collaborative Care to fund 15 churches in Buffalo, Lackawanna, and Niagara Falls to directly contact over 200,000 people who are Medicaid or Medicaid eligible in our area. And we have workers, community-based work in our churches, embedded in our churches, that are going to be doing phone calls, robocalls to each and every one of these persons, and then having a conversation with them about whether they have had access to testing, whether they have a primary care physician, whether they needs for food, clothing, and shelter. And if those needs arise, or if they need to make an appointment, they'll have through this Hulan IT system, they'll have the ability to make the appointments right on site, make arrangements for transportation. We have resources to provide food for folks that are have issues as it relates to food. So the real key thing about that, Senator, and the rest of the Assembly and Senators panel here is collaboration. That we have been able to build the kind of collaborative response to these issues around structural and institutional racism and around the social determinants of health, and then come up with projects that can address some immediate needs right now, while engaging in the larger macro conversations, as Dr. Murphy had cited, with all 12 of the medical schools that are now 12 of the academic centers in the University of Buffalo working with us on that. And certainly Dr. Murphy can also talk about a little bit about how we have been able to impact the actual number of minority students that have got into the University of Buffalo Medical School.
I want to thank, unfortunately, we have to stop right there, Mr. George, but I'd say that please submit stuff, anything in writing to us, because all of our staff are taking notes from a policy point of view. And I want to turn to my colleague, Assemblymember Bronstein, because we have other Assembly members that want to speak.
Thank you, Senator. We're going to go to Assemblymember Mike Riley, Ranking Member of the Assembly Cities Committee.
Thank you, Ed. Once again, this is another great discussion by this panel. So I thank you all for joining us. I have a couple of quick questions, maybe not so quick answers though, from you. I'm wondering, any policies that were put in place since we first identified that we're in this pandemic in New York, specifically anything rolled out by the legislature or maybe the governor's executive orders. Do we know if, from your point of view, if there were any specific orders that may have hindered some response in our communities? And that's open to anyone on the panel.
I would like to just start by talking about testing in the country, not just in New York State, in the country. The whole strategy we have still is a very medical care centered strategy, testing individuals one by one. It used to be restricted to symptomatic, and now then we expanded to the first responders, and now we're in some of the prisons and some of the nursing homes and doing universal testing. But we still don't have the population-based public health surveillance kind of testing where we could know that a probability sample. Public health departments do that all the time. You sample people and then you know that today, this is the estimated prevalence, plus or minus 1% of the infection in your community. If we were to do the population-based public health surveillance testing, including asymptomatic as well as symptomatic people, we would be able to go beyond documenting the course of the pandemic to actually changing the course of the pandemic. We would be isolating all of our positives, especially the asymptomatic positives. And we need to isolate them in safe ways, not necessarily sending people home to multi-generational families in 2 rooms. But we do the isolating, especially of the asymptomatic as well as symptomatic, then the contact tracing, then the quarantine, and then we could get a handle on the pandemic, as opposed to just having a 2-week-old estimate of what the infection was 2 weeks ago if we're just looking at symptomatics, a 3 to 4 week old estimate if we're looking at deaths. It's not the way to do public health.
Thank you. Thank you.
I think kind of,
Perhaps chime in, that strategic testing should also be prioritized in vulnerable communities. We prioritize nursing homes, we prioritize healthcare workers, which we should, but we should be prioritizing vulnerable communities and in a strategic way. And I think we were behind behind the curve a bit on that because of the delayed testing. I think also, I'll just say one more thing. The difficulty in getting race data that was brought up earlier, I think that was not well done at all from the beginning. And that's something that we should insist on and should be continuous.
So in absence, I only got 2 minutes left. I want to touch on something else. I apologize. It was mentioned before about NYPD enforcement, especially when it came around to social distancing and wearing masks. And I want you to understand that being a former lieutenant in the police department, I thought it was a bad idea from the beginning. I thought that the NYPD and all law enforcement should just strongly be encouraging, not driving a wedge between our communities that we've actually built a relationship with that was hoping and promising going forward. I think this just actually put a stronger wedge in it. But I want to touch more on the racial disparities. And a few years ago, before I was elected to the assembly, I was a member of the Community Education Council for Staten Island, which is the school board. And we worked on this project called Building Empathy, Equity, and Excellence. And it was more about a systems thinking. And one thing that I think we can really use is we have a model now with the regions in the state. We can put together those systems thinking strategies in those regions and build upon our community organizations so we can get past those inherent biases that we all have. And if anybody denies that they have inherent biases, they're wrong. I mean, that's the first thing that we did during that work was acknowledge that we all have it. And that's the first step to getting past it. So if you can quickly touch on that.
Assemblyman Riley and my Buffalo brothers and sisters, Brooklyn is doing very similar work. When I heard you, I've heard now several times the term of arts, SDOH. We're doing similar work with our PPS in Brooklyn, working with hospitals, community health providers, faith institutions. We're covering half of Brooklyn, about 1.2 million of the 2.6 million residents in Brooklyn. We've also been using the participatory action research model as well. So we have students, I'm at Medgar Evers College, and we have students from the various CUNY campuses. There are actually 4 in Brooklyn. We're doing community ground up, people-driven solutions. They are literally trained to conduct surveys, interviews, focus groups with community residents on the ground, with health professionals, with hospital workers. And then we're putting that information together to come up with an analysis of what the residents say are their needs, participatory action research, making sure, Dr. Jones, that the residents are at the table when we're formulating solutions to the challenges of quality healthcare delivery in these various neighborhoods of Brooklyn.
Thank you very much. Thank you. Now we're going to move on to Assembly Member Alicia Heineman.
Thank you, Chair Bronstein. I appreciate the wonderful work you've been doing this morning. I'm getting a lot of text right here. Thank you to all the panelists and thank you to my colleagues in the Senate. Dr. Flateau, it's always a pleasure listening to you and reading your work. And there's a couple of things that you mentioned in your post-pandemic world that I think is very interesting. First of all, I know Vital Brooklyn is an example that has been used in many conversations. And as we can see in Queens, we've been hit very hard. And
yes.
Nothing new of us asking for more hospitals, more allied health professionals in this borough. And we've been doing this for a while. So I know there are disparities in Queens, and post-pandemic means that we won't have to deal with this again. The other thing I wanted to bring up is about maximizing Black digital education. What we've seen is that in our traditional public schools, there is a deficit, definitely, when it comes to digital education. I know because that's what I'm doing every day with my daughter. Most of the teachers are working out technical difficulties as opposed to teaching. And Assemblyman Crespo said his daughters from day one were, and they go to
Smooth sailing.
They go to a charter school, and we all know that, but that just goes to show you the disparity when it comes to digital education for our children, and not just the children, the parents who are dealing with this. So I just want you to speak on that, and also speak on the Black urban farming. I will say this, that in my district, we have Gotham Greens, a hydroponic facility that has about 1.5 acres on one of the buildings on Jamaica Avenue. And every day the lettuce, the basil, and other products are shipped outside of a community with a lot of homeowners. So just if you could speak on those things, and that's my time. Go ahead.
On the digital education. So another component of that is IT infrastructure. It's bigger than just us having the devices and paying for or having free internet service. In Brooklyn, I'm in Bedford-Stuyvesant, and we had a brownout. There's been an explosion of, since we're all at home, an explosion of young people, parents, and teachers on the line, and that's good. That's a good thing that there are some neighborhoods where we already have access, but we also have to look at the larger IT infrastructure that's supposed to undergird our internet access. You need devices in the home, you need the internet service. So I think that's another issue that we need to pay attention to. And the other piece you mentioned about urban farming, that's the reverse of what should be happening. We're exporting products being produced in our communities that could be nutritious food for our residents, and instead, you just pointed out, is being exported out of our communities. We need to reverse that supply chain. The food supply chain is another area of business opportunity for our minority and women-owned businesses. A disproportionate number of us are in the food services area. A previous panelist mentioned restaurants. We're running restaurants. Why are we not in the food supply chain for our own communities that are in need, that are food insecure right at this moment? We need to reverse that problem.
Thank you very much. Now we're going to go to Assembly Member Latrice Walker.
So thank you, of course, Dr. Flateau. Your testimony is always very timely and on point. I also want to, thank most of the other, or I should say all of the other panelists, but definitely Dr. Jones, who spoke to us about institutional racism and calling it that, and not sort of coming up with these pretty terminologies in order to blanket some of the issues that we've been having. So I just wanted to piggyback off of a comment that Assemblyman Crespo brought to mind. So the CDC has an Office of Minority Health. The U.S. Department of Health has an Office of Minority Health. The New York State Department of Health has an Office of Minority Health. But yet we have to have these sort of conversations as if it was some sort of a eureka moment about an impending pandemic and the effect that it would have on healthcare equities and allocations of resources. In addition to that, we know that the governor has impaneled in the past the MRT, Medicaid redesign teams, et cetera. There's billions of dollars coming into the state from district monies. And many of these dollars were going to different hospitals located throughout the state of New York to be concentrated on minority health. A number of surveys, reports. In fact, I also noticed that the CDC, the last report that they did on minority health was in 2016, which is why, there are consequences to elections. And since in our post-Obama world, we have not really seen much coming out of that office. But Dr. Flateau, since you mentioned that the Du Bois Bunch Center, Medgar Evers College, and a number of other institutions were involved in some of this work and planning, reports, etc. Can you tell me how, if any way, that information has fed the conversation about minority health and the COVID-19 pandemic that we've experienced?
Well, the reports that we've done, we've shared them. Our elected officials, you have participated in the community outreach process, town hall reports back to the community stakeholders, and we've shared that analysis with the State Department of Health, City Department of Health, and other key decision makers. And we've been doing this work now for 4 years. And those same social determinants of health that we keep talking about, we've outlined in these reports over the last 4 years. And I believe that the state and you as legislators and advocates have been pushing for resources to address some of these determinants. That's what has resulted in the quote Vital Brooklyn plan that is now
right. So I agree that some of that work has been done over the course of time, over the course of the past couple of years. But just with respect to what has been happening here in the here and now with respect to coronavirus and the immediate need, has anyone from the Department of Health reached out to sort of, let's take a look and synthesize some of these materials? Has anyone from the New York State Office of Minority Health at least reached out to say, we recognize that there were some of these disparities that are being displayed all across the country, but we want you to know that we have our finger on the pulse. Like, are any of those resources that we have been funding and investing in over the course of time actually been utilized or being utilized? And I know before you answer that, I also want to note too that we have been doing a lot of work with respect to asthma, clean air, clean energy in our communities as well, which really hasn't been a conversation that people have been talking about, the environmental exposures. And I appreciate Dr. Jones for mentioning that. But I also just want to flag asthma and dirty air connecting to a lot of what it is that we have been seeing. And how did we move away from looking at asthma as an important medical circumstance within our communities? And so, not that you have to answer that, but I would be interested in knowing whether or not the Department of Minority Health has actually been working.
So we finished the 3 minutes a while ago, but we'll give another 30 seconds if someone wants to answer that question.
The short answer, Assemblywoman Walker, is yes. Hospital administrators from the Brooklyn-based hospitals and community health providers, I happen to know, are in direct communication with the State Department of Health officials and City Department of Health officials.
Okay. Thank you very much.
Thank you.
Senator Jackson, if you want to introduce the next panel.
Thank you.
Thank you very much, everybody.
Our next panel is the labor panel, in which we have, at this point in time, we had 4. Quite frankly, we're running way behind schedule. And so, but that's okay. It's a very good discussion. So we have Pat Kane, the Executive Director of the New York State Nurses Association, and Vladimir Klajunet of 32BJ Airport member, SEIU Local 32BJ. So with that, I'd like to turn it over to Pat Kane, Executive Director.
Hi, good afternoon, everyone. My name is Pat Kane, and I am the Executive Director of the New York State Nurses Association. NYSNA represents more than 43,000 nurses and healthcare professionals across New York State collective bargaining. As nurses, we have been strong advocates for universal access to high quality health care. We have also advocated to protect vital safety net hospitals that provide a disproportionate share of care for communities of color, low income workers, immigrants, and the uninsured. The current COVID crisis has highlighted, as many have said, long-standing inequalities, and no more so than in our healthcare system. The impact of the crisis on these communities that are most vulnerable and exposed to the pandemic. So from our perspective, the disparate impact on minority and low-income communities arises from several key factors. These communities are victims of a two-tier healthcare system. The large private academic medical centers generate huge revenues and profits by focusing on the well-insured, affluent patients and procedures. Low income and communities of color rely more heavily on underfunded safety net hospitals. And you could see the inequalities in funding manifest throughout the height of the pandemic. We saw in our safety net hospitals less access to personal protective equipment for both staff and patients, lower levels of staffing, shortages of equipment and necessary supplies, and ongoing lack of funding to maintain operations during the height of the crisis. These communities are also overrepresented in the low wage and essential service industries, including healthcare, that did not and don't have the luxury of working remotely and reducing their risks to exposure to COVID-19. Finally, these communities have faced long-standing historical inequities fueled by racism and reflected in such social determinants of health that others have spoken about, such as poor quality housing, bad working conditions, less access to healthcare, dirtier air and other environmental factors, less access to healthy foods, and other factors that contribute to poor community health and higher susceptibility to COVID-19. We have submitted our full written testimony, but I'd like to briefly summarize some of our key proposals to address the class and racial inequities that the COVID pandemic has brought to the foreground. First and foremost, we need a fair distribution of funding for safety net hospitals to put an end to this two-tier healthcare system. And this has to include fixing healthcare funding formulas based on need, targeting DSH, ICP, and Medicaid reimbursement rates to safety net providers. We need to see a rescinding of state budget cuts to Medicaid and other healthcare services, increased funding for rural and urban enhanced safety net hospitals. We need to implement finally minimum direct care staffing standards in our hospitals and nursing homes. It's really unconscionable when you look at the capacity metrics that the state has for reopening that we're just talking about empty beds and we're not speaking to the most critical resource to providing care, namely the healthcare workers themselves. It was really the lack of trained and appropriate staffing resources that was the biggest challenge at the height of the pandemic, especially in our safety net hospitals and the hardest hit communities, where we saw extreme stresses on a healthcare system that almost brought us to the breaking point. We need to enact a moratorium on all hospital closings and elimination of mental health and other vital but unprofitable services. We need to force profitable hospital systems to assume a greater role in providing care for our vulnerable communities. And finally, but perhaps most importantly, we need a universal single payer system to cover all New Yorkers by enacting the New York Health Act. And in order to do these things, we know that we have to look for funding for new revenue sources from those that are most able to pay: corporations, Wall Street, financial firms, the billionaires and millionaires and owners of luxury real estate. I want to talk about essential workers who are also disproportionately affected by the pandemic and who are almost always more likely to be people of color, or immigrants, and low income. We have to see measures that include expanding paid sick leave for all workers, including paid time off for isolation and quarantine for those exposed to COVID. Again, at the height of the pandemic, we saw a lot of our workers being forced to work sick, and while they were still contagious. We need to enact strict and enforceable infection control standards in workplaces for all workers based on science. We need the personal protective equipment in all workplaces and in vulnerable communities. We need more transparency in this regard. We need universal testing on demand, focusing on essential workers and vulnerable communities. And we need presumptive death and disability benefits under workers' compensation for essential workers who get COVID-19. We've requested OSHA logs from over 150 hospitals and nursing homes, and we've only received 8 reports. Finally, in the longer term, we need to take serious actions to address social determinants of health that have made the COVID pandemic worse in our vulnerable communities and workforces. And this includes addressing environmental factors such as air quality, local pollution that impacts community health, improving the quality of our housing stock for all communities, increasing access to fresh foods, improved educational systems, better paying work opportunities, and other similar factors that will require a sustained and long-term systemic effort. And on behalf of NYSERD, I thank you very much for the opportunity to speak.
Thank you, Pat. And obviously you submitted that in writing to us, is that
Yes.
correct? Thank you. So next we turn to Vladimir Clergenet. Did I pronounce your name correctly, Vladimir?
It's Clergenet.
32 BJ. Pronounce your last name for me, sir, if you don't mind.
It's Claire. Yeah.
Say that again, please.
It's Clergenet.
Clergenet. My pleasure.
Clergenet. That's all right. It's Montana Jackson.
Okay. You got 5 minutes, brother.
Okay. Well, thank you to the members of the Assembly, the Senate and the Assembly for the opportunity to testify. My name is Vladimir Clergenet, and I'm a member of SEIU 32BJ, which represents 85,000 property service workers in New York, including 8,000 airport workers. And up until early April, I was a passenger service representative at JFK for 11 years. Now, I'm a first American, and I'm a son of Haitian immigrants. I currently live in Jamaica, Queens. Well, we know that from the data that the coronavirus has impacted communities of color hard. Today, I share my experience as a worker of color, which has shown me 2 major ways we can address this disparity. First, by providing truly accessible and affordable healthcare. And the second is increasing power in industries that have a high concentration of workers of color. I personally have worked through the swine flu, the bird flu, the Ebola outbreak, the SARS, and the coronavirus now. And I feel pretty lucky this far, managing to stay healthy despite working in those conditions. But many of my coworkers have not been as lucky. Many have become sick, and we lost 6 New York members to this virus. And the CDC notes that the lack of access to health insurance and paid leave are 2 factors behind the disproportionate impact of COVID on minority communities. When compared to their white counterparts, Hispanics are almost 3 times as likely to be uninsured, and African Americans are almost twice as likely. When workers don't have access to health insurance, they worry about the cost of medical care and avoid seeking medical care unless they absolutely need it. When workers don't have access to paid leave, they're more likely to continue working sick while not only harming their own health, but exposing their coworkers to diseases like COVID. These are things I've experienced and witnessed firsthand. 95% of my coworkers at the airport are people of color. The coronavirus has just exposed the difficult choices that we've been forced to make over the years. And for us, this is important because the employers at the airport offer such expensive health insurance options that we either forego health insurance or the trade-off of paying our bills in order to pay these high premiums, our high premiums and deductibles. And I have coworkers that are thousands of dollars in medical debt, coworkers that have diabetes, lupus, who pay out of pocket for their medications. And because of the subcontracting system that rewards the lowest bidder, we need to set a standard across the board so these contractors aren't incentivized to cut them in order to win contracts. This is why the state should pass the Healthy Terminals Act, which would ensure that all employers provide airport workers with a benefit supplement that they can use to pay for health insurance. Passing the Healthy Terminals Act would be an immediate step toward reducing racial disparities in healthcare by helping thousands of predominantly minority workers. I'd also like to talk about how labor unions have played a crucial role in protecting workers, especially workers of color like me. When I started at JFK 11 years ago, I was making around $7.15 an hour. I had no voice, no benefits, no security, no respect. And I was able to fight alongside my coworkers. And 7 years later, we won a union. We won a path to $19 an hour. Our unions helped push for proper training and equipment and provided us with avenues to communicate with our management. For example, back in 2014, during the Ebola outbreak, 200 cabin cleaners in LaGuardia walked off the job over health and safety issues. And as a result of that, they were able to get additional training to protect themselves from infectious diseases. Our unions helped us file OSHA complaints against employers in cases involving handling infectious materials and bloodborne pathogens. They're providing us ongoing guidance on how to best protect ourselves from COVID, because at the end of the day, workplace justice is racial justice, it's health justice, and New York should be ensuring that all workers have the ability to collectively bargain, form a union, and that their rights are upheld. And, I just want to say on a personal note, being laid off has been stressful enough. We're getting the pandemic relief from the unemployment, but, it's going to end. And in the midst of everything that's going on in the world right now, we should be assured that when we get called back to work, we'll have real meaningful access to healthcare. I'm fighting on behalf of my coworkers. I'm fighting to realize the dream that our late President Hector Figueroa, his vision for workers like me. We need the Healthy Terminals Act passed now. Thank you.
Thank you. Now we're going to turn to Senator Jessica Ramos from Queens, who is the chair of the Labor Committee. Jessica?
Yes, hi. It's so good to see everyone, even under such terrible circumstances, of course. I want to first extend my condolences to all of the members of the panel, because I know people have lost colleagues, loved ones, patients, people that we care about. And that is just an added burden on working such long hours under such tough conditions, perhaps with little to no PPE. And that's really where my question is going to go. And I'm sure that the brilliant new president of NISNA is going to have a few things to tell me. But also for 32BJ, and of course everybody knows I worked there for many years, and I worked on the airport campaign specifically, and you guys are also very exposed to bodily fluids and things, behaviors, people's peculiarities and their specific behaviors that might leave you at great risk, and especially at such little pay with such little protection. Can you tell us perhaps more specifically for the airport worker, if you can tell me what more protection could have been provided? And then for NISNA, I'm wondering about how those nurse whistleblowers have been faring when they've alerted us that our nurses are not necessarily being taken care of how they should be.
Okay, so I think we've been working closely with our employers to make sure everyone has PPE and then the proper training. But I think at the end of the day, no matter how much training you have, or no matter what equipment is provided, the most important PPE is always going to be health insurance. Because we're on the front lines. We secure the airports. We clean the airports. I myself was working in a team with some of my coworkers, government officials, and health officials where, because one of my primary duties is crowd control, we were separating individuals who had been potentially, who were coming from countries that had been potentially affected from COVID, from the countries who had not been affected from COVID. And, I feel like we're right in the thick of it, which is why health insurance is just paramount.
Now, I know that you were laid off, and I'm sorry for that. Do you know if any of your former colleagues and folks who stayed on the job were offered any hazard pay?
From what I understand, there's some money that's been allocated from the Treasury that we're waiting on to be released. That we've been working closely with different officials to ensure that we get those funds in hand that would provide hazard pay and things of that nature.
Yeah, no, that's exactly right. Actually, it was Assemblywoman Arabella Simotas and I who sent a letter to the governor telling him that the federal stimulus money that he receives for our state should go towards hazard pay. So that's really important, and I do want to thank you guys for being such an ally on that. Now, can we hear about the nurses who have done the right thing by letting us know that they didn't have enough protection? How has it gone for them?
It's been a mixed bag, Jessica. So, and I mean, the reason why folks really needed to speak out was we were getting one message, right, that there was enough PPE, and actually the rationing that we were seeing was based on standards that the CDC put out called crisis standards, that are standards that are in fact used during a shortage. So by definition, that meant we didn't have enough PPE, and those standards carry with them risks of infection, not just to the worker, but to actually spread that infection. So yes, as registered nurses, we're held to a standard of practice and felt we needed to and we tried, to do that in many other venues. But so it's been a mixed bag, and we appreciate the legislation that you put forward to deal with this. Most folks know we have a whistleblower law on the books that doesn't protect us in a certain way to go to a government agency. But when that agency maybe isn't listening and we need to go outside to the public, it's important for us, especially as healthcare workers, and I think really for all workers, to have that protection in place.
Yeah, no, absolutely. And are there any other, I actually don't know, are there any other worker titles or classifications that you guys represent that perhaps, are in the nurse's shadow, if you will, that we should also know about and look out for?
I mean, we do represent other healthcare professionals. We represent some respiratory therapists, folks like that. And I do think in general, all healthcare workers, I mean, we work as a team, right? We couldn't do our jobs without each other. So I think it's important for everyone to have that. And we saw, many of the facilities where these nurses work did try to push back and threaten discipline and things like that. And it was really very courageous for a lot of these folks to come forward and do the right thing and do what they needed to do. And we finally did see some improvements on a facility by facility basis, but then finally overall as things as things went on. But
do you think that we would have fared better had we had safe staffing then, for example, at the very least?
Absolutely. I mean, many of the facilities, and especially the facilities that were hardest hit, were already staffed at a minimum, right? So there was no surge capacity there when it came to staffing. And, everyone kept talking about beds and ventilators, but if you don't have the staff to take care of those patients that come in, and someone else spoke about it before, and particularly in our, in communities of color and low income communities, a lot of the safety nets didn't have the resources to pay the exorbitant prices charged by these staffing agencies. And it's very difficult to bring people into an environment and expect them to function under those circumstances. So, having properly trained registered nurses that are available, in a pandemic, yes, if we had the safe staffing, and we still haven't gotten a report that was due out last December, really, from the Department of Health. We never even received that survey. So it's very concerning that these metrics don't address that for safe reopening that we have to have availability of trained healthcare workers.
Yeah, it'll be very interesting to see the data and compare data later on.
Okay, thank you, Senator. Now we're going to go to Assembly Member Dick Godfrey, the Chair of the Health Committee.
Thanks. Yeah, I have a question, I guess, for all the labor folks. Practically every labor leader I've ever talked to on this topic says that, yeah, the union has terrific health benefits, as yours do, but that the union has had to constantly give up wages and benefits in order to protect the union health plan. And certainly, I was thinking of 32BJ, the family in the penthouse probably earns easily 1,000 times with a 32BJ member who works as a handyman in the building. And yet the insurance company wants the same premium, the same deductible, et cetera. How does paying for those health insurance benefits affect the economics, the take-home pay of union members?
So I'll talk about that, Dick. So I think, we at NICE have always been strong advocates to kind of to separate those things. We see, in negotiations with healthcare employers, and one would think like, you're negotiating with a healthcare employer, and especially a lot of our other objectives, including safe staffing and other issues, having that healthcare issue come off the table would be really beneficial, I feel, to labor unions in general. But my 32BJ.
Yeah, I mean, well, I can't really speak to that. I think the culture at the airports is a bit different because we have a system that the subcontractors use, which pretty much rewards the lowest bidders. There's sort of a race to the bottom. I think, if we're able to get the benefit subsidy of the $4.54 on top of what the current wage is, there should be no effect to the take-home pay.
Okay, thank you.
Okay, thank you. Now we're going to go to Marcos Crespo, Chair of the Assembly Labor Committee.
Thanks, Ed. And to the labor groups for presenting, thank you. I know Jessica covered quite a bit of good questions, and so did Richard just now. But I think, by the way, I speak to most of my colleagues when I say that we are very grateful to the work of your members. Both of your unions have been at the forefront, in so many ways, not only in terms of essential workers and doing the work up front, but actually in terms of the impacts and the number of families affected in communities of color. Your membership is majority people of color, and therefore a part of this conversation. To Vladimir, I would simply say, I know before we were interrupted in our legislative work, the Healthy Terminals Act is a piece of legislation that we were looking forward to moving along, and I hope that as we look to reconvene, maybe it's something we can take up, rather quickly, or have serious discussions around improving that access to care for all workers in your industry, in your sector in particular. And to your colleagues who in 32BJ who are part of the maintenance staffs everywhere, these are folks that I feel such a connection to because so many of my family members did this work. And, I think in many of their work environments, the people who they work closely with tend to have a certain appreciation for them. But I think just in terms of as an industry, all of us should really appreciate the work that those men and women do every single day. Even in our offices up in the LOB, our cleaning staffs that come in every day. And, we take for granted the fact that they weren't notified in the beginning of all of this, of which members, were infected. I heard from my cleaning lady said she didn't know that the two of the members on the floor that she cleans were impacted by COVID. And so, but there they are, right? Doing the very thing that needs to be done, but puts them at greater risk. So no question, the work you have all done should be appreciated and celebrated and rewarded. To Pat, though, I did want to ask you, I don't want to cover what was already asked, but could you please repeat or elaborate a little bit on what you mentioned with your thoughts on the paid family leave and or shortcomings with that program, or what's needed in that area? That because I know, we've done some things in the last 2 budgets to address those programs or those services, but what's missing? And could you just expand a little bit on what that idea was?
So I think in this context, Marcus, I was talking about the paid family leave in relation to the COVID, right? Because what we saw was healthcare workers were treated very differently. We had more hoops to jump through to access that leave, and it was under the guise of, again, shortages, not based on science, but staffing shortages. I saw the CDC to come out. So while folks were told to quarantine for 14 days, for example, ours was cut in half. We were told 7. So we really couldn't access the 14 days. Many of our nurses had trouble accessing the full 14 days of paid family leave. And ours are nurses and healthcare workers who really are vulnerable themselves, to get them reassigned to maybe a job where they wouldn't be as exposed as as some of the other folks was very difficult. Some of them had to access leave that was in most cases an unpaid leave. But there should have been a way, we thought, to put them to work in different areas. And the other thing,
Pat, I'm sorry, that transfer would have been within a particular hospital. Say, yeah, they're in the emergency room, they could be transferred to a different department just to give them a break.
Yeah, and I mean, if they, when you think about the situation, you're someone that's immunosuppressed because you're taking medications, because you have a chronic condition, and you take these medications so you can come to work, but they suppress your immune system. Now you're in this kind of situation without the proper protections, right? Without the highest level of respiratory protection. So they clearly, needed to be in a different, in a different level. And, many of the hospital systems that we're working in were huge. We have pregnant nurses, for example, that, were right on the front lines here that needed to be reassigned. And, even in the context of right now, we have nurses upstate that are being furloughed. We have furloughs and layoffs happening at the same time that we're looking for all these contact tracers. I mean, we have registered nurses that hospitals are saying, they want to lay off or furlough. And we're talking this whole, morning really about the need for public health and expanded public health system. And what better ambassadors to go out into the public and community and help educate the nurses that have been at the front line in this crisis. So
thanks, Pat. I know we're out of time. What I would love to maybe offline get more info on is the levels of stress that your members have dealt with. I know anxiety is something affecting everyone, but I can't imagine, particularly for your work members, what that has been like. But maybe that's something we can follow up offline. Thank you.
Definitely.
Thank you, Marcos. Now we're going to go to Assembly Member Mike Riley, Ranking Member of the Assembly Cities Committee.
Thank you, Ed. I appreciate the panel giving their take on this. Thank you, Pat. Good to see you. Thank you so much. I actually wanted to touch on what you were mentioning about the whistleblowers. And I think one of the issues that we're seeing are those first responders and frontline workers that work for state agencies. Many of them may not have gotten the PPE in a timely fashion as well. So I think those work protections, where it comes to the whistleblowers and being able to highlight those OSHA violations, I think we really need to make sure that we look at the agencies as well. Specifically, we've seen in New York City, the Department of Sanitation, I received a lot of messages from constituents, the NYPD not getting satisfactory PPE supply, FDNY, EMS. So along with our hospital workers, we're seeing that there's a lot of shortfalls there. Have you been hearing the same thing from that side, from the state public employees position?
Yes, yes, we have. And, I think our approach maybe was a little bit different, Mike, than, our members, wanted to take action, and we supported that. But I know it's been difficult, in some other places for the issues that we talked about, the fear of retaliation, and the difference between being employed by a state agency versus a private agency, can weigh heavily on someone's ability, and can chill their ability maybe to speak out about a situation that really needs to be spoken about and to be fixed. So, but I heard from many folks across, all kinds of sectors of essential workers, and people that have a lot more to be afraid of, people from the immigrant community, uniforms, workers, EMS, et cetera, across the board. This was a big problem that wasn't being addressed.
Well, once again, I just want to thank you guys for sharing your insight, and thank you so much. Appreciate it.
Thanks, Mike. Now we're going to go to Assembly Member Rodney's Bishat.
Hi. Thank you for having this panel come on. I want to thank both 32BJ, NISNA, and all of our labor members. Thank you for your work. Thank you for sacrificing, and thank you for taking a risk for all of us, all New Yorkers, and being essential to us. I first want to say hi to Vladimir Claire Jean, who is my Haitian brother, Sak Passe. Happy birthday. And I am aware of your bill. By the way, I was just a little bit upset with my team because I was supposed to be on that bill. And I realized that my name was not on. But I see that it's very important, the Healthy Terminal Act. I had a question about the $4.54. Is that mandating the contractors to add that to the wage that they propose? Or is that something that's automatic? How is the $4.54 implemented? I understand that it's covering health insurance. But how is that implemented? Is it from the contractor side or internal to 32BJ?
Well, once the Healthy Terminals Act is passed, it would pretty much mandate the airlines, which pay the contractors, to allocate the funds to provide the benefit supplement, pretty much.
Okay, so it will be on the airlines.
Yeah.
Okay, great. All right, thank you. Well, completely support it, and I thank you for all that you do. I do have a question for Pat Kane. Pat, thank you so much for representing NISNA. My question to you is around, you talked about safety net hospitals, and obviously safety net hospitals are safety net hospitals because most of their members, or all their members, are Medicaid, all their clients are Medicaid users. In terms of the nurses, did you find that there were more nurses impacted in the safety net hospital versus the non-safety net hospitals? Or was there a disparity there? I'm trying to get a sense of the impact of the healthcare workers in a safety net hospital versus a non-safety net hospital.
Yes, absolutely. There was a much bigger impact on the nurses that work in the public sector and the safety net facilities. I think we've lost now, I think we're up to 26 members. Most of them are women of color, and most of them worked in those areas that you mentioned. We had, folks were talking about data and the difficulty with getting data. We, other than the surveys that we were sending out on a weekly basis and sometimes bi-weekly, we actually had like a COVID diary that we would send out to the members where they could tell us if they were sick, but it all depended on getting a response, right? But there really hasn't been any data, and in some facilities, they would give you aggregate data about the number of employees that were affected, but it's been very difficult to get data on the impact to the folks that work in the proportionally impacted communities. But I would say just anecdotally, seeing what we see in the COVID diaries and just even in the members that have fallen during this fight, that yes, absolutely, we saw more impact in these communities.
Okay, thank you. We're now going to go to Assemblymember Joanne Simon.
You cannot unmute.
You're
You have
unmuted.
to unmute me. Okay.
You're unmuted.
Thank you. Sorry. I was trying to do it on my end, but okay. Well, thank you all very much for your testimony. This has been a really incredible day, and this panel has been, just excellent. I have a couple of questions for really anybody on the panel with regard to whistleblower protections. We know that New York's law is very, very limited, and some of you have at least have referred to that, but I'm wondering whether you have gotten complaints from your members with regard to retaliatory actions because they voiced complaints, whether they went public or not. I'm curious whether or not that's been reported to you. And then, so if you could answer that question, anybody.
It has in our union. We've had several members that have been brought in for, for discipline. None of those have been fully, adjudicated or whatever the right word is, but, and they were, and once people started voicing their opinion, there were, spilling emails from several employers to our members directly, trying to stop them from speaking out.
And was this around the lack of PPE or?
Yes.
For example? Yeah.
It was mostly around the lack of PPE and also what they were seeing in regards to staffing shortages as well, but mostly it was about the PPE.
Okay. And does that break down differently from one sector, one area of nursing? For example, you talked before about hospitals, private hospitals versus the public hospitals. I'm curious whether or not that's broken down separately in your, at least if any data that you have with regard to hospitals versus nursing homes versus, any other settings.
In terms of the whistleblower issues or the PPE?
Yeah, in terms of the retaliatory action for complaining.
Mostly hospitals.
Mostly
most
hospitals.
bigger systems. And I mean, the public sector is definitely more, people have more rights, right, built into the public sector, as long as they, in certain parameters, but bigger private hospital systems is more where we saw it.
Okay.
I don't know if Vlad saw that at all. But.
Thank you. And does anybody else? Yeah, thank you.
Well, I can't say that we saw too much we saw any individual retaliatory action. Once the concerns of PPE were raised, we have labor management committee all over the airports that have direct contact with management, and I feel like we were able to resolve those issues fairly quickly, without the threat of, without the threat of a strike or, anything of that nature.
Thank you.
Okay, time is up. Thank you, Assemblymember. Now we're going to move on to Assemblymember Harvey Epstein.
Thank you, Chair, and thank you to the panelists. I want to go down the same path that Assemblywoman Simon was just talking to you about. I'm wondering about, in this post-Janus world, whether you've seen any impact on not being able to do, membership drives, or you've seen any drop-off for dues, or other post-Janus issues that have come up based on COVID.
Want to go first, Vladimir?
We've been encouraging our members to, to voluntarily pay dues, and I think that's going well. I think that's all I can say. That's to the extent of my knowledge.
And there hasn't been issues with members around PPE issues saying, well, as a union, have my back. I don't have PPE, related to dues and membership. Has that come up at all?
We haven't seen that actually. Actually, we've, during this pandemic, we actually have active organizing drives where we've been contacted by nurses in hospitals that don't have representation that they want to be represented by NISNA. So we actually filed the other day at a hospital, we're seeing actually the opposite.
And so that's my second line of questioning is really, have you seen like the request for additional membership drive, and how are you being able to support professionals who in hospitals, facilities where you don't have a current union drive going, and is there changes that we need to be thinking about to allow you to do better membership drives in those facilities?
I think there are. I mean, I think initially, I think now, the original rules that came out were very difficult. I think now they are going to let us do by mail, right? Remote kind of, if we're asking for recognition, of course, in places where we have 30% card signature, but if they insist on going to election, I think there's something in place. But I will get back to you on that. I think there are some things. I mean, certainly it's been difficult for us, and doing everything remotely like what we're doing here today, being out in the field and having our members just access to the facility and proper protection for our staff. I mean, it's been difficult, but obviously we've been able to, we have town hall meetings, and there's other ways that we can manage things, but I'd love to get back to you on some of those issues.
Great. And just, I know I'm almost out of time, just if there's any other thoughts around Taylor issues that have come up post COVID-19 and making sure that the members have the right to exercise their power if there were issues going on. It'd be great to hear post hearing whether those issues have arisen, and obviously around race and class and how that has impact on the ability for members to exercise their rights under law.
Okay, thank you, Assembly Member. And now we're going to go to Assembly Member Michael Salaj.
Just thank you to our panel. It was really insightful to hear about many of the issues that labor is going through during this tumultuous time. Ms. Kane, I have had many of the NISA nurses contact me regarding a private hospital within the bounds of my district. And I just want to first thank all the nurses for the sacrifices. Many of them live in my community. Many of them are people of color, and seeing the trials and tribulations that they've gone through. Really quick, what was the process for a nurse to acquire a PPE?
It really depended on the facility. So early on, what we saw happen was normally this PPE is outside of an isolation room. It's, you come into work, you get your assignment, the PPE is there right near the patient's room where you're going to need to don that PPE. People started being worried about, people pilfering, and that kind of became the reason that PPE was then put under lock and key. And that's a very troubling situation and can be a very dangerous situation because, of course, you never know, right, when a patient's condition is going to change, and multiple people are going to need to run into a room, and to kind of have to wait to access PPE behind a locked cabinet or go to a manager's office to get PPE became very problematic. So instead of it just being there when you needed it, very often it was locked away under lock and key. And then at some of our facilities, and sometimes it still persists, people are just, sometimes people have to ask when they come to work for their PPE, which should not be the case. And if their PPE is great.
Another quick question, because my time is running out. Were there nurses denied PPEs for the reasons of you already had your allocation for the week or day?
Yes, we did see that.
Okay. And then regarding the staffing issue, I know that there were many floating nurses that were coming to different hospitals. Do you think the allocation of those floating nurses were fair?
Not always, and it's very difficult, matching skill with need. But there were definitely communities that did not get what they needed because it was based on what they could afford to pay.
One of the greatest tragedies is that we had two facilities, the Comfort and also the Javits Center, that was completely empty. And we were not able to access or manage that in a efficient way. How many nurses do you think were infected because there was just so many patients in one area and there wasn't adequate staffing?
We had thousands of our nurses infected.
Thank you.
Okay, thank you very much. And thank you to our witnesses and all of your members for the great work that you do for us. We appreciate it. Now we are going to move on to panel number 6. It's been 8 hours and we've got through 5 panels and we have 4 panels remaining. So I just want to remind everybody, we're going to try to stick to the time frame. And once again, I want to encourage everybody, especially the witnesses and the members, to try and focus our energy on solutions. So panel number 6 is, first we have Clayton Banks, CEO of Harlem. We have Yvette Bayran, Chief Executive Officer, Astor Services for Children and Families. Alice Bufkin, Director of Policy for Child and Adolescent Health, Citizens Committee for Children of New York. Alicia Webb, Vice President, NPower. And Mallory Tompkins, Chief Learning and Partnerships Officer, 82nd Street Academics. We will start with Mr. Clayton Banks. You have 5 minutes.
Thank you very much. And what an honor to be in front of you in this wonderful hour of the day. I've been here just as you have for the entire day, but it's been great. I want to come through as simply as this. I want to be a solution provider for New York State. It is the best state in the entire country, but yet we're finding that the disparities is basically leaving our state behind. So when I found that we were going to have this conversation about disparity, I could not wait. Because the one thing that we have in common throughout all of the testimonies today, if there was one thing, there's something good about being late in the game and listening to everyone who set me up beautifully, which is broadband matters. That's what we found not only in the pandemic. Practitioners like myself have been saying it for years and years and years, but to hear so many people with so many different ways that they're looking at our state, there is this denominator called infrastructure. And that infrastructure is not just streets, tunnels, and bridges. That infrastructure is, in fact, internet connectivity. And the three-legged stool of that, which is what I very much focus on and have some suggestions for the Assembly and the Senate, there's 3 legs to this stool. One of them is, of course, you need a device. Number 2 is you need an internet connection. By the way, all this in the home. And third, you need digital literacy. I've been putting in policy to the House, the federal government House. It's been read on the floor. It's getting less and less partisanship because every state needs this infrastructure. So I recently put in one called the Digital Equity Act. It looks like the Majority Whip, Clyburn, has picked up a little bit of it, has created his own version of it, America Connected. And I think New York State should be the leading state in this country that commits itself that every single home has internet, an affordable internet, if not free, a device, affordable, if not free, and certainly digital literacy ongoing, not only instantiated in our schools, but all the various practitioners that are in New York State that I've been hearing all throughout this call will get the resources it needs to provide ongoing digital literacy. And I say that with this bold prediction. Not only do I know this is going to happen, but I know how it can happen. A lot of the people on the call today have talked a lot about the what and the why. I'm Clayton Banks. I know how, when, and who, right? That's a big difference. And the thing that we could miss as a state is what's the next digital divide? What is the next digital divide that will continue the disparities in health and education and everything else we've talked about? It's the advanced research that's coming that's showing that things like virtual reality, right, where we actually are going to be able to use that in the medical field to save lives, which we do right now, but the only people who have access to it are people with money and people who know about it. That's the real definition of a divide. You either know about it or you can afford it, or both. I'm here to close that gap with this body, putting together perhaps something called the Broadband Matters Act or everyone act however you want to do it. I bring the humanity to it, and I'm bringing this all to this session because I know if we don't do it, we fall behind. And we see it already in Harlem where 40% of the homes do not have broadband in the home. 40%. It's an outrageous, I see people saying it now. I know where the statistic came from. It came from Pew Research, which I was a part of. So I'm saying to this committee and to all who may end up listening to this afterwards, that we should rally together like they did in 1935 when there was no electricity in New York rural areas. In 10 years, as part of the New Deal, every single one of those rural areas had electricity. That's what broadband is today. Broadband is the electricity of today. Without it, you're in the dark. Why would we want to leave anybody behind? Even the kids in the street of Harlem who know how to hook up a stereo to a light pole or build bikes and ride them all over the place. We got geniuses in areas of our city that we are ignoring. So I'm actually almost pleading to this body to put this at the top of your legislation. The governor has tried, the mayor has tried, everyone's tried. Mayor in 2015 came to talk to me. We were on this, I got on his broadband task force, talked about having everyone connected by 2025. That gives us 5 more years to make that happen.
Okay.
So I'm just ready, and I hope that this helps. This is a solution. It will help with the health, the seniors. I do demystifying for seniors. And let me add one last story.
Please quickly.
So
we're out of time. Go ahead.
I'm sorry.
Go finish up.
Just this one little thing. So in the projects in Harlem, I go in and I teach kids how to code. Some of the kids that are most at risk. And I can tell you, those kids open up their prism when they get somebody in there that cares about them, even when there's a leaky roof. And you can go from there. A leaky roof leads to a lot of problems, but they learn how to code and now can actually get into the socioeconomic ladder that we want all to be able to get to.
Thank you very much, Mr. Banks. Next, we're going to go to Yvette Bayran, Chief Executive Officer, Astor Services for Children and Families. If I mispronounce your name, if you could just correct me.
Yvette Bayran, that's fine. Thank you. So thank you so much for allowing me this opportunity. I know it's been a really long day, and I thank you for hanging in there with us and for asking really important questions. I am not only the CEO for Astor Services for Children and Families, but I'm also a Latina woman who was born and raised in the Bronx and who now lives in the Hudson Valley area. However, all of my family members continue to live in the Bronx. So what happens there is very, very personal to me. I lead Astor in the administration and the oversight of children mental health services, child welfare services, school-based and early childhood development programs. And I do that in the New York State, Mid-Hudson Valley region and the Bronx. We serve about 10,000 children plus their families annually, and our organization employs about 900 staff. We've been doing this work of children's services since 1953, so I do consider us an expert in this area. With this in mind, we have many, many challenges in the area of mental health. Throughout the day, you have heard already many of them. Children and adolescents and teens who struggle with emotional issues are going to come back to schools, are going to come back to to have communication with their friends, and are going to be in a lot of distress. This pandemic, we already know, has affected communities of color in ways that that have been detrimental. We know the impact firsthand. The majority of our clients reside in the areas with the highest infections and the death rates. This is all fueled by these social determinants of health, which some of us have already discussed. I was reading something that recently said, try to come to some understanding of why Blacks and Latinos and individuals of color are suffering of this with this pandemic at higher rates. And it said that many of us live in what they call multi-generational households. Well, that's a nice way of putting that many of us cannot afford the rent and have to sometimes rent out a room in our apartment because we need to be able to feed our families. So we don't do multi-generational households by choice. We do it because we have a need to feed our families. I want to make sure that we address the inequities that exist in our communities. And these inequities are further exacerbated by the needs of the children and the families as far as mental health is concerned. We were able to shift to telemental health services fairly quickly because Astor had been providing telepsychiatry. I am proud to say that since we started doing remote work, which was on March 16th, we've been able to serve 20,000. We've been able to have 20,000 telemental health sessions, and we've been able to enroll 514 new clients. We continue to provide this work because we know that it's critical to ensuring the success of these children and their families, especially during this pandemic. However, let's be real here. The fact that children's mental health and behavioral health services continue to be at the bottom of the agenda is completely unacceptable. If we're going to meet the needs of these children and families, we have to do a better job. Now here's where you can help. You can help by ensuring that there's access to care. While I may not be an expert to health insurance, I can tell you that access to care is critical during this time. Medicaid services cannot be cut. I want to make sure that my point comes across that services need to be available through these health insurance companies. We need to make sure that children's mental health benefits such as children family treatment support services become part of CHP, especially for immigrant kids. We need to make sure that we hold Medicaid managed care and commercial payers accountable to paying the rates that they should be paying for these mental health services. We talk about reopening plans. Well, we need to make sure that if we're going to reopen and reopen effectively, we have proper PPE and incentive pay. We also need to make sure that we have the staff in place to be able to provide the services we're going to need. Some of you may have heard of the shortages that we have in the mental health field as far as staff. We need to make sure that licensed mental health counselors and licensed professionals can diagnose children just like licensed clinical social workers can. Now more than ever, we also need the flexibilities in our regulations that we currently have to continue to be long-term. So please make sure that those regulations and the flexibilities exist beyond just this pandemic, because that'll be critical in the work that we're doing. Thank you so much for supporting our work, and we look forward to working with you in the future of this pandemic.
Thank you very much. We're going to move on to Alice Bufkin, Director of Policy for Child and Adolescent Health at the Citizens Committee for Children of New York.
Good afternoon. Thank you for taking so much time for this really important hearing today. My name is Alice Bufkin. As you said, I'm the Director of Policy for Child and Adolescent Health at Citizens Committee for Children. CCC is a multi-issue children's advocacy organization dedicated to ensuring every New York child is healthy, housed, educated, and safe. It's undeniable that structural racism and systemic racial inequities have created the conditions, including inadequate healthcare access, unaffordable and overcrowded housing, job insecurity, that have in turn exacerbated the effects of COVID-19 on children and families of color. The effects of this pandemic are numerous and complex, and therefore we as a state need a multi-pronged approach to combat its effect on children and its disproportionate effect on communities of color. I want to touch on some of these issues today in the area of health, housing, education, and safety, but my written testimony does include additional details. To ensure every child is healthy, we must first recognize the devastating impact this virus is having on the mental health of children, particularly children of color. And I really want to thank other panelists and other legislators throughout today who have really emphasized the critical need to increase behavioral health capacity within the state. Extensive research on adverse childhood experiences tells us that the kinds of trauma caused by COVID-19, including economic and housing insecurity, disruptions in mental health care, loss of loved ones, have long-lasting repercussions across the health and well-being of children as they become adults. 3/4 of essential workers in New York City are people of color, meaning that the burden of fear, loss, and separation anxiety is falling disproportionately on their children. We applaud Governor Cuomo for his recent announcement that insurance companies must waive copays and fees for mental health and substance use services for all essential workers. We believe this waiver must also be extended to the children of essential workers. We also urge the state to strengthen behavioral supports in school before and after students return, to help screen and identify children who have experienced trauma and connect them to care. This must include support for whole school healing-centered approaches, as well as increased support for clinical care and strong connections to community-based services. We also urge, as the previous panelists indicated, making sure that children's mental health benefits are covered in the Child Health Plus program and the Essential Plan, not just in Medicaid. Additionally, the state must address the injustice of the federal response to COVID-19, which has almost universally excluded undocumented people from recovery benefits. As a state, we can begin by expanding unemployment insurance options and health coverage for undocumented New Yorkers. Finally, like many others, we strongly oppose Medicaid cuts and urge increased funding for both emergency food assistance and for outreach and education to connect New Yorkers to federal nutritional assistance. In the area of housing, New York must provide short and long-term rent assistance to cover rent arrears and support ongoing rent payments, including strengthened and expanding housing vouchers. Over 2/3 of job loss in New York City has occurred to people of color, and this will continue to drive housing insecurity. New York must provide rental assistance when the eviction moratorium comes to an end. In addition, expanded preventive services are critical to respond to families' needs before a housing crisis. Preventive services must include case management, eviction prevention and rental assistance counseling, and service referrals for childcare, education, training, workforce development, and others. In the area of education, the state's fiscal year 21 enacted budget included no increase for education funding for the first time in 6 years. It's clear that the impact of education reductions will disproportionately hit students of color, particularly given extensive new challenges related to learning loss and the digital divide, which we've discussed at length today. With the possibility of further cuts coming during quarterly reviews, we urge the legislature to find alternatives, including revenue-raising options, and prevent further cuts to education. Additionally, given that essential workers in New York are overwhelmingly people of color, more must be done to ensure childcare is available to the essential workforce. While we applaud the governor for creating a child care scholarship for low and middle income essential workers, New York must draw down more federal funding to ensure all essential workers have child care options. Finally, we must protect youth programming. Due to the economic impact of this pandemic, New York City's proposed budget eliminates all summer programming for youth, leaving nearly 175,000 children in New York with no option for summer engagement. Unfortunately, communities of color will be disproportionately affected by these cuts. CCC urges the legislature to prevent any further cuts in the state budget to after-school programs and youth services, and to preserve the state's contribution to summer youth employment. And finally, to ensure every child is safe, CCC and child welfare partners are calling for greater investments in child welfare preventive services to ensure that community-based organizations can meet the basic needs of family, achieve family stability, and promote child safety. The recently enacted state budget reduced child abuse neglect prevention resources by $25 million, a cut that will have long-term consequences for many children and families throughout the state. Now is the time to ensure New York invests in preventive services, particularly general prevention, to support recovery in the hardest hit communities across the state. So again, I really want to thank everyone on this committee for this really essential hearing today, and I'm very happy to answer any questions.
Thank you very much. Now we're going to move on to Felicia Webb, Vice President of NPower.
Hello, and thank you. Thank you for organizing this joint assembly. And I also want to extend my sincere thanks to Assembly Member Walker for the invitation to present. I'm Felicia Webb, and I am the Vice President of Development and Philanthropy at NPower. And we're a tech workforce training organization that's been providing tech training for free for New Yorkers and young adults for more than 10 years. And so, as my panelists and others have said earlier today, you know, the digital divide is very real, and the most at risk have been negatively impacted by the economic gap, which feeds into social determinants of health. And so, as we spoke of earlier with prior panels, the social determinant of health is something that we must address, but at the root of that, it comes down to income inequality and job opportunities. So therefore, I just want to impress upon there is a need for investment in tech workforce training for minority communities. So, you know, inequality is magnified during times of national crisis, and communities of color have long endured the structural inequalities of economic, social, and civic systems. So, you know, we know that like 30 million people have applied for unemployment. You know, in New York alone, we're almost reaching 2 million people impacted by COVID-19 applying for unemployment. The service industries have been the hardest hit, but I just want to also bring forth the data again. Around 58% of the frontline workers are people of color. and that's representing 66% of the essential workers. And I also want to address the fact that 53% of the women of color in the United States work in these industries that are the highest impact. And so, for all of these workers, the COVID-19 crisis puts their health and their lives further at risk. So I just want to say that this disruption of employment and the cause of COVID-19 is only going to worsen the longstanding challenges that minority communities face and for women of color. So, and this is the time to prioritize that investment in workforce training and technology for communities of color. And I just want to give a point of comparison. When we look at the 2008 recession, how when unemployment was at a high, overall employment rates peaked at 9.6, and in 2010 for African Americans it was 16%. And so now today, chief economists have estimates that unemployment rates for African Americans may reach up to 19%. So, the pandemic is changing the way we live and work, and the future of work will be in tech. And tech is going to drive the economic recovery and the new economy that emerges out of this crisis. So before COVID, we witnessed the significant growth in tech jobs, and minority communities were stand to lose their jobs to automation. So post-COVID, we have to realize that the families be further impacted. So our recommendations would be, in terms of, applying for the Dislocated Worker National Reserve Fund, which was applied for in 2017 after Hurricane Maria and Irma, to also include, that funding to go towards workforce programs, because we know the linear path will cease to exist for career and post-secondary education. And so with that means also investments in the digital divide with broadband and technology for all. And then in addition to, going back to where we started, where New York has a 17% projected increase in technology jobs by 2026, we have to understand that, not addressing automation and AI and the lack of opportunities for people of color will disproportionately continue to perpetuate the health disparities, economic disparities, and overall social determinants that were at the root of why people of color and minority communities have been impacted the most by COVID. So I want to, quote Dr. King and Assemblymember Crespo, who said the urgency of now. So this is the fierce urgency of now to think about the post-COVID economy and how we want to move people of color out of poverty, generational poverty, and close the digital divide. We need to invest in job opportunities and job training for them to reach those opportunities. So with that, I'm excited to have this discussion with everyone today and answer your questions, especially related to women of color who head up the households of this population.
Thank you very much. Now we're going to go to Mallory Tompkins, Chief Learning and Partnerships Officer, 82nd Street Academics.
Good afternoon, and thank you for the opportunity to speak with you today. There is strong representation of our communities entrusted to Senator Ramos, Assemblywoman Cruz, Assemblyman Aubrey and Dendecker, and I'm really here to amplify their message from the lens of a small nonprofit. I lead 82nd Street Academics, a school supporting Queens communities, and today I'm going to highlight our work specifically in Jackson Heights, Corona, and Elmhurst. Queens represents 15% of last week's newly confirmed cases in New York State, and 70% of the areas that we serve come from Latinx and Black ethnicity groups. Many of you have had an opportunity to come and visit with our students and hear directly from them about the ways that we advance their path to college. We have 105 staff members that bring that mission to life, and at great sacrifice, none of them have lost the opportunity to work their regular hours remotely during this crisis. Normally, 60% of our students attend through government funding and 40% attend on a family tuition and scholarships. We have returned all family tuition for the last semester of school and are providing online learning for free to all of our families. While this sacrifice means that we are extended on a line of credit with the bank and we've lost the savings account that we've built over the last 3 years, it also means that our students can continue to participate as their families experience death of parents and job loss. It means that our staff team can at least finish this school year without getting behind on their rent bills. I'm going to speak with you for a moment about Johan, who's one of our 5th grade students. He comes from a single parent household with a mother who's recently been laid off. He has just joined our online tutoring program in math that we started earlier this month as a result of the students not returning to school. And one thing Johan recently taught me was the availability of Google during online learning. He was in a lightning round in his tutoring session the other day, and he looks away from the camera, and it looks like he's really thinking about the multiplication problem. And soon I can hear on the other end of the screen, Siri is confirming for him that 5 times 7 does equal 35. And in the moment, it's an amusing anecdote and gives me a little dose of what happens when a smartphone comes to school. But beyond this one moment, my heart really hurts for Johan and students in his situation. Through online learning, I am determined to make sure that Johan is ready for middle school. But what happens to all of the other Johans? Whether you're looking at the lines in the street in front of food pantries at Assemblywoman Cruz's office or on Roosevelt Avenue, or you're hearing hard facts from other advocates, you know that there are families that are thinking tonight how they will stretch their next paycheck to keep food on the table. There are no permanent food pantries in our neighborhoods, and we don't have the systems in place to address the long-term impact of this virus. Families have lost dignity and choice only to be replaced with lines that are 6 and 10 blocks long. Many of our community members approach the culmination of Ramadan, which is typically celebrated with the sharing of food, but those same families this evening will eat school lunches for dinner. We are a small business, but more importantly, we are a school. I must now prepare my staff members that have worked with us for more than 4 years to have a summer that does not include a paycheck from our school. I must maintain high engagement with them through the summer in hopes that they will return in the fall, though we risk losing their talents to other available jobs with increased security. Over 3/4 of our staff are women of color, and we've spent our entire savings and reserve protecting the valuable efforts of those employees and the life-changing impact that an education has on a community of color. We are at 0. There is a solution in partnership between small businesses, nonprofits, and government funding. Keeping our team employed will help them stay on top of their rent bills, keep them off the overwhelmed food pantry lines, and maintain the relationships for student success. I'm speaking this evening on behalf of Johan and his friends. In the diversity of Queens, Johan is not the exception, he is the rule. 5th grade for him will end next month, but there's still time to prepare him for his middle school. We are ready to be part of a solution, and we thank you so much for your time and the opportunity to listen and learn with you today. Thank you.
Thank you very much for all the witnesses for your testimony. We're going to start with Assembly Member Maritza Davila, who is the chair of the Task Force on Puerto Rican and Hispanic Americans.
Yes, hi. Thank you once again, Chairman, for allowing me to get back on. This question is going to go to Yvette Bayran. Is it Bayran?
Mm-hmm.
Okay.
Bayran, yeah.
Bayran. Well, I certainly do understand that you have your job cut out for you at this point. I am very familiar with Children and Family Services and how they work very closely with ACS and other agencies to ensure that children that are at a loss or even abused or taken away from their homes, you guys immediately intervene and you find a sort of a good setting for them, right? Until there's a court disposition made. What if, I know you talked about teleconferencing with psychiatrists and keeping the family engaged in that sense with technology. But I'm curious to find out, what are your social workers at this point doing, and how are they engaging? Because I know that you have to literally knock on a door and see if a family is safe or a child is safe. And I'm not sure how that's working now. And this is why there's so much worry about a lot of child abuse, right? A lot of domestic violence, a lot of things that can definitely slip under our noses. But I really was curious to find out, how are you handling that? Because it's such a huge overtaking, and I'm sure you had to switch, but what are you doing right now to address these issues?
So what we're doing right now is going out with the PPE that we've been providing our staff to knock on those doors and to still do that community work. The option for us to do telemental health in that setting does not exist. Telemental services are wonderful, and they've provided the level of flexibility for us to reach thousands of children. But when you're talking about children that are at risk in terms of abuse and foster care, those are not options that we have. So our prevention workers under our ACS contract are still required to go out into the community. What Aster has done is provided them with the PPE that we have spent thousands and thousands of dollars to acquire, because they didn't. It's something that we have dedicated, that we would spend time ensuring that our staff were being secured. So to your point, we're out there. We're out there in the community. We are considered an essential worker. So we're still going out to the homes, and we're still visiting the families that we need to visit. We're just making sure that we're asking them the questions that the CDC has recommended that we ask. Is anyone in your home ill? Has anyone had fever? Has anyone? All of those critical questions are being asked of the families before we do the visit. And then we're also providing the protective equipment to our staff.
Are you also giving the families PPE, or are you in need of also giving out to the families? Because it's important, if we're going to contain this virus, we have to, those people that are literally having that type of contact should be able to give out those PPEs. And I know there's a big shortage.
Yeah, but if the family has indicated that they don't, then we will make it available for them as part of the work that we're doing, because obviously we want to make sure that they're safe and that our staff are safe. But it is a shortage, and every day we have a stockpile that we keep trying to get, so that throughout the next couple of months we're able to do this work effectively. But we are out there in the community for those clients.
Thank you. I appreciate that. Thank you all. Thank you.
Thank you.
So next we're going to hear from State Senator Brian Benjamin from Manhattan. Senator Benjamin.
Thank you, Chair Jackson and Bronstein. I want to commend my good friend Clayton Banks for all the hard work he's doing on broadband in our community. I agree with him that broadband is like electricity. So I want to thank him for all of his hard work in Harlem. Let me ask a question to Felicia. You mentioned, Felicia, the conversation around the post-COVID-19 economy. And I completely agree with you. We've got to be preparing folks for the future, not the past. My question for you is, when you said you want to prepare for opportunities in the future, can you give us a little more color on what you see that looking like? Retail is going to be completely different going forward. There's so many industries that are going to have a hard time coming back. People like my parents now shop online, which she would have never done that in a non-COVID environment. I'm very concerned about what that means for what our world looks like going forward. So can you just give us a little color on what you believe the opportunities of the future are, that we should be preparing communities of color for those types of jobs?
Oh, absolutely. We have seen that every company at this stage has become a tech company, and there are some level of technology needs. And so we're moving beyond just being desktop support, but in addition to information securities. And so we're seeing those jobs that would have been, retail service frontline jobs moving to online, and it's online in a digital way. And so those are opportunities for our populations of people of color who necessarily don't go through the college track, but are looking for these entry-level jobs that we can train them in those skills. And, I think investment in apprenticeships in New York State to take on those type of IT generalist roles will be key and critical for young adults who are looking for employment and employment opportunities and need those skills. So it's going to touch across all industries, the telemedicine, the retail, service industries. We now know that people are doing apps, minority businesses in Harlem, like the Frederick Douglass, district, they've had to transition to being curbside delivery businesses. And so therefore, they needed technology for that. So as we move in this—
Sorry to cut you off, but I'm about to lose my time. So I just want to ask a quick question before my time goes. I try to respect the time. But
yes.
So what do you think that means for education, right? I mean, how are we going to have to change the way we teach our kids, particularly those in high school? I mean, what are your thoughts about how this impacts how we look at education going forward?
Absolutely. Remote learning, and we transitioned our program to online remote learning, and we're actually implemented how to give opportunities for our students who are in our programs to understand what it means to be in a remote work environment, and digital learning and remote learning is going to be the key parts of moving forward, and they need that discipline and that broadband access for that and the tools.
Okay, thank you. We're gonna move on to Assembly Member Catalina Cruz.
Thank you. Thank you, Mallory. This question is going to be for you in a little bit of a statement. Can you guys hear me? Because it says that I'm muted.
Yes, we can hear you.
Okay, perfect. Mallory and I actually live in the same building. We're neighbors, and we've had several conversations at our doorstep about what our community is going through and how we've individually worked to help through the process. One of the things that it was very clear to us from the beginning is that, unfortunately, in the 39th district, there is absolutely not a single food pantry run by the government or run by a nonprofit that's permanent. And that has led to many of her students and many of my constituents to have to find our office and other places to get food. One of the things, and I reiterated this because I said it before, that is unbelievable to me, is that there is not a single city or state agency taking part of this hearing, answering the many questions that we have. I can't understand why that's okay for them. My constituents are people of integrity, and I thank Mallory for the work that she's doing. But when you have 4 to 5 families being forced to live in a house together, we have to think about the fact that they can't self-isolate. So I know I only have about a minute and a half, and so I want to ask Mallory, has anyone from state or federal government approached your office, your students, your parents to say, how do we help to make sure that you can self-isolate? How do we help to make sure that you have the food that you need, that you have the healthcare that you need? Has anyone approached you and say, other than elected officials, has anyone said, how can we help?
You're on mute, Mallory. You got to unmute. Mallory, you have to unmute.
To unmute me. There we go. Thank you, Assemblywoman Cruz. The answer is no. The only reason that we have gotten as much as we have gotten is because I have done a lot of background work, and I already understood some of the background work that needed to be done. I speak with my colleagues who are also preschool and pre-K operating small businesses and nonprofits as pre-K and preschool centers, and they are closing because they don't have some of the groundwork that I just happen to already understand. And that's not fair. And they're smaller than we are. They don't have the resources to keep their doors open. So not only are they not getting the outreach that they need to keep their doors open when the students do have to go back to school and their parents do go back to work, but they're also not receiving the understanding of how to get even the resources that are available.
Thank you, Mallory. It's incredible that in a country where my constituents have paid billions of dollars in taxes when we most needed the help of the federal, state, and city government, they've turned their back on us. And so I want to close with a quick statement rather than a question and kind of remind people. Dr. Masi from Elmhurst Hospital at a recent chat that we had virtual, one of the things that he said is, if we can't find housing solutions for lots of these folks, we're going to end up with more epicenters like Corona, Jackson Heights, and Elmhurst, because people can simply cannot afford to live individually. And so this is, which I'm hoping they'll eventually watch it, but I'd like to invite our state and our city to leave some of their politics to the side and continue to finally talk to each other, because I've about had it. I've about had it from having to ask questions after questions. Where are the money that was promised to our community? Why are we not helping the nonprofits? Let's stop playing politics and simply help people, because people are dying and we need their help.
Thank you, Assembly Member. We're going to go to Assembly Member Mikhail Salaj.
Thank you to all the panelists. We know that COVID-19 will leave a mark on our youngest New Yorkers, our children. So I appreciate all of you fighting for our youngest New Yorkers. In New York, we're seeing an increase of intimate partner violence, substance abuse, and mental health issues, which in turn is going to leave trauma to our children, or more cases of ACEs. So especially, I'm just concerned for the children of immigrant parents or are undocumented. And Alice, in your proposal, in your testimony, I noticed that you talk about extending the child and family treatment support system to CHIPS and the Essential Plan, which is very important. And like I mentioned before, there's really attack on the federal government. They're not giving resources to mixed status families. And so can you talk about your proposal? And in addition to any of the panelists, we've seen that there's a 54% drop in child abuse reports in New York City. And that's because children are not having access to their helpers in their life, whether it's a teacher, educator, childcare professional. So can anyone speak to how we can tackle that?
Sure. Thank you so much for that question. I can start on the question around child and family treatment and support services, or CFTSS. And these are really critical services that were a real core component of the children's Medicaid redesign. And we're still in the process, as I know many of you know, of rolling those services out. They are designed to be community-based. They're designed to be family-focused. They were created with enormous thought, and they're enormously important for children. But right now, they're only available to children who have Medicaid. And so the CFTSS services, we really do feel like it's important to extend them to the Child Health Plus program as well as the Essential Plan, especially because we know as unemployment is increasing, we'll see more and more families who need to access CHIP and who need to access the Essential Plan. And so we need to do everything we can to maximize the mental health supports that are available in all the programs, especially those that may be available for undocumented workers and their children in a way that Medicaid is not. And I'll leave the yeah.
Can I just add also? I don't know. Can folks hear me?
Yes.
Yes. Okay. So I would just add that as far as those CFTSS services, those are great services to have also in school settings. And I know that Astor provides those CFTSS services, and in the Bronx, we provide them primarily in schools. So to be able to open the access in terms of health insurance, that would be really wonderful. But also, I just want to know that we've had a lot of providers who have pulled out of those services because the Medicaid rates are so poor that we just can't afford to provide them, especially in other settings outside of New York. So it's really critical to expand the insurance.
Okay, thank you. Now we're going to go to Assembly Member Al Taylor. You there, Al?
Do that one more time. Is that better?
Here you go. Go ahead, Al.
Let me repeat myself. Good evening, good night, hello. It's been so long, I'm kind of losing track of what time it is, but it's so relevant. And thank you all for the sacrifices that you made to be here today. And I want to follow up. I definitely want to maintain the, I don't want to become too compassionate because I'm getting a little frustrated because we know what the problems are. We've seen the areas that are problematic, but at the same time, I still don't have any testing sites in my district. So the people in Harlem, Washington Heights, in the 71st Assembly District, they've got sparse people coming in testing. I think we can level the playing field if we're talking, and my good friend Banks here, if we're using technology sooner than later, then why not use that apparatus if there are devices in the homes that we can use that maybe with the folks that wanted to weigh in and see if there's child abuse or something going on, figure out how these agencies can work together. And my question would, if that's doable, it doesn't create too many legal problems. But then to Clayton, what's the immediate way that we can move forward from the state perspective so that we're not talking about something that's going to take boots and fly in 20 years? We barely have 20 days to survive this. And I think it's going to be a lot darker than it was before we started if we're not all on the same page doing it. And I think people are always telling us how we can do our communities, and it's just not happening from the top bottom. It's got to be from the bottom up. So Clayton, if you could answer that. And then someone was talking about child abuse, the numbers. Is the technology a way that we can get into the homes and utilize what we have as we expand?
All right. So first of all, Assemblyman, it's so good to see you, and thank you for hanging in there with us today. In our district, one of the things that I'm finding to be very important is what you've been doing throughout your own oversight is we have to do ecosystem that involves not only the public sector, but it has to involve the private sector, the universities, as well as our stakeholders. And then we get to hear what the citizen has to say. And the reason why I'm saying it like that is because I, in a blasphemous way, I'm actually a for-profit. I think almost everyone else has been a nonprofit on this call. I'm a for-profit, and the reason why is because of that, what you just described. The lack of infrastructure is really a level of telecommunications, and of course, telecommunications is a for-profit business. So I'm here to sort of help bridge that gap for so many people, but it has to be in collaboration with nonprofits because the nonprofits can create the digital literacy and mitigate all those gaps you just described.
Which, of course, NPower is the nonprofit that helps with that digital literacy because we do cultural competent programs for minority populations and young adults. So I completely agree with you, Mr. Banks.
Yeah, we're very, very big fans of NPower, and we have always, followed you and collaborated and everything else. So this is how the ecosystem works. What the Assembly and what you guys can do in Albany is put together resources, especially for things like NPower, which has done a great job to get so many people back into the job force and all that kind of stuff.
Okay, thank you very much. And we know it was a long day. We greatly appreciate everybody's time. We're going to move on to the next panel. Senator Jackson, are you there?
I'm here.
Okay.
Thank you. Hi, everyone. So we have panel number 7, which deals with the area of food and shelter insecurity. And we have Dr. Melanie Samuels, the Executive Director of the Campaign Against Hunger, Sherry Tomasky, Director of Public Affairs for Hunger Solutions New York, Pilar Moya Mancera, Executive Director, Housing Help, Inc. And that's it for now. We've had several panel members that, because of the time, had to leave. But this is the panel that deals with food and shelter insecurity. And with that, I'll turn to Dr. Melanie Samuels, the Executive Director for the Campaign Against Hunger.
Good evening, everyone, or should I say good? Well, it's definitely good evening, everyone. Thank you for the opportunity to testify and to just share what's been going on in our community. I am Dr. Melanie Samuels. I'm the Executive Director and founder of the Campaign Against Hunger, and it's one of the largest anti-hunger organizations located right there in Brooklyn on Fulton Street, 2010 Fulton Street. And we are sharing 21 years of experience with you. Since COVID-19, I want to talk to you first about what we looked like pre-COVID-19. So I just want to get right to it. Of course, we are serving the Black and Brown community, immigrants, those that, of course, have been food insecure before and still is. Before COVID-19, we served 250 families per day. 30,000 individuals, averaging 30,000 individuals per month, infusing 3 million meals into about 151 zip codes in the city. Now let's look at what has happened since COVID-19, and we are talking about approximately 8 weeks or 7 weeks since we really went into full gear to distribute. And in all cases, I must add that we have had a lot of difficulty getting resource into the hands of those that need it the most. And I've been listening all morning to all the panels, and I've heard them echo every time: food insecurity, unable to reach access to healthy food. And hopefully I can address some of that to see how we can work together to make changes. So now, after we used to serve 250 families per day, we are now serving 2,600 families per day. We have a 900% increase, and yes, we are struggling to get the resources, but that's what we've been doing. Since March 16 until present, we have successfully distributed 2.9 million meals to 321,871 individuals. We have established, and we could not have done it without our partners, our policymakers. We have established since COVID-19, 100 new partners on the ground, from public housing, shelters, churches, senior centers, working with ACS. And what is unique now is additional pantries. Pantries are coming to us, asking us for help. We had to hire 50 new staff members. We changed into a curbside distribution. 30% of the soup kitchens are now closed, and that means there is a serious problem. Quickly, let's look at some of the solutions that I think are recommendations that I think must take place. Is that we must, I believe that it's time to work on a task force, working on a coalition that would help us to, on the ground, to help us with distribution, build a new infrastructure, get families involved, create a food hub, and I've been saying this for a while, for healthy food to vulnerable constituency. A warehouse space is needed in the neediest boroughs. 6 months of food must be stored, healthy food, rotating our food, moving it from one area to another, strategizing ways of pinpointing the most vulnerable community in our districts, expanding our mobile market, and we can talk a little bit more about that. Prepare other drivers, because one of the things we found that was difficult, restructure how we deal with our seniors. And I heard about the broadband, and we have it here, keeping in mind the seniors have special dietary needs. Oh God, time. Online food ordering, it's been working. We have used that. It's been effective. We need to expand on that. Work with upstate farmers. That's still, I think there's still work to be done there. Working with you, of course, policymakers, to see how we can get access enough food so that those pre-diabetes, diabetic, hypertension, obesity individuals are not at risk in time of crisis. Restructure our present communication system, which I just heard, create community zone with the ability to pinpoint or to contact those that are in disaster areas, but we have to have that on the ground. So there should be a new zoning how we do this. Participating organization, the task force should be able to testify quarterly on our improvement. We need to have a better way of getting funding, and I'll end with this: support non-for-profits by hiring local. We need support to hire local unemployed individuals, funding for food social media, where we can access. 311 is overwhelmed. We need to look at something different. And I want to thank you for the opportunity to speak. And I applaud you for your effort in taking this step, and ask if anyone wants to visit us. We are welcome to it.
Well, thank you. You're doing God's work on behalf of the people. So you're blessed. So I appreciate that. So next we're going to move on to Sherry Tomasky, Director of Public Affairs, Hunger Solutions, New York.
Thank
Sherry.
you very much. Thank you, Senator. And thank you, all of you, for your patience today during this very important hearing. We're very glad to be part of this. Hunger Solutions New York is a statewide organization that is focused on maximizing participation in federal nutrition assistance programs. Those include SNAP, WIC, the Summer Food Service Program, School Breakfast and Lunch, and the Child an adult care food program. So my comments are actually going to be a great complement to those of Dr. Samuels, who is focused on a more of an emergency feeding model and helping people meal by meal. And I'd like to speak about ways that we could also strengthen the safety net and the infrastructure to help people have access to food benefits for a longer period of time. If we learned nothing from the recession in 2008 and 2009, we learned that it took years for many people who are low income to recover to the point of financial security. And SNAP was one of the most important and cost-effective investments that was made during that time. In fact, research has shown that investments in SNAP had the largest return on investment of any other federal program during the recession of 08-09. And that will prove to be true again during this pandemic if that is how our federal and state governments choose to approach federal nutrition programs. So I'll just caveat my recommendations with a few points. Number one, the pressure on the emergency food system is unsustainable right now. We cannot sustain the level of demand that is on our food pantries and our food banks, and the lines that are miles down the road is not where anybody wants to find themselves. We can relieve some of the pressure by making sure that eligible people are enrolled in SNAP and WIC, and that they're receiving benefits to help get them through a month using those programs. The second thing that I'd like to say is that many people who are applying for federal nutrition assistance programs are doing so for the very first time. And therefore, application assistance and outreach is critical to help people understand their eligibility and understand how to accurately and completely fill out an application so they can get the benefits that they are due. A third point that I'd like to make is that for many people who are receiving unemployment right now, including the $600 federal pandemic unemployment payment, those benefits make many people income ineligible for federal nutrition assistance programs. So the lines of folks that you're seeing at Dr. Samuel's locations and many others across the state are people who have yet to receive those benefits or cannot receive them for any reason, or who are probably food insecure for quite a while and the situation has exacerbated it. But when those federal payments go away, we are going to see an incredible crush of people who are newly eligible for federal nutrition assistance and will need emergency food help as well. And if that happens towards the end of July, we have to be prepared with a safety net that will help those people come August. So what I'd like to make are just a couple of recommendations about ways that the state can help shore up the federal nutrition assistance safety net. Even though these programs are regulated at the federal level and administered at the state level, there's a lot that communities can do. Around SNAP, it's very important that communities are maximizing their SNAP outreach programs and working with their SNAP outreach coordinators in all of their communities. Our organization runs the Nutrition Outreach and Education Program, which is the state's largest SNAP outreach program in the state. Unfortunately, our contract for renewal happens to be hung up with all of the other contracts that are at Department of Budget, and our services are at risk right now. And that will be a big loss for communities if those services can't continue. But it's critical that SNAP outreach be part of every community's response so that people can receive the federal benefits that they are due. My recommendations for WIC are very similar. Even though we've seen a lot of flexibility and relaxing in the federal nutrition assistance program rules, we are not seeing a corresponding increase in the number of people who are receiving WIC benefits, and that's very concerning. WIC may be a program that people need extra help to understand. There may be a lot of preconceived notions around it, and outreach can help combat that. And the last program I'd like to speak about quickly is the Summer Food Service Program, which is a program that will start providing meals to low-income children when school meals have ended for the year. And we expect a pretty significant disruption in the network of providers for that program across the state. And it's going to be imperative that communities coordinate their efforts to make sure that there is a robust network of providers for the Summer Food Service Program to feed children who are eligible. The rest of my recommendations will be in my testimony that I will submit late tonight or tomorrow morning.
Thank you. I mean, obviously, this is so important overall in the whole scheme of things. And we appreciate everything you're doing to make sure that everyone knows what they're entitled to in order to help feed those that are in need. So let me move on to Pilar Moya Mancera, the Executive Director, Housing Help, Inc. Pilar.
Thank you. Good evening, everyone. First of all, I would like to begin by thanking the New York State Senate and the Assembly chairs for giving me the opportunity to share with you what my experiences are working right now with low-income families in the Huntington Station area and the surrounding areas, Huntington Station being one of the hot spots of COVID-19. As I stated before, I'm Pilar, I'm the Executive Director of Housing Help, Inc. And yes, you heard right, housing. It's a housing counseling agency, a neighborhood preservation organization. And our mission is to create affordable housing and to prevent homelessness. Unfortunately, as a result of COVID-19, we have been bombarded with phone calls of former clients, of our clients who were informing us that there was no food available. And as a result of that, we end up starting a program in partnership with the Suffolk County Police Department, the second prison, as well as another church, where using all private funding, right, we have been able to provide 1,000 prepared meals per week. We are also providing 1,200 bags of groceries per week. And also we are doing door-to-door groceries deliveries to families in the amount of 75 families per week. As I stated before, I'm not in the food business. I'm in the business of preventing homelessness, right? Unfortunately, the need is there. One of the biggest concerns that I have right now in terms of the food, right? It's that, and unfortunately, we do know that there are several programs available, but unfortunately, if immigrants are afraid to apply for these programs, right? Because there is such huge fear that actually came from the administration regarding the public charge rule, right? So many of the immigrants are so afraid to apply for any of these programs. Although we try to clear this to them as much as we can, we just have been we have not been successful. In terms of housing right here, what we have found is that many of the families that are the most at the higher risk of being infected with the virus, unfortunately, live in overcrowding conditions. Overcrowding conditions, intergenerational housing, however we want to call it. We're talking about 15 individuals, 18, 20 individuals living in just one house, sharing one kitchen and sharing one bathroom. Obviously, as a result of that, it's horrible. People are getting sick, kids are getting sick, and it's just, it's very, very, very difficult. And another issue that we're seeing is the fact that although there is a mortgage, there is an eviction moratorium, unfortunately, there are some landlords, not all, there are some landlords that are unscrupulous landlords that are evicting immigrants. They're illegally evicting vulnerable immigrants. We have heard cases of landlords who are locking out tenants, landlords who are disconnecting utilities. We recently heard a case of a landlord that sexually assaulted a tenant, and after assaulting her, put all her belongings on the street. What is the solution to that? The solution to that is calling the police, right? But how do we expect these communities who are so afraid to call the police? And that was one of the reasons we partnered with the Suffolk County Police Department. If there's a silver lining that I could see from here, from Long Island, is that the fact that that we have police officers distributing meals every week to those that are most needed, to those that are the most vulnerable, has really helped to build trust, to be, trust between the police and the immigrant community. In terms of to what we are proposing, the changes that we're proposing is on a statewide rent assistance program inclusive of undocumented immigrants. That is extremely important to prevent homelessness. We are also requesting that this rent assistance program will be at least of 75% of the tenant's rent payments. We also suggest that these payments should be made directly to the landlord to prevent the risk of foreclosure. And also we also would like to share with you guys that it will be great if the state will allow the housing courts to appoint arbitrators and mediators for the housing cases, because we know when the eviction moratorium is lifted, the housing courts are going to be there are going to be too many cases that they won't be able to handle. And I guess by having an arbitrator or a mediator, that will actually help both parties try to come into a repayment agreement. And I guess that's it.
That is a mouthful, and thank you for all of the advocacy work that you're doing and being able to be flexible enough to transition, because the bottom line is you're helping people to live and survive. And thank you for that. And is that in Nassau County or Suffolk or all of Long Island?
So my agency serves all of Long Island, but the food insecurity right now is being met in the area of the township of Huntington Station, which is like Western Suffolk.
Okay, very good. Thank you. So, Assembly Member Bronstein, are you there? Okay. So then let's go to Assembly Member Maritza Davila first. Assembly Member.
Yes, this is going to be very quickly. I just want to commend Melanie Samuels. I think we met during the course of this year sometime at the Brooklyn delegation meeting, and I was impressed then. But I do want to first thank you, because we have been working with you. The Bushwick Generator has been working with you. Sun, who is the Sustainable United Neighborhoods. And so together we have been able to muscle up some food and give out almost 2,000 meals a day. And that's thanks to World Chef's Kitchen. But there is a lot of food insecurity, and I want to go back to my brother Al Taylor from Manhattan, and my friend Catalina Cruz from Queens. Not everybody, listen, I was never into gathering food and giving it out until Puerto Rico suffered its massive Hurricane Maria, and I learned very quickly. But we need to set up a system that is going to be sustainable, because at the end of the day, when this food runs out, we're going to have bigger problems. People need to be fed. And if you can feed 2,000 people a day in one neighborhood, right, and spread it out, that means that there's a huge food insecurity all over the city. So I'm just saying that we need to get together. We need to start talking with each other as members and as agencies as yourself that know how to get this food and be able to spread the love throughout the entire city, because it's just not fair. It's not fair that some people get to eat and others don't. We're in New York City. It should never happen. So I want to thank all of you, even Monica, for all your help with the housing situation. I want to thank all of you for being in the forefront of what you do. Thank you. It was just a comment. Thank you, Senator.
Thank you. I'm going to go with Senator Jim Gorin, who's a co-chair of the Local Governments Committee from Long Island. And then I'm going to turn it over to my colleague, the co-chair of this hearing, Ed Bronstein. So, Jim, you have the floor for 5 minutes.
Thank you, Robert, Senator, and you're doing a great job. And thank you to all the witnesses. But I do want to ask a few questions to Pilar, and I want to thank Pilar for joining us here today, but really to thank you for what you're doing on the front line. I visited the other day where you're distributing the food, and the volunteers and the outreach and everything that you're putting together is amazing. And the difficult thing is that food that gets filled up is going out every single day and needs to be replaced. So, I thank you for that. I think one of the issues you raised, of course, was some of the difficulties that everybody's running into with the immigrant community and the landlords who are just blatantly violating the law. And one of the things that I know that you work well with is our Suffolk County Police Department, who are out there, not just delivering food, but also working with the community and trying to break through and get through, this fear that we have, that folks have in this country right now. So I'm just wondering, what can we do on the housing situation when they're just totally violating the law, kicking people out, and doing some of the horrible things, that you mentioned?
All right. Well, so I think what I think it could be done at this point is that the state, right? It could be in touch with the local, now with the townships, and actually each township, especially on Long Island, they have they have a public safety department, and they are aware. The municipalities are aware of who are the landlords, which landlords have several tenants. If we could get the word out to the landlords, stating to them a message from the state or the county or the townships stating that there will be severe consequences to these illegal evictions. It's one of my frustration is that I spending a tremendous amount of time trying to get the community and the police together. And yes, some of the community members are no longer afraid to call the police. And to me, that's success. But still, it needs to come from both parts, from the tenants and also from the landlords. As I stated before, also from the state, I am so concerned about the tremendous number of housing related cases and evictions we're going to have when the moratorium is lifted. It would be great if we could start appointing, arbitrators and mediators that can help the landlord and the tenant come together to try to work out a repayment agreement that will prevent, from the landlord's point of view, will prevent a potential foreclosures, and from the tenant, it will prevent an eviction. One also needs to be and have this. Sometimes we tend to forget that not all landlords, right? Not all landlords are rich and wealthy, and not all landlords are evil, as well as not all tenants are deadbeat tenants. And it is very important that we also work with the landlords, especially right here on Long Island, where most of the rental housing, the very little rental housing that it's available, it's owned by the small homeowners, right? These are all very small landlords. They're small business owners. So I would suggest to keep that in mind too.
Okay, and you also, of course, mentioned, unfortunately, the big problem we have with overcrowding within the community as well, which, Huntington, had a very high case, especially early on of COVID because of it. I guess really the answer is we just need to figure out ways we can provide more affordable housing so that, we don't have such overcrowding conditions.
Absolutely. Mm-hmm. Yes, absolutely. We absolutely need more affordable housing, and also if we could ease up on the regulations for the accessory apartments, that might also help create more rental housing for for many who really need it. But even that, getting the paperwork necessary to have an accessory legal apartment, that process is very long, it's lengthy, and it's costly.
Thank you, Pilar. And then thank you, everybody.
Okay, thank you. Now we're going to go over to the Assembly. We'll have Assembly Member Mikhail Salaj. Can we unmute Assembly Member? Good.
Well, thank you to our panelists. The next shockwave of COVID-19 is the food crisis, and especially for our communities of color who are already challenged with accessing healthy, nutritious food. Really, it shows that our food system and the whole way we organize providing food for supplemental food for individuals is at stress. I know that the USDA has a new program. It's called the Farmers to Family Food Box Program. And recently they doled out the contracts, and I noticed that the Northeast region received the short end of the stick. We have some of the lowest monies that were allocated in the federal level. Have any of your, and just for background, some of that money is used to support farmers to buy their food and also to give local community groups food boxes that come with the locally sourced food, keep it regional. So has any of your organizations seen any benefits from the USDA work? None?
I can speak on behalf of not that particular program. I know of it, but I'm not well versed in it. USDA has been in a position to have to grant waivers and flexibilities to the state to operate the programs in a variety of different ways. There have been some cases where USDA waivers came swift and they were effective. And in other cases, it was not swift and not effective. New York waited 6 weeks for its pandemic EBT program to be approved, and that happened last week. That's a program that will provide food benefits on a card to every single child getting free and reduced price meals from school. 2.1 million children will receive this benefit between now and August, and our state agency has the completely unenviable task of standing this up in a short period of time. But USDA spent an awful long time getting that waiver approved, and a lot of families are missing out on those benefits as a result, just because of the 6-week delay. We do think that there are actually 2 waivers pending at USDA right now from New York State Education Department. One, to waive the area eligibility requirement for summer meals, so that just like schools are right now, summer meals can serve children all throughout their community and not just those individual students eligible for free and reduced. So that would open up another food program in the summer, but USDA has not approved that waiver. The other waiver that's pending is to increase the reimbursements for the summer food service program to make that program viable for programs that want to run it locally, because the food packaging costs and transportation is not reimbursable, and it's making that program completely unsustainable. You know exactly what I mean.
Yeah, we see the farmers upstate dumping the dairy, and it's no fault to their own or getting rid of produce, but they're saying that they have no means to package it, and all the New York packagers are not providing any support. So definitely. Have any of you seen a need for diapers increasing?
Yes.
Yeah?
Yes, there is a need for diaper increase.
Okay.
But of course, we don't have the resources.
Mm-hmm. Okay. And the food hub idea, I think it's essential. We need to open up a food hub in every region, and 6 months is a doable, goal to ensure that we give a healthy food that is culturally sensitive to different areas and different communities. So thank you. Kudos. Let's fight hunger.
Okay,
Right.
thank you.
I just want to add, if possible,
Go ahead.
that presently we are in a temporary warehouse space, and that has allowed us to increase our distribution, I would say maybe 400% or 500%, in the sense that we can social distance, and we have far more staff, far more volunteers, and trucks are moving in and out at a rapid speed, and churches and everyone else is coming in and picking up. And like I mentioned, it is strange to see pantries are actually coming to us for food because they don't have enough, and we are one of the only pantries that are distributing a high volume of fresh fruits and vegetables.
Okay, thank you. Now we're going to move on to Assembly Member Latrice Walker.
Awesome, thank you. So of course, Dr. Samuel, you know, the president of your fan club, at least for this line, is over here. And I just wanted to note, though, that with all the tremendous work that you're doing and feeding nearly 2 million individuals, can you tell me how much of those resources that you've received actually came from the state? That's what I'm a little unclear on.
We have not gotten any state funding.
So there was, I believe, in our last budget round, I believe there was $25 million that we allocated to go for food resources and food distribution. And so I'd like to know where that money is and why it is that it's not on the ground, you know, where it needs to be. Well, because clearly there's a need. And also to make a point that not only are you doing work and we're ready to do the work during this because you've been doing it for so long without any state resources, that there also some need with respect to mobility to move the food around as well. And so could you speak to your needs when it comes to sort of transportation and mobility as well?
Okay, so thank you, Assemblywoman Walker. Appreciate that. What we have done different is that we have been working on the ground doing individual delivery. We increased the online services, but for the vast amount of deliveries, we have to be renting trucks because we cannot, as an organization, we don't have enough vehicles to move in all these boroughs. And we are not only in Brooklyn, we are in Rockaway, we're in parts of Queens, we're in South Bronx. And so we have to rent, and it costs us, just one vehicle per week costs us over $1,000 easily. So it's been very difficult, it's been very trying, and we don't have enough support. And I have mentioned the 6 months hub, and we need one in Brooklyn. We have seen it too many times in crisis. And the thing is that with that hub, we want to make sure we have sufficient lean meat because that's important to the diet of those that we're serving. We also want to make sure we can at least have a lot of fresh fruits and vegetables and staples, of course, 6 months rotating, moving. I believe that we can really make a difference. Transportation is going to be a key component. And at this time, I'm looking to purchase, we have to purchase a 26-foot truck ASAP.
Okay, thank you, everybody. We from panel number 7, we appreciate your time and your patience, and thank you very much. We're going to move now to panel number 8. This panel will consist of Alice Fontier, Managing Director, the Neighborhood Defender Service of Harlem, Young Soo Choi, Chair, Korean American Civic Empowerment Legal Task Force for the Protection of Immigrants, Adrian Holder, Attorney in Charge, Civil Practice, Legal Aid Society, Deborah Axt, Co-Executive Director, Make the Road New York, and Carolyn Martinez, Class, Organizing and Policy Coordinator, Communities United for Police Reform. We'll start with Alice Fontier, if I'm pronouncing that right, Managing Director, the Neighborhood Defender Service of Harlem.
Thank you. You are pronouncing that correctly.
Okay.
And I'm glad there's still some people here this late in the evening. It's good to see all of you. As noted, I am the Managing Director of the Neighborhood Defender Service of Harlem. NDS is a public defender office serving the Northern Manhattan community. Our clients all come from the communities in Northern Manhattan, that is Harlem, East Harlem, Washington Heights, and Inwood. Serving just these communities for the last 30 years, we have seen over these 3 decades the disparate impact of the economic and racial injustices that have always existed. The current public health crisis has heightened these realities, and unless the city and state dedicate resources to our community, the negative toll will be devastating and long-lasting. As the number of those infected and killed by the coronavirus continues to disproportionately impact communities of color, we are also seeing the devastating impact of the legal system on our community. There is no doubt that public health measures implemented by the governor and mayor are essential to health and safety of our entire city. Yet the most vulnerable communities are experiencing a more profound impact. The existing challenges of poverty, made worse by this crisis are compounded by systemic injustices within the family, civil, and criminal systems. These issues will be further amplified when the court system begins operating at full capacity again. Even worse, we are now seeing the legal system being weaponized against communities of color in the name of health and safety. Just 2 weeks ago, we saw that the NYPD added officers for the purposes of enforcing social distancing. Immediately, as many of you know and have commented on today, images and videos of officers assaulting, pepper spraying, and intimidating people of color emerged. These stood in sharp contrast to images of park workers and police officers in wealthy white neighborhoods politely distributing masks to people who are outside gathered enjoying the sun. The enforcement of social distancing rules is not the only example of the racially biased impact of the legal response to COVID-19, but it is one of the most visible. This is ultimately a health crisis. Issues like these should not be left to law enforcement. One of the things that we need to immediately do is look at how we are enforcing social distancing and how we are treating people. We should be treating this as a health crisis, and people who are enforcing these measures should not be law enforcement, but should be from the health department or from any other institute that does not have powers to arrest. The Administration for Children's Services has long operated from the presumption that people of color are inherently less capable parents. ACS and the Family Court are continuing to separate families despite the fact that family support is even more critical during these times of forced isolation. We have seen newborns separated from their mothers, sometimes without a court order. ACS accuses our clients of being non-compliant with supervision when they are simply trying to enforce social distancing rules by asking ACS workers to stay at the door. Yet, at the same time, many of our clients who have children in the foster care system have been unable to actually see their children since the crisis began. The foster care agencies are shutting down and stopping all in-person visits, permitting only visitation by phone or by Zoom, which, as you may have experienced from this very long hearing today, a Zoom appearance is not the same as an in-person visit. That is particularly true with small children. Despite the eviction moratorium, our clients are still not guaranteed the safety or stability of their homes. We have seen landlords attempt to circumvent the law and illegally evict tenants. Even for those who remained housed, landlords have refused to provide services like bathrooms, heat, and mold abatement, basic essentials that are ever more vital when there is no choice but to shelter in place. Our clients were living on the edge of extreme poverty prior to the current crisis. Now they are, the economic toll on our community has yet to be fully realized, but almost certainly when the eviction ban is lifted, there will be a substantial housing crisis in need of immediate protective action in the legislature and the courts. I realize I'm almost out of time, so I just quickly want to say that the crisis of COVID-19 in the jails is absolutely still happening. It is at a peak. 81% of people across the state who have died from or have been diagnosed with COVID in jails are people of color. We need to stop, we need the governor to grant clemency. We need to pass the HALT solitary confinement bill. Solitary confinement is worse during the coronavirus. It is not actual isolation. They are forced to be escorted at all times and in close contact with officers who are bringing the virus into the facilities. So there are many things that we can do. And I will just close by saying that, I live in fear that there are cuts coming from the state budget, and that in the name of equality, there will be cuts across the board, which is what we keep hearing. But we live in an inequitable world. If there are cuts that are made just across the board, they will hit the vulnerable communities the hardest. Nonprofits, legal defense organizations must remain funded, because the need is going to be greater when this crisis ends. And I'm sorry, I realized I went a little over time.
Got it in. You got it in. Thank you very much. Now we're going to move to the next speaker, Young Soo Choi, Chair of the Korean American Civic Empowerment's Legal Task Force for the Protection of Immigrants. Mr. Choi, please go ahead.
Thank you. Good evening, everyone. Taking this opportunity, I'd like to express my gratitude to all colleague nonprofit organizations, as well as elected officials for doing critical works for the minority and immigrant community day and night. I'm Young-Soo Choi. I'm the chairperson to the Legal Task Force for the Protection of Immigrants under Korean American Civic Empowerment, a New York City based nonprofit organization. To cope with the community crisis, CASE has created and run task force consisting of 5 volunteer attorneys to assist Korean American small businesses and unemployed individuals for about 2 months now at home, and assisted over the phone about 700 callers, primarily from Korean American community, which is in highest small business rate. That community almost lacks a good command of English. So we generated information and provided information to the community on information on federal assistance program, including EIDL, PPP, stimulus check, mortgage payment, and state unemployment insurance, rent payment. Based upon our experience during these critical times, we have witnessed some degree of systemic and structural issues in all levels, executive and legislative levels, and all federal, state, and county and city levels, which is getting improved, especially under this cruel anti-immigration policy taken even amid the pandemic, including suspension of immigration and revised public charge rule in effect right now, which ultimately disproportionately providing adequate information and financial assistance during this pandemic, and taking early preventive actions in providing health safety. And we are also seeing some degree of a similar pattern among American people: hate crimes, racism, non-compliance with the wearing masks, social distancing rule, and protesting for premature opening businesses. These are unprecedented and unwanted events appear to be happening from the lack of proper government functions and the vacuum in government services created by government closure. With that, not only new green card holders, mixed state family, and undocumented individual, but also United States citizen immigrants are especially vulnerable during this pandemic in terms of their ineligibility and inability to get an access to government financial assistance and health and safety due to the immigration status. With that, further pondering over the role of a government, I'd like to recommend the followings to protect disproportionately affected minority community from the perspective of first-generation Korean American, based upon my individual observation. These recommendations are directed to state elected officials and state government. We have not seen direct and collective efforts from New York State government and elected officials, so that I feeling that the elected officials and government must proactively engage with the nonprofit organizations and community leaders in more aggressive manner. Personally speaking, I see more community engagement in election years or season than during this pandemic. That's my personal observation. With that, I'd like to recommend some of the government actions. The New York State government and elected official, as a representative of immigrant community is to set up a more reliable and more accessible state system with a full mobilization of government functions from all relevant departments, effectively and directly disseminating information with the resident in various languages, providing information on government disaster assistance and public safety, and therefore mitigating the fear of federal public charge rules. Secondly, I'd like to ask the government and elected officials to expand the state health program, expanding New York State Family Health Plus, an essential plan to ultimately reduce the spread of disease like COVID-19 and to mitigate impact from public charge rule. Thirdly, I'd like to ask governments and elected officials to revisit the fundamental problem within the government function by implementing programs to educate public servants who appear prioritizing safety of their own over public services on spirit of public services and build a program to monitor performance, increase job performances, and by updating outdated online system, especially Department of Labor, online system for unemployed.
Mr. Choi, we're well over 5 minutes. Are you almost done?
Almost done, yes.
Okay.
Okay, two more things. Fourthly, I'd like to ask all the elected officials and government to, quickly introducing and passing relevant bills in partisan manner. Especially, I'm seeing the rent cancellation bill, which has been pending with the state for a long time. And lastly, I'd like to ask all New York State government and elected officials to establish some kind of a channel and ways to communicate with the federal level, elected officials for this disproportionately affecting federal assistance program and policies under the pandemic. Thank you for all listening. I look forward to some questions and your position you may have about recommendation I made, opening some discussion on what state and elected official can do for the.
Thank you very much.
Thank you,
Mr. Choi. Now we're going to go to Adrian Holder, attorney in charge of civil practice at the Legal Aid Society.
So good evening. Can everyone hear me?
Yes.
Great. So we have a lot of ground to cover here, and I know I have a limited amount of time. I'm Adrian Holder. I'm the attorney in charge of the civil practice of the Legal Aid Society, and I'm representing the entire organization, our criminal defense practice and our juvenile rights practice. You heard from some of the previous witnesses who have testified today and even on this panel, what are some of the challenges that are facing our clients, and it should come as no surprise to anyone when you think about the systemic issues that our clients face as being low income and people of color, that the COVID-19 has just brought our communities to their knees. But I'm actually here because I actually feel really good about the fact that I'm actually testifying before so many of you all who understood what those issues were before this pandemic, who understood so much that half of my recommendations are to pass legislation that you have already introduced, that we have worked with you all for years. Some of you all I've known for years when you all were activists and now you are public servants. And we have worked together to do some wonderful things here in the state. And we were asked that we be able to push forward and use this as an opportunity to actually have some real reforms. Crisis demands redefinition, and I think there's room here for a lot of things to be redefined. The housing crisis is huge, and it's not just an issue of kicking the can down the road. The issue is that we need to talk about what it is that we are going to do to be able to not only make sure that housing is affordable, but actually keep people in place. What we're looking at right now with this health crisis is we're looking at a public health issue that people need to remain in place. So the housing insecurity impacts are far broader than the households that we're talking about and that we even represent, because with this kind of pandemic, the fact that people become homeless becomes an issue, or have to live overcrowded and doubled up becomes a health issue for all the rest of us. And so we would ask that the legislature should enact the Safe Harbor Bill, and this bill would amend the RPAPL to provide that during the state of emergency and through 6 months after the state of emergency is lifted, no tenant can receive a judgment of possession for a case brought
by his or her landlord for non-payment of rent. And it would allow, and another piece of legislation would actually, or the same legislation would allow the tenant to remain in their home, but allow the landlord to pursue a money judgment against the tenant. The legislature should also enact the Good Cause Bill, and so happy to see our folks here who have been wonderful advocates in this area. But that would extend the right to a renewal lease and protection from unconscionable rent increases to all tenants across New York State, even those living in owner-occupied buildings with 4 or fewer units. We also would like to see that the home stability support bill would create a statewide housing supplement program providing payments up to the fair market rent. Again, you all have been visionary on this, so many of you all even on this call, and so we're saying we already have these bills introduced, why don't we pass them? The legislature should also enact the Housing Access Voucher Program, which I actually testified about, I think at the end of February, before we all had to start to sequester from within, which would create a statewide Section 8 program and provide homeless and low-income New Yorkers with access to stable, safe, and affordable housing by providing housing vouchers and capping the tenant's rent at 30% of household income. We also understand that there needs to be more emphasis. We're so happy that we've been able to advocate with you, so many of you all, and with the state to request waivers from OTDA on the ways in which people can apply for emergency assistance. We've seen there has been a tremendous amount of food insecurity. I don't need to tell you that, but it has gotten even worse in the last 2 weeks. And we would like to see that there would be ways in which immigrants and other folks who might find themselves without the ability to get some safety net benefits, that they would also be able to benefit from that. We also think on the side of employment and what you're dealing with low-wage workers and the disparate impact that this crisis has had with them, that we would like to address some of these systemic problems with raising the unemployment insurance rate. The state is lowest around its neighboring states, but also now that the federal government has created the Pandemic Unemployment Assistance Program for workers who are eligible for UI, including independent contractors, the state seems to have taken an unlawful position that Uber drivers and Lyft drivers and other similarly gig economy employees can't get it, which is in contravention of a case, the Postmates case, that has shown that these folks are actually employees. I know I'm running out of time, and I haven't even gotten to some of the criminal and the juvenile rights issues, but I guess on terms of the weaponizing of things that are going on in our community, we should also know that not only are we looking to roll that back and making sure that our communities are protected, but we're also very much concerned that what we're seeing and what we've been able to do in terms of getting folks out is that we'll continue to see that. The idea that we've gotten hundreds and hundreds of people out of the state prisons and out of Rikers, and the fact that we, along with some of our partners, have gotten over 150 detained immigrants out, just shows that it was unnecessary for those folks to be in the first place. And so we need to continue to build on that, not only because it's safe and safer for these folks to be out in the community where they don't have to be in these hotbeds of disease and with the pandemic, but also because it just doesn't make any sense that we had so many people being held and with their loss of ability to be around their family and in the communities. In conclusion, we just look forward to working. I look forward to the questions that we can talk about, but we look forward to working with you all because, again, this is a real opportunity that we are sitting here and we are ready, I think, to implement so many of the things that you all have already started to do even before this pandemic to try to deal with racial equity and actually doing what's best for all of New York State. And it's especially critical during this time of the pandemic, which we're going to have to live with, not only the effects on our economy, but we're going to have to live with the idea that there will be no return to normal, and normal didn't work anyway, but at least for another year. And there's a lot of things that we can do to try to help out all New Yorkers through dealing with these issues that you all have already identified. And I thank you for your time.
Thank you very much. Next, we're going to go to Deborah Axt, Co-Executive Director, Make the Road New York.
Thank you so much for sticking around till the end of the day. The substance of this conversation has really given me a lot of strength and hope. And thank you for allowing me to testify on behalf of Make the Road's 25,000 members, most of whom are Black and Brown community members living in epicenter communities, including a huge portion in Jackson Heights and Corona, Queens. We work in New York City, Long Island, and Westchester. And our staff, English teachers, community organizers, health access case managers, and attorneys are supporting, guiding, and representing thousands of families and workers weekly, and are leading hotlines, text blasts, robocalls, mass town hall meetings, and huge webinars to reach tens of thousands more. I guess it's safe to say the situation is ugly for our members. Every week we commemorate those among our member leaders that we know we have lost to COVID-19. This week, the list surpassed 60. I can only hope to carry their spirit and that of their families to you a little bit this evening. Last week, we released a report, Excluded in the Epicenter, based on a study that we conducted of several hundred of our members. The results are horrifying. 92% of households have lost at least one breadwinner, and 84% of all folks interviewed were unemployed. 5% received unemployment benefits in the last month. More than half couldn't pay April rent. 89% couldn't pay May rent. You know what happens in June. Our people are working in essential jobs, delivery, cleaning, home health care, Amazon warehouses, where the richest man in the history of the world is about to be a trillionaire, but workers don't have time or supplies to sanitize and can't even take unpaid time off. Don't come home to our neighborhoods and say we couldn't afford to help. Undocumented workers cannot get a single penny from the unemployment insurance system or pandemic unemployment assistance. When our undocumented brothers and sisters lose their lives or their jobs, how exactly do we expect them and their families to stay home and maintain social distance? Their families are running out of food. Their landlords are banging down the doors. Last week, Jessica Ramos and Carmen De La Rosa held a briefing, and we heard from two men with very different stories. Morris Pearl, a millionaire, who shared that April was one of his best months in recent memories, and that none of the income he received was taxable. And Patricio Santiago, a car wash worker who usually works 12-hour days to feed his 4 citizen children, had an April where his job was gone and his family is now destitute. You can afford to help. Federal funding will help. The mark-to-market billionaire wealth tax that Ramos and De La Rosa proposed would provide around $5 to $5.5 billion this year. You can close the carried interest loophole. And this is an emergency. Use the Federal Reserve's municipal liquidity facility. And what we need you to do, I'm gonna focus just on the absolute emergency interventions to stave off death and homelessness in our neighborhoods. We need a $3.5 billion excluded workers emergency fund, and we need it now. Income replacement for excluded workers and immigrants who have lost their family breadwinner to COVID. We need weekly or monthly benefits. It can be simple and easy, but it should match what a typical low-wage worker makes in unemployment, about $750 a week, through the end of the crisis. The mark-to-market tax and worker bailout fund that Senator Ramos and Assemblymember Carmen De La Rosa have introduced still fulfills that need. We need to cancel rent and suspend mortgage payments, extend the eviction moratorium for the rest of the emergency, plus 2 months to let people get out of it. And the rent solution must make sure that landlords who get relief trade it for tenant protections, the right for a new release to a new lease, and the right to no renewal of their rent. And of course, include renters regardless of immigration status and cover workers in the informal economy too. And please, we must decarcerate folks. The folks who are not at home, imprisoned, and without income are in jails, are in detention centers, are in cages. And we must rescind fines and civil and criminal penalties that exacerbate that situation. Thank you so much for standing with our communities. We're counting on you now, and we need you badly.
Thank you very much. Now we're going to go to the last speaker on this panel, Carolyn Martinez Class, Organizing and Policy Coordinator, Communities United for Police Reform.
Thank you for inviting us to participate in today's hearing. My name is Carolyn Martinez-Class, and I'm testifying on behalf of Communities United for Police Reform. My comments will focus on the issue of abusive policing action and enforcement during COVID-19 and its damaging impact on New Yorkers of color. In this time of heightened fear and anxiety, it's outrageous that our communities must contend with abusive policing as well. Over the last few weeks, we have seen viral video after viral video pertaining to NYPD's so-called social distancing enforcement. The limited data that has been released by the city tracks with what we're watching in these videos. In one report, 92% of social distancing related arrests were Black and Latinx New Yorkers. However, the disturbing trends we see in these videos and the data are only the tip of the iceberg. CPR and CPR member groups have done intake on multiple disturbing and violent incidents where excessive force was used, individuals were pepper sprayed, officers retaliated against individuals for asking for officers' identification, even though that's within their legal rights in New York City. There have been unconstitutional stops and searches. And in many of these interactions, no arrest or summonses were issued. The thing is, these bad practices are not new. Before the start of the pandemic, it was overwhelmingly Black and Latinx New Yorkers who were being stopped. Year after year, 80 to 90% of reported stops are of Black and Brown New Yorkers. These practices are being rebranded during COVID. The state legislature has a critical role to play in efforts to address this issue. When the Senate and Assembly reconvene, we urge you to prioritize the passage of the Safer New York Act, including the Repeal 50A, the Police Stat Act, the Marijuana Regulation and Taxation Act, and the Perry Bailey Special Prosecutor Bill. One of the tools police departments use to hide information from the public about misconduct and discipline is 50A. 50A allows departments to block information, including misconduct complaints made to civilian oversight agencies and outcomes of police disciplinary trials. New York is one of 2 states in the country that has a law in the books specifically prohibiting the public release of police misconduct information. The lack of police transparency and accountability continues to be a serious issue in COVID, and it is exacerbating tensions in communities of color because of the special secrecy rights afforded to police. Many of us saw the video of Donnie Wright being beat and arrested by an NYPD officer in the Lower East Side. Officer Francisco Garcia has a history of wrongdoing. He's been named in 7 separate civil lawsuits since 2015, the settlements of which have cost taxpayers $200,000. Because of 50A, it's unclear whether Officer Garcia ever went through any disciplinary processes related to those lawsuits, what the outcomes of those processes were if they occurred, or whether there are other instances of misconduct in his record. This is just one example of why 50A must be repealed. Officers like Francisco Garcia should not be empowered to be engaging in social distancing enforcement. On the other hand, officers who have patterns of being in abusive interactions with the public should not be on the force at all. In the same incident involving Donnie, NYPD claimed that they approached 2 people initially for social distancing enforcement. One of those people wound up being arrested for marijuana possession. This is one of multiple incidents where social distancing enforcement was used as the pretext to initiate and escalate interactions, which resulted in unrelated charges and people being physically harmed. That's in the context of marijuana possession having been decriminalized since 1977 and further decriminalized by the legislature in 2019. That's why the legislature needs to pass the Marijuana Regulation and Taxation Act. Another key issue that has become more apparent during the crisis is the lack of comprehensive police enforcement data of social distancing enforcement, especially as related to low-level encounters. The Police Stat Act is a bill that would require statewide reporting on low-level enforcement for violations and misdemeanors and comprehensive reporting on deaths and killings occurring during police activity. New Yorkers of color are not only dealing with devastation through the loss of lives in this pandemic, they're also contending with abusive and discriminatory policing. The viral videos of police violence resulting from social distancing enforcement we've seen over these last few weeks should outrage all of us. But it's necessary to name that these types of interactions are too commonplace for Black and Latinx New Yorkers. The only way to meaningfully move forward is to prioritize police transparency and accountability. The legislature must fully repeal 50A, must pass the Police Stat Act, the Marijuana Regulation and Taxation Act, and the Perry Bailey Special Prosecutor Bill. On behalf of our allies at the Releasing Aging People in Prison campaign, we also urge the legislature to pass legislation they have prioritized to help save lives and mitigate the racially disparate harm that COVID continues to inflict on communities of color impacted by our state's prisons. Since the first COVID-19 related death in the New York State prison system, 81% of the people who have died behind bars in New York State prisons are people of color. While Black New Yorkers make up roughly 14% of the state's population, they've represented nearly 60% of deaths in state prison custody in the era of COVID. It's time to act. Thank you.
Right on time. Thank you very much. So I'm gonna take an opportunity to ask a question now that our witnesses are over. My question is for Mr. Choi. We've heard several panelists today discuss the impact that the public charge rule at the federal level is having on non-citizens seeking out and obtaining benefits. Can you expand on what you see with the Korean American community with that, and if there's anything that we can do at the state or city level to ameliorate the problem?
Yes, as you all know, starting February 4th, the revised federal public charge rule has been in effect right now. So we had some educational seminars and community education sessions. We're feeling that most of the immigrant, especially undocumented, fear of applying for what is allowed to apply. And so under these circumstances, we have some of the fund coming from federal government, the food pantries, and also other benefit that undocumented immigrant can receive. So I like to focus on the state action to expand state health program.
Let me ask a question just so I can understand it myself, because I'm not entirely familiar with the public charge rule. So if you're a green card holder who has aspirations to eventually obtain citizenship, and you seek out and obtain benefits, whether it's Medicaid or SNAP, you're hindering your chances to obtain citizenship under the public charge rule? Is that how it works?
Yes, once you have a green card, you don't have to worry about getting public benefit. But if you're undocumented status, non-immigrant visa holders seeking for adjustment of status, to file for a green card, that is the most critical factor to apply for green card applications.
So it does hurt your chances to get a green card if you are obtaining benefits. So it's
yes.
Okay.
So especially starting April 24th, the Medicaid is part of the big problem. There's a lot of restriction on receiving Medicaid. So I like to ask the elected officials to focus on expanding the Family Health Plus and Essential Plan, which are the New York State health program, that are considered to be not a problem to public charge rules. So I like to ask the elected officials to investigate the ways to support the immigrant community, not putting them into this kind of immigration trap, so that they ultimately cannot receive immigrant benefit in the long term.
Okay. Thank you very much for that recommendation. And now to you, Senator Jackson.
Thank you. So we have quite a number of senators and people wanting to speak. So we're turning to Julia Salazar, the chair of the Women's Committee in the State Senate.
Thank you, Chair. Thank you all for your testimony. First, I really want to express my deepest condolences to the families of the 65 Make the Road members who have lost their lives to the pandemic. I want to talk a little bit about the NYPD enforcement of social distancing that Carolyn spoke about. As you all probably know, a few days ago, the mayor announced that the NYPD is not going to continue to enforce social distancing rules, that they won't be issuing summonses, at least, and making arrests specifically for social distancing, but instead are launching a pilot program in public spaces to monitor crowds, etc. What is your opinion on, is this enough? Certainly it doesn't speak to the policy recommendations that you made, but do you think that this will have a positive impact, that this will effectively reduce the number of arrests of people of color, or at least the disproportionate number of arrests of people of color during the pandemic and for as long as we have to be socially distancing?
Thank you. I'm happy to take that question, RG.
Yeah.
Okay. So quickly, my answer is no. I don't think it's enough. I don't think it will solve the problem until there is a very clear rule that the NYPD cannot approach people because of social distancing rules. They will continue to use it as an excuse. It was immediately in the first weekend that the NYPD was enforcing these rules, it was clear that it was the new version of stop and frisk. They made 40 arrests in one weekend, 39 were people of color. There were over 20 videos that surfaced on social media in that first weekend of brutal interactions, pepper spraying, assaults, as I mentioned, all people of color. And so even though if we're saying we don't enforce it, it doesn't mean that the NYPD can't use it as a reason to stop and talk to somebody, as reasonable suspicion. There are videos of NYPD just sitting in their cars on blasting over their loudspeakers in public housing units that people had to go inside to stay out. And in this time, the idea that people can't step outside of their home, get some fresh air, it's simply cruelty. And I think as long as the police are enforcing these rules in any way, or allowed to at least address these rules, there will continue to be disparate and unacceptable impacts on communities of color.
The other thing I'll add is that Communities United for Police Reform has actually been calling for an end to low-level enforcement and broken windows enforcement since mid-March, having identified that this would be an issue. And part of the problem is the mayor's language that was released around the end of NYPD's social distancing enforcement explicitly says that enforcement will continue if there are other kind of behaviors or violations that are found. And so it actually does not address kind of what the core issue is. And we've seen repeatedly in so many of these cases that interactions that began as social distancing enforcement have resulted in separate charges if people are charged at all. We actually know of a few cases where folks have been pepper sprayed, where folks have been like physically harmed, that haven't resulted in any summonses or any arrests. So that's kind of the place that we're at in this moment.
All right. I have a little bit more time, so I'll try to fit in one more quick question for Mr. Choi, because you mentioned the term cancel rent. There are multiple bills proposed in the legislature that would effectively suspend rent payments. They differ in terms of scope, I guess. But how, one of the, as part of the resistance that I've heard to at least the legislation that I introduced, for example, is how the state would cover the potential fiscal impact, perhaps more than $1 billion that would be needed to provide relief for property owners or mortgage servicers. What's your response to that? And what might you propose for addressing the fiscal impact?
Julia, who were you addressing your question to?
Mr. Choi, if he's...
Okay.
Sorry. Okay. Right. We've been, monitoring the progress in, a state assembly and Senate I know that has been about 45 days since that bill was introduced. I just want to find out that if anyone can answer on that bill's status right now. A lot of people has to worry about the paying rent when we end this pandemic period. So this will be the key, legislation to immigrant community, especially in Korean community, where small business owners simply paid lots of rent. Not many people owning their commercial commercial properties to business with. So I just want to find, if you can answer some of the progress made in that particular bill.
I'm unfortunately out of time, but hopefully one of my colleagues can respond to that or speak to that if they're willing to use some other time.
Sure.
But I appreciate your response.
Ed, let me just respond quickly. To Mr. Choi, we have two work groups in the New York State Senate. One deals with COVID-19 housing work group and COVID-19 revenue work group. We're going to be discussing those, I believe, in conference tomorrow. We're considering all things to try to help not only tenants and homeowners and small businesses. We're going to try to do our best, and obviously Gustavo Rivera had mentioned throughout his tenure in this hearing process, revenues. So we have to raise revenues in order to get the job done, and it takes three to dance in the state legislature. The three leaders and 150 state assembly members and 63 state senators, or the majority thereof. So that's what we have to do, and you should be hearing what we're going to be doing within the very near future.
Okay, thank you, Senator. We're going to go to Assembly Member Mike Riley, the ranking member of the Cities Committee.
Thank you, Ed. Thank you to the panel. First, I know I said this earlier today, but I wanted to make sure that I address this in this panel. The social distancing enforcement by the NYPD, as I've said from the beginning, they should have never been charged with enforcing social distancing and facial coverings. I thought immediately that was going to drive a wedge between communities, and obviously it has. I think they should have been strongly encouraging social distancing and wearing facial masks. Ironically, back in 1918 with the Spanish flu in New York City, the mayor of New York City authorized the health commissioner at the time, Copeland was his name, and health department workers were giving police status to issue summonses and arrests for people spitting on the sidewalk. So this is nothing new. This has been something that obviously has been an issue in communities and society for a long time. But I do believe that this did open the opportunity for some oversteps and definitely something that I don't agree with. I also was deeply troubled by watching the videos. It was unnecessary interactions that didn't have to rise to that level. And being a former supervisor in the NYPD and an officer, I truly do feel that way. And I want you to understand that. You touched on, some of the conversation here touched on 50A. Now, I want to be clear, there's another side to 50A. Now, and I do believe that we should weed out officers that definitely should not be on the force. But remember, those lawsuits that you mentioned, a lot of them are frivolous. I received 2 to 3 lawsuits as a police officer. I did not even get a chance to represent myself in court with the corp counsel to defend myself against those lawsuits that were had no factual basis. I wanted to go to court. I was not allowed to. They settled out of court. So if you looked at my record, you would have thought, wow, he got sued 3 times for excessive force. I was willing to defend myself. I could not. The city automatically settled. That is something that needs to change. So you have 2 things at City Hall and the executive in the state as well. They're the ones that put the charge for the police departments to enforce social distancing. They're the ones that decide who's going to settle those lawsuits. Now, on the other end with 50A, you have Civilian Complaint Review Board. I received 4 civilian complaints as a police officer, 2 from the same individual. That individual, on the second one, was filing the complaint because we arrested him. He tried to take my firearm. I had to hit his hand numerous times after he pulled me down in an SRO. We were on top of him. He's trying to get my gun. And the reason why he was being arrested is because he assaulted and he brutally beat his prostitute wife. He was her pimp. In order for me to get him to stop getting my gun, I had to punch him in the face and I knocked out 2 of his teeth. I admitted that in CCRB and told him exactly what happened. CCRB did not exonerate. They said unsubstantiated. Unsubstantiated, if you look at it, you will think that, wow, it couldn't be proven or disproven. So now I had a CCRB against me. You would look at my record and you would think, wow, he used excessive force. That's the other angle to this. There's also the angle of 50A when you have off-duty incidents, say a family squabble, right? Husband and wife argue. That goes into your record. Even if it's a he said, she said, that a full repeal of 50A gives you insight into that record. Now, that's one of the things that I want to make sure that we approach with a balanced effort. Because if we don't, it's going to put too much forward on the other end. And I do understand that there need to be reforms. We just need to make sure that it's balanced and fair. And that's all I ask. And I think that'll go a long way in improving relations in all our communities. And I've worked in many, many communities across the city. I worked in East Flatbush. I worked in Williamsburg. I worked in Midtown Manhattan. So I just want to give you some insight into the other end. Thank you so much.
Thank you. So next is Senator Brad Holman of Manhattan. And Brad, you have 3 minutes.
Thank you. Yes. Thank you, Assemblymember, for your perspective on 50A. I know there's a lot of us who want to see it repealed. I'm one of them. We would love, to have a discussion about how to get that done in a way that you think is fair. But so far, we haven't had much dialogue. But I wanted to thank, in particular, my Senate colleague, Jamal Bailey, for having a hearing this summer on the issue, which was very illuminating. And I think it's more important than ever, given the concerns that have been raised during this hearing. A quick question, though, to Adrian. As Adrian knows, I carry the legislation in the Senate called Protect Our Courts Act, which would protect the undocumented and others from ICE arrests in and around courthouses. I wanted to know what your thinking was in terms of ICE enforcement actions. They've obviously not occurred because the courthouses haven't been open for the most part. Are you concerned that as soon as those doors are flung open, you're going to see ICE making these, taking these, illicit and damaging actions against our immigrant community?
You have to unmute. Yeah, Adrian, you have to unmute. The host, you want to unmute Adrian Holder, please?
Okay, thank you. Yes, it kept saying I couldn't unmute myself. Yes, I am very concerned about that. And when you actually think about some of the actions that ICE has taken, and also that
the Justice Department has had the Immigration Court continue the proceedings that our detained clients find themselves in. It's a scary proposition that they are still persisting with some enforcement now, and I think it's going to get even worse if and when the court should reopen. But just the idea that in so many jurisdictions, especially here in New York, immigrants just don't have anyone to represent them. So I remain very concerned about that. I also wanted to add, because one of my clients is here, right? During the pandemic, the Legal Aid Society has continued in our leadership role in trying against the public charge immigration rule, and which punishes immigrants for using certain government benefits. And so Make the Road New York is our client. And I want folks to know just really quickly, I mean, there's so many horrible things that are going on to our immigration community, and the lack of support even before the pandemic and as it stems now. But in April, we filed a motion together with the state and city of New York seeking an injunction to set aside the public charge rule during the remainder of this crisis, so that non-citizens in New York and across the nation will not hesitate to use healthcare and other government benefits that they're eligible for and need to get through this public health and economic crisis. And I can't stress enough that when we're talking about this, we're not just talking about, which we care about, of course, our client community, but it's all of us. It's about public health. And even today, we were in court on an oral argument on the public charge case, arguing against the government's motion to dismiss.
Thank you for that. And I just want to finish up by emphasizing the point that you said. As long as the courthouses are closed, ICE and evictions, for example, cannot occur. But once the courts start opening, we're going to see a tsunami of those types of actions, and we need to be prepared for that. And I want to shout out Senator Benjamin for leading a group of Senate colleagues in terms of opposing NYPD actions on social distancing and encouraging community-based responses to make sure that the public stays safe. Thank you, Mr. Chair.
So, Senator, may I just add one thing to the immigration question?
Go ahead.
I just wanted to say quickly that during this crisis, we have actually seen ICE arrests at home increase. They're happening more often than they were happening prior to the crisis, because immigration is operating pretty much at full capacity. And the reason they go into courts is because people are easy to find. When people are now told to shelter in place, they're going to their homes. Protect our courts is incredibly important when these reopen, because that will again become the easiest place to find people. So we do continue to support protect our courts.
Thank you very much. Now on the Assembly side, we'll have Assembly Member Yulee New, co-chair of the Task Force on Asian Pacific Americans.
Hi, can you hear me?
Yes.
Okay. I just wanted to say thank you to everyone for testifying. I also wanted to say that I'm very sorry for the loss of so many of our friends and family, especially so sorry to hear from Deb on Make the Road losses. I wanted to kind of clear up if I'm a little bit confused by some of the stuff that was said about public charge. So I know that folks probably are a little bit confused as well. I just wanted to clarify and see like if there was anybody who wanted to say something a little bit different, because I think that there was some mixed messaging on it.
I'm sorry?
I think Yulee asked if someone could just clarify some of the issues around public charge, because perhaps because of our discussion earlier, it got a little confusing. I would suggest Ms. Holder, if you want to just explain to us, you know, the problem with the public charge, just so we understand a little bit better.
Yeah, there was a little bit of mixed messaging going on, so I wanted to make sure that there was some clarity.
Hello?
Yeah, we're getting frozen.
So I think.
So I guess I'm not sure what the public charge rule would say, that immigrants who would accept certain types of public benefits
would therefore then jeopardize their ability to actually have legal status. And what I was saying, I don't know what the confusion, but what I was saying was that what we are trying to do as we continue, we began litigation against public charge prior to the pandemic, along with the New York State Attorney General's office, with CCR, with the city. What we're saying is that we have continued to press on with that litigation, but in April, we also filed a motion together with the state and the city to seek an injunction to set aside the public charge rule, because the federal court is being told, has said that the government can go ahead in implementation of it. And we think that during the pandemic, that the charge rule needs to be suspended or set aside, the decision about public charge being able to move forward during this crisis, so that non-citizens in New York and across the nation will not hesitate to use the healthcare and other government benefits that they are eligible for and need to utilize as they get through this crisis. That's the problem. And we don't, and it's not only something that we feel very strongly about, because people are dying and our communities are already, so many of our communities are already, falling away and dying and not getting what they need. But it is the issue that this is what's best for the public, and we want to make sure that everybody, our immigrant clients, are protected.
Yeah, I just wanted to add that there is some real complexity. So public charge is certainly a horrific and racist wealth test that's been expanded by the Trump administration, which we need to stop. But it also is true that immigrants get misinformation and believe that they will be found to be public charge when it is not actually the case. So emergency medical assistance is not covered, disaster relief is not covered, national school lunch programs. So there are a lot of benefits and supports that people can safely access, but people are being confused and terrified into avoiding safety net supports that they desperately need. And it's important to mention the $3.5 billion excluded worker fund that we've designed also is safe for people to accept, because unemployment type income replacements and disaster relief supports are all fine and safe to accept to get through moments like this.
Amazing. Thank you. I just wanted to make sure that that part was said on the record. So thank you, Deb. And thank you, Ms. Holder.
Good. We are now going to hear from Senator Gorin, the chair of the Local Governments Committee.
Thank you, Senator Jackson, and everyone and panelists. You have been terrific. Ms. Holder, I have another question for you. You've been getting a lot of questions, but your expertise, I would love to hear on a topic that I don't think I heard in this panel, but it came up in the prior one and some others, and that is landlords are unscrupulously using self-help and evicting tenants who are immigrants during, it seems a lot more during this crisis. And one of the, witnesses is from my district, and I've been working with her directly on this problem. And, the issue is their remedy of going to the police. Some of them are doing that, and some of them are getting some relief, but many are just fearful, because of their immigration status, of doing that. Is there something we should consider doing in terms of legislation? I mean, I'm thinking, should we increase sanctions, penalties? Is there something we could do, to deal with these unscrupulous landlords, to maybe put something over their heads so they might think twice? Because obviously they don't have a problem doing this from a moral basis, but is there something we can do with a sanction that might make them think twice?
That's a really hard, that's a very hard question. I have to say though that the lion's share of cases that we've seen that are emergency or essential cases that have been going into housing court have had to deal with illegal evictions, but we know even before the pandemic that there are so many, and that so many of our clients who are immigrants, so many of our clients who are marginalized, never even get into court, right? They just get harassed out of their homes. You know, how we do that, I mean, I'm so grateful for a lot of our community-based organizations and others that try to disseminate real information, which is power, and the idea that there are places where folks can go when they're being harassed, and the fact that we, you know, increasingly are able to work with organizers and other folks, but has become more difficult because of, you know, the idea of having to deal with folks remotely. But I mean, it's a very good question of what additional penalties there could be, but there has been a real increase in the number of folks who've been harassed out of their homes for a bunch of reasons, and so many of them are immigrants and people of color who find themselves in those situations. But it is a tough issue, especially when you just don't know about it. People just leave, and you just don't hear about it, and they don't come to legal services or to elected officials.
Thank you very much. Thank you, Mr. Chairman.
I just want to add, it is the most heinous thing, right, for someone to be driven out in normal times, but particularly now, the idea that people would lose their home during the time of a pandemic, when people are being told that they have to shelter and stay in, and the idea that people are being kicked out and being harassed out with no place to go, and with the homelessness crisis statewide and in particular in the city being what it is. I mean, it has always been a very scary and heinous issue to have to deal with, but it's particularly deadly at this time, and it's going to be for a very, very long time. And it's very upsetting when you think about what's at stake, and why there's not more urgency in which to try to really address all these issues about keeping people in place.
Okay, thank you. Now we're going to move to the assembly. We'll go to Assembly Member Cruz. You're up.
Hi, thank you so much, Deb. Can you hear me?
We can hear you.
All right. Thank you so much, Deb. My sincere condolences to your members. You guys have done an incredible work and have often had to pick up the slack of, well, frankly, what government should have been doing. So I want to ask you something that generally doesn't get asked is, how is your team doing? And what has this done to your ability to do your job? And I think that the second question is I want to talk a little bit about the folks who have passed away and how difficult it probably has been, because many of them called our office, and that's how the bill that you guys are helping us with was born. How are they coping with how expensive it is to bury someone when, one, you don't have a job, two, you don't have access to a lot of the bailouts that everybody else has access to, yet you have a loved one who has passed away. And so those are my two questions for you for now.
Thank you. It's ugly. I've been incredibly grateful. Our team has such a culture of love and care in the way that we work. And so we've been holding each other and supporting each other. It was insanity for weeks. And then there was something particularly gruesome about the week that we had to train all of our frontline staff to walk people through how to get a body removed from your apartment if someone has died and they're still sitting there. And then of course the flip side is, how do you claim a body that's in a hospital before they get moved to a mass grave? And how do you do that within 14-day deadline when you don't have the money for funeral expenses and only one funeral home in all of Queens is even open and accepting calls? And so it's been horrific. And I think the folks that we talked to in our survey, you know, that said 5% were receiving unemployment insurance, 13% said they had received some sort of government facilitated support, and 67% said they had gotten some basic cash support through not-for-profits. And so we've been fortunate to be able to set up a modest fund to be able to distribute a few $100s to families to get by with food. It's not enough to make rent. And the modest funds that foundations are supporting are not enough to make rent. And so unless we're going to provide income support and income replacement that is similar to what other eligible workers receive, people are going to be destitute and they're going to be heading out to look for work when they shouldn't. And they're going to be accepting incredibly dangerous jobs with no protections. And that's what we're seeing happening with our folks. And the death toll is just going to keep mounting. So I'm sorry to end on that tone, but I hope that the love and appreciation of our members carries to all of you too, to help you fight with us.
Thank you, Deb. I think, just hearing that reminds us that unfortunately, while many of us have been lucky enough to not have suffered the personal loss, it is a loss for our community, it's a loss for our neighbors, for our friends. And while we as electeds probably for the most part could afford to give our loved ones a proper burial, our constituents often cannot. And so I urge folks to be supportive of the bill that Senator Sepulveda and I have put forward, because all it looks to do is, at the worst time in someone's life, which is to have to deal with the loss of their loved one, to give them a little bit of dignity, just so that they can get by. And thank you to your team, Deb. They have been fantastic, and our community continues to be here for you.
Thank you so much for your leadership.
Thank you. Next up is Jessica Ramos, the chair of the Labor Committee in the State Senate. She's from Queens. Jessica?
Hey, Uncle Bob. What's going on, everybody? I know it's getting late. We've been here all day. We're powering through this. So because the breadth or the scope of what's being discussed with this panel is very broad, I'm going to ask two questions. One is for communities for police reform. I'd like to know about some alternatives to police being the enforcers of social distancing. Have you thought about alternatives to policing during this pandemic? And for Make the Road, I want to ask about something that has not been mentioned during this hearing at all. How has our transgender community been impacted by COVID? I mean, I know anecdotally, because of the district I represent, so many of my transgender neighbors are sex workers, and because of the pandemic aren't able to work, are much more susceptible to housing discrimination, and obviously are much more vulnerable than many other groups, and it probably merits a hearing on itself, but I would love to know a little bit more about that. Those are my questions. Thank you.
Thank you for your question, Senator Ramos. For Communities United for Police Reform, our position has been that social distancing enforcement should be handled by health organizations as well as community-based organizations like religious leadership and some of the cure violence organizations and violent prevention organizations. And so,
have any protocols been drawn up that can be shared? I'd be curious. Okay.
And
I'll make sure to send them your way.
Thank you.
On the transgender community, as you know and imagine, the impact has been really horrific on our transgender members.
We lost Lorena Borjas.
Yes, an incredibly high proportion of the member leaders that we've lost have been transgender members. And you know, your design of the worker bailout fund has been really thoughtful to keep in mind workers like that who are barred from receiving unemployment insurance, not just based on immigration status, but for other reasons, including working in informal sectors of the economy. So that's another critical thing. And needless to say, just the discrimination, the housing conditions, and the really, really bad health care that our transgender members have received just creates a really awful situation for them in the face of COVID.
Thank you. I'll cede my time so that we can speed up.
Oh, okay. Thank you. Next, we're going to hear from Gustavo Rivera, the chair of the Health Committee from the Bronx. Gustavo.
All right. I thought that Brian was before me, so I went to prepare myself a little bit of dinner. That just, for me, that just means warming up something, but you know, it is what it is. So here we are. So I wanted to make sure that we had an opportunity to talk about folks that are incarcerated. We haven't done that enough. And I know that Ms. Axt talked about it for a little bit. But I wanted to make sure that we had an opportunity to talk about it. There's some people that I suggested for this hearing. Obviously, it is a long one, and a lot of things didn't make it onto it. We could talk about this for weeks, as Robert said, all the way back at 10 a.m. in the morning. So I will, well, at 11 actually, 10:45 or something like that. So as far as incarcerated individuals, I wanted to make sure that we talked about those, since I will remind everyone this hearing is about the disparate impact that COVID-19 has had on communities of color all across the state. And if we're talking about particularly around communities of color and around incarcerated individuals, most incarcerated individuals are people of color from communities like the ones that I represent. So if we could talk a little bit about the impact that it's had on them, I would really be appreciative. Anybody that wants to chime in, please do.
Senator, thank you for bringing this back up. Yeah, I actually I have more in my written remarks and more that I actually wanted to say. So thank you. Thank you for giving me a little bit more time to do that. No, the coronavirus crisis we have been ignoring it happening in the prisons and jails to deadly effect. There are, just at Rikers Island, hundreds and hundreds of people who have been tested and have tested positive. They report that 3 people have died. It is more than that. We have a client who we made multiple bail applications, filed a writ, tried to get him out. He contracted COVID while in Rikers. Finally, we got an emergency bail fund to pay his bail. He died 2 days after being released. So he doesn't count as a statistic of somebody who was, died because of the conditions in the jail facilities. DOC is taking the position that the jails are now safe, that they've reduced, that the population has been reduced enough. It has not. They're simply not testing people. But if you look at even the Bureau of Corrections statistics, they say that there are over 300 people now that have tested positive, but there's also another, I believe, about 1,300 that they believe have been likely exposed. That's over about half the population, according to the Bureau of Corrections, either has tested positive, is showing symptoms but has not been tested, or they believe has been exposed. We don't know what is happening in the prisons across the state. We do know, as I mentioned very quickly, that about 81% of the people who have actually tested positive are people of color. It is absolutely impacting people of color. It is, and the simple fact of the matter is that most of the corrections officers that are coming in and out of these facilities are also people of color, returning to communities of color. The infection rate amongst the corrections officers is unbelievably high. And so these are still pockets where it is impossible to social distance, and that the infection rate is high and is going to continue to be high until something is actually done about it. The governor has granted almost no petitions for clemency. He has the ability to do that. The mayor took the step of releasing a few hundred people onto work release who are serving very short sentences. The governor could do the same for state prisoners. We have to do something.
Gotcha. And the last minute, I have 58 seconds, so I will just say once again, for those of you who thought that I might have gone away, more revenue. We need billionaires and millionaires to pay their fair share. Everything that we've heard in the entire 8 or 9 hours that we've been in this hearing has been around about the fact that communities of color and poor and working class people across the state are bearing the brunt of this. Millionaires and billionaires. Governor Cuomo, I know you got one of your people watching, so I'm going to tell one of your people, whomever it is that's watching, tell the governor that Senator Rivera said, get taxes for billionaires and millionaires. And for God's sake, do not cut Medicaid. Do not cut Medicaid, because every one of the communities that we've been talking to, folks that are coming out of prison, poor and working class people across the state, those folks are what Medicaid patients. So please, for the love of God, don't cut that and pass New York Health Act this year. Thank you, Mr. Chairman.
Thank you. And next, we're going to hear from Senator Brian Benjamin from Manhattan, one of our leaders who leads the floor in our conference.
Well, that's a tough act to follow. I kind of wish you had Robert. But first of all, I just want to this is really a very impressive panel, by the way. I probably could ask 30 questions to all of you, but unfortunately, I only have 3 minutes, so I'm going to have to train my fire. Let me just start by saying, one of the things I want to talk about the social distancing, because to me, it's really important given all the trauma that our communities are going through. To add on top of that in this COVID-19 environment, NYPD trauma to me is just unbearable. And so I just wanted to say, I know there was a mention earlier that the police are not enforcing social distancing and they're doing a pilot program. While there's some of that's true, there's a caveat, which is that unless there's a serious danger to the public, and the NYPD determines what serious danger to the public is, which to me is completely unacceptable. So, we already know that the NYPD can safely and easily enforce social distancing downtown, but they have a hard time enforcing it uptown. And so my point is that they should be out of the business entirely, because we need fairness across the board. Here's my question that I think is it kind of builds on what I think Senator Ramos was asking. One of the things that a number of us have called for, we sent a letter to the mayor and the police commissioner calling for them to transfer social distancing facilitation. I don't like the word enforcement, because I think we got to really focus on education, not quote unquote enforcement, but transfer that to community groups, cure violence groups, who can work together to sort of make sure that people are educated, and we try to do social distancing in a way for public health. My question to anyone on the panel who cares to answer it is, are there other ideas that you think, besides the one that I think is useful, that possibly could also help in this front? Obviously we do not want the police to do it, at least I don't, and a number of us on this call don't. But is there something else that we should be thinking about that's not cure violence groups or community groups, faith-based groups, etc.?
Parks Department employees. That's where most of these issues are happening, is in and around parks. I mean, they are there. They're taking care of the grounds. Have Parks Department people speak to people as well. Anybody who is, working in a public setting that is a city or state employee should be able to educate people about social distancing, be provided with masks and PPE, and hand them out.
Anyone else?
I would also add that one of the key parts of the solution is that folks' basic needs need to be met, right? And so something we haven't had an opportunity to talk about today during the course of our conversation is the Homeless Can't Stay Home campaign and the call to end police sweeps in this period, which is a CDC recommended guideline, and are still ongoing throughout the city. And it's like, if we're not offering people permanent housing, and if we're not even offering people short-term solutions to the housing crisis, right? The fact that we're still engaging in these policing practices are actually putting all of our communities at greater risk. And so, we can't overstate the fact that folks' basic needs have to be met for the dynamic to change around enforcement. And so that's my pitch.
Perfect.
I just want to throw one other thing out while we have, I just can't forgive myself if I don't say it. When we get infection tracking, it cannot be surveillance. The information cannot go to law enforcement. It cannot be, the police cannot have access to it. It must be a health only tracking.
Talking about the contact tracers?
Yes, contact tracing cannot be accessed by law enforcement.
Good point. Very good point. Thank you.
Okay, thank you. We have a couple of assembly. We'll go to first Dick Gottfried, Chair of the Assembly Health Committee.
Just very quickly, I agree with Gustavo Rivera 100%. That's it.
All right, that was great. That was great. Now we're going to go to Assembly Member Joanne Simon.
And thank you all for being such a great panel. I have a very quick question because it's something that keeps coming up in various ways, and that is messaging. There's obviously conflicting messaging between the state and the city, but also how do we get to what I think are a lot of young people who are not wearing masks, and why they believe they don't need to, or what's going on for them that they're not getting on board with this. I know this is an issue in my district. Certainly I see this in a variety of communities in my district, and I'm not sure how we are able to get through to people about why this is so important. And I'm curious whether any of you who are working with people directly on the ground in community-based organizations have any guidance for us in terms of messaging. You know, it's the message, it's also who is the messenger, and which I know is very important. And I'm curious if you have any guidance for us on that. Any of the panelists?
I was hoping somebody younger would speak up and tell you how to speak to young people.
I understand.
I think there's no answer because it's a very difficult question. I mean, I think obviously one of the biggest problems is that there is conflicting messaging from the top, all the way down to what this means and whether it is dangerous or not. And the only thing I can think is the same way I talk to my toddler. We just have to keep saying it. We have to keep repeating it and keep enforcing it until hopefully it sinks in.
Okay.
I think the question of who is the messenger is such a critical one because it has to be folks who are credible in the community. And so what we have now identified, right, is that the appropriate response is not sending NYPD to violently arrest folks in a health crisis. And so, I mean, I think, for different communities, who the right messenger is and how they're receiving the message is gonna matter. And so I don't think there's also one standard answer. But I think a number of the things that folks have talked about, including Senator Benjamin, about empowering community organizations, empowering folks who are credible health, who belong to credible health organizations, right? Empowering community members with the information and resources so that they can actually do that themselves. Because policing is not going to be the right answer to this crisis.
Yeah, well, and just one other quick thing. I know the city has gone to this ambassador program, which is not NYPD, but other ambassadors that are supposed to be intervening. I don't know actually whether that's started or if it has, whether anybody has any intelligence on how that is working. Okay, so nobody has. Okay, all right. Thank you very much.
Okay, thank you, Senator. If you want to do the next panel.
Thanks. So I'm going to ask everyone to please stay on board. This is the last panel. These individuals have waited to speak, and I want you to hear what they have to say. And this is about access to care. And so we have Elizabeth Ryden Benjamin, Vice President of Health Initiatives at Community Service Society of New York. We have Cecilia Gentili, Board Chair of New Pride Agenda. Jawanza James Williams, Director of Organizing, Vocal New York. Tracy Gardner, Vice President of Policy Advocacy at Legal Action Center. And Reggie Nance, Associate State Director of AARP. So with that, let me turn it over to Elizabeth to start the ninth and last panel. Elizabeth?
Thank you. First of all, I want to thank everybody who's stayed this whole long day. I, for one, have found it incredibly fascinating, and I'm just so impressed by our legislature who is willing to have a very, very long panel on perhaps the most important topic of our time.
What happened, Elizabeth? I can't hear you.
Oh my goodness, I'm unmuted.
Okay. Go ahead.
Can you guys, can you hear me?
Yes.
Okay. Rewind the tape?
Yeah. Yes.
Okay. All right. Thank you. So I had a whole long big thank you to thank you all for being here. You know, I feel really lucky to live in the state of New York where such an important group of members of our legislature are willing to stay at this for whatever it's been 9-10 hours on the most important topic of the day. Quite frankly, I work at the Community Service Society of New York. It's a 175-year-old organization. Each year, we're committed to working on low-wage worker and low-income and all-income people's in New York's issues, and we try to bring their voices to the policy conversation. Each year, our health programs, which I run, see around 130,000 New Yorkers in every single county of this state, this great state. And it's been a very trying time. We've been very lucky to work remotely. We see people through 50 community-based organizations around the state and through a live answer helpline that has an over 95% call answer rate, even during the COVID pandemic. My first half of my testimony is really dedicated to just sort of outlining all the disparities. I'm going to skip that because I know this is a solution-oriented team that's still left here tonight. I did want to say that the reason why we're having these health disparities is a multi-decade policy, structural policy, racist structural policies in the making. So we did some really bad moves in, I guess, the 90s when we took steps to essentially eliminate 20,000 hospital beds. And boy, did we need those 20,000 beds. So because we deregulated our hospital reimbursement system and gutted our health planning system, we no longer have 20,000 beds. So we went from 74,000 beds to 55,000 beds. And where did those hospitals close? They closed in Queens, 4 of them in the last 20 years. They closed on Staten Island. They closed in the Bronx. They closed. Our safety net institutions have closed. And so it's these decisions that have really led to there being a disparate impact on people of color in New York State. And the thing that's happened as a result is that we are seeing incredible medical debt by people of color, and it's disparate impact on people of color. So for example, in Onondaga County, 41% of people of color have medical debt, 14% white. In Albany, 26% people of color, 10% white. Rochester, 27% people of color, 7% white. That's a huge problem, and we need to address it. I wanted to go to my solutions because I have a lot of solutions. And I think it's just really important to note, and I'm just going to put a pin in this, that there's other financing issues that have caused these disparate impacts on how people are able to access care. The federal government's funding, people in Clinton County, for example, are getting around $370 per person. I think Senator Lill might have left by now, but in Queens, we get $13 per person, or the Bronx, $58 per person in these federal healthcare funds. So we have a problem. Set up a COVID for Immigrants healthcare program. I think it'll cost around $15 million. It's a temporary expansion of the essential plan to immigrants so they can get it. We need to enact a moratorium on debt collections. We did a recent search of e-courts and found that 11 hospitals who are the most aggressive debt collectors, who get more in charity care funding than they actually spend, have filed 122 lawsuits against people that can't defend themselves in March of this year, and they're still going for it. and people cannot appear in court virtually. We need to get rid of the 9% medical debt interest rate. The federal funds rate's been like 1% for 20 years practically. We need to make there a uniform financial assistance program form. We need to have hospitals use the funds they are able to get to take care of uninsured patients, not sue them. And we need to help consumers, again, have an extension of the time to pay their health insurance premiums. The most important thing we need to do is, as Senator Rivera said, is raise revenue so we can act the bigger structural solutions, which is the New York Health Act, universal coverage. And number two, if we can't do that, we should at least restore global budgeting so we can protect our safety net hospitals, because they will not survive this pandemic and we need them. I have constituent resource list at the back of my testimony if anybody needs it. That was really hard to do in 5 minutes.
You did it. Congratulations. Thank you. So next we're going to hear from Cecilia Gentili, Board Chair, New Pride Agenda.
Hi everybody. Thank you so much for the time, and I'm very excited. A little bit tired after about 11 hours, but still with the energy to do what we have to do. So my name is Cecilia Gentili. I am the chair of the New Pride Agenda, an organization trying to look out for LGBT communities and their intersections with race in the state of New York. Yesterday, May 17, was International Day Against Homophobia, Transphobia, and Biphobia. So I have to say that I counted, and it took 10 hours and 40 minutes for the word transgender to be mentioned in this meeting, and I am a little bit upset about that, because it happens to be that many of the people that we serve when we talk about communities of color happen to be transgender, like myself. Discrimination, in high rates have been coming our way as people of color in the intersection with also being transgender. I personally had to twist the arm of many community members to access medical care when they did not want to, and it is many reasons for what trans people choose not to access medical services. It is like a history of discrimination in the medical settings for what trans people have a hard time accessing services. In the case of my very good friend Lorena Borjas, thank you, Senator Ramos, for mentioning her. I called her. She was she was for a week with fever and coughing, and she was not going to go to the hospital. I had to actually, call 911 and then tell her that an ambulance was going to go for her, because she did not want to go to. I know this is not the best time to criticize the medical settings, because they're doing an amazing job. But I have to say that while she was there, she did not receive any services in Spanish. Most of the time, I had to be on the phone with her, translating with the doctors about what was happening to her. So it is many issues for what trans people choose not to go to the doctor, and sometimes, like when you intersect the problems of trans people with people who are Spanish-speaking language only, it can become even much harder to access medical services. We are facing many issues as trans people. A lot of trans people had planned surgeries, for a long time, and those surgeries have been canceled at this time, and nobody knows when they're gonna happen. Because many of us lost our jobs, some of those surgeries were going to be covered by our insurances, and we don't have those insurances anymore. So that means that we'll not be having those surgeries at all. We are facing many issues as trans people and LGBT people in general. Community health centers and other safety net providers fighting HIV and AIDS and Hep C and the opioid epidemic are under severe financial strain as they struggle to serve vulnerable communities during COVID-19 pandemic. These hospitals and community-based organizations will continue to be critical to expanding testing and eventually ensuring equitable access to COVID-19 treatment and vaccines whenever these vaccines became developed and available. I have to say that in the trans community, a big part of the community, because of discrimination in the workplace, were forced somehow into using their body to provide what they need. And for that, we have many members of the trans community who are sex workers. These folks who are sex workers, of course, are not able to apply for unemployment. And some of these people who are undocumented also are not receiving any stimulus check. For that, we have people in the trans community, specifically in Queens, who have been experiencing a lot of mental health issues, a lot of depression. We have a community member who tried to commit suicide because she doesn't know how she's gonna pay her rent. We have many trans people who have been facing sexual harassment from landlords because they can't pay their rent. Now more than ever, we need to come together to build a more equitable healthcare system that prioritizes COVID-19 testing in neighborhoods where people of color live and work, and make sure that the critical supplies and equipment get to hospitals serving our communities. I had a much better idea of what I was gonna say, but that was 11 hours ago. I hope that helped. Thank you.
Yeah, and please send anything that you have in writing. That would be good also. And thank you for staying the course with us. I hope you had, during the course of the day, had something to eat and drink and what have you and so forth.
I did.
Okay. Is frozen? Then if you can. Jawanza James Williams, the Director of Organizing of Vocal New York. But before you do that, my screen was frozen. And Cecilia, did you hear what I said about?
I did.
Oh, okay. I hope you
did.
got something to eat and to drink during this marathon that we had. Okay, Jawanza James Williams.
Hi, my name is Jawanza again, and I'm the Director of Organizing at Vocal New York. And Vocal New York is a grassroots organization working to end AIDS, mass incarceration, and the drug war and homelessness by building the political power of low-income people across New York State and providing public health services for people who use drugs in Brooklyn. On behalf of Vocal New York, I want to thank the committee chairs and members of the New York State Senate and New York State Assembly involved in today's hearing for the opportunity to provide testimony. Before I begin, I would be remiss not to mention that several committees are not a part of this hearing. The Senate and Assembly's Corrections, Housing, Social Services, and Alcohol and Substance Use Committees should be present in the conversation about racial disparities in COVID-19. The issues I will be talking about today fall largely within the responsibility of these committees. Additionally, many grassroots organizations that work on exactly the issues that should be discussed today requested to testify and were denied the opportunity to participate. We cannot begin to address the impact of COVID-19 on communities of color if both working closest with the communities are not involved. We cannot begin to talk about the impacts of COVID-19 on Black and Latinx communities across the state without acknowledging the structural violence our communities faced long before this epidemic. Jails and prisons have long been used as a catch-all to manage our most pressing crises: record homelessness, unmet mental and behavioral health needs, substance use, joblessness, and poverty. On any given night before COVID-19, over 92,000 people slept in shelters or on the streets. And our state's historic overdose crisis that has claimed over 23,000 people under Governor Cuomo 43,000 people are caged in New York State prisons. Whether or not New York State will use the COVID-19 public health crisis to take action towards truly transformational change remains very much in doubt. In fact, what we've witnessed so far is further harm to Black and Latinx New Yorkers. Without a significant shift in the state's approach to criminal justice, drug use, and the overdose crisis, and homelessness, one centered on addressing structural social issues, we will never get there. Homelessness disproportionately impacts Black and Latinx New Yorkers. In New York City, Coalition for the Homeless reports 86% of all homeless single adults identify as Black or Hispanic, while just 10% identify as white. Homelessness is unequivocally a racial justice issue and is one manifestation of historic and persistent housing discrimination, biased economic and housing policies, extreme income inequality, and disproportionately high levels of poverty among people of color, as well as biased policing and incarceration in communities of color. I'm gonna skip through a lot of what I have written here and just hit some points so I hit all of our issues. So for 2 months, homeless New Yorkers, advocates, healthcare professionals, and local elected officials have demanded 30,000 of the city's 100,000 vacant hotel rooms be offered to homeless New Yorkers living in crowded shelters and those on the streets. FEMA confirmed it would pay for hotel rooms on April 3rd. The city's own Department of Health commissioner ordered it to happen on March 25th, yet the governor, Cuomo, and Mayor de Blasio have refused. Instead, the mayor and governor shut down subway stations, and law enforcement has been ordered to force homeless New Yorkers off trains in the middle of the night and sometimes in freezing temperatures. So all levels of government are implicated in the inhumane, cruel, and utterly horrifying circumstances that homeless, majority Black and Latinx New Yorkers are facing. A refusal to open up hotel rooms or house homeless New Yorkers in permanent housing is an acceptance that Black and Latino lives don't matter. On policing and jails and prisons disproportionately targeting and impact Black and Latinx New Yorkers, I'm just gonna skip to our sort of recommendations here because I'm running out of time. Okay, my testimony is pretty long, so I'm trying to like cut through what I can. We hear the message loud and clear that our incarcerated community members, no matter the race, do not matter to this panel. I'm sorry, I need to say what panel. I'm just gonna start over here. It's no secret that COVID-19 has infected jails and prisons across the state and that testing and response there is woefully lacking. According to DOCCS, 450 incarcerated people have tested positive for COVID-19 and 16 people have died from the virus. This is surely an undercount. Although Black and Latinx people make up 37% of the state's total population respectively, they make up 70% of the state's incarcerated population. Although there is no death penalty in New York State, since just January, 47 people have died in New York State prisons, the vast majority of people of color. Data published last week in the Daily News exposed that people of color account for the vast majority of those who have died in custody since the outbreak of COVID-19 over the past several weeks. So some recommendations include passing elder parole, Senate Bill 2144, fair and timely parole, and the HALT Solitary Confinement Act. And I want to just quickly talk quickly about our drug use to health work. Given that COVID-19 has made it difficult for people to make money and the drug supply is unstable, many people are going through intermittent withdrawal, which is not only excruciating, but drastically increases the risk of overdose. Numerous studies have shown that before COVID, Black communities have less access to buprenorphine than white communities. Telemedicine should increase access to buprenorphine for communities, but access information on virtual clinics and telephones remain an issue for some. Because of barriers, many turn to the illicit market to buy buprenorphine, and study after study illustrate that diverted buprenorphine is used therapeutically to prevent withdrawal, 79%, maintain abstinence, or self-wean off drugs. Yet even in COVID, arrests for buying and selling buprenorphine are rising. And let me just close out with this. Our state has been in grief for years from the mass death that has been caused by the overdose crisis. Now, with COVID, our state is grieving two crises. We demand the lives of people who use drugs are not forgotten by our elected officials or their policies to address the virus. We urge you to take the hard look at the issues of homelessness, drug use, incarceration, and policing. Especially in this moment, we need a vision and plan of action for addressing these interconnected issues that does not include the police or jails, and instead focuses on getting resources into Black and Latinx communities that desperately need housing and vital public health services. Thank you so much for your time and consideration.
Thank you. You were going very fast, but you got everything you wanted to say. But are you submitting that in writing also?
Yes, it's been submitted. So anybody that needs to access what I was speaking about, I skipped a lot of the data. I tried to cover the issues for 4 of our issue-based unions. And so there's a lot of thought and process that went into this document. So if you could all read it to detail, because I wasn't able to present it in 5 minutes.
Thank you. Thank you. And next we have Tracy Gardner, I believe, the Vice President of Legal Action Center. Tracy, am I correct?
Yes, but you promoted me. I'm Vice President for Policy Advocacy. Oh, what a long, strange day it's been, huh? Okay. I am going to submit my testimony. I am very appreciative to the legislature for convening this discussion, for convening this hearing, for soliciting recommendations, and I'm glad that the impact of COVID on communities of color is not as a surprise to you as it was apparently to our president and our governor. Jawanza, who is my heart, has said so much of my testimony, I almost don't have to talk. We are colleagues and allies in the fight to help people understand that where we are today is not an accident, it is by design, and it has been long in coming. I work with Legal Action Center, and so we are definitely seeing the impact of COVID on the people in communities with and for whom we work, individuals involved in the criminal justice system, those with chronic illnesses of substance use and mental disorders, and HIV/AIDS. And I'll talk about some recommendations toward the end. Fundamentally, and my hero, Dr. Robert Fuller said it at the very beginning. The COVID pandemic is testing the state's and nation's system and exposing the connections between poverty, mass incarceration, race, and poor health. And so it should not be a surprise that it's hitting low-income people in communities of color hard. It's ravaging the incarceration, people who are incarcerated, because in New York, especially, community health and correctional health are inextricably linked. It probably started before, but certainly its major origins are in the Rockefeller drug laws. And so the very same communities that have sent Black and brown bodies to the correction system for the last 40 years are the same communities that are struggling because of a lack of investment in health infrastructure, and acknowledging that 95% of people who go to jail and prison return home. It is simply an ongoing churn of illness and lack of investment, and will yield probably an even worse health emergency. These are the same communities that have weathered the opioid overdose epidemic that we were just coming out of, HIV, Hep C, MDR, TB, you name it, these are the same communities. The overlay continues to happen. And so what we're really talking about, particularly given the link between community health and correctional health, is acknowledging that connection. New York, the legislature 4 years ago acknowledged that we need to address reentry from corrections in the same way that we do discharge planning from hospitals. And so while many people who are in the correctional setting should not be in there because of COVID and other comorbidities, we've got to build the infrastructure in communities to ensure that they have the care that they need. It's not enough to release them. We are releasing people now to shelters and to the streets, and we are reaping the rewards of that. One of the main issues is that has created the situation is that for the past 50 plus years, Medicaid has been restricted from being used for people who are incarcerated. And that has created a constant churn of people who are sick inside. And then when they come out and try to access Medicaid or get covered by Medicaid, their time in the correctional system thwarts their ability to connect with health. So we have advanced and been talking to the state about working to remove that barrier, which many states around the country, New York included, have developed workarounds. It is not an accident that people with addiction and mental health issues are disproportionately represented in the correctional system. It's not an accident that they are mostly Black and Brown and Latinx. And it's not an accident that these are the communities that are the hardest hit. We've made the wrong investments. And so if we don't learn from this, because we certainly can't go back to the way things were before, if we don't learn from this, we will be vulnerable to an even worse health emergency that is completely preventable if we take the lesson that we're in. I think I'm going to stop for now and cede my time to other folks who are going to testify because we're
Okay.
sleepy.
And you didn't have any time left, but that's okay. The last panelist, last but not least, Reggie Nance, the State Director of AARP. Reggie?
Thank you, Senator. And first, just let me say, on behalf of the 2.5 million New Yorkers who are AARP members across the state, we thank you for this opportunity to testify on their behalf. And certainly we share the concern that you have about the disparate impact that COVID-19 is having on communities of color. And to that end, we looked at a report that said that the social determinants, things like employment and access to healthcare, are far bigger predictors of who gets COVID-19 infection than anything, including general health. Profound, but not surprising. And it's those social determinants that we speak to when we look at the disparate impact that COVID-19 is having on communities of color. In 2018, AARP launched the Disrupt Disparities Initiative. We partnered with the Hispanic Federation, the Asian American Federation, the NAACP of New York State, and the New York Urban League to look at the enduring disparities that affect people of color, particularly looking at the 50-plus population in the state of New York and looking at solutions. And what did we find? We found a couple of things. Older adults are the fastest growing segment of the population in New York State. People 65 years and older grew 26% over the past decade. We also found that in addition to the health disparities we found that New York State has the highest income inequality out of any state in the entire nation. So add all of that to the mix, and then here comes COVID-19. No surprise that lower income, older New Yorkers who live in communities of color are dying at a higher rate than anybody. Older New Yorkers, when you look at the death rate, are bearing the brunt of this virus. So what do? Number one, a lot of people have talked about testing. Let me tell you about that from an AARP standpoint. We believe that people who are 65 years old and 65 years and older should be given priority when it comes to testing. We're told that that's happening, but we don't know. We think that should be policy across the board. The second thing we want to look at is access to food. You've heard a lot about that today. I will just say that through our Disrupt Disparities report, we found that 330,000 people 60 and older are eligible for SNAP, yet they are not reaping that benefit. So we need to do outreach to those 330,000 people who are eligible for SNAP and don't have it. We need to expand online grocers who can receive SNAP. That's clear and obvious as to why we need to do that. The next thing we want to look at is how do we protect the health and safety of our long-term care staff and residents. This virus showed up first in a nursing home in Seattle, Washington State. And it's wilding, it's cunning, it's tenacious, but it also instructs us. It showed up first in a nursing home. And what would it have looked like if we had shored up our nursing homes, given it showed up in a nursing home first? And the one thing that we can do right now is a long-term care task force. You see the governor every day, major triage, a yeoman's job, giving us the numbers of the hospitals, the deaths, and it's making a difference. Why not the same thing for nursing homes and long-term care facilities? The second thing is that the government expanded testing in long-term care facilities, but that also needs to apply to assisted living facilities. It needs to apply to hospices, and it needs to apply to home health aides, people who go every day into the home to take care of people. They need testing too as well. And then the other thing is bring the long-term care ombudsman program back, the people who advocate on behalf of people in nursing homes, especially when the family can't see them. The other thing I want to mention, and I'm running out of time, so I'm gonna go to data. Data, data, data. We need as much racial and ethnic data as we can get. Right now, we are not getting that data for nursing home deaths. A newspaper organization had to file an open records request to get data for nursing home deaths by race and ethnicity. And what they found was that of the 11 nursing homes with the highest amount of deaths, 46% of those people were people of color. Again, the governor said that when this thing hits a nursing home, it's like fire in the dry grass. The fire is burning and it shows no signs of abatement, and there are things that we can do to take care of that. And with that, I do want to make a final plug for our organizations. We talked about them today. We need to make sure we're taking care of them in the short term. They struggle day in and day out anyway in the absence of COVID-19. We need to ensure that in the long term, we are giving them the resources that they need to be here long term. They are on the front lines day in and day out with COVID-19, and we need to make sure that they're taken care of. So thank you on behalf of AARP New York for this opportunity to testify today.
Boy, Reggie, you must have practiced that because you finished with 3 seconds left. Thank you.
I've done this before.
So we're going to go with Senator Gustavo Rivera. He raised his hand first, and then we're going to go to my co-chairs, Assembly Member Bronstein, to then call the Assembly Member that's next after that. We're rotating until we're out of here in about 15 to 20 minutes at the most. So Gustavo Rivera, you're up.
Thank you, Mr. Chairman. I will say, I think I said this over Twitter the other day. You might be a marathon runner, but I've done marathon hearings. Did one. Gottfried and me did one that was 13 hours. So this one is not even going to be 12. That's a BS right there. Now, but in all seriousness, so we started this day. We are almost 12 hours to the point that we started. The reason for all of this, and it is this cannot be the last hearing of this. At the same time that we all know, and most of the people that spoke today, if not every single one of them, and every single legislator that spoke today or paid attention today knows that there's a lot of stuff here that we did not need to, we knew about this stuff already, but it is becoming clearer, right? But this cannot be the last time that we have this conversation, because it is not only about talking about these issues, but we're talking about what options we have on policy to resolve it. Now, I would say that Jawanza, by the way, you are dope. Like he just went and went, covered so much. And even after 12 hours, the energy just kind of got into me. I was asleep over here, and you woke me. So there's a couple of things that we have to do here. This is about how we use the state to utilize policy that actually helps these things change. We've said it a couple of times during the day, and we will say it one more time. I will say one more time, this cannot be a process between the old normal and the new normal that is like the old normal. We cannot go back to the way things were. We need to change this in so many different ways, and today was a conversation in which, even though it was almost 12 hours, it is still not a full conversation of everything we have to change. But as it relates to some of the things that I'm working on, and I'm going to go to Elizabeth Benjamin in a second, we have to pass the New York Health Act. I would tell every colleague of mine that is not a sponsor on this right now to think about this, because we need to guarantee universal health coverage for every single person. And is it complicated? Yes. But it is not more complicated or more costly than what we have going on right now, which is a perfect example of what happens when we do not have universal access to coverage. So please, every single one of you, consider this. This has to be it. Your constituents need it. Every single New Yorker needs it. We need to make sure that we increase access while we get the New York Health Act done. Immigrants are still people. They're still New Yorkers. They still get sick. So we need to make sure that we expand care to them. So we expand the care to immigrant New Yorkers. And between now and then, so that I talked about the very long term, not very long term, but the longer term, which is the New York Health Act. We need to pass that. We need to extend care to New York Health, to immigrant New Yorkers, and we need to make sure that for those folks who are now going to be saddled with debt, medical debt, which is something that is happening, whether you're insured or not, you're getting that. So those folks who are saddled with debt, and I'm going to give the last minute, I'm going to give to Elizabeth Benjamin. You're going to have to talk very quickly. I'm going to have 44 seconds to say the following. This cannot be the last conversation we have about this. This has to be a transformative moment. We all have to say to ourselves, we have to challenge ourselves. We cannot go about, lily-livered, half-assed. We have to be bold in the way that we resolve the issues. We have to propose bold solutions to these issues. We cannot go back to the way things were, because the people that we've been talking about this whole day, people of color, poor and working class people, folks that are incarcerated, folks that are drug users, folks that are sex workers, trans Americans, transgender people, we cannot leave them behind. And if we go half-assed, we will leave them behind. So you get the last minute, Elizabeth Benjamin, on medical debt. What are we doing in medical debt that we can do in the state? There you go, discard. Tell me. 53
So
seconds.
we wrote this report that unfortunately came out in March, so no one probably read it, but it's called Discharged into Debt. And it showed that our private, every single hospital is a nonprofit in New York State. Every single one of our hospitals gets millions and millions and millions of dollars of state funding, but our so-called private and voluntary hospitals are suing our patients right, left, and center. We found over 40,000 medical debt cases, and people cannot defend themselves in court. They don't go to court. They don't know how to deal with it, and it's a pernicious thing.
We can do something legislatively, which is what we've done.
Legislatively, we can have a moratorium on debt collection. Legislatively, we need to cut the interest rate that hospitals can charge patients from 9% to 1%, the treasury rate. Why are we allowing nonprofit hospitals to charge commercial rates?
Make billionaires pay more revenue, more revenue, more revenue.
More revenue, more revenue, more revenue.
Chairman.
And, let's do a small program for immigrant folks to have COVID coverage. We can call it COVID coverage for immigrants during this period, but we must cover the people that don't have access to care now.
Thank you, Mr. Chairman, and thank you, Elizabeth.
Thank you. Co-Chair Bronstein.
Thank you, Senator. We're going to go to Assemblymember Mike Riley, Ranking Member of the Cities Committee.
Again, Ed, thank you. Thank you, Senator Jackson. You guys did a tremendous job today. Long day, but you ran a great meeting. For this panel, thank you. It was really nice to listen to and get all the information. I actually wanted to touch on Joanza. That was great. The point that you brought up about the other committees, that was going through my head today when I mentioned the alcohol and substance abuse, because I'm on that committee. I'm a member of that committee, so I was thinking the same thing, that this ties in with so many other committees. And so it was great that you pointed that out, and I'm sure the rest of my colleagues that are still at this hearing now, who sit on other committees, will bring this information to them as well. So I'm confident that that'll happen. The next thing I wanted to touch on was the impact on nursing homes. And Mr. Nance, you brought that up, and it was totally, your remarks were dead on, right, spot on. I think what we really need is we need a full-blown investigation into the policies and the enactment of things that went on in New York State during this time period. Unfortunately, I think we've seen there was a misstep at the beginning. And the reason why I say that we need a full investigation isn't necessarily punitive. It's more about making sure that we don't ever make those mistakes again. And for that to happen, I think both the state Senate and the Assembly have to have hearings on it and flush out all those things specific to the nursing homes. And if anybody can add to that from the panel or would like to address it, please. Thank you.
Yeah, from an AARP standpoint, certainly we support the investigations, and the governor has tasked the attorney general to do just that. And we believe there should be an investigation. But in the meantime, we still do believe that the nursing homes and long-term care facilities deserve the same level of triage and attention that hospitals are getting, because like I said, it started in a nursing home. So yes, an investigation, but in the right here and now, form that long-term care task force. We've sent a letter to the governor asking just for that, so that we can deal with the fact that, in his words, there's a fire, like fire to dry grass.
I would suggest that maybe.
Before you go on, I just wanted to touch on, I know that the governor and Madam Attorney General is looking into conducting an investigation, but I actually think that we need something that may require outside monitoring, maybe a special investigator appointed by, if that was possible, the legislature, because we need different eyes on it. We can't have, I think, in my opinion, someone who represents the state and the policies that may have impacted those decisions. There'd be a little bit of a conflict of interest, even if there really isn't and their heart is in the right place. The perception is what we have to avoid.
Right. I think it's important to say that the first reported case was identified in the nursing home, and I would bet one of my favorite shoes that there were cases in jail, in the correctional setting, that just weren't tested. I mean, at least nursing homes ostensibly had an ability to provide that kind of space. But again, it's another institution where older people with comorbidities were. So first reported.
Okay. All right. I mean, listen, I heard from so many people that it was, and this isn't meant to slight anyone. It's like, here we are, we're releasing people who are incarcerated based on COVID, and yet we were sending elderly back to nursing homes, which was in effect a prison for this pandemic. And it just did not, the way they approached it did not align with what the messaging was supposed to be about, in my opinion.
Could I add to that? I think to that point about older folks that are uniquely vulnerable to COVID-19, I'm pretty sure that Releasing Aging People from Prison, RAP, the organization, was not on this test to testify today. And there's a lot of folks across New York State who are elder folks who there's been legislation and a whole movement calling for these folks to be released from prison. So they were not sentenced to die, yet they're at the risk of dying. So we need to be able to have the kind of leadership in New York State that can hold the complexities of what does it look like to release our folks from out of these jails and prisons, which are petri dishes, get them not into shelters, which are also petri dishes, but get those folks into hotels and then build a pathway to permanent and stable housing, like by passing Senator Kavanaugh's Housing Access Voucher Program or Hevesi's Home Stability Support. We have to be able to hold that complexity and put forward the kind of solutions that consider the unique vulnerabilities of people of color, of people who are aged, people with comorbidities, and people that have been systemically oppressed. That's where we are right now in New York State.
Senator Jackson, you want to unmute? There you go.
Sure, I did. So next we're going to hear from Senator Brad Holman from Manhattan, and he has 3 minutes.
Thank you. Thank you, Senator Jackson. Thank you to the chairs, my colleagues, for this hearing. Wanted to ask Cecilia a quick question to give her as much of my time as possible to describe the particular experience of transgender women who are dealing with human trafficking issues, health concerns, and possible deportation. How does that intersect with the pandemic, and how are you able to quantify the ravages of this illness to this particular community?
When it comes to transgender women, I think like because we have like a long history of distrust with the healthcare system, it has been like really hard for us as organizers to get trans women to go to the doctor to begin with, right? We pass gender, yay, that's amazing. Nobody knows what gender is. I bet you go to I don't know, a doctor in Buffalo and you say, what is gender? They're not going to know what it is, right? So gender passed, but without any implementation, providers don't know that they can discriminate against trans people. And actually, trans people don't know that they can be discriminated against, right? So because of that, accessing healthcare is still something that takes a lot for people to go and see a doctor, right? When it comes to sex workers, like most of the sex workers that I know are people who exchange sex in a consensual way, right? I'm not saying that it's not people who are not being trafficked, and that's a reality that we also have to take under consideration. But the problem is that people who exchange consensual sex for money, food, housing, whatever it is, have been always criminalized, right? So these people now are suffering terribly because due to a history of criminalization of their jobs, they're not able to, for example, apply for unemployment. You can't go and say like, oh, sorry, I can't do my job anymore because of COVID-19, and because I'm a sex worker. You can't say that because you are. It makes you instantly a criminal, right? Another thing that had happened is like I have to say, many of my friends that I know who are sex workers had to break quarantine, and they had to see some of their clients because they had no food, right? Because they couldn't pay their phones, because they couldn't pay their rent, right? When we talk about like some of these trans women who are undocumented here, they're not getting unemployment. They're not getting a check from the government, right? So one of the things that we have to do is somehow start decriminalizing sex work for people who consensually exchange sex for things. And we have to implement gender, right? Gender is great, but if nobody knows about it, it doesn't mean anything.
Thank you. Assembly member.
Thank you, Senator. We're going to go to Assembly Member Kathy Nolan.
I just wanted to talk a little bit about hospital beds to this group, the people who spoke earlier. First of all, having been opposed to those cuts at that time, it was Manhattan-centric groups like yours that were urging those Queens hospital beds to be closed. And one of the rationales were that the providers were Catholic facilities. They didn't provide a full range of women's reproductive health choices, and many of the hospital beds in Queens were considered substandard because they were owned by doctor consortiums. And still most of us opposed the closing. I mean, Dick could speak to this a little bit more, but in the end, the reality was that people do not stay in hospitals the length of time that they once did. And the hospitals in Queens, not being nonprofits in the same way, owned by these doctor consortiums, I'm sure Dick can speak to it better than I, and then the Catholic hospitals not providing a full range of reproductive health choices, they did not continue. But the reality is, when I was a candy striper at Wyckoff Heights, which we worked very hard to keep open, they too were on the chopping block, but we were successful in preventing that from happening. When people had a hip replacement, they were in the hospital for 6 to 8 months. There was no rehab to go to at that time. I had my hip replaced 10 years ago. I was at the hospital for 4 days. And I understand today, sometimes it can even be faster than that. So I really have to take issue with your comment like, oh, we lost 20,000 hospital beds. I think that's like an oversimplification. We've replaced those beds with rehab, with urgent care, and with other things. I'm not saying that we were in a great position. Obviously, we needed the beds for the pandemic, and we were able, thank God, to ramp it up. But I have to say, honestly, for those of us in Queens, the problem has not been the hospital beds so much as it has been clinics and other things that would allow people to access primary care, especially when we talk about our minority community. We have a clinic, Floating Hospital, for example, in Long Island City. And in the middle of this pandemic, they almost closed because we had to contact people to arrange a loan for them. Then we couldn't get them a testing site initially because of some other bureaucratic regulation. Then there was some other problems. So, it seems to me that though I appreciate it, and at the time I was, very much opposed, and we worked hard to keep Wyckoff open, and obviously hospital beds are important. I just want to take a little bit, not issue, but kind of disagree with your statement because you don't have a context there. Those beds in Queens were lost because they were owned by doctor-owned hospitals, and they were not seen as the wave of the future. So let's just put it, and it was groups like yours, you weren't probably there at the time, that were very much in favor of those closures, because I remember that quite well. So I just want to say, sometimes you have to put things in a context. And I think going forward, the answer is not going to be, we're going to open up 20,000 hospital beds in New York. The answer has to be, what are we going to do so that we have a stockpile, so that we have an ability to move quickly? So a clinic like the Floating Hospital doesn't have 10 roadblocks in their way in the middle of something like this. I don't know, Dick may want to speak to it. And thank you. Apologize. It's too late to be contentious, but I just couldn't let that pass unremarked. Okay? Thanks.
Okay, thank you, Kathy. Senator Jackson?
Sure. And Senator Salazar, the chair of the Women's Committee, you're up.
Thank you, Chair. Thank you to the panelists. This has been extremely informative. Thank you just for sticking around this long. I want to actually just give an opportunity essentially to elaborate on why, in your opinion, any of you on the panel, it's a loss, and why it's detrimental to the quality of care in our healthcare system for us to lose tens of thousands of beds. I can only speak to what I've witnessed in Brooklyn and in my district, where we have Woodhull, the safety net hospital that has been threatened with closure, that has continued to suffer because of cuts, and which has had to make serious compromises to quality of care as a result. I'm curious if any of you would speak to even why cuts like this are made in the first place, when sometimes they seem counterintuitive, as are, in my opinion, the proposed cuts to Medicaid that we saw in the state budget.
Well, I'm a person who live undocumented in this country for 10 of the 20 years that I've been here. And, when it comes to going and access health services, I would feel more comfortable going to a hospital instead of going to an urgent care. Because to a hospital, that you can go, you can get your services, and then you'll get the bill, right? And you deal however you deal with that. But going to an urgent care is an expectation that you have to pay in advance, right? And it's an expectation that you have to pay a lot of money to be seen by a doctor. So when we say that we replace beds with urgent cares, I'm sorry, that's BS. That's terrible, and it doesn't do anything for people like me who has a history of being undocumented in this country and living without health insurance.
Can I also can I say something? Can I also respond? I mean, I think the point is that when maybe I spoke too quickly, but when we went to a free market rate setting system in the 90s, we used to have it was called the New York Prospective Reimbursement Mechanism. And what it did is it set reimbursements for hospitals in a fair way, so that not all the money went to the rich hospitals, basically in Bedpan Alley. So in Manhattan, for example, we have 6.4 beds per 1,000 people, but in Queens, that ratio is 1.5, right? But in Queens, we have 22 COVID cases, whereas in Manhattan, we only have 12. So we obviously don't have our hospitals allocated in a reasonable way, in a way that serves the geographic community. And we certainly are in, and we've set up our system so it's almost like a for-profit system, even though these are nonprofit hospitals. So it's survival of the fittest. So only the richest and powerful hospitals can prevail. And guess what? They're not in Queens and they're not in central Brooklyn. And if you look at the map of where people of color live and where the hospitals were closed, those are the same damn districts. And what we need to do as a state is really rethink our health policy so that we are fairly allocating our health resources so that the safety net hospitals are saved. And maybe not every single hospital in Queens should have been saved, but some of them should have been. Isn't enough hospital bed capacity in certain areas of Queens, in certain areas of Brooklyn, in certain areas of Staten Island and the Bronx, and that's where the people of color live. And this hearing is about health disparities. If we care about health disparities, we must learn how to allocate our resources in a just way so it doesn't just.
What happened?
We can hear you, Elizabeth.
Oh,
You went off.
oh, I didn't touch a thing. So maybe can you hear me now?
Yes.
Okay. So we can't just benefit the upper, I don't know where you lost me, but at the Upper East Side of Manhattan, where the whitest people live, at the expense of where people of color live and where low income communities live. And I have no idea what the Community Service Society said about those 4 Catholic run hospitals in Queens, but I'm sure we wouldn't say that there shouldn't be hospitals serving communities of colors. And I'm sure we never said that as I'm sitting here, as long as David Jones was ahead of it. And I don't mean to get testy, Assemblywoman Nolan, but I don't really know all that history. It was before my time. So, I just think we have to have a more rational healthcare system. And if we can't have the New York Health Act, we have to go back to regulating hospital rates so that true safety net institutions that are serving communities of color are supported. Otherwise, we have just what we have now. These are structural racist policies. And when you only finance the well-heeled at the expense of the less well-heeled hospitals, we have a problem.
Okay, thank you, Senator. Obviously, yes, Kathy, I get the impression you want to respond, so we'll give you 3 minutes. Go ahead. If we could unmute Kathy Nolan.
Just quickly, I'm not suggesting, by the way, I opposed every one of those cuts, and I'm not suggesting that urgent care is the way to go, and nor am I suggesting that the Community Service Society was evil in some way. I'm pointing out that it happened, and as someone who was involved with it at the time, frankly, we did not have your organization with us. Maybe Mr. Gottfried could speak to it, because it's still a bitter pill for me 20 years later. And I don't know if Maritza is still on the call, but as someone who at that time, when she and I barely knew each other, were involved in the effort to save Wyckoff, which Dick Gottfried came out too. We were successful in saving Wyckoff, but these others we were not. And I just am trying to point out that you are not going to replace those 20,000 beds with 20,000 new hospital beds. Yes, there should be more equity. I opposed every one of those things, but maybe Dick can speak to it. But I just felt that your testimony was kind of that simplistic, well, we need 20,000 more beds in Queens. That's not happening. So we need to come up with realistic answers. Some of these things were opposed. They happened anyway. And some of them were, though, I will say, somewhat the inevitable consequence of differences in how healthcare is delivered. Like, for example, being in the hospital 6 months for a hip replacement versus 3 or 4 days. That's all I was trying to say. I'm not supporting urgent care. I'm not criticizing you. Just trying to give a reality. That's all.
Okay, you have about a minute and a half left. Dick, if you want to respond to what Kathy said or not, and then we need to move on.
Thank you. Peace to everyone. Thank you.
Dick, you want to say something?
I don't think Community Service Society ever supported the closing of a single hospital bed.
I'm going to find the paperwork.
And Elizabeth is right that probably the biggest single thing that a couple of things that have led to the extraordinary consolidation of wealth and hospital beds in a smaller and smaller number of richer and richer hospitals. One was the deregulating of hospital prices in the mid-90s, which predictably led to increased concentration in the hospitals that have a high level of capital, namely the academic medical centers. The over-concentration of power on the insurance company side led to mergers of hospitals to try to defend themselves. That's what this is all almost entirely about.
Okay, thank you. And Dick, you're on the list with your hand raised. Do you want to continue to stay on the list, or was that the point you wanted to make?
To say.
Okay, thank you. Now we're going to go to Assembly Member Marcos Crespo, the Chair of the Labor Committee, for 5 minutes. Go ahead, Marcos.
All right, thanks. I may not need all 5. I just wanted to kind of reiterate where I started whenever we got started. Feels like a long time ago. None of this that we have discussed all day in every single panel is new. And it's a big "we told you so." Again, I'm going to rephrase that because time and time again in these panels, we've talked about issues that have been brought up by members of our community, legislators from our communities, advocacy organizations. If in almost all of the recommendations, we're revisiting ideas that we've been pushing for or discussing in legislative, years, a bunch of discussions, and just end up at the end of the list of priorities when it comes down to budget crunching time. But now, because of COVID and the impact of these deaths, we are realizing the magnitude of the impact. Look, in the time that I've been in the legislature, and I've seen in the Assembly when we didn't have the right partnership in the Senate, the Assembly has always been the house that has pushed for these sort of progressive ideas and moving the needle forward and bringing up minority issues. I remember when Amadou Diallo got shot in my district is when we started talking about criminal justice reform and the CJ package that members of color were bringing up. I was an intern at the time, and we're still on that fight. I give a lot of thanks, and I don't think he's been mentioned all day today, but Speaker Hastie, when his leadership came on board, prioritizing, finally making not only the sentiment of the Assembly, but the actual budget outcomes to be those priorities. Minimum wage, imagine where we would be in this pandemic if we hadn't done minimum wage increases, paid family leave, and the criminal justice reforms. How many more people would have been in a worse position or situation? And so I'm just saying, I'm really grateful to have been a part of a House that has led on those charges. And now we have partners in the Senate, and we've seen what we can do, and there's so much more to be done. But I think just to revisit this, one thing has to be made clear at the end of this conversation. Number one, it's not the end of the road of these discussions. And I know that not every chair is here and not every topic has been elaborated on, but we all know that, we're going to have times to move this needle forward, and this is going to take time to address these issues. But it is imperative, and I'm grateful to our chairs and all the members and all the panelists today for participating in this conversation. What I hope we take away is the fact that the solutions that we're looking for don't have to be redeveloped. They've been floating around. It's a matter of putting political will in prioritizing the right issues as we move forward, is making sure that we raise the revenues that we need to spend where appropriate. It's being really bold and rethinking the way we approach some of these issues, whether it's homelessness, whether it's the continued discussions on criminal justice reform, education, you name it. Look, communities of color have always been at the short end of the stick on every one of these conversations. We've been saying that for a long time. It's a matter of making sure that we spend correctly. And look, I do want to mention this because a lot of things have been alluded to, the second floor and the leadership of the governor. I will say this, in my experience in the Bronx, I can speak to the Bronx. I have been in touch with them regularly from the beginning of this. We've talked about testing. They've been asking where the needs are. I've seen my colleagues, community-based organizations, mobilizing resources, giving out supplies in the community. And the governor's office has been, I have to say, very helpful in that regard. Have they done a perfect job? Absolutely not. No leader has in this situation. We all have lessons to be learned, and we all can critique each other. But I've been amazed at, and I've been grateful at the participation of colleagues who have maybe disagreed with us on policy when it comes to votes. But just hearing them today, it sounds like they're on our side on a lot of these things. And I hope that they remain so when it comes down to a vote. And when it comes down to the budget theater side, where we all take our normal lines in the sand as, partisan politics. Let's really acknowledge this. Communities of color are the essential workers. We are the front lines. We take the brunt. We are left behind. We have had the short end of the stick for a long time. If you want to change that dynamic, then you know what? Just start listening to us when it comes to our proposals. Give us the resources to execute that work, and do not disinvest in the very community-based organizations that are on the front lines and the advocates that are on the front lines who can deliver that message, deliver the programming, and address the disparities. That's what the lesson we have to take away from what's happened. I again, thank all the chairs and all my colleagues and the staff that are not seen today that really put all this together. I just want to say gracias. This has been an incredible way to really discuss these issues, but I know more work needs to be done.
Thank you very much, Marcos. And we're all gonna miss you. You're gonna be around till December though, so I have a feeling we'll hear from you.
More like July, but I got you.
Okay. Well, thank you, Marcos. Now we're gonna go to Assemblymember Catalina Cruz.
Thank you. I'm going to keep it short. I want to again reiterate how disappointed I am, and every time, just like Gustavo's always asking for raising revenue, I'm going to say it every time I get to speak, how incredibly disappointed I am that no one from either the state agencies or the city agencies in the city of New York showed up to this hearing to provide us with much needed testimony so that we could better understand. Because at some point we are supposed to be partners, yet doesn't feel like that when you don't show up and tell us as the elected officials what you're doing, and so that we can give you feedback. And if you want our support, we're here to do it, but we can't do that if you don't show up. I believe Cecilia's still on. Cecilia, before I ask you the question, I just wanted to highlight that the rates that came out today yet again indicate that Jackson Heights and Corona have the highest rate of death and I believe also of infection. So we continue to unfortunately be the epicenter of the epicenter, while our elected officials at the top level of the city and the state fight each other and try to take credit for the work. Our communities continue to suffer. We don't have the resources that we need, but they still can show up for a hearing, a much needed hearing. So Cecilia, that brings me to your question. I've asked every single one of the folks that I've had an opportunity to talk to, did the city or the state at any point reach out to any of the organizations that you work with to say you have a particular vulnerable section of our community? How can we help?
No, that I know of. Of course, when I know that it may be a little bit salty of me to just when I mentioned that it took 10 hours and 40 minutes for to have the word transgender in this forum, but that's just a reflection of where the community is in this ladder, right? This is where we are, and this is what unfortunately what we are used to, and this is what sometimes we came to understand that we deserve, because many of our communities just are complacent. Just we've been through all this hell for forever that we feel like this is just what we deserve. No, it has not been any outreach whatsoever. And I have to tell you, Assemblywoman, you know what worked the most for our community? Mutual aid. Us with a little bit of an extra coin, how we call it, giving to those who didn't have it, right? And it's a shame that we had to just kind of tap into our own resources. And thank God we have it, though. Thank God we were able to, everybody was donating, everybody was giving something. But if it came from the state, we had no help. From the city, we had no help. It was not mentioned that it's trans people having a hard time with this pandemic, and we had to do what we had to do by ourselves.
And as our time is done, on behalf of my colleagues and I, who have always stood with the issues with our transgender community, my sincere apologies, because our government has failed you, and you can count on those of us who are here. Reach out to us, you know where to find us.
Thank you.
Thank you, Assemblymember. And now we're going to go to Assemblymember Joanne Simon.
Hi. Thank you very much. And thank you all for staying, my colleagues for staying, and the witnesses. I know you've been here since the beginning, and this has been an incredibly long day. And I really so much appreciate your testimony. I did want to speak just very quickly, a question of Mr. Nance, who mentioned a long-term care task force. to look into the issues of long-term care. You know, I have a bill that I called a temporary commission on investigating the effects of closure of long-term care facilities. Now, that may be a little narrow because it was about closure, but I'm curious if you would take a look at that bill and let me know what you think about it. And certainly there may be a way of modifying that to address what is perhaps the broader need that you identified in your testimony. And that bill is A1418. It's something that I've been trying to get going for a while, and I think this is a really important time to start pushing that again. So
yes, we will.
Thoughts on that?
Yeah, we will. I mean, I don't know the bill, obviously,
That's
but
fine.
our advocacy folks from Albany are texting me back and forth, and they have given me the green light that they will. I've written the number that they're going to take a look at the bill, and we'll get back to you.
Great. Thank you very much. I appreciate it. And again, thank you to
Absolutely.
everybody and to all my colleagues. Thank you.
Okay, I think that's everybody. I want to thank all the witnesses for hanging out. It was a very long day. I want to thank all my colleagues, and Senator Jackson, you want to take us out? Got to take your mute off.
Well, it's been a long day, but we finished. And as Marco said, that this is not the end of it. I think we're going to have a continuation of hearing to dealing with so many issues in order to improve the lives of New Yorkers, not only people of color, but all New Yorkers. That's really what it's about. And I say to you that I'm committed to go the distance. I've run 3 New York City marathons, and I know what it takes to get it done. You have to have the physical strength and the mental capacity to get it done. And so, are you willing to stand up? And so let's stand up and fight back. So with that, Ed, thank you. I can't wait till we get back on the basketball court and playing basketball.
Me too, me too.
Because I enjoy it. And if you don't know, Ed's a good, very good basketball player. and I'm old and still trying to play.
Still good, Senator. You're still good.
Jessica Ramos calls me Uncle Bob. And I take that with pride too, you know. But anyway, thank you all, but especially thanks to staff for putting this all together on our behalf. Is it perfect? Nothing is. But this was very, very good, listening to everyone who had something to say. And now the work continues because they have all of the testimonies, and they're going to summarize it in order for, I guess, us to understand exactly what the direction that we're going as far as all the suggestions. And one thing is talk, talk, talk. As I said many times before, our constituents want to see action. And so with that, Ed, thank you as a co-chair. Thank to all the other chairs that were involved, that were listed there. They were about, including the other chairs, and the caucus and the task force. There were about 16 chairs. And let me tell you, it was a long hearing, but thank you. I appreciate it. All right, how do you turn this off?
Thank you. Good
Bye,
night.
everyone. Thank you, all the staff and the moderator. Thank you, and everyone for doing the job. I know that we're all tired. Let's get something to eat and get some rest. Tomorrow's another day. Assalamu alaikum. Peace be upon all of you.